Okay, so the next theory that I wanted to talk about today is done by Erik Erikson, and I've mentioned him before. Erik Erikson is really important for us in art therapy to help guide the types of interventions that we choose to do with clients. When children are in infancy, they're in that trust versus mistrust, and that's that attachment phase that we just talked about. They have to learn to trust. And if somebody can't trust, you've got to take them all the way back to the beginning and work on that trust and then move forward through all the stages of Erik Erikson's stages before you to get to the point where they are age wise, and then you can start working on the issues. So, infancy is about trust versus mistrust. Early childhood is about autonomy versus shame and doubt. So, early childhood is about potty training a lot, and so it corresponds with Freud's anal stage. But the idea here is um, that they learn that they can do things, that they can be successful at things, or they learn to experience shame and doubt. And the way Erikson's theories work is that if in one theory they aren't able to follow the positive path, then that makes the next stage much harder to stay on the positive path, and you're more likely to be on the negative path. So, for instance, if in infancy the child does not trust people, then they're more likely to experience shame and doubt in early childhood. So, if the earlier the damage is done, the more impact it has on their lives because it's going to create problems with each stage, which is why you have to go all the way back to whatever stage was disrupted and work forward from there. So they might not, they say they were great with trust. They learned to trust their parent. They did great with potty training and they found autonomy. But then in preschool, something happens. Mom gets sick or something occurs and they move into the guilt phase where they feel like maybe they caused it or maybe parents got divorced or something like that. Then they might, in preschool, it's supposed to be about initiative versus guilt. So doing things without others telling you to do them, initiating it yourself versus feeling guilty about the things that you do. So if you're disrupted in preschool and you carry a lot of guilt throughout life, you don't need to take the client all the way back to trust versus mistrust. You can just take them back to the initiative or the preschool stage, initiative versus guilt, and start working on, well, why are you feeling guilty and is causing the guilt, and looking at how you can trust yourself more and learning those skills of being able to think through an issue and come up with a positive solution. So that's kind of how it works developmentally and how we use it in art therapy as we go back to the stage that seems to be where the problem was and then move forward. Um, so the rest of the stages are at school age. You have industry versus inferiority. Adolescence is identity versus role confusion. For any of you who have adolescents or work with adolescents, you know that they try on a lot of different roles. They try out being the good kid, they try out being the bad kid, they try out being the sport person or the art person. They try out these different roles to see which one fits them. And by the end of adolescence, they will have decided which roles fit them, or they will end that stage with role confusion where they're not sure about their identity. So if you're working with an adult who has difficulty figuring out their identity, what they want to do for a career, are what is their role in life? Are they a parent? Are they able to take responsibility for things? These kinds of things. If they're having issues with that, then you need to take them back to that adolescent stage and help them work on their identity. If you are working with adolescents in art therapy, you will know from Erikson's theory that that's the number one thing they're working on is identity. So you would want to create a lot of art therapy interventions that deal with identity formation and helping them to form their identity. Young adulthood, they're looking at intimacy versus isolation. Middle adulthood is generativity versus stagnation. Mature adulthood is ego integrity versus despair. So at the end of life, if you're working with older adults, what they're really trying to decide is, did I have a meaningful life or not? And if they decide they have not had a meaningful life or a good life, then they experience a lot of despair. if they feel like they have, then they feel pretty good about the things they've done in life and their ego is still pretty strong. So you can see how each of these stages builds on the next, and how if one gets off track, it can cause the next one to get off track. And so as a therapist, as an art therapist, we have to go back to wherever the problem was. Okay, so now what I want to talk about is artistic development. So in art therapy, artistic development is pretty important. We need to understand when we're looking at drawings, is this normal for this age? Because what that will help us to do is to think about what might be going on. So if a child is, say, delayed, say you have a 11, 12-year-old that's really drawing at like a 4-year-old stage, then that probably tells you there's some kind of cognitive issue going on. If what you see is that you're working with that teenager and cognitively they're okay, like they do okay in school and on tests, but they're still drawing at the 4-year-old level, then that tells you there's a lot of emotional damage. So you have to compare what you're seeing in the drawings for artistic development to what you know they can do cognitively, and whether or not cognitively they're where they should be. And by doing that, you can decide, is this structural? Is this something, is there some kind of damage to the structural makeup of the brain or how it's developed? Or is this due to trauma or emotional issues that they are regressed? So the artistic stages are separated by age, but also by what they're doing. And one of the things to remember with any of these stage theories is that a client could move forward, and then the next time you see them, they could be back a stage. Stages aren't something that once you move forward, you always go forward. Sometimes you regress. If you, like I said, if you're working with a client and they're doing something that's age appropriate in their art, and then one day they come in and they do something that's really regressed or much younger, that's an indicator that whatever you're talking about that day probably is very emotionally difficult for that person. Or that something happened in the time between when you saw them last, and you need to find out what that is. Okay, so stage one is the scribble stage. The scribble stage, really what this is about is the physical activity. They start by making movements, and then at some point that movement, they might have something in their hand, or they might have food on their tray, and at some point they figure out that that movement can create a mark. And so then when you give them crayons or something, they start making marks. But again, it's still about the movement and trying to control it, and the joy of that movement, that feeling, is what makes them feel good. Children go through stages within the scribble stage. So usually they start out by just making marks, like side to side or up and down. And then those marks will connect sometimes. So sometimes you'll see triangles or rectangles or squares start to form. And then eventually you'll start seeing circles. And when you start seeing circles, you're getting to the end of the scribble stage. That's how you know that they're almost ready to move on. So with a 1-year-old, you're just going to have random marks. With a 2-year-old, you're going to start to have some organization to the marks. And by a 3-year-old, you should start seeing circles. You know that they've moved into the pre-schematic stage when those circles become a face. And that universally, it's fascinating to me, but universally, children around the world, no matter where they're from, this is what happens. They go through the scribble stage, and then they start making these circles, and then the circles become a face. So usually the circle becomes a face by having 2 circles put inside the bigger circle, and they realize, hey, that looks like a face. Those are 2 eyes. And if you think about that, during attachment, when a baby is an infant, that's the number one thing you're doing, is making eye contact. So the eyes in the human being are very important for children and for babies. And that's why we see that in the very early stages of artistic development. So these children, they do something called tadpole figures, and those are some of my favorite figures that children draw, where it's just the head with maybe 2 eyes, and then these legs and arms are just sticks coming out of the main circle. So they're called tadpole figures. What they're figuring out during this stage is that they can start connecting lines and connecting shapes to create symbols for images. So a person starts out as a circle with 2 circles in it for the eyes, and then mark straight lines for the arms and the legs. And then eventually they figure out, hey, if I draw a couple straight lines and make a rectangle, I can do the body. And then I can put the arms and legs on. So they figure out how to start putting together basic shapes to create images during the pre-schematic stage, which is 3 to 4 years old. In the schematic stage, a schema means that you develop a symbol system. That's what a schema is. So in the schematic stage, your schema solidifies. So in the pre-schematic stage, you're trying out different ways to combine shapes to create figures. But in the schematic stage, you start to come up with a symbol for how you want to draw something. So when you draw a person, then your person is going to look the same every time you draw it, or it's going to look similar. So you're going to come up with what you think represents a person. So they have clearly assigned shapes to objects that they're attempting to communicate. They develop a schema for creating the drawings, and there's a defined order. The big clue that they've moved into the schematic stage is that there becomes a separation or a ground line. Things aren't floating around anymore. In the pre-schematic stage, everything's floating. In the schematic stage, they start to ground it, and it can be grounded at the bottom of the paper, or they can literally draw in a ground line and put things on it. There's some fun things that happen in this stage because the kids are trying to figure out how to represent the world that they see. So they understand what they're seeing, and they're trying to figure out, how do I show that in what I'm drawing? So they start to ground their figures at the bottom of the page, but you will see at this stage that they do a separate line for the sky and a separate line for the ground. So they might have blue drawing for the sky and then the ground line. And that's normal for the schematic stage, which is 5 to 6 years old, because they're trying to figure out, how do those connect? I know the sky's up there, and I know the ground's down there, but how do I draw that? How do I connect them? So they're trying to work through that. Some other things that they do that I enjoy in that phase is they sometimes do what are called X-ray drawings, because what they know is more than what they can draw. So they might draw a person, and they might know that that person, say, has a tummy ache. So they might draw the stomach inside of the person to show that it has a tummy ache. So you're getting that X-ray vision. So they know the tummy ache is there, but they want to draw that the tummy ache's there, but they're having the conflict between, they know that they can't see the tummy, but they know that the tummy has an ache. So they want to represent it. They will also emphasize things at this stage that are more emotionally important to them. There's this wonderful drawing of a child who is the child that's being represented, and they're standing in grass, and the feet are bare, they don't have shoes on, and the toes are really big. And that's because the child was really focused on what it felt like to have bare feet in the grass. And so the feet were the most important part of that experience for them. So that's why that had the emphasis. They'll also do things like draw mommy really big or daddy really big, depending on who they think has more power within the family. So size often relates to importance in that schematic stage. Another thing that they'll do in the schematic stage that's kind of fun is we call it a drawing that's been laid out. So when they're trying to figure out, how do I draw, they haven't figured out how to draw perspective yet, and that's what they're struggling with. So there's a picture of a child who's standing on one sidewalk, and then across the street is another child that's their friend, and they're waving to that child, but they can't figure out how to draw perspective where they can see both sides of the street and both trees and houses, but be able to see both people waving. And so what they do is they just lay it out. So you have one person on that side of the street with their head up here and their feet here, and then the street, and then another person on this side of the street with their feet here and their head there. So they just lay it out like they've opened a book, and they're looking straight down on the scene as if they're in a bird or in a plane, because they're trying to figure out how to do that perspective. So that's their solution. Okay. The next stage is 7 to 9 years old, and this is dawning realism. This is a really important stage for kids. 7 to 9 years old, they will decide at this point if they think they're any good at doing art. If they feel like they're not good at doing art, then after about 9 years old, they will start going other directions. They might get more into sports, they might get more into music, they might focus more on, their academics and move away from art making if they think they aren't any good at it. So this is the stage where they start to become more critical of themselves and critical of what they're doing. And they're trying to match what they do in their art to what they see in the world. So in the last stage, they started doing that, but they were okay with their solutions, even though the solutions weren't quite right. In this stage, 7 to 9, they start to become very critical of their solutions. So they become more critical. They're trying to show objects with more realism. They still use schema. So you'll see some drawings that are very schematic that still, I think we all can remember that around this age, we drew one thing over and over again. It could have been a car or a dog face or a flower. And we learned to draw it really well, and we put it in all of our borders on our note papers and things like that, or I did at least. And you got really good at drawing that. That's your schema that you're really good at. So you'll see schemas at this stage that kids do over and over, and we call that stereotyping. But then you'll also see attempts at realism for the kids who are trying really hard to capture that realistic aspect. One of the other things that you will see is with adults, they may be working at this stage, at the dawning realism stage. So they might be doing schemas or trying to draw more realistically, but it's not quite pulling it off. And those adults are usually ones that have not had any art training past about 9 years old. So if they decide at around 9 years old that they're not good at art and they go in another direction, then they stay at this stage. So because you see an adult drawing like a 9, 10-year-old, it doesn't mean they're developmentally delayed. It just means that's where they stopped. So what they have found is that up to this age, we naturally develop these skills. But to go beyond this stage, you have to start taking lessons and learning more. And that's because of things like understanding perspective and figuring out how to draw more realistically. So the fifth stage is 10 to 13 years old, and this is what's called the pseudo-naturalistic stage. Again, the children continue to be very critical of what they make. They can get frustrated very easily between 10 to 13 years old because you might be asking them to draw and they aren't really believing that they're very good at making art. So if you start seeing frustration in 10 to 13-year-olds or adults when they're trying to draw realistically and they're getting very frustrated, then move away from realism. Go to more expressionism or more abstract kind of art and more emotional art. Don't give them pencils. Don't give them black and white pencils. Don't give them erasers because they will erase and keep trying to draw it over and over again. So you want to move them towards the expressive side in art therapy, or they're going to shut down because they're going to get frustrated and they're just going to be like, I can't do art, and they're not going to try. So you want to watch for that. And I would say from about 9 years on, you want to watch for that frustration level and make sure you pick a media that is going to move them away from that idea of perfectionism because they're not going to be able to attain it.
好，大家晚上好，欢迎大家如约来参加我们今天晚上的线上公开课哈。我是李月，来自 WABC 艺图学院。那目前呢是主要负责中美艺术治疗课程的规划和研发。那目前呢是和我的伙伴们一起在共同推广中美艺术治疗课程在中国更广泛领域的应用和发展。那平时呢，其实我的主要大本营是在深圳哈，此刻应该是温暖如夏的。但是我现在这个装扮是在比较寒冷的地方，就一趟高铁就把我带入了冬季。我现在是在武汉，那我们在跟武汉的美术馆还有这个协和医院肿瘤中心， 我们合作了3场的线下体验课，效果的非常好。那这个也见到了我们部分的一些线上课的学员，所以那这里呢想跟大家说，这里一切都安好哈。那今天晚上来参加我们这个线上公开课的有一些应该是老朋友了，是我们线下或者是线上课的一些学员，那也有这个新朋友，大家都是带着对艺术治疗的深入学习的这份好奇还有热情，所以特别感谢大家。那同时呢，也感谢简单心理的一如既往的给予我们的支持。其实我们已经是通过合作成功推出了我们的明星老师 Michael 老师做到的这个艺术治疗入门课，也是深受学员的喜爱。那么这次呢，我们继续再跟简单心理 Uni 来合作，在这个我们美国艺术治疗课程体系的这样的以它为核心，那我们再继续的再结合了我们艺图学院，在艺术治疗领域我们多年的这样的一个应用的实践。在这次的课程当中，我们把课程内容、课程结构，包括整体后续学习的全面做了一个升级，所以又推出了这次的艺术治疗的一个进阶课程。那即将推出哈，刚才我们前面也都说到了，在11月27号我们就全面正式上线了。那我也是这次课程的一个助教。这个课程是非常适合我们对这个艺术治疗能够再进入深耕学习的更多的朋友们。那我们这次呢就非常开心也非常荣幸的，我们这次的主讲老师呢是 Penny Orr 博士。那 Penny 呢，她是非常的专业和资深了，她是这个美国艺术治疗领域非常权威的认证机构，我们叫艺术治疗认证委员会，我们叫 ATCB， 叫 Art Therapy Credential Board， 她的前委员会主席。所以她非常的资深。那这次我们其实是非常非常的荣幸能够邀请到她来给到我们就是定制了这3门课程，就包括我们的伦理、我们的历史和理论，还有我们的这个应用和技术。那其实这个过程当中有包含了我们不断进阶的这个理论学习的部分，同时也有这个学员们一直非常非常关心的就是这个应用和技法的部分，所以这个都已经包含在里面。那这个今年呢非常特别哈，就是老师的录制过程也非常不容易，因为老师其实一直都要在家里面去办公，但为了我们的录制效果，他经常的要把这个场景从家里面再搬到这个学校他的办公室特别感谢他给我们的这份用心。那今天晚上就在我们的即将课程要推出之前呢，我们也很开心邀请到他这个给我们做这样的一次分享哈。这次的主题就是我们的艺术治疗让创造力来帮助内心的成长那今天晚上的时间呢，也特别感谢有我们的翻译哈，一直的整个课程翻译也是由他来进行的，来推动的哈，就我们的 Joy， 我们的美颜。那今天晚上的时间我们会有3个环节，包括了老师的讲解还有我们的这个一个创作体验，大家可以抽空尽快把自己的这个画材准备好。那还有最后的一个答疑时间。那我们接下来呢就话不多说了哈，把时间就交给我们的 Penny 博士。好 ，So okay Penny, yeah, it's your time.
Yeah.
Okay, so I'm going to share my screen so that you can see the PowerPoint.
好，接下来我来分享一下屏幕，这样大家可以看到我们的 PPT。
Okay. Welcome. I'm Dr. Penny Orr, and it is my honor and pleasure to be here to present to you an arts and healing program put on by the WAPC.
大家晚上好，特别开心能够来到这里。今天我非常荣幸，也非常开心，来跟大家聊一聊这个艺术治疗这个，由 WAPC 艺图学院来呈现的整个的课程。我是 Penny Orr。
So you have already been introduced to me a little bit. I just wanted to let you know that I have been a practicing art therapist for the past 23 years, and I hope that I can share my knowledge and experience through these courses to help you get an inside view of what arts and healing is like.
大家刚才已经听过了我一些简短的介绍，那么我再增加一下，就是我在整个的艺术治疗的实践当中已经有23年的经验了。那我特别希望能够贡献出来我的知识和体验，帮助大家能够对艺术治疗有一个更深入内在的感受。
So welcome. So first I wanted to talk about what is art in healing. Art in healing is a integrative mental health and human services profession.
所以首先呢，我想来先跟大家讨论一下什么是艺术治疗。艺术治疗它首先是一个综合性的心理健康和公共服务的专业。
What we do in art and healing is we use the arts as a method for communication to help with the healing process.
我们怎么利用这个艺术呢？其实艺术它就是一个沟通和表达的方法，能够帮助我们进行交流。
Depending on where you live and what culture you are in, what we call it are different things. So throughout the course, I will call it by several different terms: art therapy, art psychotherapy, art in healing, art for wellness, or arts in medicine.
那么根据不同的地域、不同的文化，大家可能对艺术疗愈这件事情有不同的名称。在整个课程当中，可能会有艺术治疗、艺术心理学、艺术疗愈、健康疗愈、健康艺术，或者是医学艺术等等。
For this program, we're going to call it art in healing.
但是我们整个的项目，它总体上称为艺术疗愈。
So what is art and healing? Art and healing is a profession. Usually to do art and healing, you need some form of training, and that's what this program entails to do.
那到底什么是艺术疗愈呢？一个要实践艺术疗愈的人士，他是需要进行专业训练的，这也是我们整个项目的目的。
We can use art and healing in community programs, in individual sessions and groups to support treatment or to support skills and mental health of the individual.
那其实艺术疗愈可以应用在一些沟通交流的项目当中，或者是1对1的个案，或者是团体治疗当中，来帮助来访者提高心理健康的技巧和治疗。
We can use art to improve cognitive or sensory motor functions, foster self-esteem and self-awareness, and cultivate emotional resilience. It can also be used to promote insight, enhance social skills, reduce and resolve conflicts and distress, and advance societal and ecological change.
其实艺术疗愈它的功能非常多，比如说可以改善认知和感觉运动功能，培养自尊心，培养自我意识，培养情绪的适应力、复原力，促进洞察力，提高社会技能，减少解决冲突和痛苦，促进我们的社会和生态的变化。
So let's start with a main division that we see in art therapy or arts and healing. There are two main areas. One is art psychotherapy and the other is art as therapy.
那首先呢，我们来进入艺术疗愈的一个总体的2部分，一个是艺术作为心理治疗的一个方法，另一个是艺术疗愈。
In art psychotherapy, this is more focused on the mental health area, and it's insight oriented. It's based on psychological theories and uses metaphors and symbols for expression and discussion to address mental health. Mental health areas can be things like depression, anxiety, and stress.
那整个如果把艺术应用在心理治疗当中呢，它一般是根据心理治疗的一些理论和方法，使用象征还有隐喻等等，来帮助来访者来进行表达和讨论他们的一些病症，比如说抑郁、焦虑或者是压力。
In art as therapy, this approach is also based on psychological theory, but is less insight oriented.
而如果把艺术当作整体的疗愈方法呢，它也是基于心理治疗的理论，但是呢，它更多的并不存在于内在的状态当中。
In art as therapy, the simple act of making art can be therapeutic by itself. It can create things like a flow state, which is a meditative state, help to enhance positive emotions, physical expression, and increase social interactions.
那么整体上，如果把艺术作为大的疗愈方法呢，它实际上能够，通过就简单的创作这个艺术就已经是一种疗愈了。同时呢，它能够带领人们创造一种心流的状态，这种心流类似于禅修、禅定的状态。那么这个时候就可以增加我们的积极情绪、身体表达还有社会互动。
And the art media that we choose, what we work with, can actually help create that therapeutic intervention through sensory stimulation, through creating a soothing or calming experience, or increasing excitement or pleasure.
那么我们选择这个媒介的本身就可以当做一种干预的方法，比如说我们选择某些媒介可以进行感官刺激，或者是舒缓情绪，或者是让这个人更加兴奋等等。
So where do we use art in healing? Art and healing can be used pretty much any place where you want to improve mental health or social functioning or feelings of wellness.
所以我们到底艺术疗愈可以应用在哪些地方呢？其实只要是你想提高心理健康状态、社交功能或者是整体的健康状态，你都可以应用艺术疗愈。
Some examples of places that it has been used in the past are medical hospitals for things like cancer treatment, trauma, or long-term illness, psychiatric hospitals for inpatient, outpatient, or in private practice, just as an individual therapist, community centers working with the elderly or persons with disabilities or at-risk youth, schools for psychoeducation. We in the US use it for military veterans to combat post-traumatic stress disorder, and then people use it for wellness for personal use.
所以其实我们可以列举一些过去人们常用的艺术疗愈的实践地点，比如说首先是医疗医院，这些用于疗愈癌症、创伤和长期疾病的病人，还有精神病医院。在住院部、门诊部，还有私人执业都是可以的。在社区中心，可以涉及到老年人、残疾人、高危青年等等，也可以应用到学校的心理教育。而尤其在美国，它也会经常应用到退伍军人上，因为他们往往会承受一些创伤后应激障碍的一些痛苦，还有一些个人的艺术疗愈的使用。
So when we're doing art and healing, there is some form of training that is necessary. This program will help with some of that training. We'll be looking at understanding psychological theory that is behind what is happening in sessions, understanding the impact of the art materials themselves on the people that we work with, and to make sure that we're not causing harm. That's probably the most important thing about what we do.
那么我们想说，如果要实践这个艺术疗愈，培训是非常必要的。那我们整个项目就是为了帮助大家来进行相应的培训，帮助大家了解咨询当中发生的心理理论背景，还有了解工作的材料、使用的媒材对工作对象的影响。最重要的是，我们需要确保这个来访者不会受到我们的伤害。
And one of the reasons you need training is because making art with a client can bypass normal barriers that we have towards holding in our feelings or handling our feelings. And so making art can sometimes unexpectedly open people up too much. So we need to know how much is good.
所以其实我们在应用艺术进行疗愈的时候，它的一个非常好的效果就是能够让我们跨过一些我们常见的一些情感的障碍，而有的时候我们会非常意料之外的发现来访者打开的特别多，所以我们需要了解多少程度是适合的。
So we have to be careful how we use the art and as an intervention and what we do with it. For example, today we are going to make a mandala. A mandala is a circular pattern, and the mandala that we're going to be making is a special people mandala. When we do this type of activity with a person or a client, we're focusing on a positive, special people using positive psychology.
那所以其实我们可以今天就来做一个相应的艺术项目，这个项目叫做特殊人物曼陀罗。那在这个通常情况下，我们会针对来访者或个人做一些实施积极心理学所采取的画出积极人物的曼陀罗。这个曼陀罗它是画圆圈的形式。
So even though we are focusing in the art on a positive aspect of the person to increase feelings of wellness, to help people identify their social supports and to help them feel better about their lives, there can be a negative impact as well if we're not careful.
所以虽然说我们即使让大家画曼陀罗的时候，专注于一个人的积极的方面，比如说可以增加这个人的健康的感受，可以了解到他自己有什么样的社会支持，对自己的生活感受会更好一些。但是有的时候还是会有一些负面的感受出现的。
So asking someone to make art about people in their lives that support them or help them to be happy or bring them joy and hope can also open them to remember people that they've lost. So that it might open them up to grief. It might make them realize they don't have a lot of people in their lives and open them up to loneliness. Or it might make them feel like they are inadequate because they don't have enough support.
所以有的时候，即使我们在艺术疗愈当中，我们希望这个来访者他找到支持自己生活的人，或者是让自己非常开心快乐的人，或者是给予自己很多帮助的人。但是呢，有的时候也会提起这个来访者的记忆，让他想起来这个人已经不在了，所以我们可能会引发他的丧失与哀伤。有的时候他也会意识到自己确实没有这么多人支持他，那就会引发来访者的孤独的情绪，有的时候会引发来访者觉得自己不足够胜任的情绪，因为没有那么多支持是存在自己生活当中。
So when making art with somebody who is emotionally vulnerable, we need to recognize that for every good thing that we ask, there also could be a negative, and be ready to support and contain and help and hold that person to work through those difficult feelings.
所以当我们在艺术疗愈当中，我们的来访者工作对象他的情绪是非常脆弱的时候，当我们邀请他画一些积极的事物或人的时候，也可能会引发他一些负面消极的情绪。那这个时候作为治疗师是需要能够支持住他，给他提供容纳或抱持的感受，去帮助他处理度过这一段艰难的情绪。
So this is why training is necessary, so that we are able to recognize the possible issues with what we're doing and address them and support our client while we're working with them making art.
所以这个也就是我们为什么要参加培训，因为在培训当中你会了解到他可能引发什么样可能的议题，并且呢能学会如何解决这样的议题，去更好的支持到我们的来访者，在他的艺术创作当中提供更好的帮助。
Okay, so what I want to talk about next is the 3-course sequence that we have put together for this training.
那接下来我想跟大家聊一聊我们在整个的培训项目当中涉及到的3个系列的课程。
So after the introductory Intro to Art in Healing, WABC is providing a 3-course sequence to train those who wish to learn more and go more in depth with this process. The first course is about ethics in the art of healing practice. The second is the history and theory of art in healing. And the third covers techniques and practices in arts in healing.
所以在艺术疗愈入门的课程之后呢，我们将会给大家提供3个系列更深入的课程，帮助大家学得更多，走得更深。一个是艺术疗愈实践的伦理，第二个是艺术疗愈的历史和理论，第3个是艺术疗愈的技术和实践。
So within these 3 courses, we're going to be looking at many different things. We're going to look at ethics, which focus on making sure that what we do does not harm anybody, that is in the best interest of our clients, and that is helpful in that process. We will also look at theory, that the psychological theory that lies behind each decision that we make, and then we also look at the art itself and how to use it within practice.
所以我们首先呢会了解到艺术疗愈当中涉及到的伦理，来确保最重要的是要确保我们并不会伤害到我们的来访者，并且呢能够帮助到来访者。另一部分呢，我们会了解到每一个在艺术疗愈过程当中我们所做的决定，它背后的心理学的依据和理论。那第3部分呢，我们会了解一下艺术本身它整个的使用情况。
So within each course, there are many different learning activities to help you learn the content, but also enjoy what you are doing. So you will have reading from professional literature. I will provide links and videos, links to websites and videos that demonstrate ideas and concepts and the art making. There are PowerPoints for each video and each unit. There will be a quiz on each unit to make sure you're paying attention. Assignments for each unit. There will be a video lecture from me and discussion questions which you will do in groups with peers. You will also be making a lot of art throughout this course, so be ready for that, and I hope that that's enjoyable as well as helping you to learn what it is that we do. There will also be
Yeah. 所以在整个课程当中，我们会涉及到很多的活动。我们希望不仅能够帮助大家更好的学习我们的课程内容，也希望大家能够享受这个过程。首先呢，大家可以有很多的专业文献的读物，当中会包含一些网页链接，还有视频内容，可以帮助大家更好的理解艺术疗愈的概念。之后呢，每一堂课都会有 PPT 的展示。还有在课堂结束之后，我们也会有小册，这个小册就帮助大家能够更加专注在整个课程内容的学习上。那在小册之后呢，我们也会留作业，这个作业能够我会录制一些相应的视频，帮助大家一起在同辈的团体当中一起进行讨论。那特别希望大家能够在整个学习过程当中能够得到帮助，同时也享受这个过程。
So we will be making art in this course to reinforce ideas and to provide different techniques that you could use with clients. There'll be video demonstrations of different artistic techniques and discussions about the materials and how to use them. And you also have brief assignments with each course. And in some of the courses, we will have working group projects.
所以其实我们是希望在整个教学过程当中，我们有视频可以供大家讨论，也有一些作业供大家一起学习。最后呢，我们还可以在团体当中一起进行讨论。同时呢，在整个过程当中，大家会创作非常多的艺术作品。
My hope is that the combination of these types of learning experiences will help you to learn the material, but also enjoy the learning process.
那我的希望就是觉得大家应该在整个过程当中，既能够学习到东西，同时呢又享受这个学习的过程。
Okay, so I want to talk about each of the 3 courses a little more in depth.
那接下来我再深入的来讲解一下我们每一个系列具体要学什么。
So the first is the course that you'll take in the series is called Ethics in Art Healing. The purpose of this course, the reason we start with this course, is to make sure that you are doing art for healing at the highest ethical level and thinking possible to make sure that you aren't going to cause any harm to others.
所以我们首先来了解一下第一个系列艺术疗愈的伦理。这个课程的目的是在于确保每一次在实践艺术疗愈的时候，大家都保持着最高的伦理思想标准，来确保没有对来访者造成伤害。
In this course, we'll be exploring ethics as it applies to you actually doing art for healing for yourself and for others. and we will examine the ethical practice in art therapy, psychotherapy, and counseling, and then how are those related to each other and to what you're doing.
在这门课程当中，它可以实践于你自己的艺术疗愈和成长，也可以应用到其他人。那我们也会探索艺术治疗、心理治疗和心理咨询这些当中的理论实践，来帮助我们了解艺术疗愈的伦理实践。
So even though this course is a little more intellectual, we will also be making art and doing interactions to help with that learning and to make it enjoyable.
所以说，即使我们这个课程是需要特别动脑的，但是呢，我们也会做很多的艺术创作，来进行很多的互动，帮助大家去情感上喜欢、享受这个课程。
So we will be covering the underlying values that inform what we do and decide as it concerns ethical decision making.
那我们会涉及到基本的伦理价值观，来帮助我们进行伦理上的决策。
We'll be exploring the concepts of benevolence, integrity, responsibility, justice, respect, and creativity as it applies to art and healing and ethics.
那我们所有的基本价值观包括仁爱、正直、责任、公正、尊重和创造力，来帮助大家实践艺术疗愈。
We will also be exploring in this course the idea of responsibility. What is your responsibility to the client? What is your responsibility to the profession? And what is your responsibility to the art itself when you're doing art and healing?
我们也会更多的探索一下责任，也就是对于来访者的责任，对于专业的责任，对于艺术的责任。
And then in the last part of the course, we will look at how do you apply these ideas of ethics. And we will apply them in professional relationships. We'll talk about confidentiality, evaluation and assessment, taking care of the art itself, termination or ending services with a client, and other management areas.
那最后一部分，我们是来讨论一下，在具体的实践过程当中，包括我们的职业的资访关系、保密性评估、妥善照顾艺术作品、服务终止时应该怎么办，以及其他的管理领域。
The second course in the series is about the history and theory of art in healing.
那我们第二部分课程就是叫做艺术疗愈的历史和理论。
In order to understand where we are in the present in art and healing, we have to first understand our past. So the purpose of this course is to introduce you to foundation events, ideas, and theories that help to inform art and healing practice today.
为了了解我们的现在，我们必须了解过去。在艺术疗愈当中也是一样，我们要更多的了解艺术疗愈的历史，它在实践形成过程当中的基础事件、思想和理论。
Art and healing as a practice exists around the world in many different cultures.
在艺术疗愈其实在全世界各地都是存在的，而且应用于不同的文化当中。
In this course, we will focus on using a Western lens to explore the history and theory because that is the foundational practices that's most commonly seen around the world.
在我们的课程当中，我们主要是以西方世界的视角来探索艺术疗愈的发展，因为确实在艺术疗愈形成过程当中，这个西方视角是比较普遍的。
That doesn't mean that other histories and other approaches aren't as important. We just had to focus in order to make the course not too overwhelming.
所以这个并不是意味着说其他的历史或其他的文化并不重要，而是说我们希望能够专注在一条主线上，让整个课程更加清晰，并不会给大家过度的感觉。
In the history of art therapy, we will look at an overview of the history of art and healing, such as prehistory, ancient art making.
那么 我们首先呢会进行艺术疗愈整个的历史的概述，包括史前、古代等等。
We will look at early influences between the 1700s and the 1900s that influence the formation of the profession.
那之后呢，我们会具体的了解一下早期形成的时代，这个1700到1920年代，最后影响了最终的艺术疗愈的形成的这个时代。
We will look at how the profession started to form in the 1930s and 1940s, how the idea of art and healing slowly came to the forefront to become a profession.
那我们接下来会了解这个职业，它在1930年到1940年代这个期间，职业是如何最终形成在最前线，让我们看到了它的存在。
Then we will move forward in time and look at specific pioneer art therapists or artists who do healing, and then we'll look at how that profession started to expand around the world.
那接下来一部分呢，我们会看到就在艺术治疗当中一些先锋人士他们做的活动，主要是在1950到1960年代，这个艺术疗愈是如何扩展的。
And then we'll look at how art and healing looks today and how we use it in our current culture.
接下来我们会更多的了解艺术疗愈在当今以及我们当下的文化当中是怎么实践的。
The second part of the course will be on theories in art therapy. These are the underlying psychology-based theories that inform what we do.
那在第二部分，我们会更多的聚焦到艺术治疗的理论、心理理论当中。
As with the history, there are many more theories than we can possibly cover in one course. So we focused on the main ones that are used most often in arts and healing.
如果从历史上来看，其实有太多的心理治疗的理论可以来讲解，但是呢，在整个课程当中，我们希望专注在最主要的那些理论当中。
Some examples are psychodynamic and psychoanalytic art therapy. We'll be looking and exploring Jungian and Gestalt art therapy, humanistic, person-centered, existential art therapy, and cognitive, behavioral, and dialectical behavioral art therapy.
所以，比如说最主要的包括心理动力学、精神分析的艺术治疗，还有荣格格式塔艺术治疗、人本为中心的还有存在主义的艺术治疗，还有认知行为与辩证行为疗法。
We will also be exploring a little bit on family art therapy, developmental theories and attachment theory in art therapy, trauma-focused art therapy, and positive psychology in art therapy with some mindfulness in art therapy.
那我们其实也会了解到家庭艺术治疗、发展依恋理论艺术治疗、聚焦创伤的艺术治疗，还有积极心理学的艺术疗法。那么当中也会涉及到一些正念。
So the purpose of the third course, Techniques and Practices in Arts and Healing, is to give you a hands-on understanding of materials used in arts and healing.
那我们进入第3系列课程，就是艺术疗愈的技术和实践。其实它最主要的目的是帮助大家了解艺术疗愈当中大家所使用的艺术媒材的作用。
So in the previous 2 courses, we will be making art and practicing art interventions you could use with clients. In this course, we're going to really take a deep dive and look at the materials that we are using.
所以在刚开始的几节课，我们会大量的进行艺术创作，并且练习我们所学到的艺术疗愈的干预方法，帮助大家能够更深入的去挖掘自己在艺术疗愈当中所使用的媒材。
So in this course, we will look at what are the therapeutic qualities of each art material, what concepts surround the choices that you make on why you choose a certain material with a client over another.
那在整个过程当中，我们会看一下每一个艺术材料它所代表的特质是什么，并且呢，当你选择这个材料的时候，你为什么不选其他的材料？它的原因所在是什么？
We will explore something called the expressive therapies continuum, which is a theory that is unique to arts and healing.
那我们也会探索一些，比如说表达性艺术治疗的连续体这样的概念。
The expressive therapies continuum helps to guide us in where to go next with a client, what choices to make for materials, as well as interventions.
这种表达性艺术疗法的连续体这个概念呢，能够帮助我们指导我们去下一步应该选择什么样的材料，应该做什么样的选择，做什么样的干预，都可以告诉你。
This course will also explore art techniques, things that we can do in arts and healing, and the decisions that we make about which techniques to use and when. And it will provide, in the last part, case studies to help you understand those applications.
在这一部分，我们也会提供一些艺术的相应的技巧和技术，来帮助大家做决定，选择什么样的技术，选择什么时候应用这个技术，来帮助大家在进行艺术疗愈。
So in the first part of this course, we'll be looking at techniques and practices in arts and healing. We'll be looking at some of the theory that is behind it and how to actually conduct a session.
所以在这个第一部分呢，我们会主要介绍一下艺术疗愈技术和实践背后的理论，以及你具体怎么去进行一次艺术疗愈的个案。
The main part of this course is in the second section, which is in which we will explore materials. So we're going to look at many different materials in this course.
那其实最主要部分我们是放在第二单元，第二单元大家会更多的去探索各种各样不同的艺术材料。
We will be exploring ideas like material choices versus technique choices, when to use black and white drawing materials and when to use color, and how those black and white drawing materials are therapeutic.
所以在这个课程当中，我们会了解你如何做选择，什么时候选择黑白的素描材料，什么时候选择带颜色的材料，以及为什么这些材料能够产生疗愈的效果。
We will also be exploring colored drawing materials and talk about how the introduction of color increases emotional expression.
我们会具体讨论，如果你选择用颜色来进行绘画的话，如何引发来访者的情绪变化。
We will explore painting materials and look at how fluidity, opacity, and resist within painting change that interaction the client has with the media and how it affects the session therapeutically.
那我们也会进行，就是了解一下在绘画材料当中的流动性、不透明度和阻力是如何影响我们的来访者与艺术媒材之间的互动，以及我们的整个的艺术疗愈的效果。
We will also look into printmaking techniques and explore the benefits of being able to make art in repetition and having multiple versions of the same piece.
我们也会了解版画这种创作方法，能够学习重复的好处，以及同样一个艺术作品的多版本的好处。
We'll be exploring collage and found object art making and looking at how making special, taking something and putting it on a pedestal makes it special, and how bringing things together can be helpful therapeutically.
我们接下来也会了解拼贴画和识得物这样的艺术创作形式，如何把很多东西组合在一起就能够产生疗愈的效果。
We will also look at sculpture, and in sculpture we're going to explore the concepts of malleability versus rigidity and the effects those have on therapy.
那么其实我们在材料当中也会探索雕塑的效果，包括雕塑当中的延展性和刚性如何影响我们的疗愈效果。
We will explore fiber arts and think about how the soothing movements of working in fiber arts and making those connections and pulling together is also therapeutic.
我们也会了解纤维艺术，我们会探索为什么这个纤维艺术当中的舒缓的动作和这种连接的感觉能够产生 疗愈的效果。
We'll be also exploring mask making, body casting, and making imprints as a way of memorializing the self.
我们也会进行面具制作或者是身体素描这样的一个绘画方式，来帮助我们更好的去纪念自我。
And then we'll also be looking at digital art making, how being able to undo things and have different versions and add sound and movement and time can be healing.
我们也会了解数字艺术，也就是如何点击撤销按钮，或者是有不同的这个创作版本，加上更多的声音、动作等等，能够帮助大家进行疗愈。
In the last part of this course, we'll be looking again at how do we apply this to practice.
那在最后一部分，我们是要看到这个艺术疗愈它是怎么具体在实践当中操作的。
So I will share with you case studies in this last part, and then we will analyze the case studies for looking at how the materials were used and what choices were made.
所以我们最后这一单元会分享很多的实际操作的案例，并且我们来一起分析一下，我们做的各种各样的选择是什么？为什么要做这样的选择？
We will look at analyzing the needs of an older adult who has depression, and we'll also look at the form of the treatment planning and the process for that case.
我们会具体的分析一下老年人患抑郁症的患者他们的需求是什么样子，并且对他们进行艺术疗愈的相关的治疗规划和计划。
The second case we'll look at is an adolescent who has high anxiety, and we will also explore how the individual sessions are structured and how we work through them.
第二部分呢，我们会具体来探索一下青少年，如果他们有高度的焦虑的症状的话，我们应该如何进行1对1的个案？这个1对1的个案是如何进行结构设计的？
In the third case, we're going to be focusing on the last part of a session, which is exploring or processing the art after it's been made, and we're going to learn about the art of listening as part of that process.
在第三部分呢，我们会希望跟大家一起来学习和探索，如何在创作完艺术之后，我们来探索这个艺术作品，也就是我们要学会倾听的艺术。
And then in the final case study, we will be looking at safety with the art materials in particular, but safety in general, and how to use art materials during a crisis intervention.
在最后一部分，我们会学习到如何用艺术材料来创造安全，尤其是在危机干预当中的这个安全感的创造。
Okay, so now for the fun part of today, we are going to make some art. So what I would like you to do is to pull out some art materials. It can be any that you have on hand. If you have color materials, that would be great.
所以那今天最后一部分呢，我们来做一下小小的艺术项目。大家手边有任何的材料都可以拿出来应用一下。如果你要有带颜色的材料，那会是最好的一个状态。
So what we are going to create today is what I call a special people mandala. I talked about it earlier in the course. The purpose of this is to identify resources and supports in your life, to increase feelings of gratitude, and to identify any areas you need more support.
那今天的这个项目的名称叫做特殊人物曼陀罗，这个我们在刚才的课程当中也有提到过。这个的目的是希望大家能够寻找自己生活当中的一些支持的资源，或者是能够找到自己在哪些方面需要更多的支持。
The theoretical orientation that lies underneath this type of a project is called positive psychology, and it's person-centered. What that means is that we try to identify the client's needs, and we want them to focus on positive solutions for those needs.
所以，那今天这个艺术干预，它的理论的背景就是我们的积极心理学和人本主义取向。这个也就意味着我们需要去寻找来访者的本质的需求是什么，以及我们如何能发展出来积极的解决方案来满足这个需求。
Whenever we choose to do an art project that has a cultural component to it, we need to be careful and respectful.
当我们在任何情况下我们要做这个艺术创作项目的时候，其实它都会涉及到文化的因子，所以大家需要更加小心，更加有尊重的态度。
Mandalas have been made around the world in many different cultures, but the most common one that people are aware of is the Buddhist concept of the mandala and its healing nature.
那其实曼陀罗这个艺术项目在世界各地都普遍应用，而且在很多文化当中也出现了。那最显著的一个应用就是在佛教当中，这个曼陀罗的形式，它是有非常深刻的疗愈效果的。
So what you will create today is a modern version of a mandala. So what I would like you to do is to create a circle on your page.
所以那我们今天做的这个创作的这个曼陀罗，实际上就是现代版本的曼陀罗。首先呢，邀请大家在画当中画一个圈儿。
And then you want to put in the very center a symbol that represents you, like a flower.
那我们接下来邀请大家在整个画的最核心的地方放一个象征，这个象征代表你自己，比如说画一朵花，也可以代表你自己。
And then around you, within the circle, you want to put other symbols for other people in your life that help you, that make you happy, that make you feel better.
那在你的这个核心周围，并且也是在这个圆儿之内，希望大家可以画出其他的象征。这些象征代表着你生活当中的那些能够让你更开心，能够帮助到你，并且让你生活变得更好的这些人的一些象征。
I have an example, but it's behind me, so I got to get it. Hang on a sec.
好，我给大家举个例子哈，但是呢，我从身后拿一下。
Find one that you can see. Okay, so a mandala is a circle. So this is a mandala.
所以整体上来讲，这个曼陀罗就是一个圆儿。刚才大家看到这个图片上也是一个圆儿。
This is a mandala that has the symbols. So in the center, let's see, right here, is a bird, which represents me.
所以在这个曼陀罗当中是有很多象征的，在核心当中有一只小鸟，这个象征着我自己。
So I filled the circle with colors and lines and shapes to represent other people in my life.
并且呢，我会把这个整个圈儿当中填充好各种各样的颜色、线条和形状，来代表我生命当中的其他的人。
And then this is a final example.
这是最后一个例子。
This one I used flowers, and each type of flower represents a different person in my life.
这个例子当中有很多的花，每一朵花都是我生命当中不同的人。
So what you want to do is take your circle, you're going to decorate it about the people in your life, and I have some questions here for you to think about to help you identify who those people are.
所以大家就是要求在整个白纸上画一个非常大的圆圈儿，在圆圈儿当中用象征的符号代表你生活当中的人。接下来这些问题能够帮助大家去思考，想一下哪些人能够帮助到你。
So when you're thinking about who to include in your circle, ask yourself, who supports you? Who makes you laugh? Who teaches you new things? Who makes you feel safe? Who compliments you? Who do you play with? Who helps you?
所以当你在 创作这样的符号的时候，你可以想象一下，谁支持了你，谁让你笑了，谁教你新的东西了，谁让你感到安全了，谁称赞过你，你和谁一起玩过，或者谁帮助过你。
So we will take about 15 minutes to work on this.
那接下来我们会花15分钟的时间来创作这个作品。
And then I will talk about how you would process this with a client.
那接下来15分钟以后，我们一起来谈论一下，你如何跟你的来访者一起处理和讨论这个作品。
If you would like to listen to music or have silence, whatever is comfortable for you while you are working, you are welcome to do that.
非常欢迎大家，如果你想听音乐，一边创作一边听音乐是可以的，或者是你就是想非常安静的创作也是没问题的。
美颜，
哎，
建议老师把那个弄一下静音。
So Penny, so we shall mute ourselves to keep silence for the audience. Thank you.
We will take about 5 more minutes on this.
所以大家还有5分钟可以结束下来哦。
Okay, find a place to come to a stopping point. You, of course, can work on this more as we talk, but come to a stopping point so you can focus.
所以接下来大家可以慢慢结束下来，这样我们才能更专注的一起来讨论。
Okay, so a very important idea that to keep in mind when you're doing art in healing is that you don't need to be an artist to participate in it, and that the final piece doesn't necessarily have to be pretty.
所以在艺术疗愈当中有一个非常重要的想法，就是你不需要成为一个艺术家，你才能参与到艺术项目当中，而最后最后的成品也不一定非得是最艺术的那种作品。
The purpose of making the art is about the emotional expression.
我们来创作艺术的目的，就是为了来表达我们的情绪。
So when I would ask a client to do this, I could, if I was talking to a client, I could just say, who supports you? And they might quickly say, my parents or my friends.
如果我在跟来访者一起工作的时候，我可能就会直接问这个来访者，谁是你的支持者呢？他可能就会说是我的父母或者是我的朋友。
But by asking you to make art about your parents and your friends, it helps you to contemplate them, to have time to feel and think about them as you are working on the art.
我们来邀请来访者创作这样一幅艺术作品，来表达他们的父母或朋友，其实就是给他们时间，让他们更充分的去思索自己的朋友，去感受和思考这朋友和家人。
It gives you, by making art, it gives you time to think about stories or memories or other people in your life that maybe don't come to mind right away. It gives you contemplation time.
所以在我们的艺术创作过程当中，实际上是给自己一个思考、思索的时间。那有些人他需要就慢慢的想记起来，有些在生活当中你没办法立刻想到的，在思索过程当中可能会慢慢想到。
Also, by taking your feelings and putting them into the art, you now have taken your feelings and externalized them onto a page, so it's outside of you.
而当我们把这个感受通过艺术作品来创作在页面上的时候，实际上已经把这种情绪外化到页面上了。
We call that emotional distance.
我们会把它叫做情绪距离。
And having that emotional distance makes it easier to talk about your feelings.
如果有这样的情绪距离，会让你更容易去谈论这个情绪。
When your person that you're working with finishes their art, you want to what we call process it or explore the art to talk about it.
那当这个来访者他创作完成之后，我们会希望更多的去加工、讨论，或者是探索这个作品。
It's important when we process the art for us not to make any assumptions.
我们最重要的，当我们在探索这个作品的时候，我们不需要做很多的假设。
The client is the expert on themselves, so you should not interpret their art, let them interpret their art.
来访者其实他们是自己作品的专家，你不需要去解读这个作品，而要邀请来访者自己去解读。
For instance, with the piece that I made today, if I could make the assumption that this is a sad piece because there's a lot of black in it.
那比如说我今天创作的这幅画，我可能会有这样的假设，说这是一个非常悲伤的一个作品，因为我认为这里有非常多的黑色的颜色。
But if I did that, I would be wrong. So I would want to ask the client, why did they choose the colors they chose? So for me, the reason it has so much black is because these were the only colors I had to work with.
所以其实做这种假设有可能是错误的，所以你要去问一下来访者为什么选择这个颜色。那如果是我的话，我可能会回答，这个黑色是我今天唯一能够拿到的颜色。
So never assume that you know what the client made or that you know what it means. Always ask the client.
所以永远不要假设说你了解这个来访者他到底做了什么，他的意义是什么，永远要邀请来访者自己来表达。
So I usually start by asking the client, tell me about what you made.
所以我通常会以这样的问句，跟我讲一讲你的创作作品吧，来开始。
So I might say, well, I made the mandala that you asked, and I used these colors because that's what I had.
所以这个来访者可能就会回答，你邀请我画一个曼陀罗，所以我画了一个圈儿，并且呢，我用了这个颜色是因为我只有这个颜色。
I might, as the therapist, I might ask, well, tell me what each of these symbols means for you.
作为治疗师，我可能会问，要不要跟我讲一讲这每一个象征符号对你来说意味着什么呢？
So I might say, as the client, I might say, this is me in the center, and then the pink are the women in my life that support me.
所以作为来访者，我可能会回答说，这个中间这个是我，那旁边这周围这所有的粉色代表着我生命当中的女人，来支持我的女人。
The flowers outside of the circle are people that are important to me, that I feel still guide me, but that have passed away or moved out of my life.
那在圆圈外面的花朵呢，就是那些曾经支持到我，但是呢已经去世的人。
I might, as the therapist, ask questions like, is there anyone in here that feels closer to you than others?
那治疗师有可能就会问，那在这些人当中，你觉得有没有哪一个人是离你最近的那一个？
I could also ask, is there anyone that you did not include that you feel like you should include or that you chose not to include for a reason?
作为治疗师，我也可能会问，有没有谁你觉得应该在这个圈里，但是你就是没有包含在内，或者是你选择没有包含在内，因为某一些具体的原因。
We're back.
我们又回来了。
Okay, is it okay to keep going?
OK，
Okay. So I might ask, who is missing? Who would they like to add anybody now that they're thinking about it? And let them do that.
那么接下来就是可以问一下，你还想再加哪些人呢？可以让他们继续加一下这些人。
And I would let them talk about each of these people in their lives that support them.
接下来我会邀请来访者去具体的讨论一下每一个支持到他的人，去具体的聊一聊这些人。
What this does is allow them to spend time with positive feelings about these people and to realize the good things they have in their life.
我们做这个活动的目的呢，是希望他们花一段时间去专门体验这种积极正向的感受，去感受一下他们生命当中的一些积极的人物。
But it also gives them the opportunity to talk about what do they need in their life? What are they missing? Or what do they need more of?
那他们也是需要有一些时间和机会去讨论一下，他们生命当中还需要哪些，并且他们错过或者是没有在生命当中出现的是哪些。
And as a trained arts and healer, I can support them in identifying those needs and help them problem solve ways of meeting those needs.
那作为一个艺术疗愈师呢，我会能够帮助到他去逐渐识别自己的这些需求，并且找到一些解决方案。
And then I could also go through the individual questions that I originally started with, and they can tell me about each individual that they have worked with, or that
所
they
以
identified.
之后呢，我也可以就每一个具体的问题、具体的个人的问题来进行解答。
So that is an example of a type of intervention that I might do with a client.
所以刚才我们就是给大家展示了一下具体的一个小的干预的示范。
And it's also an example of an activity that somebody could do on their own for their own wellness.
那这个小的干预方法呢，其实也是可以自己在家里做的，就是促进自己的健康生活。
In art therapy, like I said, it's not important how pretty the product is. What's important is what it expresses.
所以我们刚才也一再跟大家表达说，在艺术疗愈当中，最重要的并不是这个最终的成品它有多美，而是说这个作品它帮助你表达了哪些意义。
So throughout our courses, I will be introducing different things like this for you to work on and to help you to learn about the different ideas that I present. I hope that the combination of the hands-on and the intellectual, the reading and the writing, will help to solidify these ideas for you. You can see from this one very simple intervention, there were many things that we needed to learn about and think about when doing this, which is why training is important.
所以在整个课程当中，我们会讲解类似于这样的小的干预方法，很多的这样的干预方法，去帮助大家一边是用这种体验式的感受，一边是用这种智力上的学习，包括阅读和写作等等，来一起结合起来来学习，帮助大家能够大家刚才也看到，我们就这么一个小的简单的干预方式，也需要很多很多要学习和了解的。所以这个也是为什么我们的培训是非常必要的。
So thank you for listening today. I would like to move to opening it up to questions that you might have that I'd be happy to answer. So thank you for attending.
那特别开心，特别感谢所有的听众今天能够参与进来。那接下来的时间也开放给观众的问题。主持人帮忙看一下观众提了哪些问题，老师可以回答一下。
好的，谢谢 Penny， 也谢谢美妍，辛苦了啊。然后我想我们学员应该今天在这个课程当中，今天的公开课当中应该听到了非常多的信息哈，需要慢慢的消化。然后其实 Penny 博士在之后的课程当中还是非常多的干货满满哈。很期待。然后我这边呢，陆续有一些学员有问题了，我来读给你哈。第一个是可否简单的说一下如何进行艺术治疗的评估？面向不同的群体，评估的维度是不是也会不同？比如抑郁症，这个自闭，或者是儿童、青少年、老年人等等。
So the first question might be how to do assessment towards different population. Maybe there might be different dimensions towards different population. For example, some with depression, or some with autism, or some are children, some are adolescents, or the elderly. So what's your opinion?
We will look at assessment a little bit in these courses. We actually plan on having an assessment course just by itself later. The reason that it will be its own course is because it's very complicated. Go ahead.
所以我们确实在课程当中会具体的，其实会有单独的一节课来具体介绍一下这个评估的方法，因为它是非常复杂的，所以要单独出来一节。
There are art therapy assessments that we can do that help us to understand our client and understand if they are working through depression or anxiety or things like that. But we do not diagnose using art.
所以其实我们会有一些艺术疗愈的评估方法，帮助更加理解我们的来访者，去 探讨一下他是否正在经历抑郁或者是焦虑症状，但是我们并不能用艺术来进行诊断。
But I can make interventions depending on what I feel the client needs, what they're expressing, and what their feelings are. So if a client is depressed, for instance,
所以，但是其实呢，我们确实能做的就是，当我们感知到这个来访者的需求之后，他想表达的感受之后，我们可以做一些干预。比如说，有一些来访者他是抑郁的话，
I might ask them to do an art intervention that is more physical so that it gets the body moving and that helps with depression. I would also ask them to do something that dealt with color so that they focus on the more positive side of things. And then I would talk to them about those things that are weighing them down as well.
所以这些艺术干预方法呢，可以包括做一些动作来帮助他们疗愈，也有一些可以让他们使用一些颜色来帮助来访者体验更积极的情绪。同时呢，我们也会跟来访者聊一聊，让他情绪低落的一些原因是什么。
I might use psychology techniques such as reframing their thoughts to help them look at them in a different way. I might focus on helping them to see more gratitude or ways to think about how they're feeling and why they're feeling that way.
那我可能会用一些心理学的方法帮助他们重新架构自己的认知方式，并且或者是帮助他们学会感恩的态度，去思考一下为什么他们会有这样的感受。
But I can't just look at somebody's art and say they are depressed.
That's
Because
so-
as I showed, it might be different. They might be thinking something different than what I'm seeing.
但是我们千万不能做的就是直接看到来访者的一幅作品，直接就说他是抑郁，因为这是我们刚才有提到说他们的想法可能是完全不一样的。
I hope that answered the question.
我希望这样能回答到一些这个问题。
好的，谢谢老师。那第二个问题是，老师有提到说艺术疗愈会打开心扉，比如说会让来访者有体会到那个丧失或者是创伤的情绪。那在这个艺术疗愈的活动结束前后，有什么能够帮助平复心境的这个建议吗？
So the second question is, as you have mentioned, the art making can help open the mind of the clients, but they also might experience loss or trauma or such feelings. So just before or after the art making, how can we do something to help calm down the feelings of the client?
Really good question. Trauma, I'm going to focus on trauma because that's the hardest piece.
那首先，这个问题非常好。那我们首先要专注在这个创伤，我们以创伤为例，因为它是非常难的一个议题。
So making art, the physical act of making art is actually helps the brain to come together and calm the person. So we do something called bilateral drawing, which is using both hands at the same time.
所以其实艺术创作这个过程就是帮助大脑进行更多的连接，并且能够平静下来。我们有时候会做一些双边的同时进行的创作。
The bilateral drawing helps to stimulate both sides of the brain at the same time and unifies the brain, which calms the anxiety or feeling response.
这种双边创作呢，它可以同时激活大脑的两个半球，这个之后会连接到一起，帮助来访者能够平静下来。
So if I have a client who has trauma and is emotional, I would do a bilateral drawing first.
那如果我是有这样一个有创伤的来访者， 我首先就会带着他一起做这种双边的绘画练习。
This will help to calm them and integrate them so that they can talk more and do art more about the trauma.
所以这样的话，他们就会更平静、更整合，他们就有机会更多的去谈论，或者是在艺术创作当中表现自己这个创伤。
And I would never just start with addressing the trauma. I would never say, let's do a picture about your accident. I would not do that.
那我们也永远不会说直接上来就跟他说，我们来画一幅你创伤的画吧。我永远不会这样做。
Because that would be overwhelming for the person and difficult.
因为这样的话对这个人来说就太过了，并且呢对他来说是非常难的。
So I want to make sure I build a relationship with the person for several sessions before we get to the trauma so that they feel safe with me.
所以我们在治疗当中，首先要跟这个来访者建立好关系，可能会花3到4次的这个单元来进行关系的建立。之后我们再处理创伤，这个时候其实他对我已经感觉非常有安全感了。
And I actually have in the course a specific method that I use for working with the actual trauma incident itself using the art. And so you'll learn that in the course.
那么我们在课程当中也会专门提到如何处理创伤，有相应的方法来进行。
If you have a client that does get overwhelmed or upset during session, you can use the art making again through scribbling or doing something physical to help bring them down. And you can also use breathing and mindfulness exercises.
但是如果你一旦在咨询当中遇到这个来访者，就当下就已经情绪非常过了，或者是非常沮丧的时候，您可以采用一些双边的绘画，或者是画一些涂鸦，或者是做一些身体上的动作，或者是练习呼吸，或者是做一些正念的练习，这些方法来帮助他平静下来。
And you never want to end your session if a client is upset. You want to make sure that they're calm and you have closure and they feel safe again before they leave.
那每一次单元结束的时候，你是不希望来访者是以悲伤的情绪结束的，沮丧的情绪。这样的话，你需要给他一个结束的环节，让他平静下来，感觉安全再离开。
So I use a ritual or routine at the beginning of each session and the end of each session so that the client knows that that's the boundaries and it's safe.
所以我们在每一次的咨询的开始和结束的时候，都会有一些小小的仪式或者是习惯。有这样的仪式感之后，来访者就会感受到边界，感受到安全。
And every art therapist is different on what those rituals might be. But at the end of a session, I always summarize what we did and then talk about what they can do when they're outside of session to help further that work, like a homework sort of thing.
所以可能我们每一次咨询当中的艺术作品创作过程不一样，但是呢，在结尾的时候，我总是要总结一下今天发生了什么，同时呢，也交代一下我们在咨询之外，他们比如说在家的时候可以做一些什么，留一下家庭作业。
And we clean up and put away the art supplies, and that is a very calming act to make order again out of chaos.
那我们也会一起来清理一下这些艺术的材料，这个清理的过程也是最后帮助到大家能感受到平静，感受到秩序和整洁。
So again, a very good question, and I hope that I was able to answer it.
所以还是想说这个问题问得真好，我也希望能够回答到这个问题。
好的，谢谢老师。我们这边源源不断的有学员有送问题过来哈，感受到我们学员的热情，学习的热情了。想问一下老师第3个问题，对那些理解能力和沟通能力都比较差、比较弱 情绪又不稳定的来访者，我们怎么从艺术治疗的角度去做干预呢？
So there are so many questions because of the enthusiasm of the audience. And the next question might be, if for the clients who are unable to communicate or comprehend too much or have an unstable emotional state, how to use the art healing interventions towards this population?
Okay. So that's really kind of two different questions. The first question is how to make art or to use art in healing for people that either can't communicate or comprehend or have low motor skills.
所以其实这个是两个问题。首先呢，这个就是如何帮助这些理解能力或者是沟通能力、这个情绪动力状态不是那么好的人进行艺术创作。
So when I work with children or adults who have disabilities, I focus on using sensory stimulation, exposing them to art making that uses as many senses as possible.
所以，如果当我的来访者是一些有障碍的人群的时候，这个时候我会更多的带他们体验一些感官刺激的活动，让他们暴露在感官刺激的艺术创作当中。
So, for instance, I worked with someone that did not speak, that was mute, that had lower intellectual functioning, and not very much movement.
比如说我的来访者，他可能是缄默症人群，他可能智力功能并不高，那他的心理动力也没有那么强。
So I played music that had a calming feel to it, and I made the art for them, but I gave them choices. So I might have two kinds of paper, and I would rub the paper on their hand so they could feel it, and then ask which do they prefer, and they would look to one or the other to choose.
所以对于这样的人群呢，我们可以首先选择一些非常有镇定效果的音乐，之后呢，由我来创作这个作品，但是呢，由来访者来做选择。比如说，我手里拿着2张纸，我会让这个纸在他们手上感觉一下，让他们选择一下哪一种感觉他们更喜欢。
So what was important there was to use more than just seeing or speaking. They would feel and they could hear. So I want to use as many senses as possible, and I want to give choice to the client.
所以我们在咨询过程当中，可以不仅让他们只是用视觉来看，或者是用言语来说，可以给他们更多的感官刺激，比如说可以让他们感觉，可以让他们听。
And every client is different. I've worked with some clients who are selectively mute, and with them I actually teach them sign language so that there's no pressure to talk, and then we share through the art.
那另一类的来访者，他可能不太一样，他是选择性缄默症这样的人群呢，我会教他做手语，这样他就没有压力，说一定要去表达。
And there was a second part to that question that I now don't remember. Do you remember what it was?
Second part, I think you just answered. So towards different population with disabilities, how to help them.
Yeah, and there are lots of devices and different adaptations that we can do for the art supplies to make them so they can grip them or use them. I've seen head pieces where they put the paintbrush on a thing on the head. Different adaptation tools.
所以我们可以在选择材料上，也可以去适应这样的人群，比如说有些可以戴在脑袋上的这样的材料。
好的，感谢 Penny 老师。那我们这边还有陆续来哈，第4个 对于自闭症儿童，可以进行团体性的艺术治疗吗？如果可以，如何进行团体的艺术疗愈？在课程当中会讲到吗？
So for the first question might be for the autism children, can they do the group art therapy? If they can, will you talk it in the course?
In this particular course, we don't look specifically at autism, but that could be a really good future course. Specifically looking at different disabilities. With autism, as you know, they fall on a spectrum. So with autism, you have very high functioning to very low functioning. So you have to assess their ability to work in a group based on how they're functioning.
所以，这个问题呢，就是我们当下这一系列课程可能并不针对性的提到这个自闭症人群，但是这个可能是一个非常好的想法。我们未来可以更多的开发相应的不同的障碍人群，他们相应的艺术治疗。那接下来就是这个这个自闭症人群，它可能是一个谱系的状态，有的人是高功能的，有的人是低功能的，所以在进行治疗之前，需要跟他进行一个评估和诊断。
But you can work doing art in a group with children with autism, and it's very beneficial because you can add in social skills to the art making process.
其实自闭症儿童呢，他们在团体当中使用这样的艺术治疗的方法是非常有效有益的，因为你可以通过这个艺术治疗，可以帮助他们发展更多的社交技能。
I think the main thing you have to focus on is making sure the group is not too large so that you can meet the individual needs of each child or adult. And to make your planning easier and your management easier. So you don't want a large group.
但是呢，需要建议这个团体人数并不需要特别多，这样才能确保每一个成员或者是儿童或者是成人，他的需求是被照顾到的。你可以更好的去带动这个团体。
As you know, if you have worked with people who are autistic, some have what's called tactile resistance.
What is tactile resistance?
Not wanting to touch things that feel weird or that are messy or.
所以其实有些自闭症的儿童呢，他有一些就是对触碰的阻碍，他们对某些很乱的或者是不喜欢的感受的东西，他们很阻碍去触碰。
So you have to be careful about what materials you choose and allow them alternative materials in case something is too stimulating.
所以其实这个时候就希望大家能够更好的选择这个艺术材料，去避免说这样的艺术材料过度的刺激到这个孩子。
I always have medical gloves in my sessions, so if they want to wear those, they can, if they don't want to get messy.
其实我在我的咨询室当中也会准备一些医用的手套，这样的手套，当他们觉得这个材料太混乱的时候，就可以戴着手套来进行。
And again, you want to focus on sensory stimulation, which is trying to bring in as many different senses into the art making as possible.
接下来一个建议就是希望大家也是更多的加入一些感官的刺激，越多的感官刺激越好。
But if you've worked with persons with autism, you will know that each one is very different from the next. So that's why you have to plan groups for people who will work well together within the group.
所以但是呢，大家也需要小心，就是其实每一个自闭症的孩子，他的个性都是不一样的，所以大家需要提前去做规划，如何让整个团体更好的进行参与进来。
So within the courses, I do case examples. I do talk about clients I have worked with, and some of those did have autism. So you will hear about it, but it's not a specific focus area within these particular courses.
所以在我们的课程当中呢，我会做一些案例的示范，还有去讨论一下我曾经带过的来访者，其中一些来访者就是自闭症的人群，但是呢，我们的课程焦点并不会，这一套课程并不会完全聚焦在自闭症的这个主题上。
Okay.
好的，那我们下面一个问题，第5个问题，有学员在问说，学习艺术疗愈需要一些基础的艺术知识吗？
So the 5th question might be, if I want to learn the art therapy, shall I know the basic knowledge about art?
Good question. You do not have to be an artist yourself. What you have to understand are art materials and techniques.
这个问题也非常好。那其实你不需要成为一个艺术家才能做艺术疗愈，但是呢，你确实是需要去更好的去了解艺术材料的这种特性，以及一些艺术的技巧。
The 3rd course in this series focuses specifically on the art materials and techniques. So if you come to this without knowing a lot about art making yourself, you will learn it.
那其实我们在课程当中的第3部分就是提到了这个艺术技巧、技术以及实践，所以在这个第3部分的时候，大家就会更多的了解这个艺术材料和技术，这样大家就可以学习到。
So you are not teaching your clients how to make art. You're not teaching them how to draw or paint. What you're doing is showing them ways of working, and then it's up to them what they choose to make.
所以其实作为艺术治疗师，并不需要去教育或者是培训这个来访者如何艺术创作，或者如何绘画、如何画油画等等。其实你需要做的只是展示一下我们整个的工作流程是什么，之后是由来访者自主来选择他们想要做什么。
It's also important to have an understanding of creativity. We are all creative in our lives. That creativity might be in different areas. It might not be visually. It might be with cooking or gardening or music in other areas. But valuing creativity, I think, is very important.
但是另一个非常重要的就是要非常重视我们的创造力。这个创造力，其实我们每个人生活当中都有创造力，但是呢，它在其他的领域，比如说在厨艺呀、在花艺呀、在音乐方面都是有创造力的，这跟艺术治疗不太一样。
I also think it's important to practice your own wellness through art making. So even if you don't see yourself as an artist, still making art or participating in art to help yourself is important so that you can understand how it affects the client.
那其实另一个建议呢，是希望我们作为治疗师自己，首先要通过参与和创作艺术来提高自己的健康水平。当你切身的参与进来的时候，你会更好的感受到这个艺术治疗它如何能够帮助到来访者，有什么样的影响。
Okay, thank you.
好的，我们现在时间已经接近10点哈，这边还有几个问题，我们加快的来问一下，抓紧潘妮老师的时间。那这里还有一个就是刚才学员有体验到，就是像曼陀罗这样比较温和的，可以一边能够支持到自己，也能够支持到他人的这种方式，在学校里可以作为课后的社团活动和同学一起做吗？会有任何伤害和规则吗？谢谢。
So as the time is limited, we will ask several questions. And the next question is, as we have done the mandala exercise, it's such a peaceful activity and you can support yourself and others. Shall we use it as after class activity in the association with other students? Are there any rules or boundaries that we have to notice?
For this activity, of course, you can use it for yourself and you can share it with others. Art in healing or art therapy does not own the art, but you have to be careful and remember the cautions that I said in the course to be ready if there are problems.
确实，这个作品呢，这个艺术创作可以帮助到你自己或者是其他人，但是呢，其实艺术治疗不仅仅是绘画，那我们也可以应用到这个日常其他的场景当中，但是大家需要在应用的时候，小心我之前在课程当中提到的一些注意事项。
So the purpose of training is to make sure that you don't cause harm and that you provide the best help that you can using art. So the more you understand it, the more training you have, the better you get at it.
所以其实要知道更多的注意事项是需要更多的具体的培训的，这样的话我们才能确保不去对来访者造成伤害，为来访者提供最佳的帮助。因为我们通过越理解、越接受培训，我们才能更好的帮助他人。
The rules around who's allowed to do art and healing is different for each country.
其实在每一个不同的国家当中，有谁可以参与到艺术治疗是有不同的规则的。
In the United States, there are many rules, and only people that have certain degrees can do it. But in other countries, those rules are not in place as much, so you can do it. But the purpose of the rules is to protect the client, to keep them safe.
所以其实比如说在美国，它有很多的规则，有些美国的要求就是必须要取得相应的学位，你才能做艺术治疗师。那在其他的国家，并不是一定需要这样的规则。所以，不同的规则其实最重要的是为了帮助我们如何去保护来访者。
So you can use this with others. Just keep in mind that there could be some emotions that arise that you need to be ready for and to help support.
所以确实可以把它用到其他人的身上，但是呢，也需要做好心理准备，知道这个有可能会引发来访者的这些情绪的因素，我们需要做好准备，能够足够的支持住或帮助到他。
And this question really speaks to the type of questions and thinking that we explore in that first course on ethics, on who can do it, when should you do it, when shouldn't you do it, those types of questions.
所以，那其实这个问题呢，更多的涉及到就是我们课程当中第一部分伦理问题，也就是谁可以参与，什么时候可以参与，什么时候不可以参与。
Thank you.
好，谢谢。那接下来这个问题可能跟随着上面一个问题哈，就是也有学员在问说，曼陀罗是艺术治疗的一个分支吗？
And the next question is mandala just one branch of the art therapy?
It's just one technique. It's just one thing. There are many, 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 many other things we can do.
它只是一个小的技术而已。其实我们有很多很多其他的方法也可以做。
好的，谢谢。那我们看时间哈，我们最后再来问这个问题。请问老师，如果有依恋障碍的患儿，对于音乐治疗也很难介入的那种，怎么从其他艺术治疗的角度去做干预呢？
So the next question is for a child who has a disability of attachment. Even the music therapy cannot help the kid how to use other art therapy to help the kid.
When a child has an attachment issue, you have to go back and reform the attachment.
Reform.
Fix or redo.
Okay.
Start over.
所以一旦我们遇到这样的有依恋障碍的来访者呢，我们需要去重新回顾他这个年龄段，然后重新重塑这一段依恋关系。
And I actually do in the theories course a unit or a section on attachment theory specifically, because we do use attachment theory a lot in art therapy.
那我们在理论部分，历史和理论部分有一集是专门介绍这个依恋关系理论。那因为我们确实在艺术治疗当中会用到很多的依恋关系。
And if you think about how attachment is formed between the infant or the child and the caregiver, it's about taking care and support and having things provided that are needed. And we can do all of that in the art making process. We can provide the materials that are needed. We can provide the support.
所以我们来思考一下整个的依恋关系，它的形成其实就是婴儿或者是孩子与照顾者之间的这个关系。照顾者希望能够提供给这个孩子以照顾、支持或者是一些供养。那这个时候在我们的艺术治疗当中也是会涉及到，比如说我们会提供给这个来访者以艺术材料，或者是我们会来照顾这个来访者。
And we can work with the child and the caregiver together in a session to work on starting over on that attachment.
其实我们也可以邀请照顾者和这个小来访一起在艺术治疗当中共同的工作，我们可以重新重塑这个依恋关系。
Thank you.
谢谢。
好的，谢谢。我们现在大概剩下8分钟的时间了哈，7分钟。那我们再来看看，学员的问题还是很多的。那我们来看看这个，还有学员在问，就是关于这个认证的部分。
So maybe we just have 7 minutes left, and there are so many questions. One of them is about the credential of the art therapist, how to become an art therapist.
Credentialing and licensing are, again, country specific. So I can only speak about what that process is like for the United States from my background. I think in China, I don't think there is a credential at this point, is there?
所以我可能只能说，根据我自己的背景，只能提到美国的场景。这个认证是依据各个国家是不同的。那在中国当下有艺术治疗的认证吗？李月老师，咱们中国是不是有没有艺术治疗认证呀？
目前在国内还没有。
Right now there is none in China.
That was what I thought. So doing these trainings is a wonderful first step to understanding what you need to understand to do this. Hopefully, more people that learn about arts and healing, these more organizations will form, and hopefully the credentials will come out of that down the road.
所以那如果是这样的话，其实老师也大概是了解中国目前还没有艺术治疗的认证。那我们接受培训，可能就是去发展这个事业的第一步，去更好的去理解艺术治疗。希望在这个过程当中，越来越多的人了解到艺术治疗，越来越多的机构形成建立，来制定艺术治疗的政策。
The typical progression towards getting credentials in countries that are forming art therapy is to first form an organization, then an ethics document and training. And that's kind of where you are at this point.
所以其实一个典型的，当一个国家正在形成艺术治疗职业路径的时候，会首先需要建立一个相应的组织机构， 然后我们建立好伦理文档，最后呢，我们来开展一些培训项目，这个是一个非常普遍的流程。
And then that organization eventually will give the credential or develop the credential and identify what education is needed to get that.
那所建立的这个组织机构呢，它最后就会去定义到底什么样的认证资质是可以的，你是需要什么样的教育背景或培训经历才能够拿到这个认证。
Thank you.
谢谢。
好的，非常非常感谢。那个我们今天时间也差不多了啊，因为其实关于为什么会特别问到这个部分，我来把我的就是为什么会特别问到这个部分，因为实际上这个在我们的学员的学习当中是被经常提到的，关于它的认证。然后其实 Penny 博士刚才已经提到了几个很重要的点。就因为其实艺术治疗在中国也是一个目前引到中国用这么系统专业的体系，把这个美国大学的这样的一个硕士课程引进到中国，可以说是意图学院的是第一家在这样做。所以其实做认证的这件事是一件非常挑战的事情，但是我们也在努力的去往这个方向去发展。就我们也请到了像潘妮博士这么专业的一个人士，他提到了很多关键词，我刚刚有记下来。就这个在他们的这个惯例是说要有这样的一个专业机构然后需要有这个专业系统，然后设立这样的一个标准，包括伦理的文档等等，要去了解学员的等等这个培训体系。这个实际上就是意图学院目前正在做的事情那其实我们也希望有更多的这样的力量，能够这样专业的人士来支持到我们去让我们的学员在学习当中能够有更多的这样的实践，然后呢也能够让他们学有所成能够得到这个资质的一个认证。那这个时间也差不多了，我们也特别感谢今天所有的这个我们看不到的，但是依旧在这个电脑前或者手机前一直在守护着有2个小时的时间的我们的学员，所以期待着大家能够加入到我们的这个团队当中，也加入到我们的学习当中。我们最新的一期这个27号就要正式的上线了那我们在今天我相信潘妮博士虽然只短短的这2个小时可以看到他的这个专业那其实因为在整个的半年的课程录制当中，一直是我和团队伙伴一直在跟他对接他的专业度我已经一次一次的体验到了，就他的每个课程我们的翻译美妍也感受到了，就是真的是干货满满那所以我也期待着这个我们的学员能够赶快决定我们来进入到我们的课程学习当中那我们差不多了，也再次感谢Thank you Penny and have a nice day. Thank you for your time. Thank you.
Thank you.
好了，那我们就今天晚上的直播就顺利进行到这里，也再次感谢美妍。好，感谢我们简单心理的技术支持。那我们期待在之后的学习当中。
Hello, and welcome to my new course. This course is called The Introduction to the History and Theory of Art in Healing. My name is Dr. Penny Orr, and I have been an art therapist for about 25 years. I work at Edinburgh University in the United States, in the state of Pennsylvania, and I'm pleased to be creating this course for WABC. In this course, what you'll be learning about is the history, is in the first section, of art therapy. Where did it start? How did it develop? What were the things that came together to create what we currently know today as art therapy? And then the second part of the course will be focused on the theories that inform what we do in the practice of art for healing and art therapy. So in the first part, we're going to have 6 sections, and those sections are going to be an introductory section, an overview section, which goes over a little bit of ancient and prehistory, as well as a section on early influences, which goes from about the 1700s to the 1900s. The formation of the profession up until about the 1950s, expansion, the 70s through the 90s, and then today, the 2000s to the present. In the theory section of the course, the second part of the course, we're going to be looking at a lot of different theories. The thing to keep in mind about theories is that theories are there to help inform us, to help give us direction. But a theory is just that. It is a theory, which means it's an idea, and it can help to guide us. But it's not something you have to follow as set in stone. It's something that is flexible. So the theories that we're going to be looking at are the psychodynamic and psychoanalytic theories, the Jungian Gestalt art therapy theories, a humanistic or person-centered theory, existential art therapy, cognitive behavioral and dialectical art therapy, family art therapy, developmental and attachment art therapy, trauma-focused art therapy, positive psychology, and mindfulness in art therapy. So the structure of the course, within each unit that you will go over, you will have several things that you need to do. For most units, there will be a suggested reading, or there could be a suggested video or a website that you should go to look at. This will inform you and help you to understand better what I'm telling you in the videos and in the PowerPoint. So you will also have a PowerPoint and a video lecture like this to help you grasp some of the central ideas that I want you to focus on in the course. After that, you will have a discussion question, which you will answer and interact with your peers in the course by answering. And then there will also be an art experiential, or a chance for you to make art around whatever theme or topic we are working on. And then finally, there will be a short quiz on each section of the course. So today what I want to do is start by introducing you to the very oldest information that we have on art therapy, and to kind of get you grounded in how this fits in with our lives. The thing to remember about making art for healing or art therapy is that we need to understand that we have been doing this as long as we have been human beings. So we have a history way back to the beginning of mankind that shows that we have used arts as human beings in our lives to help us understand the world, to help us process the world, to provide spirituality, to provide healing. So there were a lot of influences that in our human nature that come together to show this need that we have for expression and for beauty and for building a resilience through the arts. So in our ancestors and influences section, this first section, what I'm talking about is prehistory, ancient history, and basically the very earliest things. So if we go back, the oldest known art, the oldest known piece of art that looks like it was intentionally made or drawn by a human being, goes all the way back to 290,000 to 700,000 BCE. So that was a very long time ago. And this very early mark is just a simple circle and a squiggly line. We don't know what it means. We don't know why it was made. All we know is that it was something that was made intentionally by a human being. So making art as human beings has been around since the beginning of humanity. Prehistoric people often created art on themes such as human figures, animals, tools, weapons, maps, symbols, and ideograms. So this earliest image could be a map, it could be a symbol, it could be many things. We don't know at this point because we don't know why they created it. So we aren't sure why human beings created art in early humanity, but we have some different types that they made and some hypotheses about perhaps why they made them. So prehistoric art making includes body art. That's a big area, and that could include the addition of color, tattoos, piercing, beads, jewelry, creation of art that's outside the human being that we would wear to decorate ourselves, and then the creation of art where we do it on our person. Many of the drawings and glyphs that we found show patterns, modifications of natural forms, so taking a rock that kind of looks like something and making it more look like that thing. We've also found very early musical instruments. I think the oldest known instrument is a flute that's been made from the bone of a bird. And then there are sculptural forms. A lot of the early ones that we still have today, of course, are done in stone. The Venus is an example of one. So why in early prehistoric history did we make art? Again, this is a hypothesis, but if you look at the types of things they made, you can see that the hypothesis makes sense. So the first hypothesis is that as human beings, we make art to make things special. So that means we make things that'll stand out, things that stand for status or beauty, and we decorate to beautify things. So if you look at the body art, the cave paintings, things like that, we're bringing attention to something and we're making it special, either being a person or a drawing or a sculpture. There's also a section of art that's very functional. Some types of body painting were used for camouflage, for like hunting. And is that art? Maybe, but it's also got a nice traditional function. People also made art as a product to trade. So making beads and working on jewelry and things like that would be good for trade. Also decorating items that you might trade with somebody else might increase their value. And then there were maps. Some of the earliest glyphs that we found are drawings that have been scratched into stone and that represent the terrain around where that stone is. So it's sort of a map. So art was made to make things special, and it was made as a functional aspect of life. And then a third area was for decoration, just for the simple beauty of it, to create patterns, to communicate, to enhance something that looks like something else, something that already sort of looks like a horse head. We might take it and carve it and use some natural dyes to dye it to make it look more like a horse head. And then the last is to capture an image. So some of the earliest cave art, like in Lascaux, France, you'll see more about capturing the image, absolutely beautiful images of animals and human beings and interactions that were created. They showed things like hunts and animals in herds and things like that. So they were really observational and capturing the natural world. Now, why did they do the cave paintings in Lascaux? Again, we don't know, but we have a hypothesis. So how does this tie into art therapy? Well, the way this ties in is that art has been made since the beginning of time for well-being. So if we look at all these artifacts that are ancient, that people have made in history, some common threads that we see is that they are made for well-being, to improve somebody's life. So art was made to improve the quality of life, creating beauty, things like that. Art was made for enjoyment because they enjoyed making the art and capturing the beauty of what they saw around them. Art might have been made for spirituality, a part of the spiritual belief systems of that group, which could improve their quality of life. And then art making for communication, and art making, of course, for celebration. So since the very beginning, the central tenet of why people created art was for the well-being of the self and society. So I think it's important that that you understand that we have that natural drive deep within us to make art for our own wellness and to help others. Okay, so in this course, like I said, we're going to go through some different phases. And what I want to do now is just outline the different historical phases that we're going to be going through, just to kind of give you an overview of what the rest of the course will look like. So the first section, we're going to look at early influences. And what the early influences show are things like people started collecting images of the art of the insane, of people that were in insane asylums in the 1800s. So they started collecting those kinds of images that were created spontaneously and without any help of an artist or somebody going in, like an art therapist, going into insane asylums and asking them to make art. Much of this was art that they chose, the inmates themselves chose to make. So we'll see the influence of that collection process and the interest people had in this type of art and trying to understand it. We're also going to look at the development of mental health as a field. So we're going to look at how in the early 1800s we had institutions for the insane, and that's where a lot of this art came out of, were those institutions. And then we're going to explore the psychiatrist's view of what did that mean to have a mental illness, or to be, as they called it back then, insane. What did that mean and how did we understand it? So we're going to be looking at the early theorists like Freud and Jung to try to start exploring that. And then we're going to skip forward a little bit into the 1900s, and we're going to look at how did the formation of the profession, the formation of art therapy, begin to evolve? So one of the things to recall is that in the 30s and 40s, one of the big events in the world was World War II, World War I and World War II. And because of these wars, there became a lot of interest in how do we help soldiers who have had trauma from the war. So we started to look at where did this art by mentally ill patients come together with these theories by these new psychologists, Freud and Jung, and then what were these soldiers doing and how could we help them do that art in a meaningful way that could help them to heal. So those things came together to start the formation of the profession in the early 1900s. We're going to be looking at, in the early parts, at what happened in the United Kingdom and what happened in the United States. And one of the things I want you to recognize is that art therapy was also forming in other areas around the world at this time. For instance, in China, you all have been doing art for a very long time as part of physical health and mental health within your traditional medical practices. So I don't want to take away from that, and I want you to value that history. What I've been asked to do for this course is to help you better understand how art therapy as a profession was formed within the US and in the UK, since those are the two areas in Western culture that have provided a lot of the structure that has formed art therapy in the rest of the world. So we'll be looking at both the UK and the US in its formation. The second area we're going to look at are the pioneer art therapists and events. What were the main people who started things? What did they do? Why did they do it? What are they known for? And then also, what were the big events within the field that helped us to progress from just an idea to an actual profession, to something that has education and membership and things like that. So we're going to be looking at pioneer art therapists in the 50s and the 60s in both the US and the UK. And if you look on the slides, I've outlined the list of who those people are. And then we're going to talk about expansion. What happened when we formed our first ideas with these early art therapists? We started to develop educational programming on how to be an art therapist and do art therapy. And how did that start expanding? How did that expand around the world? But also, how did that expand our knowledge? How did the theoretical orientation, or how did our thinking about art therapy change from singular ideas to a much broader, inclusive idea of where we are now with art therapy? So we're going to look at that expansion in the US and the UK. And then we're going to talk about what's happening in art therapy today, what is happening in the world. I'm going to talk a little bit about what's going on in China and how are we expanding, and maybe a little bit of a look at where do we think we're going in the future with art therapy. In the second part of the course, what I'm going to be talking about are the theories in art therapy. Within each theory that I outlined earlier, we are going to be looking at the main theorists, the main people that are behind it, that kind of put together these ideas. We're going to look at the theoretical tenets, the main ideas that are associated with each theory, and then we're going to look at how does that apply to art therapy, because most of these theories were developed within the psychological community, not necessarily within art therapy. Although family therapy actually started in art therapy and then transferred over to psychology, but all the rest started with psychology and transferred over to art therapy. So we're going to look at how do the particular theories we're studying apply to art therapy, and what does that look like? How do we use it within our practice? So welcome to the course. I hope that you will find this an interesting course and that this will help to better flesh out or fulfill your understanding of what the field of art therapy is today and how did we get here? What was it that brought us to this point? So thank you very much for listening, and I look forward to seeing you in future videos. Hello, I'm Dr. Penny Orr, and today I'm going to be working through the second section of this course, Introduction to the History and Theory of Art and Healing. Today, what we're going to be focusing on are the early influences. What were the things that made us start to think about that there could be a connection between art making and mental health, and intentionally start to investigate that? Of course, in the last section, I talked about prehistoric art and that as human beings, we have a natural inclination to do these things. It wasn't really until the 1700s, 1800s in the US and the UK that we started thinking about the intentionality of that and trying to understand what is that connection between art making and healing. So today what I'm going to do is talk about the 1700s, 1800s into early 1900s. And to start with, what I wanted to do was to talk about the mental health system in the UK. And the reason I'm focusing on the UK is because while the US during this time period did have insane asylums and did do similar things to the UK, we didn't buy in as much to the art making side of it as the UK did. And so I don't really cover that much in this particular presentation. We'll be looking at more what happened in the US in art therapy later in the section that we'll be doing about World War II. So early influences. One of the things that happened was institutions for the insane started around 1790, and this is the term that they used. We don't think it's appropriate today, but that's the term they used, so I'll be using it in this first section. So they had institutions for the insane. And early institutions were really just a way to lock these people away and to keep them out of normal society so that they weren't a burden on families and so that they could be kept off the streets. In the late 1700s, early 1800s, they moved to a movement called the moral treatment movement. And that's because prior to this time, the institutions for the insane were pretty scary places. They tried a lot of things that didn't really work. They caged people with mental illness or disabilities. It was a pretty rough situation, pretty horrible. So in the 1790 through 1816, they began to use and embrace these moral techniques. So what are morals? Morals in this movement were defined as a system of rules that the culture agreed upon. They thought that you were getting better from mental illness if you were able to conform to those values and assimilate into the community. So that's an important aspect. They actually believed that people with mental illness could get better, whereas prior to this time, that's not really what their focus was. So with the morality movement, it was actually started through religion, through religious organizations and individual societies to treat people better that were in these institutions. As a result, they came to form this idea that people could get better from mental illness if they were able to assimilate and to control themselves. So in a way, it's good. They thought you could get better, that there was a solution, but in a way it was bad because they also defined it as that mental illness was a choice and that you could choose to get better. And so that was a little bit off. We know now today that there are circumstances beyond our control, that there are biological things that are happening and genetics as well. But so not everyone can get better in the sense that they were thinking, assimilating into society. They saw art as appealing to a more refined sensibility in the person. So they began to bring art in as part of this morality movement. They thought that art making was something that during this time period, art making was something that the elite did, that people who were more refined in culture and society did, and that the lower classes didn't do as much, what they defined as being art. So they thought that if they brought art into these institutions, that refined sensibility is something that would help the patients. And they thought it would help them in two ways. One, they thought that creating this type of art required discipline and self-control, which it does. They thought that this discipline and self-control would help them to gain control over themselves again so that they could go back out into society. They also thought, as part of this moral treatment programming, that simply being exposed to good art was something that could create peace within the person and to help them to have positive emotions. So they actually put art galleries in these institutions, and they put art in the art galleries that they felt was calming, that they felt was high art, and that would help the patients. The arts and moral treatment were thought to be central to treatment by a few people who were actually proponents of it. One really well-known person was W.A.F. Brown. W.A.F. Brown was the director of the Royal Hospital in Scotland in 1841. And he felt that the arts had two main benefits for his clients, for his patients. He thought it contributed primarily to healthy vigor within the body, so it was good for our physical health to create art. And then he also thought that by putting these delusions and images onto the paper, we were expelling them from the body, and that would help with tranquility. Now, we know that both of these concepts do have some truth in them that we still use today, which is that creating art, the physical nature of creating art, is really good for the body. It's good for your stimulus system. It's good for the, to reduce cortisol, to help you physically. But then we also know in art therapy today that by externalizing imagery, that it can help us to gain some control over those thoughts and feelings and to find peace. So he was actually onto something here. So Brown actually appointed artists to work with patients in his asylum in Scotland in 1847. He prescribed drawing as a curative measure for the patients in the asylum. So nowadays you might get a prescription for Prozac or a type of medication. In those days, he prescribed drawing as a curative form or curative measure, which I think is fantastic. Brown also started one of the first collections of what was called pseudo art. He labeled it pseudo art. We didn't. He labeled it that, which is interesting because to him, the art was art, but it was also not art. It was pseudo art that the clients in his facility were creating. There was another man about this time period that brought arts to the wellness of people in general. So we start to see this little division that's happening and that we continue to see within art therapy. One is using art making as a psychological tool to help with mental illness. And then William Morris, another man during this time period, he revived the arts and crafts in society in general as a way to promote wellness. So you have art for mental illness and art for wellness. And those are the two divisions we're going to consistently see. So William Morris, he revived the arts and crafts movement within England. So prior to this time, art was considered high art, right? And it was something that you were trained to do, that art was only the fine arts. And what he did is he said, now wait a minute, there's a lot of things that we're doing that aren't considered fine arts that people find a lot of enjoyment in doing. So he was talking about things like embroidery and needlework or pottery or doing things like painting murals in your home. These he didn't consider to be fine arts. They were arts and crafts. But he recognized that by bringing those into everybody's lives, that he could increase their sense of wellness. So he thought that the arts served two purposes within wellness. One was to enrich your quality of life, and the other was to provide personal satisfaction, bring about happiness. He specifically applied these to the worker, and that's because during this time period, you began to see the Industrial Revolution, where a lot of people moved to cities and lived in very poor and wretched environments, and they would go to work, they would work very hard all day long, and they would come home, and that was it. They didn't have much joy in their lives. So he thought bringing back the arts and crafts to these people would help them with their overall happiness and society's overall happiness. So you can see during this time period, these two men were actually very much onto something that we still use today. I wanted to talk about a particular artist that was in the asylum under Mr. Brown at the Royal Montrose Mental Hospital in Scotland, and his name was Adam Christie. I included a couple of images of his work, and if you do a search on the internet, you can find more. The thing that he's really known for are these little stone men that he created. In the hospital, he was actually given his own studio to work in. he did two main types of form. He did these men stone sculptures, and then he also did art on cigarette packages, the backs of cigarette packages. When he made the carvings in the stone, he tended to use non-traditional items to do the carving, like nails, rather than using what an artist might use, chisel and hammer. So his work had very different look than a realistic art that was done at that time period. So if you look at Michelangelo's sculptures and compare it to these, you can see there's a real difference, not the quality, but in the expression that is there. And part of that is the choice of tools and how he went about making it. And they're really quite lovely. He also did work on the back of cigarette packages. So this was a time when we started thinking about what is art called that is made spontaneously, not by somebody trained in the arts, and that is made usually with objects found in the environment that are made not with traditional art materials. And so the term art brut and raw art started to be looked at and thought about in the early 1900s, before World War I and World War II, to explain this type of art. So we had this really nice movement from a poor system of asylums to a healthier system of asylums, and a healthier way of looking at working with clients in those asylums and the role of art within those asylums. Then we hit the 1860s. And the 1860s, 1870s, we sort of had a setback. And that setback was called the degeneration movement. During this time period, the 60s and 70s, you had a couple things happen. You had Darwin. He wrote his treatise on Darwinism and the evolution of the species. So when he wrote it to help us understand why animals in nature evolve over time. A lot of his work was taken kind of out of context and was worked a little bit by the psychiatric community. So the psychiatric community took this idea of evolution and said, some of us are more evolved than others in society. And so they came up with this primitive or savage as a notion of a group of people within society that were more primitive or savage than other people in society. Other people were more evolved. You can see how this led to World War II thinking with the Nazis and creating the superior race. So this is where it started. And they thought that you were primitive or savage if you were somebody that didn't have complete control over yourself. They felt that other people who were more involved should control you. And the interesting thing is to look at who they put into these categories. So they considered primitive or savage people, the category listed was women, criminals, children, beggars, the Irish, and then the insane. And so all of these groups of people were considered more primitive and more savage, and therefore not able to make good decisions for themselves, and that they had to rely on people who are more highly evolved, mainly white men, to help them understand their lives. The idea with the primitivism is that they thought being more primitive was not only a part of evolution, but it also was a part of adapting to your environment, that notion from Darwin, but you're adapting in the wrong direction. So they thought that environmental influences that could influence whether or not you were a primitive person were alcohol use, sex, when women showed male traits, when they tried to act like men, poor nutrition, and then a deviant environment, which basically meant most environments where people were poor. So you can see that was quite a setback. A.C. Haddon was an anthropologist during this time period, and he took these ideas and applied them to art. He thought that the more ornate and the more naturalistic or realistic an image was, the more evolved it was. The more abstract, the more symbolic or expressive, the more primitive the image was. So what this led to was that concept of realism that was very strong at this time, that you were going for realism, that realistic art was better, and that anything that wasn't realistic art was considered primitive. Cesare Lombroso was the most famous psychiatrist before Freud came on the scene. And he wrote a book called L'Uomo Delinquente in 1879. And in this, he perceived that the value of art for the insane was to provide visual evidence of their mental pathology. So we go from the concept of more naturalistic and realistic art is more evolved, and symbolic expressive art is more primitive, to now saying when you're doing the symbolic and expressive art, it's actually pathological. It's not just more primitive. So he saw symbolism as a form of throwback to a more primitive means of self-expression. And he's also the person that came up with this notion that artists were very close to madness. There's a fine line between being a genius and being mad. And you can see that that notion still reflects in society many times today. But he based it on this notion that more primitive art or abstract art or symbolic art or expressive art was considered pathological. So there was an artist that was born in 1864. He was orphaned at age 10. His name was Adolf Wolfli. And Adolf Wolfli did some absolutely amazing art. And I encourage you to look him up on the internet and look at more of his work. I included an image of his work, but there's a lot more out there. He was diagnosed with psychosis in 1895, so right in the middle of all this stuff that was going on. And he was placed in the Waldau Klinika in Bern, in Switzerland. And his art in that facility was actually collected. It was kept by the facility. And as a result of this collection of art, later, Morgenthaler, a person who studied his art, published a book in 1921 called A Mental Patient as Artist. And in this, what he started to do was to recognize that the art form itself had aesthetic value. It wasn't just a pathological symbol, it had value. So when Adolf was creating the art, it was seen as pathological. A little bit later, people started to look at it and say, you know, there's something here. This is quite beautiful. There's something here and it has some aesthetic value. That's why it took 20 years before anybody really looked at the art and saw the value in it. Hans Prinzhorn is a person that also collected art for mental health patients. His collection is actually pretty famous. You can still see bits of it. There's still exhibits of it that go around, and he wrote several books on it. He was also a German. He worked in Heidelberg Hospital, and where he collected this art. So he collected it all through the late 1800s, early 1900s. And then in 1922, about the same time that Adolf Wolfli's art came out in a book, he wrote a book called The Artistry of the Mentally Ill in 1922. And in this book, he argued that rather than simply inspecting the art for signs of insanity or the pathology, that we should also look at the art for its aesthetic value, that it has some value in and of its own right. So out of this time period where you've got people who are pathologizing the art, people that are just beginning to see the value in the art, you're also just at the beginning of the modern arts movements where people were starting to value these types of things. That's where you get Jung and Freud introduced to the scene. Now, Freud was Jung's teacher, actually. So Freud was first. And in Freud's early ideas, you can see the influence of the degenerative philosophy on his psychological concepts. So you can see that influence. One of the things that's interesting about Freud is he did change his theories somewhat after World War II to become more something like what we know of today. But prior to World War II, his stuff was pretty strongly based in this degeneration movement. We're going to be talking about the theories he has later that do apply to art therapy. But I wanted to introduce this now to help you understand that theories are formed within a culture and a time period. And so Freud formed his theories during this time period. And that time period had an influence on how he thought. And that's why you can't look at the theories that we study later in the course as something that is set in stone, that's 100% right, because it's not. It's an idea, and it usually evolves over time. So Freud, in the early 1900s, he had many ideas that grew out of the degeneration movement, but they don't apply as much anymore. So for instance, in 1914, he embraced the notion of primary process. And this notion, he defined primary process as imagination, symbolic and non-discursive communications indicating regression and neurosis. So what he's saying with primary process is that the primary process is something that is primitive, that it is defined as using your imagination and symbols, and it's not something you can really put into words. So what he's starting to describe here is the unconscious, but he's doing it in sort of a negative light. He's looking at it through that lens of degeneration, seeing it as a regression and a neurosis, something that you don't want. So Freud's ideas about symbolism evolved from this notion. Later, we're going to talk about his use of dreams and symbolism with them to work with clients, and that actually influences what we do in art therapy today. But originally, he thought dreams and the symbolism in dreams were basically representing latent thought that emerged from our primary process. So he thought our primary process, being primitive, was all about sex and violence, and that's why every dream you look at that he's interpreted, that's usually the main themes that he sees in them. So these dreams, this primary process, is eventually what he ended up calling the id in his theory. Dream symbolism was the survival of prehistoric modes of expression, so which is an interesting concept. So this is something Jung picked up later, was the idea that there are ancient parts still within ourselves, and because of evolution, that we still retain some of those ancient parts. And so that's where Freud thought dreams came from, were these very primitive ancient parts of ourselves. And that's why our dreams were, or his dreams were, all about sex and violence. The thing that's interesting is Jung will go on and take that idea and develop his notions about archetypes and universal archetypes versus personal archetypes. Freud also bought into that notion of degeneration when he talks about women. And you can see throughout his early work, he had a pretty poor notion of women's mental health. He's the one that came up with the terms histrionics, and that women had more delicacy to their nature because of having a womb, and it imbalanced their thinking and things like that. And, you know, some of those ideas changed later, some didn't. Okay, so art therapy in the early 1900s in Europe and England really looked at art making in terms of healthy art and pathological art, and there really wasn't much in between. So anything that, like I said, that was primitive, expressive, symbolic, was considered pathological. It took World War I, World War II to help change that thinking a little bit to make it into something more like we know today as psychoanalytic theory. So this is the first part of the course. Next, we're going to be looking at what happened during that time period of World War I and World War II. How did that affect Britain, the UK, and the US? Like I said, in this first one, I didn't really talk about the US at all because they weren't really formulating those ideas yet. It hadn't come to the US yet. You'll see that because of World War I and World War II, that there was a lot of immigration, which also immigrated ideas to the United States. So thank you for watching this, and I look forward to talking to you again in future episodes. Hi, I'm Dr. Penny Orr, and today I'm going to continue to talk to you about the history and theory of art and healing. And today we're going to really look at the 1930s and 40s. We're going to look at both the UK and the US and how the notions of art therapy started to emerge during this time period and began to form the foundation for the profession that we have today. So World War I and World War II had a great impact on our understanding of mental health during this time period. And you're going to notice that impact throughout when I'm talking about what things were happening during this time period. So the formation of the profession. The art therapy department at Worley Hospital in Essex, England, is one of the places that we began to see early art therapy. Adrian Hill was an artist, and he actually coined the term art therapy, which he used as part of TB recovery. And we'll talk more about that. Adamson was an artist who worked with him, and Melanie Klein was a psychoanalyst in object relations theory that also contributed to our early understandings. Ernst Chris fled to England. He was actually Austrian. And in that fleeing to England, he worked with Freud and helped to influence and shape Freud's ideas. And then Susan Bach was also a Jungian analyst who escaped to England. So you're already starting to see that theme of people leaving Vienna and Austria and places like that and moving and immigrating to England. And then you're going to see another movement of people from Poland and areas like that that immigrate to the US. And both of those, that immigration process and bringing these psychoanalytic ideas from the Vienna area to these other countries had a major impact on how we think about and treat mental health. So let's talk about Hill and Adamson to start. So today I'm going to start with talking about what happened in the UK, and then I'll talk about what happened in the United States. So Hill and Adamson were actually artists. They started out as artists, and what happened was Hill, during World War II, contracted tuberculosis. In that time period with tuberculosis, they didn't have a vaccine and they didn't have a cure. And so you went to a ward, a special ward in a hospital that was just for you and other patients who had tuberculosis. So while he was recuperating in this ward in the hospital, he made his own art because he was an artist. He made his own art and found that making his art while he was in this ward really created a positive experience for him in his recovery, and he felt like it helped with his recovery. So he went on to start to develop ideas to help other people that were in this ward in the hospital. He was really concerned with the idea that we have an inherent capacity to make art, and that art in itself could foster well-being. So you're starting to see the beginnings of those ideas of art as therapy, that just by making art, it helps you with your well-being, with your physical and mental health. Edward Adamson worked with Hill. He ended up learning from Hill about these notions of wellness and using art making to help people who were sick or ill. And he went on to work at a hospital assisting the use of image making in the diagnostic process with a psychiatrist. The psychiatrist was Cunningham Dax and Reitman. What they did with Adamson and the psychiatrist is they started to look at the imagery and say, can we form a diagnosis from these images? And so that was the very beginning of using art for mental health as a diagnostic tool. And we'll see that that is a theme that is prevalent throughout the rest of art therapy history. They used an open studio model. So he still followed what Hill talked about, which was just creating art spontaneously as a form of wellness. They still used an open studio model where the clients were encouraged to make images with minimal instruction from the intervention from the artist. And then they would analyze the art to see if it could help them with diagnosis and to determine the wellness levels of the clients who made the art, those kinds of things. Another couple, this was actually a couple, Champernowne and Milner. Champernowne was an actual therapist, and Irene Champernowne was a woman, and she was trained in the Jungian approaches to psychology. She set up something called Wythmead Center in Devon, and this was in 1942. So you can look at the date and compare it to the wars and see that was a big influence on what they were doing. So she set this up with her husband, Gilbert. Because she was Jungian, she developed the community based on Jungian ideas. And in the Jungian theoretical orientation, the arts are primary mode of communication. She built this entire community where people would come and live and work together with arts as the center of the community. And several influential people worked in this community as artists and therapists and things like that. Several people like Hill, he went on and worked there. Adamson went on to work there, and so did Artie Lang, he went on to work there. This is kind of the people coming together within this community was a real sort of genesis for bringing all these ideas together and forming this concept of psychology and art, and how does that fit together into something that we see that's more like what we have today. Champernowne actually became a champion of art therapy later on, and she actually influenced the work of Margaret Naumburg. And you'll hear about Margaret Naumburg because she immigrated to America to the United States and started the art therapy profession there. Milner was a psychoanalyst, and she wrote about her experience as a free association drawing during her own psychoanalysis. So she went to psychoanalysis, but she was also a psychoanalyst. And in her psychoanalysis, she used drawing as one of her ways of processing and working through things. So she wrote a book, it's titled On Not Being Able to Paint. And in the book, she reflects on her struggle with trusting her imagination and transforming the unconscious into the art on the page. So what she did is she helped to tie together that unconscious piece with bringing imagery out of the unconscious and putting it onto the page and really exploring that experience. By putting it into a book, that book became influential to people who were using art in mental health realms to start to make those connections between mental health and art therapy. So I haven't talked about what happened in the United States up till now, and that's because not a lot was happening. Like I said, we had mental health, we had ideas, but it really wasn't until World War II that a lot of Freud's ideas came over. Prior to the war, in 1925, someone named Nolan Lewis, who was a psychiatrist, and he worked at a New York Psychiatric Institute. And he was fascinated by art created by his patients. So he was part of that earlier group that collected the art, looked at the art, but didn't really understand the art yet, and was just sort of looking at it and collecting it, like we saw in England. He hadn't really formed his ideas. Later, he will end up hiring Margaret Nomberg. And Margaret Nomberg will be influenced by Chaperone from the UK. And what Margaret Nomberg will do is bring the idea of connecting art making with psychiatry in the United States. Another person that collected art of the insane in the earlier time periods in the US was Tarmo Pasto. And he was a professor of art and psychology. He collected and exhibited patient art in California to try to understand the mystery of the creative spirit, he said. That was his purpose. He received an actual grant, $80,000, to study graphic imagery of hospitalized psychiatric patients and prisoners. So you can see in the US, we're sort of following parallel to the UK. We're just a little like one step behind. Pasto was instrumental in the careers of later art therapists and had an impact. His collection had an impact on people who were using art therapy in mental health settings and starting to really look at that connection visually. So in the US, another thing that really influenced the art making in the US, that the UK, it didn't influence as much. So this is something very different for the US, was the Great Depression. In the United States, with the Great Depression, they developed something called the Works Administration. So in the 1930s and 40s, there was something that was called the New Deal. And the New Deal was an approach to try to help the United States get out of the Great Depression. The New Deal was a program that set up other programs to provide work during the Great Depression. And one of those was called the Works Project Administration, or the WPA. And this was a relief program for indigent citizens and for first-time artists. The indigent citizens could get jobs working on, roads or buildings or bridges, things like that. And then they also had a separate section just for artists. And so this was the first time that artists had been included in a relief program and seen as a valuable profession within the United States that contribute to society. So for the first time, artists were included in an influential social and economic aspect of the culture. This provided the groundwork for the new profession of art therapy. So this is why the US developed a little bit differently than the UK in this time period, was because of this influence. What the WPA did was it created the Federal Art Project, or FAP, F-A-P, which created community murals. So the Federal Art Project did community murals, and there was another Federal Music Project, and then there was a Federal Writers Project. And all of these projects employed artists to work in their communities with community members to improve the mood of the communities, emotional expression of the communities, and to enhance and beautify the communities. So the original idea was to give them work, but what ended up happening is not only did it give them work, it also improved the communities in which they worked. which again added to our notions of what art therapy can do for people. Mary Huntoon was the state of Kansas, Federal Art Project Director. She later worked at someplace called the Menninger Center. She was an artist and an activist. And when she went on to work in the Menninger Center, which is a mental health center, she brought those notions of being an artist and an activist, trying to create change through her art making, to that center. And we'll talk a lot more about that later. But she basically was grounded in the idea that the arts could be integrated into social and economic parts of society that could provide important emotional connection between the art and the society and culture in which it exists. So you can create change. That's the activist part, is the creating change through the art making. In the 1930s, you have World War I veterans coming back to the US. And at this time, it's called shell shock. So when you have PTSD, they called it shell shock at this time. And a lot of soldiers came back from World War I with a lot of mental health issues. Carl Menninger was in Kansas, and he had a clinic called the Menninger Clinic. And in that clinic were mostly veterans. In the 1930s, he hired Mary Huntoon, who I just talked about, and encouraged her and supported her in starting an art therapy program. So the idea with the Menninger Clinic is that the art was made to help treat shell shock, which we know today as post-traumatic stress disorder. Freud and Jung's ideas were used by Mary to try to help address this phenomenon of PTSD. In 1913, Freud published Interpretation of Dreams, that publication, and then in 1916, he published Psychology of the Unconscious, or actually Jung published that. So these two books were influential on Mary. She took them into the Menninger Clinic in the 1930s to start up the first art therapy program in the United States, specifically in a mental health institution, and this one was specifically aimed at working with shell shock. During the 1940s, we had another area that began to arise in the United States that was a little bit different than what was happening in the UK. And this was child psychoanalysis. So Victor Lowenfeld in 1947, he published a book called Creative and Mental Growth for Art Education, in which he had a chapter in the children's artistic development. We still use that chapter today. So when we talk about children's artistic development or children's drawing development, we're harking back to Victor Lowenfeld's work. What he did in 1947 was he collect hundreds and hundreds and hundreds of drawings by children and labeled them by the child's age. And then he put them together and tried to pull out themes and how the marks were made in order to determine what developmental stage they were in. So with child psychoanalysis, we started to see what were called stage theories. You will see that psychologists during this time, such as a lot of educational psychologists, such as Piaget, Erikson, Lowenfeld, started to develop these notions of stage theories and how we can understand how children grow and develop over time. So Lowenfeld's contribution was the drawing. Because he was an art educator, he put together this notion of developmental stages in drawing. And we still use those today to help us understand the cognitive development of children and adults with mental disabilities. Lowenfeld fled to Britain and then to the US from Vienna due to World War II. He also worked with mentally and physically disabled children, and he wrote a chapter called Therapeutic Aspects of Art Education, which appeared in his book in the 3rd edition, but was later taken out. So in the Creative and Mental Growth book, he had a chapter called Therapeutic Aspects of Art Education, which appeared in the 3rd edition. So if you can find a 3rd edition that still has that chapter, they're actually quite valuable. And in the art therapy world, we always like to pull that out and use it with classes and stuff because it's very valuable for what we do. Erik Erikson was also an artist, and he was hired by Anna Freud in Vienna to be an analyst with children and to teach them art, which is really interesting because he was an artist, but he was hired as an analyst in Vienna. These children that he was working with were actually airlifted out during World War II, When she was asked why she hired an artist to be an analyst, she said, "Psychiatry needs people who can see." And that was her reasoning on why she thought it was important to hire an artist to help with analysis. Erik Erikson went on to do a psychoanalysis degree and immigrated to the US when Hitler moved into Vienna. He practiced child therapy and he developed the theory of child and adult growth and development and stage learning. Erikson's theories were based on the idea of different milestones that we have to accomplish with each stage in our life. So as an infant, it's trust versus mistrust. And then as we get older, each stage has different things that we side one way or the other to. So either we learn to trust people as an infant or we learn to mistrust. And that depends on how we are raised. So child psychoanalysis was another thing that came into the US that was pretty influential in how art therapy developed. So art therapy developed with this understanding that working with children is slightly different than working with adults in psychoanalysis. Another thing that came into effect, this affected both the UK and the US, was something called progressive education. Progressive education is a theoretical orientation in education that basically focuses on the whole child. Prior to the progressive education movement, children were really taught to go into a career and were taught specific skills, and they weren't really looking at what the child needed or the whole child. John Dewey, in 1896, early 1900s, he worked at the University of Chicago Laboratory School. So University of Chicago is a university, and then they had a school within the university that was meant for children. And it was used as a lab to study the psychology of children and their learning and how they learn. So from his work there, he developed several ideas that are very influential in not only art education, but also in art therapy. So what he concluded was that if you focus on the whole child, one of the things you'll see is that people are social by nature, that we learn best when we're in real life experiences, when we're with other people, that it's better to learn by doing something hands-on rather than just sitting and listening to a lecture like you're doing right now. He also felt that a child's creativity should be encouraged and should be emphasized, respected, and included in the arts. So prior to the progressive movement, when children in schools learned about art, it was to learn a skill. So there were drawing classes, but they were aimed more at producing people that could do technical drawings, like for engineering and architecture and things like that. They weren't about expression and feeling. Margaret Naumburg founded a progressive education school in New York, and this was called the Walden School. And she started it in 1914. She also had a sister named Florence Kane. So Margaret Naumburg was the younger sister, and Florence Kane was the older sister. And Florence Kane became an art educator at the Walden School in 1920. So Margaret Naumburg started this Walden School, and it was a progressive school based on John Dewey's ideas. So as part of it, art was an important aspect of the school and the education process. So she hired her sister, Florence Kane, to become an art teacher at the school. And based on her work at the school, Florence Kane wrote a book called The Artist in Each of Us in 1951. In this, she really looks at the nature of the arts for everyone, for all children, and how to bring out that artist within each of us. So Florence Kane came from an education background and brought those educational ideas into more of an art therapy sort of approach. Edith Kramer is another early art therapist in the United States who trained in Vienna under Friedel Dicker Brandes as a progressive art educator. So Edith Kramer was also an art educator, and she trained in Vienna with Friedel Dicker Brandes, who ended up, Friedel Dicker Brandes did not immigrate, whereas Edith Kramer did. And what ended up happening is that Friedel Dicker Brandes actually got put into a concentration camp called Terezin. And unfortunately, she stayed there the rest of her life. And what she did is taught art to the children in the concentration camp. And in the end, she got shipped off with her children that she was teaching to be killed as part of the process in World War II. So, which is tragic. And if you look at some of the work Friedel Dicker-Brandes did with her children, it's quite amazing. So that's another person I would encourage you to look up on the internet. Edith Kramer trained with Friedel before she immigrated from Vienna to the US to escape World War II. She moved to New York in the US due to World War II. She worked originally at a school called Wiltwyck School for Boys. And this was a school that was for boys who had emotional and behavioral problems. She really came up with the idea of art as therapy and labeled it such. So she took that notion that creating art is therapeutic in itself and labeled it art as therapy. So you can see a lot of people in the early 1900s had similar ideas in different parts of the world, and those ideas were spreading. And then because of the wars, it forced people to move, to come together, to exchange ideas, and all of these ideas came out to become what we know as art therapy. So one of the things that also was arising during the early 20s in the United States was psychiatrists and psychologists looking at projective assessments. So a projective assessment is where you look at an image or you create an image and then look at it and you try to determine what you think it is. And then from that process, the assessment decides, they do a scoring system and all this kind of thing to try to figure out what that means. So a famous one, which you are probably familiar with, is the Rorschach inkblot test. That was developed in 1921. It was actually introduced to Europe first and then came to the US. So projective tests are interesting in that they can tell you something about the person, but the one thing I want you to keep in mind is they don't tell the truth. They tell the perception at that point in time for that person. So they had a lot of high hopes that projective tests would be significant kind of assessments that would be helpful in psychology, and they really haven't turned out to be that kind of an assessment. You can still use them, but in a more informal way to learn about the person, but not as an official assessment that you score and is valid and reliable. Another test that came about in 1938 was called the thematic apperception test. And what this did is it required the client to respond with stories based on a series of cards or pictures. So they would show you an image, you'd look at it, say it's a little girl peering out a window, and you would tell a story based on that image. And so they thought that from that, they could also help with diagnosis and things like that. In 1926, Florin Goodenow developed a test called Draw a Man test. So this is starting to sound a little more like art therapy, Draw a Man test. And she developed it as an intelligence test to be able to try to identify IQ and intelligence. Her idea was the more details, the more realistic, the higher the intelligence. Does that sound familiar? Because that was the thinking behind the degeneration movement. So she thought if it was more realistic, with more details, it meant that the person was more intelligent. So you can see there are issues with that. But when she started to try to use it as an intelligence test, what she found was that it didn't really work as an intelligence test, but she started to notice something else. And what she started to notice was that the test could show personality of the person better than intelligence. That's why we started to move towards that type of test with art therapy. You can understand the person a little bit better, maybe not know what their IQ was, but you could learn something about the person by having them draw a man and seeing what they come up with. And if they talk to you about it and tell you about it, you have a better understanding. Buck developed the house tree person test in 1949. And you may have done that test. You may have seen that test. That's a pretty common one that they still do places. It was designed as a clinical tool that looked at psychological depths and diagnosis. And really it doesn't, if you read the original 1940s, 50s assessment portion, where they tell you how to assess the art, you can see it's not really very good. The original ones were things like if they have a larger attic space in the house, that means they have more imagination. And you really can't do that kind of one-to-one, that making an assumption that A equals B. So later, how we use House Tree Person now is more as a tool to get some basic ideas, and then we talk to the person. I noticed you did a really large attic on this house. What does that mean for you? And then they can tell us, instead of assuming that it means they have more imagination, which is what the original test was doing. So you have these different things happening. Again, you have the psychology movement that is starting to add art into their assessment protocol. You have the education movement that is starting to add art into their well-being and as a tool for learning. Then you have people that were trained as art educators working with people with behavioral and emotional issues. So all of these factors are starting to swirl together and come together to form the foundation of art therapy in the United States. Florence Kane was also an early person in art therapy. Florence Kane was, as I said before, the older sister of Margaret Naumburg, and she worked at the Walden School. She underwent actually Jungian psychoanalysis. So she worked with Jung to go on to do psychoanalysis, and her work in psychoanalysis, so going through treatment herself, influenced her view of the role of art and the unconscious in her work with the children that she worked with. So she called herself a psychologically informed art teacher. And people actually referred patients to her for psychiatric analysis. From psychiatrists and analysts, they would refer people to her to create art. As I said, in 1951, she wrote the book, The Artist in Each of Us, but she unfortunately passed away in 1952. So she was just at the beginning of putting these ideas together between Jung and art and how that could be used. And then she passed away. But she also was a big influence on Edith Kramer through her work and her book. And Edith Kramer, as I said before, came over. She was a past student of Friedel Dicker-Brandes and part of that progressive art education movement. So Florence Kane did influence her, she just didn't live as long as we would have liked to contribute more. Okay, Margaret Naumburg. So Margaret Naumburg was considered the first theoretician in art therapy in the United States. So she was, in the US, she was the first to define art therapy as a separate mental health profession, different from psychotherapy. In 1940, she wrote Dynamically Oriented Art Therapy. Now, Margaret Naumburg also claims to have coined the term art therapy. So you have Adrian Hill, who coined the term art therapy almost at the same time as Margaret Naumburg. So it's interesting that across the big ocean, we have two people who coined the same term within the same year. It's quite fascinating that happened. But everything was in place for all of these pieces to come together on both sides of the ocean. She developed an art psychotherapy theory, and she worked in New York psychiatric institutions from 1941 through 47, and she published Studies of Free Expression of Behavior Problem Children as a Means of Diagnosis and Therapy. So she was very much on the diagnosis side and the art psychotherapy side, whereas her sister was very much on the education side and the art as therapy side of the debate. So again, you can see that split, art as therapy, art psychotherapy. In 1950, she published Schizophrenic Art, a book called Schizophrenic Art, Its Meaning in Psychotherapy. In 1953, she published Psychoneurotic Art, Its Function in Psychotherapy. And in 1966, she published Dynamically Oriented Art Therapy, Its Principles and Practice. And in 1950s, she gave training in New York, Pennsylvania, Washington, D.C., and Massachusetts to medical students, psychiatric hospital staff, and other mental health professionals. So the reason Margaret Naumburg was so important is that she was a prolific writer. So she put a lot of what she learned into writing so that other people who weren't able to work with her directly were able to learn this stuff. So people in other parts of the United States, people in the UK, people in other countries that spoke English and could get these books were able to start using these ideas. So she was influential in the beginning of the spread of ideas. She was also influential because she did a lot of traveling within the United States, and she gave workshops. So she started training people to do art therapy based on her knowledge and her background. Edith Kramer, I've mentioned her a couple times now, was also a very influential early art therapist in the United States. She conceptualized that it is the creative process itself not the interpretation of the image, that can bring about change and healing in the client. So she helped us to start to focus on the process rather than the product. So Margaret Naumburg was very focused on the product. You interpret the results, it's, you use it in diagnosis, things like that. Her sister wasn't so much into the product. She was more into the process as well, and she influenced Edith Kramer. Florence Kane influenced Edith Kramer. And so Edith Kramer was the person who actually took that idea that the process was important and put it into writing and started to use it in her teaching and started to spread that idea within the art therapy world. She more closely followed the view of Florence Kane over Margaret Naumburg, and she was also an art student of Friedel Dicker-Brandes before World War II. She developed art as therapy theory. In 1958, she wrote Art Therapy in a Children's Community based on her diary of her work at the Wiltwyck School for Boys. In 1971, she wrote Art as Therapy with Children. Kramer was friends and influential in another person that you're going to hear about called Eleanor Ullman's work. And she also taught university and college courses based on her experience in art therapy. So she was one of the first people to teach at the university level on art therapy at NYU, at New York University. So those are some through the 30s, 40s, sort of 50s. These are people that were very influential in the formation of art therapy in the UK and in the US. And you can see that their ideas are going to start expanding. We're going to start seeing more education and more training, because what's important to recognize is it's really good that you know how to do art as healing. It's really good for you to learn how to do it, to make your own hypothesis about what's working and what's not working. But in order for the concept of art therapy to spread as a profession, it had to be taught to others. It had to have theories that people could agree on. And that's where we are right now in the history of art therapy in this course, is that time period when people are starting to come together, develop theories and ideas that they say, yes, this is what art therapy is about. This is how we do this. And they start to teach it to others. And that's why in this, we're in the formation of the profession. And in the next section, we're going to be in the expansion. We're going to start looking at how those theories and education help to spread art therapy and to expand our ideas about it in the future. So thank you again for sitting through my lecture, and I'll see you again in the next one. Welcome, I'm Dr. Penny Orr, and today what I'm going to be talking about is how art therapy started to expand, the people, then the events that were the first, that were pioneers, and how all that happened within the 1950s and the 1960s. So in the UK, if you remember, I talked about Adrian Hill before. Adrian Hill was a veteran, like I said. He worked in the TB ward. And he became influential in the 1950s with many other artists who wished to also start doing art therapy. So some examples are Jan Glass, who worked in Worlingham Park Hospital, Joyce Lang, who worked in prisons in Scotland, Rita Simon, who was a social psychiatrist and worked in settings in Northern Ireland. She also was influenced by Jung and developed her own approach based on her interests in pictorial styles. There was Champernowne and Wyethmead, which we talked about before. And then in the 1960s, art therapy became a part of a movement aimed to challenge the psychiatric mainstream. So we'll be talking about all of those today. I'm going to start with the anti-psychiatry movement in the 1960s. So what happened in the UK this period after World War II, where a lot of psychology was needed to deal with the veterans who came back, but many people were still institutionalized. And in the 1960s, they began to believe that institutions weren't the best place for people with mental health issues. that they needed to be more integrated within the communities. So up until the 1960s, people with mental health conditions were separated from the rest of the community and placed within these large hospitals. Because of the anti-psychiatry movement, the government policy in the UK moved towards shifting psychiatric care from these large hospitals to community care. This actually happened both in the UK and in the US in the 60s. This resulted in the closure of these large institutions. So in the midst of this movement, the British Association of Art Therapists was formed in 1964. And the purpose of establishing that was to make art therapy as a profession within the national health system and training in the public sector. That's because most jobs for art therapists were in these institutions. And when the institutions broke down and they put it out into the community, the art therapists weren't officially recognized as a mental health professional. They had just been working in these asylums. So the British Art Therapy Association said, in order for us to maintain our profession and to continue with job security, we need to form an organization. And that's what they did, the British Art Therapy Association. And we need to use that organization to help lobby the government to make us part of the national health system, to get us recognized as a profession so that we can get jobs. So it kind of was twofold there. At this time, in the 40s, 50s, and 60s, you also started to see the training of art therapy. So if you recall from my last one, what I was saying was that we had up until, the 50s or 60s, we had people doing art therapy, people talking about the ideas, but now you're going to start seeing that people are taking what they've learned and they're starting to teach it to others and expand this notion of what art therapy is. So Wythme, that I mentioned before, was actually set up as an informal training center in the 40s and 50s for art therapists. And that's why they were so influential on the creation of art therapists in the UK. Michael Edwards set up the first formal training course in art therapy at the Birmingham School in 1969. So up until 1969, there was no formal way to get education in art therapy. That you mostly got your understanding of art therapy through coming into the field either as an artist or as a psychologist, and then learning something about the other side through workshops and certificates and things like that. Michael Edwards in 1969 actually had a course in a postgraduate education course in art education where he taught about art therapy at the university level. The St. Albans School of Art provided a certificate in remedial art, and in this certificate, this was 1970, that was aligned with the health sector and later became a diploma of art in art therapy in 1975. So the purpose of this certificate was specifically to train people to work within the health sector at doing art in 1970, and then it got refined a little bit more in 1975. Okay, so you remember this talk about with the degenerate art that, the more realistic, the more details, the more healthy the art was. Well, you had this other side of the movement that really started because of World War I, that really went about looking at, other ways of thinking about art. So in the UK, they started to question this notion of, is modern art mad art? So with the influence of the collectors of the art of the insane in earlier generations, by the 1930s, surrealist painters began to rise in popularity and the concept of art made from the unconscious arose. So you have these psychologists who are talking like Freud, who are talking about the unconscious. You're having artists seeing these collections of art created by the art of the insane. And now you have this surrealist movement, which intentionally tries to get to the unconscious and to express it. So this movement inspired artists to move towards the liberation from aesthetic convention. So artists, being artists, rebelled against the notion that good art was more realistic and detailed, and they went in another direction. So after World War II, you started to see more expressive art. You started to see people that were rebelling against the common conceptions of what good art was. And this led to the anti-psychiatry movement, and the rise of modern art that was considered to be good art was challenged. So they started to challenge on all levels what was considered to be good art, and really were open and accepting to the art of mental health as being good art because it had these aesthetic qualities. In outsider art and in surrealistic art and modern art, they really began to value this externalization of the unconscious. And it became a founding principle of artists in the UK. In the UK, they started to exhibit artwork by people that had mental health issues as an attempt to be able to say, this is still really good art, and to look at it from that aesthetic point of view. So they weren't really promoting the art as to help the patients, but more as to do it as a way to sort of rebel against the established art movement. So at the Institute of Contemporary Art, they had several exhibits. And one exhibit in 1955 helped promote and further increase the awareness of art therapy, was titled Aspects of Schizophrenic Art. It was opened by the Minister of Health and was put together by Guillaume Carstairs, who later became the first president of the British Art Therapy Association. So this exhibit was art of from different people who had schizophrenic diagnosis. And it was held at a contemporary art museum. So it was raised to the level of what is good art. Good art is what you put in museums. So it was raised to that level. He stated, I may also appear to visitors unfamiliar with the works of mental health patients, that there's nothing in the show which they have not already encountered in other exhibits of modern art. This is indeed what we hope will be the case, because the exhibition is intended to show the affinities of schizophrenic artwork with experiences which normal people have shared, and to assert only its abnormality. So what he's trying to say is that people will look at this art of people with schizophrenia and they will see that we're not that different, that their experiences and modern art are very similar. And then he said, but you're also going to see some of the things that are different. So he had 4 themes within the exhibit. He had alterations of visual perceptions during acute attacks of illness. And you have to remember that this was a time period where we did not have any medication for people with schizophrenia. So these were people with schizophrenia with full-blown attacks making art. So one grouping was about these full-blown attacks of schizophrenia. Another area or aspect of the exhibit was symbolism. What was the symbolism that was used in psychotic painting? Could you find connections between symbolism? Are there similar things that we see in the art of people with psychosis? There was a section that really looked at stylization. So what kind of style is there within the psychotic work? And this is interesting because you'll see later when we talk about assessment that one of the things that art therapists brought to assessment was looking at this stylization, the line quality, the pressure, the how it's organized, what it's what colors are used, how is it, it's looking at those principles of design and trying to see if they are if there's some kind of unifying thing there. And then interpretation of the visual imagery. So that's where you're getting more on the diagnosis side, where there's interpretation of what does this mean. So in the slide, I have a picture of a series of cat paintings, and you can see that they become more and more sort of schizophrenic in how they are put together, more abstract, more, but equally beautiful. And so they would look at the stylization, the symbolism, the interpretation, and then how did the final one, which is altered by a schizophrenic attack, look to the first one, which was when they weren't having in a schizophrenic episode. So as a result of the second exhibit, 1964, was created that was entitled Art as Communication. And as a result of this art as communication, one of the things that started to happen was there was a shift towards diagnosis, using the art as ability, as something to use in that diagnosis process. Arnold, who worked with children and adolescents, stressed the importance of art therapy as a means of communication to both people and objects, which increased networks of relationships with her students. So Arnold was a teacher. She was an artist, And as part of Artist Communication Exhibit, she had her children exhibit their pieces within it. And for her, what she thought was important about what you would see in the exhibit was this connection, the networks, the connection between people in the community, between her students, the relationships, those kinds of things, and not necessarily the mental health side of it or the abnormal side of it. Robinson at Horton House felt that the art therapy was confidence building, and Robinson was also part of this exhibit. And for Robinson, who did art therapy, felt that the purpose of it was to build that self-esteem and confidence. The exhibit catalog was interesting, and that's why I'm bringing up this one. In the exhibit catalog, they actually had psychiatrists write interpretations. So the catalog contained interpretations of the images by therapists and clients, showing a shift in art therapy towards diagnosis, use of psychological terms, and applying it to the art itself. So even though the people who did the exhibit, the artists whose clients participated, felt that it was more about relationships and self-esteem and building confidence, in the catalog, they actually had people analyze the art and put psychiatric terms onto the art that was made. Art and Mental Health was another exhibit in 1968 in the UK that was hosted by the Commonwealth Institute, which showed the work of emotionally disturbed children and adults. And these articles were written by psychiatrists and included a spectrum or speculation about the diagnosis information of each of the clients. So again, looking at the art and diagnosing based on the art, which isn't necessarily a great thing, as we know. Okay, so in the UK during this time period, it was about transitions in the art world and what they thought was good art and what was important art and how do we think about art and where does art come from. We had transitions in the art therapy world with the beginnings of education and transference of ideas. You had the introduction of diagnosis and labeling art in order to help with that diagnostic process. And then, of course, the exhibiting of art. In the US, we had some similar things happen, and then a few other things happen at the same time. So in the US, it was really a time of change and innovation. So you saw in the US during this time period, the idea of group therapy began. Prior to that, it was always individual or just like an open studio model, and now it's more group. Carl Rogers developed the idea of child-centered human potential movement in the 1960s, and he was the founder of humanistic psychology. Family art therapy was also developed in the 1960s by Kwiatkowska. She was actually an art therapist who developed family therapy. And then also in the late 50s, early 60s, you start to see the development of major tranquilizers that were used to treat psychopathology, which affected what kind of art they were producing. You also had in the 1960s, John Kennedy did the Federal Mental Health Act, 1963, which closed all mental hospitals and moved mental health into the community. The thing that we had going on in the US, it was going on in the UK too, but not quite as strong, was the civil rights movement. So let's talk about some art therapists that were influenced by all of this. So Don Jones. Don Jones was an interesting man. He was a conscientious objector in World War II. That means that he refused the draft when he was told he had to go fight. And so people that were conscientious objectors in the United States were given alternative jobs to do in the United States while other people were fighting the war. And they usually were pretty not good jobs. So he was actually assigned to work in the Marlborough State Psychiatric Hospital during the war because he refused to go and fight in the war. And he was an artist. He became very intrigued by the graphic productions and projections that the patients made. And he went on to publish an article called PRN in a mental health community. PRN means as needed in the United States. He wrote this in 1946, so really early. He also published his own artwork that he did about the patients called Tunnel. So he was an artist. He was working in this hospital, and he wrote about his experience in seeing the clients making art And then he also made art about the clients and wrote about that as well. He went on to work as an artist, but he was also a pastor. He was also a religious pastor in Kansas. And he taught art at the Menninger Clinic after Menninger saw his paintings. So Carl Menninger saw the paintings that Don Jones had done about his patients that he worked with. And so Carl Menninger hired him to come and work with his patients because he could see that Don Jones connected well with the patients through this art medium. So from 51 to 60, he worked at the Menninger Clinic. He moved to the Ohio Harding Hospital in 1967 and set up a similar program to what was done at the Menninger Clinic there, and he continued to practice there for 22 years. He was one of the original founders of the American Art Therapy Association in 1969 and was president of the association in 1975. So he was a very influential person in early art therapy in the US. Hanna Kwiatkowska was born in Poland. She was a sculptor, married to a diplomat, and she spoke 7 languages. She became Margaret Nomberg's first student and studied under her in psychiatry. She worked at St. Elizabeth's Hospital, where she designed and carried out research on graphic productions of schizophrenia. And what she was looking at was what was the schizophrenia like when they were on Thorazine, which was one of the first drugs that was used with schizophrenia. So she noticed there was a big difference in how the art was made when they weren't on Thorazine and when they were. And that's what she was looking at. In 1958, she joined the staff at the National Institute of Mental Health, where she worked for 14 years. She also taught at George Washington University in the 1970s, teaching art therapy. The thing that's really unique about Hanna Kwiatkowska is that she invented family therapy. She invented it at the National Institutes of Mental Health with schizophrenic families. So what happened was that she was working at the National Institutes of Mental Health, working with clients, with patients with schizophrenia. So she was doing this research on looking at the graphic productions of individuals with schizophrenia when they were on Thorazine and when they weren't. As part of her treatment, she also started to realize she needed to bring in the family and to start working with the family to have an overall health outcome for these clients rather than just treating a single element within the family. She felt like the whole family contributed to that person's mental health. And so she started to bring them in and sort of stumbled upon family therapy as an aspect of doing therapy with clients with schizophrenia. So she developed a 6-step family evaluation, which is actually art therapy based, that she used with these families. And the 6-step family evaluation was, first she had them draw a free picture, which means anything they wanted. And then she had them each draw a separate picture of the family, so they could look at like how everybody saw their family the same and different. And then she had them do an abstract family portrait, so she'd get more at the emotions. And then she had each person do a picture that started with the help of a scribble. So the first use of a scribble drawing. And then she had the family do a joint family scribble. So how did they all work when they were brought together as a group? And then she had them do a free picture to help them de-stress. So she not only invented family therapy, but she also invented family art therapy and an art therapy protocol for families, which is quite amazing. Another founding art therapist in the United States was Myra Levick. Myra Levick was trained as an artist, and she went on to study a master's in art history. But in 1963, she started to work as an art therapist at Albert Einstein Medical Center North, which opened her eyes to art therapy. And so she ended up never going on to finish her art history degree. She created the Hahnemann, which is now known as the Drexel Art Therapy Master's Program, as the first graduate art therapy program in the United States. She also helped to establish the American Art Therapy Association in 1969. So you can see she was pretty influential in developing that organization and then starting those educational programs to help to spread the art therapy throughout the United States. So what happened is art therapists were meeting each other at events, at mental health, trainings, things like that. but there wasn't a specific organization for art therapists. So she had a meeting at Drexel to start a standalone art therapy organization. For the result from that meeting was that the American Art Therapy Association was finally formed in 1969, and Myra Levick was the first president. When looking at who should be in the organization, it started a war. And, it started this debate on, are you doing art therapy if it's art psychotherapy, or are you doing art therapy when it's art as therapy? And so this division in the field of art therapy in the United States became pretty strong, and there were a lot of strong words between the two factions. What we know today is that it's both, that it's not one or the other, that it's both. Sometimes we're doing art psychotherapy and sometimes we're doing art as therapy, depending on what the client's needs are in the setting we're in. But at the time, they hadn't quite figured that out yet, and so there was a pretty heated debate. Two other people that were really important in early art therapy were Robert Alt and Harriet Wadeson. Robert Alt was another one of the founders, one of those people at that original meeting for the American Art Therapy Association, and he actually wrote its constitution. He worked at the Menninger Clinic, so you can see the Menninger Clinic is pretty significant in the United States for the formation of art therapy. He worked there for 32 years. He was the second president of the American Art Therapy Association, and he also opened his own art school in Topeka, Kansas. He was the founder of the Emporia State University Master's Art Therapy program in Kansas. And then he also worked with a really interesting woman called Grandma Elizabeth Layton, who cured herself through contour drawing. Grandma Elizabeth Layton is a really interesting character, but she had massive depression, and she just did contour drawing all the time, and that helped her to pull out of her depression. Harriet Wadeson had a degree in psychology, so she came from the psychology side. She met Hannah Kwiatkowska at the National Institutes of Mental Health in 1961, and she began doing art therapy with adolescent groups there. She went on to do her master's in art and psychotherapy, and she published 8 books between 1980 and 2011 on art therapy. She established and directed the University of Illinois Chicago Art Therapy Graduate Program. So what you see in common between these two people is that they both went on to start master's programs in art therapy. They both were influential in their areas, and they helped to spread the learning and the understanding of what art therapy was through education. So they were pretty important in the development of art therapy in the United States. So in this course today that we talked about, we really looked at, like I said, how did it start to form? So we saw some themes. We saw the theme that people who were doing art therapy started to get together and develop organizations. So you had the British Art Therapy Association, the American Art Therapy Association organized, and through those organizations, they were able to start to define what is art therapy, and they started to develop graduate programs so that we could train art therapists. And again, they're defining and refining what is art therapy, what do art therapists need to know, how do they practice. They started to thinking about theory. They started to develop their own theories about why art therapy works. So that's where you get that art psychotherapy versus art as therapy. Those are two theoretical approaches to the field. So you got a little division going on there. And you saw that people were publishing books on what they were doing in art therapy. So all of this added to the expansion of art therapy, the development of art therapy within the United States and the UK, and began to open that door for other areas of the world to also start building their own art therapy, because we were putting them into forms that other people had access to. So people could come to the UK or come to the US and do graduate work, or they could read the books that were being developed in those areas and take them back. So we were starting to see that this expansion of art therapy into other areas. But you can also see that we're still at the beginning of trying to understand what is it that we're doing and why does it work. A lot of people just inherently understood in this phase that what they were doing worked, and we didn't really understand why it was working. And that's what you're going to see in the next phase, is more looking at what's really happening here in art therapy and why is this working? We know it works. Now we have to be able to prove it works. We have to be able to show why it works to others. So we'll be looking at that in the next session. Thank you, and I look forward to talking to you again. Hello and welcome again. Today we're going to be moving forward in time and looking at art therapy between the 1970s and 1990s. And I call this the era of expansion in art therapy because this is the time when all the things that were put into place in the last segment that we looked at really started to influence art therapy expanding outward in ideas, in populations that they could work with, in places around the world that they were doing art therapy. So what we're going to be looking at today is the continuing trends and then the new things that were also happening in this time period. So in the United Kingdom, some continuing trends that were going on, the anti-psychiatry movement that I talked about in the last one from the 1960s. So there was still that movement towards community mental health and away from the institutionalization. There's a continued growth in educational opportunities. So some new university programs were developed in the UK during this time period. Development of the postgraduate diplomas were created and more were offered, some leaning towards art, some leaning towards psychiatry or psychology. And what happened is a lot of these certificates moved to the master's level degrees during the 60s and 70s and 80s. In 1977, the British Art Therapy Association produced a document that outlined the core course requirements for content and training in art therapy programs. What this did is really provided that structure of what does an art therapist need to know to be successful at being an art therapist, and identifying what is that knowledge and content that is needed. By 1979, the British Art Therapy Association decided to align itself with clinical approaches and moved away from art education, which is a little different than the US. In the US, we embraced both, but in the UK, they moved more towards the psychiatry side. So in the UK, one of the first, most important things that happened during this time period, really was kind of like the 80s, early 90s, was that they got professional recognition for psychotherapeutic influences. In 1992, the Department of Health and Social Security issued a memorandum that recognized and defined art therapy and set in place salaries and conditions of employment. So in 1992, basically what happened is the government said, this is what art therapy is. This is where we use it. They defined it. And they said, this is the salary that we usually give them. And these are the criteria. These are the qualifications that they have to have for employment. And this was really, really important because what that did is it said, art therapy is now a profession. It's not just something you do. It's not a modality. It's a profession. It has its own designation. That aspect is really important in modern art therapy today. And that's because you will notice that if you look at countries that don't have that recognition by the government of the field as a profession, that it's much harder to find art therapy jobs. So, for instance, Australia had a very similar trajectory in how art therapy developed there, but they never, and still today, do not have recognition by their government that art therapy is a profession. So as a result, art therapy is actually going a little bit backwards in the sense that it's really hard to find jobs. The definition of art therapy has become scattered because they've had to go in so many different directions in order to be able to find work. So this recognition by the Department of Health in the UK was in 92 was critical for making art therapy in the UK a profession. What this did is it established that art therapy was a profession that could be used by the national health system to provide therapy for clients. And this opened up opportunities for art therapists within the national mental health system. In 97, the Council for Professions Supplementary to Medicine, CPSM, provided state registration for art therapists. So this was another professionalization step that they took. In 1981, Sheffield University started an art therapy graduate program, so an official art therapy graduate program. And then in the 1990s, Belfast and Edinburgh established their art therapy graduate programs. And in 92, there was a 1-year certificate in art therapy, which transitioned to a 2-year master's program, became a mandatory requirement of that program as well. So what you're seeing in the 90s was late in the 80s and 90s. So 80s, you saw educational programs growing. They expanded and became more professional and unified in how they went about doing things in the 90s, along with this national professionalization in the 90s. Another thing that happened during this time period is that art therapy literature started to emerge in the UK. So there were some books before that, but at this point you started to see even more things being written, and that production of literature started to expand who had access to this knowledge. So literature and art therapy promoted psychoanalytic and object relations perspectives in the UK. So that was their main focus in the UK. And this focus really looked at the work of Freud, Klein, and Winnicott as a foundation for the art therapy that they were doing. So theories presented by Freud, Klein, and Winnicott were the foundational theories in the UK for how to do art therapy and what ideas to use to help guide you in what you're doing in art therapy. Simon developed an art-based theory on the symbolism of styles. So Simon did this in 92 and then another one in 97. So this was one of the first writings out there that really looked at what is unique about art therapy, that's not just from the psychoanalytic side and that's not just from the art side, but it's something that's unique about art therapy and how it works within what we're doing. And so Simon wrote about this in a theory that he created based on symbolism and styles. So the literature from the UK started to expand to encompass different client populations. It took on more theoretical perspectives, such as the feminist perspective, and they started to move into research so that they could understand why what they did was working. In the 70s, in the United States, we had many things going on. So the civil rights movement was still happening. That was the 60s and 70s, and really influenced art therapy perspectives on race. So race and multiculturalism became a very important aspect of art therapy in the United States, that it was present in the UK, but not as much. It wasn't emphasized as much because the civil rights movement in the US was so strong that it became a central feature of thinking about art therapy. So because of the civil rights movement, we started to look at ourselves. Art therapists in the United States started to look at who are these art therapists in the United States? Who's doing art therapy? Who are the clients that we're working with? And what we quickly recognized was that most art therapists in the United States were middle-class white women. The populations they served were often minority populations. So there was a big movement to recognize and support African Americans in the art therapy community. So what I've put into your PowerPoint is a list of several people that were the earliest African American art therapists in the United States who were very influential on how art therapy developed and continues to develop today. So Georgette Powell was part of the WPA. If you remember, I talked about that, the Works Progress Administration during the Great Depression. And she also was part of the Federal Arts Project. And in that, she created several murals at hospitals and in public spaces. She went on after the Depression in the 1960s, she went on to study art therapy and became an art therapist. Cliff Joseph was another African American, and he was actually the first registered African American art therapist in the United States. He was also the founding faculty member at Pratt Institute in New York. Lucille Venture was an African American woman who was the first art therapist to actually earn a doctorate, a PhD. Her PhD wasn't in art therapy, it was in art and psychology, but basically in art therapy. She also started the Maryland Art Therapy Association, and she published a book called Black Beat and American Art Therapy Experiences in 1977. So that was the first book that came out that was written about the African American experience as an art therapist working within that community. Charles Anderson was also an African American who was the founding chair of the Mosaic Committee for the American Art Therapy Association, which was the first, they were called the Mosaic Committee, but they were the first multicultural committee working, and he worked at the Manajit Clinic as well. And then we had Christine Wang. Christine Wang was the first Chinese American art therapist in 1974. So all of these people were very important in providing and expanding diversity within the U.S. art therapy organizations and who works in art therapy. So in the 70s, 80s, and 90s, multicultural and diversity issues were really important. And they started to address them then. From probably what you've seen on the news, we are still addressing multicultural issues in our culture. It is still a problem. But we started to make inroads into it within the field of art therapy in the late 70s through the 90s, and we're still working on it today. So from 1978 to 1990, there were 2 ad hoc committees that did reports on the lack of diversity within the American Art Therapy Association. So they stated that the reason we didn't have much diversity was because of a lack of cultural sensitivity at the organization level, at the American Art Therapy Association level, and then also at the clinical level. So they addressed this. One of the ways that we addressed it was to add more programming, more lectures offered that dealt with multicultural issues at the national conference. It also became part of continuing education credits that we have to do every year to renew our licensure. In 1990 to 1995, the Mosaic Committee, founded by art therapists of color, was created. And the purpose of the Mosaic Committee was to raise public awareness and raise awareness within art therapists that this is an issue, to create support and to create community for the minority communities within the American Art Therapy Association. And then in 1993, they established a caucus to address awareness with different ethnicities, religions, and other. With the establishment of the caucus, what they realized in 93 was that this lack of diversity wasn't just about African Americans. It was also about the lack of diversity in the types of religion of the people who became art therapists, the sexual orientation, lots of different aspects, whether you were an immigrant or you were born here. So this committee in 93 was established to address the awareness of these other types of diversity. In 94, they started a newsletter. The Mosaic Committee started a newsletter that they published in the journal on diversity itself. So they started to put articles and this newsletter into the journals in the research that we were reading. In 96 and 97, they put together a multicultural bibliography, which means everything that was written about it. And then in 1997 through 1998, they began scholarships and fundraising for scholarships for students of color. And then in 1998 through 2000, the idea of cultural competence arose. If you took my ethics course, you'll see that I talked about cultural competence a lot in that course. And that is because it is such a big issue for the United States to have that multicultural competency. So the other trend that continued in the United States is the expansion of educational programs. Early art therapists were often self-taught. They did it, they saw what worked, they saw what didn't, and they learned from that. In 1973, they developed specific guidelines. They were developed by Gladys Egel for the American Art Therapy Association. So just like the British Art Therapy Association, the American Art Therapy Association developed guidelines for educational programs so that if you hired an art therapist who came from program A, they would have the same kind of training as an art therapist from program B. So you knew what you were getting when you hired an art therapist. It also helped us to define what was important for art therapists to know and be able to do to be successful as an art therapist. Specific educational content was needed. So this outline they put of what educational content you needed to be an art therapist, that was used to set up an art therapy credential. So if you had that education and you followed this guidelines, then you could apply for your registered art therapist, or ATR. At the time, the ATR credential was still part of the American Art Therapy Association. So they were the ones that would look at your transcript, say, yes, you meet the criteria, we'll give you the ATR. In 1975, the Education and Training Board was developed for ADA to review and approve educational programs. So the reason this was done was that what they found was that even though they had guidelines on how art therapists should be trained and educated, that the programs were actually doing very different things to meet those guidelines. So they realized they needed a committee that could go out and review the different graduate programs and see if they were meeting a certain standard, that they were producing students at a certain level. And what that did is it made it easier for people to get the ATR, in the sense that all they had to do was say, I graduated from school A, which is an approved program by ADA. And then the people doing the ATR review would not have to look through the person's transcript. They could just say, oh, this program is approved by ADA, therefore this student meets our criteria, and they could award the ATR. So the first 5 Master's Art Therapy programs in the US, Pratt Institute in New York, George Washington University in DC, Immaculate Heart College, or is known as Loyola now, in California, and New York University. All of these formed between 1969 and 1973. So to show you how much expansion has happened in the United States, we had 5 programs by 1973. By 1977, there were 21 programs. And then by 1985, there were 32 programs. And we're hitting a new phase now of more program development, as art therapists are not only recognized at this point, but becoming sought after in the United States. So I would say we're much higher than that. We're probably in the 40s at this point with the number of graduate programs that we have in the United States. As I said, not only are we expanding literature and the education programs, diversity issues, we also were expanding art therapy in research. And if you remember, I talked about assessments previously, and that we started with these projective tests that came out of the psychology world. What we're looking at now are assessments that were actually created by art therapists. So what happened was the psychologists were the first to develop these assessments, and that used art. And we looked at those and said, yeah, they're good, but there's some problems with these. What we did is we moved to assessments that we developed ourselves based on what we know about what happens in art therapy. So what happened is that we had different approaches. Some are good, some didn't work. That's the nature of anything that is new. Assessments that were developed by art therapists are more phenomenological in nature or more diagnostic. So we went down 2 roads, and both have strengths and weaknesses. So the first one is called, and when you do your art therapy assessment class, you'll learn all about all of these in depth. But the first one was developed in 1975. It was called the Formal Elements Art Therapy Scale, and we call it FEATS for short. And basically with this one is you ask the person to draw a person picking an apple from a tree, and then you use this scale that they have to assess it. And what the scale does is helps you to understand that certain combinations of features in the art can suggest certain diagnoses. So for instance, if they're low on color and they're low on detail and they're low on organization, that might mean that that person is more likely to be showing depression. So that's how the FEATS is used. And we still use it today. It's actually a pretty well-researched one. In the 1980s, they developed something called the Diagnostic Drawing Series. And what this series does is it looks for patterns. So you do a free drawing, you do a drawing of a tree, you do abstract feelings drawing, and from this, there's a scale that you use, and you go through and you assess, and you're looking through it for patterns as well. So it was also diagnostic in nature. In 1983, Raleigh Silver developed a test for cognition and emotion to try to look at both. And she did the Silver test of cognition and emotion called the SDT, and the Draw Story test called DAS. We tend to use the Draw Story test more now. The other one's kind of gone by the wayside. The idea with the first one was that it was a predictive drawing from an observation or drawing from imagination. So when you assess the tests, either one of these, you're looking more at the content and not the actual art production itself. So it's more what the story is rather than what the art looks like. In 1986, Myra Levick put together a test where she looked at the emotional and cognitive art therapy of children. So if you remember, Myra Levick was the person who started the American Art Therapy Association. She also did the LECATA, as we call it, the Levick Emotional and Cognitive Art Therapy Assessment. In this, you would ask the child to do a free drawing, a self-portrait, a scribble, a place you would like to be, and a family drawing. And what it did is it's got these scales where you can look at the cognitive developmental level, and a lot of that's based on Lowenfeld's work that I talked about earlier, and as well as their emotional coping. So it looked at developmental stages of ego development and cognitive development rather than looking for a diagnosis. So it was more to understand where is this child now rather than saying this is what's wrong with this child. In the 1990s, we in the US started to question more what we were doing. If you think about what was happening on societal level, we were really working in the postmodern era in the 90s. And what the postmodern era does is it basically says there's no one single truth, there's multiple truths. So as a result, one of the things that started happening in art therapy is that we began to take on multiple truths. And as we defined ourselves in multiple ways, art therapy became more diffuse in its definition. So with more public acceptance of art therapy, there became confusion over who can call themselves an art therapist and what is an art therapist. So we had these art therapy educational programs that were producing art therapists who could get their ATR. And the ATR meant you were an art therapist. But then we had other people doing art therapy. So we had people who were in arts and medicine, and we had people that were doing therapeutic art education. And so arts, as in plural, expressive arts as rather than the visual arts. So we had lots of different things happening at once, and that's not a bad thing. But what that did is it diffused the definition of art therapy, and not so much for people who were working in art therapy. We get it, we understand why there's these differences. It was more the public that was struggling with, how do I know this person is an art therapist, or are they just calling themselves an art therapist? Because anybody could call themselves an art therapist in the US at this point. So one of the questions we were grappling with within the organization was that age-old question, art psychotherapy versus art as therapy. And it was in the 90s that we started to recognize that it's not an either or question, it's a both. So art therapy really is both art psychotherapy and art as therapy, depending on when and how you use it. And you can see that's where that postmodern thinking comes into play. Another question that we were thinking about is art therapy a profession or is it a modality? So is it something that stands alone to work as its own area of mental health? Or is it something that can be done in service of other areas in mental health? So for instance, arts and medicine, it's not a standalone profession. It's art that's used within a medical environment to support what's going on. So it's not an art therapist that's doing it. You also have like counselors who are artists that use art. Are they doing art therapy or are they doing counseling that uses art as a modality? So we started to have these debates. There was also, and I think a response to these kinds of debates and the diffusion of our understanding of who an art therapist was, is we developed something called the Art Therapies Credential Board. The American Art Therapy Association is a membership organization. That means anyone can join, and their purpose is to provide education and support for working art therapists, as well as the community about art therapy. They were originally designating the ATR, the Art Therapies Registration. They were originally giving that to people who met a certain educational requirement. What they realized in the 90s that one of the issues that was creating the confusion was that by a membership organization giving the credential of the ATR, they weren't unbiased in who they gave it to. So you had to pay to be a member of the American Art Therapy Association. If you were paying to be a member and then they gave you the ATR, they theoretically could be biased in who they gave that to. So people who were not members of the American Art Therapy Association but were doing art therapy weren't necessarily getting their ATRs. So they realized in order for it to be an unbiased and fair process, they needed a separate organization that was not a membership organization that would review people's credentials, would review their education, and decide if they were a registered art therapist or not. So that was the formation of the Art Therapy Credentials Board. They were formed out of the American Art Therapy Association, and eventually they're now completely separate organizations in the United States. And that's so that the people giving out the credentials, the people that are reviewing ethics, are unbiased and separate from the membership organization. So one of the things the ATCB did was it decided that we needed another step to help define who's an art therapist, and that would be a board certification. So they developed a board exam and a board certification. So in the United States, you can get your registered art therapist. That's your first step right out of school. And what that says is that you have the right education. And then you, after you've been out for a while, you can take the board certification exam. And what that says is not only do you have the right education, but now you also have the right knowledge and understanding to be certified as an art therapist. So you can have your ATR-BC, which means Registered Art Therapist Board Certified. In the 1980s, we had an interesting phenomenon starting to happen in the United States. And what happened in the United States is we have a group of mental health people called counselors. And counselors were able to get licensed in every state in the United States. Art therapists did not have a license in the United States. We just had this Art Therapy Credentials Board certification, but we didn't have a state license. So one is the ATR-BC is given by an organization within the United States. A license is given by the government, and that's a big difference. Remember how I said how important it was when the British Art Therapy Association finally got government recognition. Getting government recognition is really important. So in an attempt to provide more jobs for art therapists, because art therapists were having a difficult time because they were not government recognized, finding jobs. In the 1980s, what happened is the graduate programs in art therapy started to align themselves with counseling programs. So students would graduate with a master's in art therapy, but also in counseling. So therefore, they get licensed in any of the states as a counselor and still do art therapy. That access to the license helped us to become more official and helped us to open up the job markets a little bit more. So that was a step towards that. You'll see that we've done another step since then, but that's what we were doing in the 80s. In 1993, we got the first art therapy license in a state as a standalone license. So in the 80s, there were no art therapy licenses in the United States. There was only counseling. And so we developed programs that would allow us to get that counseling license. In 1993, New York came up with the LPAT, the Licensed Professional Art Therapist license. It was only good in the state of New Mexico in 1993. However, it didn't catch on. And it's a little bit of interesting to try to think through that on why it didn't catch on, because you would think that having your own art therapy license would make you something that you could sell more to get a job, but it never really caught on. Only a few people actually got the LPAT in New Mexico in 93. So later we will come back to this licensing issue, but the first one was actually in 93 in New Mexico. Another area where we were redefining art therapy was within how we did it. And one of the new things that was going on in the 80s and 90s, of course, was technology and the personal computer. And that had an impact on how we do art therapy and what we consider art therapy to be. So I was part of this. I got my master's in art therapy in 93. So I was part of this expansion. And when I first graduated, they did not consider digital art or art that was made on a computer to actually be art. They also did not consider doing digital art with clients as something good for art therapy. They saw it as a negative because it wasn't tactile. So there's a lot of resistance to technology in art therapy, but that has changed and there's a lot of acceptance of it now, but it just took time. Anytime something new comes about, it takes time to be adopted. So we started to see technology in art therapy through things like making digital art or art programming or distance therapy. art therapists beginning to build their own websites, those kinds of things. So there was a slow adoption rate in the 90s, but it improved a lot later on. Another area we were expanding in the US was in the area of literature. The way that worked is that the early things that were written were more anecdotal. So they were telling more about case studies, about what I did, basically, is what they were. So they were stories about the work that art therapists were doing. The American Journal of Art Therapy, which grew out of Eleanor Ullman's Bulletin of Art Therapy in 1961, the Journal of Art Therapy allowed a space for research to be written about art therapy, and it allowed a space for us to publish it. There was also the Art Psychotherapy Journal that also started and allowed another space for us to publish research. The American Journal of Art Therapy was started in 1961, and then the Art Psychotherapy was 1973. The American Journal of Art Therapy, that was Eleanor Ullman's thing that she started, switched to becoming Art Therapy, the Journal of the American Art Therapy Association. So it's really just a change in words, but the difference is that it got taken over by the American Art Therapy Association in '83. When it got taken over by the Art Therapy Association in '83, it expanded its reach, the number of people that would read the journals, and the amount of people that could get published. There was also an expansion of books on art therapy in the 90s and an increase in the use of clinical research to examine art therapy outcomes. So we started to be really focused on outcomes at this point. So prior, it was like the research and the things we were doing was all about what we did and how we did it. Now in the 90s, we start to switch to, but what happened? Did it actually work? What is the outcome? So now we're looking for outcomes, which is more formal research that shows this is what works and why. You got a book in 1992 called A Guide to Art Therapy Research that was put together by Harriet Wadeson. We also, in '98, got a book called Arts-Based Research, like how to do research using the arts. And then Art Science and Art Therapy, Repainting the Picture in 2000 by Kaplan. And Kaplan's book on research in art therapy is the one that I use now when I'm teaching students how to do research in art therapy. Another area that really took off in the 90s was the introduction of neuroscience into art therapy. The thing that's fascinating about neuroscience is that through the study of neuroscience, we're really starting to understand why art therapy works, whereas we've known forever that it does work. We just couldn't really define why it was working. And now with neuroscience, we're able to tell that better. So in the 1960s, somebody hypothesized that there was this left brain, right brain sort of thing happening. And what that meant was that the right brain was considered to be holistic, visual, intuitive. It's the one that we do imagery and stories with. And then the left side of the brain was the analytical, the math, science, those kinds of things. There's actually not any evidence for this. The brain doesn't work as a split brain. And in the 1980s, the idea really caught on in art therapy, and you can actually still see people writing about it, even though it's not actually accurate. So in 1980, Drawing on the Right Side of the Brain came out by Edwards. She wrote a book on how to learn how to draw, not because it was using the right side of the brain, but because her techniques were based on trying to trick the brain so that you get past your worries and concerns about how well you draw. So it made it so that the everyday person could learn to draw pretty easily. It focused on artistic potential and creativity rather than mastery. So that's why it was a book that caught on really strongly within the art therapy community. By the 1990s, we started doing neuroimaging. So we started to be able to look into the brain and to see what was happening when we did certain things. And so as a result of that, we've started to be able to look at how does art therapy affect trauma in the brain? You know, like if the brain has trauma, how is it processing these things? So we can look very specifically at how the brain is working, which is fascinating and still continuing today. With every time they come up with a new tool for looking at the brain and how it works in a person while they're alive and working, we learn a lot. So we're still progressing in that area. But in the 90s, that's when it really started to take off as an area. So that's art therapy up until the 90s. And I'm going to be talking about art therapy from 2000 to today in the next episode to kind of give you a sense of where we are now and maybe start you thinking about where we might be going in the future. Thank you for joining me again, and I will see you next time. Hello, my name is Dr. Penny Orr, and welcome again. Today we're going to be looking at 2000 to the present in art therapy, and hopefully looking a little bit into the future. So the overall themes of what happens in 2000 to the present are basically art therapy has expanded around the world. We've also been continuing to work on our identity and how we define that. We've really adopted what's called a full spectrum definition of art therapy, and we've started to work with focus areas such as LGBTQ, PTSD and trauma, mindfulness, positive psychology. There's been a licensure movement in the United States, and expansion continues for educational opportunities. There's also been the formation of a accrediting organization in the United States for graduate education rather than just approval. And art therapy education has gone online as well. And as well as art therapy sessions have gone online. Okay, so let's look at the future, but within context. So in the formative years, I'm just going to review a little bit of what I've already talked about. In the formative years, we were looking at, in the field of art therapy as a whole, England, UK, around the world, we were having discussions about art as therapy and art psychotherapy. So it was, you had to pick sides. We're also having discussions about what art therapy is. Was it a modality or a profession? And then we were also having discussions about what theoretical orientations people chose. So you were a Gestalt art therapist, or you were a humanistic art therapist, or you were a psychoanalytic art therapist. And so people were choosing theories that they were doing. Well, where we are now within the profession is that we really look at things with a both and thought process rather than an or. So you are both an art therapy therapist and an art psychotherapist. You are both working as art therapy in a modality and working in art therapy as a profession. You are both a cognitive behavioral art therapist as well as a family art therapist. We don't have to take sides. We can take the best of each and integrate them together. And that's really kind of where we are in our thinking at this point. So art therapy now is more inclusive of ideas and approaches and of cultures. So what we were doing 2000 to present was reimagining art therapy. So we started to reimagine what is art therapy and defining it better in the 90s. Well, we've continued to do that. So what happened is that as we expand around the world and we are moving into other cultures in art therapy, it's made us question what we're doing and who we are. So when art therapy moves into a new culture or a new area, it has to take into account some things before it could come up with a definition that's really going to fit that area of the world. When cultures meet, they mutually influence each other, right? So if you have two people from two cultures and they meet, they're going to mutually influence each other. The same thing happens when art therapy comes into a new area. So if art therapy comes into a new country or a new culture or a new area of the world, those two cultures meet and they influence each other. So every time that happens, when art therapy comes in, art therapy influences the culture, but the culture also changes how we understand art therapy. And we recognize that in the 2000s to the present, and we're accepting of that art therapy doesn't have to be one thing. In the 90s, we were really into policing art therapy and trying to say, this is art therapy and this is not art therapy. Now we're looking at it and saying, well, art therapy is going to be different for different people, and that's okay. That it has to, in order to get buy-in, in order for people to genuinely embrace it, it needs to fit within their cultural norms, within who they are and where they are and what the standards are for working there. Otherwise, it'll never really be integrated. So new definitions for art therapy have to take into account things like cultural values, the local ideas about art where it's being presented, the indigenous ideas of therapy, healing, and medicine. What are the belief systems that have already been there for a while? And then the integration of what works and then adaptation of what isn't working into a better form. So art therapy doesn't have to be one thing. And that's probably the biggest step we've made in thinking about art therapy in the last 20 years. So what I'd like to do today, instead of, we will look at the bigger picture too, but I really want to focus in a little bit more on art in Asia, since that's where you are. So what I want to do today is I'm going to talk about art therapy in Asia and how it's expanded around the world and what that means for the field. So art therapy in Asia, there are underlying concepts that inform art therapy in Asia as a whole. And that can be things like, and it's not the same everywhere, but these are possibilities. Collectivism, spirituality, different types of spirituality, traditional medicines, Western medicine, because it's also been very influenced by that, and the role of art in society. So models for art therapy in Asia are different in different areas of Asia. So some areas really integrate mindfulness, like meditation and yoga and the use of mantras. Some areas, the art practices tend to follow after other routine or overall health goals. So art therapy is more of a modality. It's an addition to something else that's already happening. So it's taking second seat. And this is really unique to the Eastern cultures. The art therapy practice is not limited to the ill as in Western society, but is seen more as important for everyday living. In Western society, we do see it as part of our everyday living, but it's not truly integrated. It's really seen as it's a therapy. It's something you do when you are sick, rather than something that just should be part of your everyday life. So I think that's a significant difference that I see between Western and Eastern approaches. Models in Asia are affected by cultural practices. So each area of Asia is different. For example, in Taiwan, they take a very authoritative approach, which is really based on structure, and it's intended to benefit the client's full social aspect. So it's a very structured approach to art therapy, whereas other places, it's much softer structure to art therapy. And so it really depends on the cultural norms of the area. So in looking at art therapy's expansion around the world, I'm just going to name some things that are out there. I'm not naming them all, and I'm not going to read all of the slides because there's more out there than I have researched. But this is just what I have found. And there's a lot more out there. So you have international organizations, and these are organizations that go anywhere in the world to do art therapy work. Some examples of those are Red Pencil International, which I'm actually a volunteer for, an ambassador for. The Ragamuffin Project in Cambodia, Artful in Disaster, which goes around the world as well. The purpose of these organizations is to usually come in when there's a problem, when there's a disaster, or if, like with Red Pencil, we go in when an organization asks for our services, and then we go in and set up a program. And we do a lot of work with places that have had like sex trafficking and disasters and things like that. But art therapy is pretty much everywhere in the world at this point. So in some examples, in South America, there's a Brazilian Union of Art Therapy Association. There's a Chilean Art Therapy Association. In the Middle East, there's an Egypt Art Therapy Association and an art therapy studio. Israel has an association of creative and expressive therapies. In Asia, there's a center for counseling that uses art therapy. In Hong Kong, there's an Expressive Art Therapy Association. In Malaysia, there's Art Therapy Association. Taiwan, there's an Art Therapy Association of Singapore. So you can see that it's really expanding. And when you get an association, that's your first step in becoming more of a formalized organization around art therapy. Once you have that association, then you can do things like create an ethics document and create an educational document that outlines what education should look like. And so from there, that's when you can start working on initiatives to get recognition for what you're doing once you have that organization. North America, there's American, Canadian, Ontario, Quebec, art therapy associations, and more. Like I said, I'm only showing you some of them. In Europe, there's an overall European consortium of art therapists. It covers all of Europe, and then there's individual ones. So there's French, there's Italian, German, Polish, Romanian, Swedish, Czech, British, Irish, Northern Ireland, all have different organizations for art therapy. And then, of course, Australia and New Zealand also have their own. So it's everywhere at this point around the world. The difference is how far in its development is it? So some places are very developed, like the UK and the US, where we're at the point of licensure and it's almost gotten too structured. And so it's not allowing as much growth as we would like. And then you have some places where you just have individual people that are doing art therapy. And no organization has been developed and no training has been developed. And then most of these places around the world is somewhere in between, where there's some training, there's some education, there's some organization, and perhaps there's some recognition for what they're doing. So going back to art therapy in Asia. In art therapy in Asia, there's a history of traditional arts being used in health, such as calligraphy and brush painting and music and dance, as you guys well know. Initially, Asian art therapists receive training in Western countries, and this is typical. Usually in the first stages of art therapy being adopted in a country, they will get training in a Western country and then come back. So we're seeing that a lot in India right now, where a lot of art therapists from India are getting trained in the UK and the US, and then they're going back to India. And it's just now that they're really trying to start their own educational programs. Because a Western education is fine, but it's not culturally situated. So you need an education program that's situated within the culture. Training has started to develop in Korea, Singapore, Taiwan, in different colleges, and then of course institutes in China and Japan are providing training. So movements are more culturally based. Foundation for art therapy in these countries is growing. So I broke it down into different areas of Asia. So there's East Asia, which includes China, as you know. And then there's Hong Kong. Within this area, the things that I noticed that are going on is that there are a lot of westernized art therapists or Western art therapists who are visiting China and doing programs and helping to start education and things like that. There are also many Western visiting art therapists who have come in for special settings, such as the 2008 earthquake. Also, there are special programs that have been set up by Westerners for meeting special needs children, as well as medical settings. There are expressive art therapists, social workers, teachers, Chinese philosophy and painting within Guangzhou. Now, I'll tell you right now, my pronunciation is going to be way off on a lot of things that I'm going to be reading through the rest of this. So I hope you get a little giggle out of it and enjoy it, but it's going to be way off because I speak English, French, and Spanish, but not any of the Asian languages. So my pronunciation is going to be off, and I apologize. At the University of Soochow, there was a teacher there that started Yi Shu, who started integration of traditional Chinese medicine with expressive arts, and that's a 3-year program. At Guangzhou Institute for Psychology, they provide an expressive art therapy course or coursework, not an actual degree. It's an NGO that provides special needs children, but also does a lot of training and of the teachers and the people who are working with these children. So I applaud you all for doing that work. And then there was also in China, the 2019 International Conference of Art Therapy was in Beijing. So that was quite wonderful, and hopefully in the future we'll get back to doing those things. In Hong Kong, traditionally art therapy is offered through workshops and conferences, not so much through degrees. There's a Center for Behavioral Health at the University of Hong Kong that does have an art therapy training program that is 3 years. It's taught in Cantonese and English, but it's only for people who are already social workers, healthcare workers, or psychology providers. And then there's an annual expressive arts therapy conference that has been going on in China for a while now. In East Asia, we've got different training opportunities. In Taiwan, there's a university there that has a 2- and 3-year program. And Taiwan also has a registered art therapist credential. So that's one of the few where there's an actual credential that you get after you've graduated. In Korea, art therapy was established at Daegae University. And there are currently 17 graduate schools offering training, and other programs offer graduate certificates and diplomas. In Japan, art therapy is taught through institutes and associations rather than universities. The thing that's unique about Japan is they've really developed their own approach based on original techniques in psychotherapy, such as Niken therapy and Morita therapy. So they really have defined their own kind of art therapy there, which is nice. In Indonesia, art therapy content is taught within a master's program in clinical psychology. And in Singapore, there is a university, the LaSalle College of Arts in Singapore, which is Western influenced, creates a master's in art therapy. That program has been growing pretty rapidly, and there's a pretty rapid growth of art therapy in that area because of that program. So I actually have founded an art therapy master's program at the university I work at, Edinburgh University, Pennsylvania. And I've worked in other programs as well. And what I have found is that when you are able to start an educational program, like what WABC is doing, you enable people in the community to get training. You enable those people to go out into the community and do art therapy, which then creates more awareness of art therapy in the community, and it just starts to grow. So access and understanding and training in art therapy will continue to grow because of a really strong program being at the center of that. So it's great what you're doing and helping to expand art therapy in your area, because that's what it takes. So I want to talk about two specific programs that are in Asia at this time, or not programs, but like events or things. So one is the earthquake, the 2008 earthquake. It was horrendous, as you guys know, and looking at pictures now and looking at pictures back then, it was horrendous. I've seen different numbers on different sites for the amount of deaths and people that were displaced and things, but they're huge numbers wherever I look. As part of that, it caused like mass displacement. It caused a huge number of deaths and a huge number of injuries. And it was just horrifying. There were two organizations that went in to help after the earthquake. One was called the International Child Art Foundation from Washington in the USA, and they developed a healing arts program that they brought to the children who experienced that earthquake. And what they really looked at was that the children who experienced that earthquake had a lot of trauma from the earthquake, also a lot of grief and loss. So what their main aim is to help the children feel stable again, to feel safe, to give them a chance to express that trauma and grief and loss. And the one thing I found really interesting in their mission was to restore the children's faith in nature. If you think about it, an earthquake is nature doing something that really disrupts your life. And so the children lost their faith in nature. And one of the things the International Child Art Foundation did was try to restore that faith. Another group called Art for All is a nonprofit community arts program out of Hong Kong that developed a series of arts programs for school children in the area, and they collaborated with World Vision. Through this, they looked again at trauma and grief, but also guilt. I thought that was interesting, that they also addressed guilt through the art making. Maybe the guilt of survivorship. And they used not just visual arts, but interactive drama, songwriting, collaborative painting. And they finished with a mural project called This Is Our Village mural to help the children to stabilize and to find connection with people in the new communities in which they had been displaced to. So it was a pretty significant event. And because of this event and these organizations going in and other organizations, there were other local organizations that went in as well, being able to see the effect of art therapy really grew in this area of the world as a result. Another program in Cambodia worked with people that were trafficked, not just sex trafficked, but any trafficking. And unfortunately, I looked at UNIPAP, which is an organization of statistics. They identified human trafficking, as the fastest growing and most lucrative form of international criminal activity. It is the third highest criminal activity in the world. And that's really scary and sad if you think about it. Atira Tan, she is an art therapist she's in India. at the moment. I've talked with her and her organization, and she did a really nice program working with survivors of trafficking. And the program was called The River of Life, and it was an expressive arts program. So what she did is she had them work on a series of images, and these series of images basically helped them to do their trauma narrative and help them to do some healing from being trafficked. So what she would do is ask them first to do an image about their life, their experience, their feelings, events, what was going on before they were trafficked. And then the second image is focused on how they were trafficked, what happened that caused the trafficking to occur. So for instance, one girl had a boyfriend that her dad didn't approve of, so she ran her way to a city, and then a woman offered her a job, and it ended up being in a brothel, and and that's how it happened. It wasn't a single event. It's usually a series of events that lead you there. Then she has them do an image about their experiences of being exploited, what they felt like being exploited, what struggles and difficulties did they go through when they were exploited, when they were working, what was difficult about that experience. And then she has them do an experience of getting out of it, either being rescued or getting out of, ending the indenture, getting away from it, the industry. How did it feel to get out of it? How did that process happen? And then she has them do a final image about how they are in the present and what plans do they have for the future. So how are they doing in the home that she's working? She was working at home with a bunch of different people that were in the home. How did they feel being there? What was it like being in this program? And how did they feel about moving forward in their future? So unfortunately, there's a saying in Cambodia that says, once a cloth is dirtied, the value is lost and we have to throw it away. And so she was really working with that notion that these people that had been trafficked felt they had no value and that they had been thrown away. So she was trying to help them work on taking back their power and taking back their value as part of that. I have done similar work to this, with red pencil as well. We tend to work with children though. So there are continued growth areas in art therapy that we're exploring around the world. And those areas are things like looking at the LGBTQ community, working more with trauma. We're doing a lot of work in trauma right now in art therapy around the world. I'm seeing more mindfulness and positive psychology coming into art therapy. In the US, we're focusing more on licensure. I think we have 14 states now that have licensure. And the reason licensure is important, like I said, is because it's a state recognition for the profession. And by having a license, like I'm in Pennsylvania, we don't have a license yet. So anybody in Pennsylvania could say, I'm an art therapist and do art therapy. The problem with that is that there are some people who are doing art therapy that don't have any training. And as a result, they can do harm. So they can actually hurt the people they're trying to help because they don't really understand what they're doing. What a license does is it says, in order to call yourself an art therapist, you have to have this education, right? And the state recognizes it. So then when companies hire, they only hire people with that license, and that helps to protect the public. So that's why it's important. And we've got, like I said, I think we've got about 14 out of our 50 states have a license at this point, and we're still working on them in many, many other states. The other areas of expansion are in continued educational opportunities, like what you're doing, are happening and popping up all over the world. And then, of course, there's online art therapy where, because of COVID, we're actually doing a lot of online therapy now in which we're doing art therapy in the Zoom environment, which is amazing. And I think we're learning a lot. There's also online education in art therapy, and that's what I do. My program at Edinburgh University can be done. It doesn't have to be, but it can be done 100% online. So from anywhere in the world, the problem is timing and cost, but it is online. And that's my program's the first program anywhere in the world that is online. Okay, theories. So in the next half of this course, it's not actually half, it's more than half. we will cover a lot of different theories. And each theory is going to be a little better organized than what we've had with the history, because history is difficult because there's lots of overlap and things happening in different parts of the world that are affecting each other. Theory is a lot easier because there's usually a main tenant, main people that do it, and then I can give you some examples of how it's done in art therapy. So we'll be looking at theory from here on out for the rest of the course, and I'm hoping that understanding this little bit of the art history will help you with that. Thank you for listening. I look forward to working with you again.
Hello, my name is Dr. Penny Orr. I will be your guide in this course. The course is called Techniques and Practices in Arts and Healing. In this course, we are going to attempt to do three things. We're going to first look at the concept of materiality and the expressive therapies continuum, as these will help us to make decisions about what materials to use with clients, how to assess what the client needs material-wise, and then what techniques we want to employ. We will also be exploring many different materials in this course to determine their therapeutic qualities. What qualities do they have that might enhance what the client needs or might help to contain what the client is expressing? And then we'll also analyze them for appropriateness for the client. Are they safe? Are they appropriate for the age or the ability level of the client? What kind of adaptations do we need to make? So in this course, our main focus is going to be on the materials themselves, the theories behind why we choose materials that we use, and when to use them. And then in the end of the course, we're going to be looking at how is that applied to cases. So this total course has 16 lessons in it. And of those 16 lessons, the first 3 deal with the just introduction to techniques and practices in arts and healing. We're going to be discussing materiality and then look at things like the expressive therapies continuum and how to write your sessions or plan your sessions. The lessons 4 through 12 are going to be about the material themselves. So lesson 4 will be material versus techniques, and we'll be mainly focusing on black and white drawing materials. Lesson 5, we're going to be looking at expressing emotion and using colored drawing materials. In lesson 6, we're going to be exploring fluidity, opacity, and resist, with a focus on painting materials. In lesson 7, we're going to look at the benefits of repetition and multiple versions of an image, and with a focus on printmaking. In lesson 8, we're going to focus on the concept of making things special through art making and bringing things together. So in this unit, we'll be looking at collage and found materials. In lesson 9, we're going to explore malleability versus rigidity through sculpture. In lesson 10, we're going to look at soothing movements and connections through fiber arts. Lesson 11, we're going to talk about memorializing the self through things like making masks, body casting, and imprints. And then lesson 10, we're going to be exploring digital art and explore the concept of being able to undo what you have done in your art making. In the last unit in this particular class, we will be looking at practice and intervention and how all of these things apply to real cases. So in lesson 13, we're going to be analyzing the needs of an older adult with depression and looking at what materials were chosen, what techniques and interventions, and why. In lesson 14, we're going to be exploring building coping skills with an adolescent with anxiety. Again, we're going to be looking at why things were done, how those goals were made, what materials were chosen, and what techniques. Lesson 15, we're going to be learning more about how to listen when we're analyzing and processing the art. And we'll be doing this by looking at a case study of a client who was experiencing breast cancer. And then in lesson 16, we're going to talk about creating safety with the art materials and how to use the art materials to contain emotion. So we're going to be, in this last one, looking at crisis intervention techniques and when you're working with clients who are potentially suicidal or after a disaster. I hope that these topics are interesting to you. We will be, like I said, mainly focusing on how to do all of this through the lens of technique and practice, through the lens of looking at art materials. So now what I want to do is show you some different projects, different art materials that we'll be looking at within this course. Within this course, we're going to be exploring a lot of different media. So the first thing we're going to want to do in the course, and we'll do this in lesson 1, is we need to create a visual journal. Now, a visual journal is a little bit like a written journal, except it's done visually. You can write in your visual journal, but it's also a place for you to take media and explore it, to think about things that you are doing, to help you plan and to help you understand. So the first thing that we're going to be doing, like I said, is making a visual journal. And this is an example of my visual journal. And it's just made with an old book. And what I've done is I've glued pages together. There's some actually sewing on this page, adding paint and things like that to create the journal. What you are going to be doing in your journal is exploring different media and materials. So you want to have a place where you can play with the materials to figure out how it works, what you like, what you don't like, what the medium, how it works for you. And that way you have one place in this visual journal to keep everything in one place so that you can refer to it later when you're thinking of projects and things that you are doing with clients. So in the course, we're going to be doing lots of different things. Let me pull out my mini visual journal, which is in my larger visual journal. So in this course, we're going to be looking at different techniques. So for instance, this is another form of visual journal, and I'll be showing you different ways to make visual journals. And we'll be looking at collage. We'll be experimenting with different materials, so painting, some drawing materials, printmaking. And your visual journal is a nice place to keep all of these examples of different things, projects, and media that you'll be trying in the course. So what I did here with this visual journal is this is just a cardboard tube from inside a toilet paper roll. And I just cut it so it makes a nice little pocket and I can store my extra pieces of my experiments. The other thing I've done with this journal is I've created pockets within the journal so I can put items in those pockets and pull them out. So in the course, we'll be looking at different media, different combinations of media. We'll be exploring, collage and many different types of 2D materials. We'll also be looking at 3-dimensional materials within the course. So we'll be looking at things like ceramics. We'll be looking at, this is actually a broken bowl project where I took an existing bowl and broke it, put it back together, and then decorated it to represent that aspect of life of reinventing ourselves and putting things back together. This is just a little horse that was made using popsicle sticks and plaster cast gauze. So we'll be looking at 2-dimensional and 3-dimensional materials within the course. We'll be exploring what choices we make with these materials, which ones work with best with which types of clients, and we'll be looking at what your own personal understanding and interaction is with those materials. So we'll be making lots of art in this course, and I hope that you are looking forward to that and enjoy the process of making art, but also learning about what you can be doing with clients and why you should make the choices that you make when you're working with clients. I look forward to working with you in this course and hope that you find it interesting as well. Thank you. Hi, I'm Dr. Penny Orr, and I am your professor for this course on techniques and practices in arts and healing. The purpose of this course is to help you to understand media better so that you can understand the qualities that media has and how do we use those qualities to help within the therapeutic relationship and within the therapy itself to help the client to become healthy. So in this course, we're going to be looking at several types of things. We're going to look at the theory that is behind how we think about materiality and how we make choices to match our materials with our clients. So in Unit 1, we're going to be looking at that. We're going to be looking at an overview of materiality. I'm going to introduce you to using a visual journal. We're going to talk about therapy versus activity, how to write session plans, how to explore and analyze the media, and then we're also going to be looking at techniques that we use as part of our assessment process to work with our clients to assess what they need and what materials are best going to meet those needs. In Unit 2, we're going to be focusing on the materials themselves. So we are going to be exploring the qualities of many different types of materials. And in the process, we're also going to be learning about some techniques that we might use within art therapy. And then in the final unit, Unit 3, what we'll be doing is looking at specific case studies and looking at and analyzing them for how the material was chosen, why it was chosen, how it changed the case, how it helped the client to move forward, those types of things. So the Unit 1 is theory, Unit 2 is really exploration of materials, and Unit 3 is how does this apply to practice. So today we're going to be looking at Unit 1, Lesson 1. And in this lesson, we're going to be exploring the concept of materiality, touch a little bit on the expressive therapies continuum, but we'll be doing more on that later. And to help you start thinking about how do we analyze and conceive of what materials are in art and how we use them. So first I wanted to start with some definitions. We often use the word media and material interchangeably. Media is basically materials that a visual artist might use to create art. So whenever we say media, we're talking about the materials. Material itself is the matter from which a thing can be made. So I might say we're going to use crayons as our media, but the material is a wax-based color substance. Another term, a couple terms I want you to be familiar with is the difference between the client artistic space, the therapeutic artistic experience, and the therapeutic relationship. The client's artistic space is the space that that overlaps in the intersection between the material qualities and the client's abilities. So each material has its own qualities. And the artistic space for the client is how they use those materials. Are they able to use them? How much background do they already have in using them? So the client artistic space is the combination of the client's abilities and the media qualities. The therapeutic artistic experience is the overlap between the material's qualities and the therapist's qualities. So the art material might have certain qualities, and then myself as the therapist might have certain qualities, and how those two things interact makes a difference. So for instance, if I'm not comfortable using digital art, that's going to show with the client. And so it might actually inhibit the client's use of the digital media, whereas the digital media by itself might be very therapeutic. And then you have the therapeutic relationship. The therapeutic relationship is the overlap between the qualities of the therapist and the qualities of the client, and how those two come together. Art and healing itself is the space and process in which the qualities brought by the client, the therapist, and the materials overlap. So art and healing occurs when all three of those spaces are interacting together. If you look at the PowerPoint on slide 5, you'll see a nice Venn diagram that shows the artist, media materials, and art therapist, and where these different spaces are. So between the art therapist and the media is the therapist space is. Between the media and the artist is the artist's artistic space. And then between the artist and the art therapist is the relationship, or the therapeutic relationship that we have. When all three of these areas come together, that's how we get art and healing. Okay, so I want to talk next about materiality, and what does that mean? Materiality is a term or a concept that we use to help us understand what we're thinking about when we explore materials. So a couple things to know about the term materiality. First off, materials are negotiated. What that means is that the importance or significance of any given material or media, we can't assume what that is, but rather it's negotiated within the personal and cultural frameworks of the client. So for instance, when I lived in New Zealand, one of the materials that they did quite often was weaving for the women and wood carving for men. For me, being a Westerner, carving wood is something I'm allowed to do in my own culture. But within the Maori culture, that material is restricted to the men because of cultural meaning and understanding. So it's not that the media is different, it's our understanding of it and our interactions with it that change depending on the people and culture involved. So materiality is negotiated. Materiality is also sensed. What that means is how the art material's qualities are sensed, interpreted, and understood. So we literally use our senses. We literally use touch and sound and smell to understand the media that we are working with. So we're using our senses to understand materials. And then the third part of materiality is the therapist's role. The therapist influences the dynamic of the choices of materials and directives. Our role is to remain alert to the client's responses to various materials and make changes as needed. So we influence materiality. If, like I said before in my example, if I am not comfortable with digital media, then I might not suggest to the client that we could do a drawing on an iPad. So I can have a direct impact on what materials are available, what materials are used, how they're used within sessions. And then it's also my responsibility to be very conscious and aware of what is the client's experience of that material. I need to know if they're getting frustrated. I need to know if they don't like the way it feels or the smell or something like that, so that I can suggest alternatives to make it a more therapeutic environment. Some things that we consider when we're thinking about materiality is when we're working with our client, we need to consider three things. We need to consider, is it appropriate? Is the material that we are going to have the client work with appropriate? And what we mean by appropriate is it developmentally appropriate, physically, intellectually appropriate, and is it safe for the client? So for instance, if I'm working with older adults and I bring out a pack of crayons, they might think that that's childish. And so it might not be developmentally appropriate for them. But if I use the crayons on a hot surface and melt them, and then pour them down a frame or something, then that could be, the same material could be appropriate for an older population because of the technique that I'm using with that material is a more advanced technique than just coloring on paper. So we also need to think about physical and intellectual ability. Can they use the materials? Is it safe for them to use the materials? And what's appropriate for them? The second area that we need to think about is personal. Each client brings to the session their own history and their own history with materials. So certain materials might bring out memories for clients, and sometimes you want to bring out those memories, and sometimes you don't want to bring out those memories, depending on what your therapeutic goals are. So each material has an association that goes with it. A person has feelings, memories, and then also cultural and beliefs that go with it, such as what I said earlier about wood. So it wouldn't be appropriate for me to ask a Maori elder woman to work with carving wood, because that wouldn't be appropriate for her culturally. So we have to look at the personal interaction the client has with that material. And then we have to also think about the third area, which is overarching. Materiality flows throughout the planning, creating completion and audience interaction. So there's a beginning point and an end point with materiality. We have the point of where decisions are made about materials. We have the point of what materials we're using and what that interaction is like. We have the techniques that we choose to use with the materials. We have certain levels of choice with material. We have completing the final product with the material, and then also the audience interaction. And sometimes that audience is the client themselves. So there are lots of layers that we'll be thinking about with materiality. In the course of this course, I'm going to help you navigate thinking about all these things as we look at the different materials. So now I'd like to shift what we're doing, and I'm going to move to talking about a visual journal. In this course, what I want you to do is, in this first lesson, I want you to create your own visual journal that you will be using throughout the rest of the course to explore and analyze the materials that you use. The purpose of this visual journal is to become a resource for you to use in the future when you're thinking about materials and the choices that you're making with clients or people that you are working with. Welcome. So what I want to do now is talk about your visual journal. In this course, you're going to be using a visual journal throughout the entire course. And the purpose of the visual journal is for you to experiment with your art materials throughout this course, to explore different techniques that I introduce, and to have a place to record all of those experimentations. So you have one place at the end of the course that you can go to find all the things that we covered. So there are different ways to make visual journals. And I'm going to introduce a few here, and you can choose whatever works best for you. So the visual journal that I showed you in the intro part of the course, this one is just made from what I call an altered book. So what I do is I find a book. I like to have a hardcover book. So I'll look for a book like this. And many times I'll pull these out of the trash. People, especially in academia, like where I work, throw away old textbooks that are outdated, that they don't use anymore. So this is an abnormal psychology book from 1948. So all of the theories and ideas in it are way out of date. So I pull it out and I keep them. And then when I need a visual journal, I will pull one of these out and start working on it. So what you want to look for if you're going to use an altered book is you want something with a hardcover. You want something that you're not going to mind cutting out or adding to or covering up. So don't pick anything precious. You want a book that has the binding is sewn, not glued. If it's glued, when you start cutting into it, the pages are going to fall out. So you want one that's old enough that it was actually sewn together, rather than glued. You also want a book that has paper that's got a decent thickness to it, because you're going to be adding to it. When I first get a book, what I'll do is I'll take a glue stick and I will just go and glue together every other page. And what that does is it glues two pages together, which creates even more thickness, so that I've got a sturdier background to work on. You can do many different things in your book. So let me show you some examples of my altered book so that you can think about how you want to put yours together. Like I said, the first thing I do is I come in and I glue pages together. So this is actually 2 pages that are glued together to create a thickness. And the reason I want the thickness is so that when I paint it, or I do something that's a wet medium, that the page holds up. It doesn't just disintegrate. Sometimes I will sew in my books. So this is a card that somebody sent me that I enjoyed. And so I wanted to put it into my book. So what I did is I sewed it down with embroidery thread, and I glued 2 pages together so that you're not seeing the back of the embroidery thread. You have a nice page and then a nice page. So I sewed those down. So that's another reason to glue several pages together rather than having them separate. Another thing that occurs, as you can see with this, is that the more you add, the fatter the book gets. And so you have to periodically come in and remove pages. And the reason that you want to remove pages is so that it will shut flat. So to remove pages, I'll just cut with an X-Acto blade a couple pages. This is actually a pocket that I made. It's actually, I need to re-glue parts of it, but it's a pocket. And I actually cut out the center of pages to create the pocket so that I could put something in it. And what I keep in that is my small visual journal. So my small visual journal fits within my large visual journal. And cutting out the pocket allows it to stay there so that it's not too fat. It's still a little fat. I need to probably go into these back pages and cut some more pages out because it's getting a little fat. But you don't want it too fat or it'll start falling apart and it'll break your binder. And that's why you want to cut pages out. So in your visual journal, you can do lots of really interesting things. One of the things I'll do early on in the journal is I will paint. So like this journal had writing. You can kind of still see it showing through a little bit. So what I did is I painted both pages and then I drew and painted on top of it to create a nice intro background. Another thing that you can do within your journals is here you can paint a page with gesso or paint so that you're covering up the words, so then you have a place to write and make notes. So you can add those as well. I also, because I like working with fibers, I do sewing in my pages, sewing on the paper and adding things there. And again, like I said, I just glue a page to the back of it so you don't see the sewing. This is called blockout poetry. So what I do here is I will identify words that are in the actual writing of the book that I like, and I keep those, and then I paint everything else so you can't read the rest of it. So it ends up, if you just read what's left, it creates a poem. So that's kind of a fun activity to do with clients if they don't feel like they're very creative. The other thing I do is if I have experiments that I make outside, I might glue them down into a page. So here I've got some feathers that I made that I put different things on. And so what I did is I glued them down into the book and then I just colored around them to unify the page, to make it come together as one page. So it's a nice way to save things. You can collage right into the book. When I collage, I usually, you want to think about what glue you're using. So when I collage, I usually start with a glue stick because glue sticks make a nice flat surface so that the things that you're gluing down, if they're thin, don't bubble. And then a lot of times I'll come back over it with Mod Podge because glue sticks don't hold very well long term, and the Mod Podge will make sure that it holds long term, that I do that over top. Another thing I do quite frequently in my journals is I will put pockets. So this is just a return envelope for a bill for something that I had that I was going to throw out anyways. So I will cut it, glue it into my page, and then I create a pocket. And in the pocket, I can keep experiment cards, things that I made that I just cut down to try out different materials that I was playing around with. I can also keep collage pieces that I think, oh, that's nice. I might want to use that later for something else. So I store things in my pockets in my journal that I might want to use in other parts of the journal later, or that I might want to pull out and use with clients to show them examples. Another thing I'll do is I'll glue the edges here of a page to create a pocket. And then I have something that I can pull out and use or show to a client. And the pocket keeps it nice and holds it within the, if I can get it back in, and holds it within the book. So this is just sort of my personal self-care journal. I keep different journals for different reasons. So what you're going to want to do is have a journal that is just for your experimentation in this course, where you can try out different media and materials. And the reason you want that is so that you have room to write notes. Okay, let me show you a different kind of journal. So this journal is another kind of journal that I make. And I like to make this one with clients because it's small enough that they can carry it around, put it in their bag or whatever, and work on it. So, and it's sturdy. It's a very sturdy journal. So this is made from file folders. In my office, I have a lot of file folders that get thrown out as they digitize records. And file folders are made from cardstock, which is pretty thick, which makes a nice sturdy journal. So what I do is I get a bunch and I cut them up to a standard size on a cutting board. And then I lay them together and I put glue down the edge of each one and I press them together, and then I'll either clip them or put them under a book so that they dry really compressed. And then after that's sticking together, I'll take another piece and put it around the outside and glue it on to make a cover, so that it ends up being a book. So this is what it ends up being. So you can see that this one, you can see a little bit of the binding because the collage material that I put over the edge was a little bit thin, so it's breaking through a little bit. So I have them decorate the covers to represent what they're doing. So, and this is my example that I use with clients. So I have collage on here about, making handcraft works. In the journal itself, again, I like to create pockets. So this is just a paper towel cardboard that comes on the inside of paper towels and toilet paper, and I just cut it at an angle to create a pocket so that I can put different experiments in there, and the client can keep things in there that they might want to use later, or they can keep experiments. It's nice for me to have these loose so that, like, if I'm going to do, this is an acrylic paint print. If I'm going to do that, I can show them, what it's going to look like when we're done, so that they get a feel for what it is. Also, little things like cards that you might make to give to somebody. These, again, are prints, experimentations that I might use. So I keep them here. The reason this is a nice layout for you for this course is because you can keep your experimentations here for the different media and techniques that we do. And then you've got this nice blank page next to it that you can write. So you want to leave in your journal an area for each experimentation that you do that you can write your notes about what the media is like. Is it fluid? Is it rigid? Does it provide structure? How complicated is it? All the qualities that we're going to be examining in the different material. So with this particular journal, after it's put together, and I have the clients put it together themselves, after it's put together, I have them decorate the outside, and I have them just paint each of the pages, just doing different experimentation, just to give it a nice background. So it's not just this ugly yellow manila flat. I have them add paint to it just to give it some nice background. It's less intimidating to work on a page that actually has some color on it than to work on a page that's white, which is why I like to do that. And then they can come in and collage. This is another pocket. Again, this is another pocket that's made just from an envelope. And I just keep things in here that I might use for a collage, or are pieces that I'm in the process of making that I'm not finished with yet. And I can keep them in this as well. As I said before, I like to glue the edges together to create pockets. Pockets are nice because then you can store things in them. So this is a woodcut print example. And I put the little thing on there so it's easy to pull out. With some of these pockets, it's a little, if something's too small and you put it in the pocket, it can get lost in there, and it's a little hard to get back out. So that's why you want to make it either large enough that it sticks out the end, or have something so you can pull it out with. Okay. Another type of journal that you can make is with a magazine. The magazine ones are nice because people throw out magazines all the time. And so it's nice to be able to use a magazine that would end up in the landfill anyways. With the magazine, the qualities are a little bit different. You can usually get a larger size. So if you want to work larger, this is a good choice. Usually you don't have as many pages, but you could put several magazines together. So once you finish, one magazine and fill it, then you can do a second magazine, and later you can glue them together to make a larger, more complete book. When I use a magazine, again, you want to try to find one with a little bit thicker paper. So, because some magazines are pretty thin. This is a National Geographic. I like them because they have good images, but I also like them because they have the paper is pretty thick that it's printed on, which makes for a better journal. So the first thing I do is go in and glue 2 pages, every other page together, just like I said before. And usually what I do when I'm gluing pages together is, with this magazine, I actually have 3 pages glued together, not just 2. And that's because this magazine's pages were a little bit thinner, and I like to have a certain sturdiness to the page. So the first thing I do is go and glue pages together. The second thing I do is I'll come in with gesso, and I will gesso pages. With gessoing pages, the reason you want to do that is so that you can create a background that stuff's going to stick to better. With magazines, the pages are glossy, and that makes it a little bit more difficult for things to stick to them. So by gessoing it first, then I can actually draw right on this page, like with oil pastels, or I can paint on this page. So it creates a surface that holds better. As you can see though, the pages wrinkle a lot more, and that's one of the reasons I'm not as fond of magazines, because you get all these wrinkles in them. One of the things you want to think about when you're working with magazines or even the other books is what glue are you using, because your glue can affect the materials. So for instance, like I said, if I want a flat surface, like from something thin, like a magazine image, I use a glue stick. That puts it down nice and flat. The other thing I like to use is rubber cement, but rubber cement can be a little bit toxic. You can buy non-toxic rubber cement, but people still like to sniff it. So I also use rubber cement, but I'm cautious about who I am using the rubber cement with. I'm not going to use it with somebody who has addiction issues. You can use regular old school glue. Elmer's glue is what we have in the States. And it works just fine. The problem with Elmer's glue is that it has a lot of water in it. So the more water is in the glue, the more likely it is to bubble thinner papers. I also use tacky glue. Tacky glue doesn't bubble as much. There's not as much water in it. It's also good for when you're gluing down thicker things that you're afraid might come off. So it creates a thicker bond or a stronger bond. So I go in and I do the gesso so that I can paint. I also will take entire experimentations and just glue them into a page. So this is actually on watercolor paper, and I just glued it down to a page. The reason it's nice in a magazine to do that is because it thickens your pages again to make them a little bit stronger. So you can see I did some experiments. With a magazine, you've already got a lot of imagery in it, not as much words. So you can work with the imagery, so you could paint around this and use just aspects of this image within the piece. So it can be helpful in inspiring clients to start when they use a magazine. But the main reason I would use a magazine is due to access. If I don't have access to other materials, I might do this, or if I want something that's a larger size. Okay, so these are the type of journals that I went over. So magazine one, this one made of envelopes and folders, and then my altered book. These are just 3 examples. There are many other things that you can use for your visual journal. You can use just a regular sketch pad that you buy in the store if you want to do that and you don't have time to actually make the journal yourself. I like making the journal because I just feel like it has a richness to it that I don't get when I just buy one. But you can certainly buy one, you can make one, and there's many different ways that you can do it. There are a lot of tutorials online if you want to go and explore those on different things that you can make. So thank you for joining me on this. I look forward to helping you to fill your journal, and look forward to seeing the experimentations that you conduct in your journal throughout the semester. So how do we use these journals? A couple things. We want to think about this as a place that's for our creativity. So this course is going to be very hands-on, and you're going to have lots of chance to work creatively within it. So you don't have to just use it for the course. It's a good practice to work in a visual journal. I often use my visual journal to, like if I'm struggling with a client, I'll do a page about one of the clients I'm working with, and that helps me to have a better understanding of the client by doing some art about them. Your journal can be used to process your own daily lives as you work. So your journal and how you use it is personal. What I want you to do for this course is to put one together that you enjoy. In this first lesson, I provided a lot of links to different sites on different ways to make visual journals. And hopefully that will help you to find a method that you particularly enjoy. So I hope that you have fun within this class. I hope that you are open to experimenting and trying new things. And we are going to be going on an exploration journey. So I look forward to talking to you again in lesson 2 and 3, where we'll continue to think about the theories behind how we explore material. And then in unit 2, we're going to start looking specifically at specific materials. So thank you very much, and I look forward to talking to you next time. Welcome to lesson 2 in unit 1 of Techniques and Practices in Arts and Healing. I'm Dr. Penny Orr, and I'll be your guide today. So in this unit, we're going to be talking about 3 things. We're going to first start with looking at what is the difference between doing therapeutic art making versus an art activity or an art education. How do we know when those things are different, and how do we differentiate those? There's a lot of overlap between them. The other thing we're going to look at is how to plan a session. And the reason I'm going over that in this course is because your media choices are a big part of your planning process. So I want us to know how we do the planning in general, and then specifically, how do we do that in terms of media. And then the third thing we're going to do is begin our exploration of media and talk about ways that we can explore it within our journals, within our visual journals. So first I want to talk about art activity versus therapeutic art intervention. One of the biggest misconceptions I think that I get, and I don't mind it that much, is, when I'm working with facilities, I often become the art lady or the art teacher, when really what I'm doing is therapeutic art making, or art and healing, as you call it. So if you look in the PowerPoint on slide 3, I put a chart where I laid out what the differences are between those things. Let's talk about the different levels and the different ways we can think about them. So if we are doing something that has a slightly therapeutic quality, say I got an adult coloring book and I'm working on it myself with crayons or markers or whatever, and I'm doing it for myself, just by myself at home. That is still therapeutic. It falls in the therapeutic range. It's not educational so much, it's more therapeutic. But it's for my own personal art making. It's based on my personal feelings and topics I want to explore. And it's more about self-care. And I don't have anybody to process what I'm doing with. This would really be called an art activity. So it's something that we do for ourselves. You don't have a teacher or a therapist working with you, but it doesn't mean that it's meaningless. It still has a therapeutic quality to it. It's just not
as therapeutic or a different type of therapy than insight-oriented. The next level is educational art making. So the way that we can tell if something is educational is a technique or a concept being taught as part of the art making process. If we are making art with an educational intent, so I take a class in oil paints and I'm taking it with a teacher to learn how to make oil paintings. My intent with that is educational. I'm very product oriented, a little bit process and technique based. And then we don't process the art for its meaning at the end. We more likely critique the art for its meaning, but also for its quality of technique and how we did it. And so this would fall under art education because you have a teacher and you're learning something and it has an educational intent. When you keep that educational component and you're doing it with, you can do it with a teacher or a therapist, more with the therapist, but when you keep the educational component, then you're doing more art as therapy. So art as therapy is based on that it has therapeutic goals. So we don't just, we might still be doing an oil painting, or we might still be doing a coloring book, but we're doing it with a therapeutic intent. So the reason we're doing it is different. Some techniques in education can be taught in art as therapy. So I might teach how to paint to a client in art as therapy because my goal might be for them to gain more self-efficacy or to build their self-esteem. Art as therapy tends to be more process oriented. We really don't care a lot with what the product looks like in the end. And you do still process with the art therapist. And then the fourth category is art and healing or art therapy, depending on what you're calling it. Within that category, the way you know that that is occurring is because it's insight oriented. You focus on process and product. It's based in therapeutic goals. So anything you're doing is for the therapy itself and the goals that you set out. And you process what you made with the therapist. So if you look at the chart on slide 3, you'll see that these are the 4 categories that that I laid out for you to help you understand the difference between how do we know when it's an art activity versus insight-oriented art therapy versus art as therapy versus art education. Because all of these areas can overlap and they can all happen at this, like with the same material. You could do all 4 of these with the same material. You could do all 4 of these with the same person. But a lot of what's different is who is the support person that's helping them. Do they process? And is it based on the goals, therapeutic goals that you've set out? So that's how you kind of know. So this is a good chart to keep in mind when you're trying to explain to people outside of our field what it is that you do to help them differentiate between those areas. Okay, session planning. So when we're planning a session, like I said, I'm going to go over that quickly today so that you have a basis for thinking about how do I set this up? How do I plan what I'm doing? And knowing that making material choices is part of that planning process. So when you're working with a client, we need to be intentional in what we decide to do with the client. So we need to plan what we're going to do based on the needs of the client and any kind of therapeutic goals or objectives that we have for that client. So I might be working with a child with autism, and that child might have the need of better social skills. So I might be having him work in a group so that he gets practice with those social skills. I might have him do a project where, say, we pass the paper around to each person and people add to it, so he gets those social skills into interactions. But I also have to think about the media choices. What media do I use for this activity? So I've already identified that I'm going to use paper. So I need to ask myself, what kind of paper, what size paper do I want to use? Do I want it to be black or do I want it to be white? Do I want it to have color? So first I have to decide what paper we're using. And then I need to decide what material are we using. And we're going to be talking throughout the course about how materials impact a client's mood, behavior within a session. So we need to be intentional about material choices. With a project like this, with a child who has autism, I probably would pick a material that's fairly easy for them to use, something they're familiar with, that's comfortable, because they're already going to be uncomfortable with having to pass their paper to the next person instead of hanging on to it themselves because they're struggling with those social skills. And they're probably struggling with change. So I don't want to change up the materials. I want to keep the materials as comforting as I can. So I would probably choose colored markers because most kids are very comfortable with them. The flow of the marker is easier than crayon. You get a better color with the marker, and you can draw faster with the marker. So it's easier to pass it around to other people. So planning is important. We need to be thinking ahead what it is we're doing, and we need to be intentional in what we're doing. But I have a caveat. As you know, if you have worked with anybody, best laid plans never work out. So go in with a plan and be ready to change, because change is inevitable when it comes to doing art for healing. Okay, so now I want to talk about the different parts of session planning, the different areas that you need to think about when you're putting together a session. So whenever you start a session, when you start planning a session, it needs to be based on the client and what the client's needs are. So the first thing you need to identify are the needs, goals, and objectives. So the need is what the client states they need, but also what the client doesn't state. So I will have clients who come to me because they're depressed. Okay, so they want to work on their depression. But I also know that the reason they're depressed is for many different reasons. And so they might not be saying that they're going through a divorce or that they recently lost a pet or something else that's going on with them. But by hearing their story and talking to them about their depression, I can identify pretty quickly what it is that they state that they need, but also what is it that's behind that need? What is it that they're not telling me that they also need? So I need to plan my sessions based on that need, the stated and the unstated. I need to, from that need, develop my goals and objectives. Now, a goal is long-term. So my goal might be for depression is to increase client mood, increase client expression of feelings over the course of 10 sessions. So that's my goal. It's long-term. Over the course of 10 sessions, I'm hoping to help them have a better mood, be happier, and learn to express themselves better so that in the future they don't get back to being depressed. So goals are long-term. My objectives are what I'm going to do within that session. So within the session, it's short-term, what you're going to accomplish within that session. So my objective for session 1 might be making a collage about their personal interests to help me identify, what interests they have in their lives. Do they have enough interests? Do they need to be planning other areas to get involved in? And it just helps to build that therapeutic relationship and help me to get to know them. So my short-term objectives might be written as something like, by the end of this session, the client will create a collage expressing interests about self. My short-term objective might be the client will verbally and visually express personal interests. So it's what they're going to do within that one session. And that one session and its objectives help us to reach the goal, which help us to address the client needs. So they're all built on each other. Once we've decided what our goals and objectives are and what the need of the client is, then we need to start thinking about how are we going to address those? How are we going to meet those objectives and goals? How are we going to address the client needs? So this is where we start, and there's many different things we can think about when we're trying to answer the how, but what I'm going to focus on are the things that are related to media, because that's what we're going to be focusing on in this course. So there are different types of interventions that we can do. I like to call what we do in art and healing an intervention, not an activity, because an intervention means that I'm trying to provide an exercise, something that we are doing in the art that is going to create change. An activity is really just about spending time doing something. But in therapy, our goal is to create change. So I call them interventions. So first we have to think of what types of interventions are we going to use. And these are the broad categories. There are directive interventions, and that means I design what it is we're going to do. So I might say we're going to make a collage. It's directive. I tell them what they need to make it on. Non-directive means it's left up to the client, and you can have different levels of non-directive versus directive. So I could direct the material. We're going to work with collage, but I can leave it up to them what their topic might be. Or I could do the opposite. I could say, I want you to create an image about your personal interests and leave it up to the client what materials they want to use to explore that. Or I can direct both of them, collage to explore personal interests, or I can direct neither. So I just say, make what you want using whatever materials you want. Now this needs to be intentional. You want to choose directive versus non-directive based on your goals and objectives. If a client needs that directive to feel safe, then you want to give a directive. If you want them to learn to explore their world more, then maybe a non-directive approach works better. So it needs to be intentional based on what the client needs are, not just based on how much energy you have that day on whether you want to plan something or not. The type of intervention also, you can do it as insight-oriented or art as therapy. And what that means is that you can do art that you intend to analyze with the client. So if I did a collage about personal interests, then I could then, after they're finished, look at the art with them, examine what their interests were, identify what are healthy interests, what are not so healthy interests, and maybe suggest other interests that might help them to reach further towards their goal. So insight-oriented means that you intend to analyze it with the client when they are finished making it. Art as therapy is more about that self-care process. The art therapist is still there. If you recall from the previous slide, you're still there to support and help with some insight if they want to do that, but it's really more about that process of expression and helping them learn to do self-care. So one of the things that I like to do that I'll be showing you later are archetype cards. And archetype cards are a form of collage in which I have the person choose an archetype like the goddess or the wizard or something like that, and have them create a collage about that archetype. It's fun. It's something they can do at home by themselves. They can choose all different archetypes to work on. So it can be part of their self-care, but it also could be something that we could later play with, literally play with because they're cards, to talk about different parts of the self. So types of intervention: directive, non-directive, insight-oriented, or art as therapy. And you can have all different combinations of those things. My piece of advice is to make it intentional. Make sure that you are doing these things for a reason, not just because that's what you are doing. When it comes to media choices, we have other things to think about. They can be therapist directed. So I could specifically choose the media, just like with the directive intervention. I could specifically choose what we're going to make and why we're making it. With media choices, I can specifically choose the media based on goals of the client. This is a little bit different in the sense that I'm choosing the media based on the goals. So for instance, with my child with autism, that child craves structure, wants structure to feel safe, but also at the same time, I want them to explore a little bit to help them get a little bit more flexibility. I want them to be able to be more social. So these are some of the goals that I might have for the client. So when I'm looking at the media, I need to think, does this media provide structure for the client? So markers. Do markers provide structure? Yes, because they're not overly fluid, but they can have a little bit of a fluid quality. They can have a little bit of mixing ability. If you add water to them or alcohol, you can actually spread them. So it can become very fluid if you wanted to. Probably with a child with autism, I would not use them in a fluid way. I would use them in the original way, which is just the marker itself, to help with that structure, but at the same time, just a little exploration. By having them pass the page around that they're making, I'm working on those social skills and also helping them to go outside their comfort zone with sharing. So I'm thinking, so my media choices there are the markers, how the markers are used, and the paper, or what it is I'm doing with that paper. So we're passing them around. So I'm probably going to have a smaller piece that's easy to pass um, within the group. Another thing that you can think about with media choices is client preference. Do clients have certain preferences for media? Usually in the first session, I will ask a client, what have you worked with before? What did you like? What didn't you like? So that I can get a feel for what their preferences are. So my child with autism has a preference for stuff they don't have to touch. They wouldn't like things like clay or salt dough, things like chalk that have a texture to them, because of sometimes with autism, you will have that preference for sensory levels, and so this client doesn't want a lot of sensory levels within the media itself. And maybe the client has used digital media a lot in the past and they like doing that. So within the first session, I learned those kinds of things about the client. And usually in the first couple sessions, I will do things that are client preference. I will intentionally choose materials that they've used in the past to help them feel comfortable and to build that holding environment that feels safe to them. Later in the process, when I'm starting to ask them to expand and work on change, then I'll introduce new media for them. You can do a combination of what the client prefers, what the therapist is directing. So there's lots of different ways you can mix all of these things. Again, I would like you to be intentional in what you are doing. Media choices are also based on the expressive therapies continuum and the dimensional media variables. And we'll be talking about those in next session, and how to use those to understand the material and to help guide what we choose to use with clients based on their needs, goals, and objectives. So on the next slide, I have an example session. And the reason I wrote this out is so that you could kind of see what it looks like when it's all put together. And this looks like what I would create for a group or a client that I'm working with before meeting with them. So I always write these out. I keep them with the client's file. You could keep a book of these that you could use with different clients, different times. It's up to you how you use them. But if you're going to use them with different clients at different times, you want to always go back over it and make sure that it's appropriate for the goals and the objectives you have for that client. So you can see, I always put at the top the client or group name, who's doing it, which is me, the date and the time that we did it. And then I list my goals and objectives. So by the end of 12 sessions, the client will increase self-care skills, increase insight into current relationships, and improve mood. Those are my long-term goals over 12 sessions. Within this one session plan, my objectives are, by the end of the session, the client will identify things in life that make them happy, create a mandala to explore their feelings, and to express verbally how they feel today. So usually within a session, I always have 3 sections to it. I always have a check-in, I always have the main art therapy intervention, and then I have processing and closure. The purpose of the check-in in a session is to help the client make that transition from their outside world to the therapeutic space. So I want them to be able to let go of their frustrations or things that were happening on their way to the session with me, and to start to focus on what we're going to be doing that day. And so I want to do a short check-in. You're usually 5 to 10 minutes at most. So for this check-in, what I chose to do is have them draw a small square and then fill it with colors that you think represent how you feel today. And then, and they can use with the media, what I could do is give them markers or colored pencils. I definitely need color for this check-in. Markers, color pencils, different kinds of like watercolor pencils, things like that, I could use. Something with color, and it could be permanent or a marker that can be fluid, that we can add water to. All of those choices on which color material you use depends on the client. It depends on how much structure the client needs. When they finish with and the reason I have them do a small square is so that it won't take that long, because your check-in, you don't want it to take a lot of time. You just want it to be that transition point coming into session and doing a check-in on where they are that day. Processing, I'll talk with them about what colors did they choose, how did they choose them, what do those colors represent to them, and have a short discussion about how they feel today based on what they painted or drew. Then the main art therapy intervention after we've done a check-in is, it usually takes up most of the session. I like to have about 40 minutes because it takes about 20 minutes for a client to get into flow. So I like to allow about 40 minutes for them to work on the actual art intervention itself. So for this one, this is a happy mandala we're making. I'll have them draw a large circle on a piece of paper. Depending on your client and how quickly they work on their imagery in the past, that'll determine the size of the circle that you give them. If they are slow workers, or if you give them a very structured material to work with, like colored pencils, you want to have a smaller circle. If you give them a very fluid material, or they're very fast workers, you want to have a larger circle so that it takes them about 45 minutes to finish, or 40 minutes to finish. So for this one, I'm saying let's use oil pastels and watercolor paints. And the reason I like those is because those have resist qualities to them. So you draw something out and then you paint over it and it resists. I tell them to use these to create imagery, lines, shapes, colors, to express what happiness feels like to them and to identify things in their lives that make them happy. And they're going to fill the circle with these things. In this particular session, I've chosen the materials that they're going to be using. You could do a happy mandala using any materials that you have access to. The choice of materials depends, again, on the client and what it is you're trying to have happen in that session. So once they've created their happy mandala, then I allow time for processing. And this is important. Many times we want the client to continue working because they're invested in the art that they are making. But it's really important to have that time at the end to talk about what they are making. If they don't finish, you can give them the choice of coming back to it next time and working on it more, or they can take it home and finish it working it at home. In the processing section, I always put a list of questions so that when I'm working with the client, if I can't think of something or if the conversation stalls, I can look at my note on my plan and come up with some questions. So questions I chose for this particular intervention were, tell me about what you made. That's generally something I always ask first because I don't want to put anything into their head. I want to hear what they have to tell me. I don't want to say, oh, that's a really nice tree that you made, because then I'm assuming it's a tree. So I want them to tell me what they've made. So tell me about what you made. What colors, lines, images did you choose? What do these mean to you? Are these things that make you happy? Are there things that make you happy that you didn't put into this mandala? Why didn't you put them in? Are there things that you included that you think that sometimes don't make you happy, to help them start to realize that dual nature of things? Sometimes things that make us very happy also make us very sad or very upset. And then you always want to have closure. You don't want to have a client leave a session wide open emotionally. You want to make sure that there's time for them for that transition back out into the real world. So the check-in is to help them come into the session and get into that mindfulness space. And the closing is to allow them time to get back into that work mode, to go back out into the world. So usually during closing, we'll continue to talk about what they made, maybe what they are thinking they might like to do next time. And we'll clean up, put away anything that we've got, and review what we've done. Sometimes I will set the homework. I'll have them doing things outside of session as well. So I just wanted to go over how to write an individual session so that you can think through where your choices in materials come into play. What are the things that we need to be thinking about? And throughout this whole class, I'm going to keep harping on it depends on the client and your goals and your objectives. It always goes back to that. Okay, material exploration. How do we do this? We have all used art materials, but how do we explore them to learn more about the material? There are different media qualities that we can think about. And I want you to think about these things when you are playing with your materials. So one of the things you want to think about is structure. Structure means how the material itself is structured. Is it easy to use? Is it easy to control? Is it messy? Is it clean? And the thing to realize about structure is that it's on a continuum. And the continuum is from fluid and messy to organized and clean. So structure is one thing. The next thing you want to do is look at use access. Materials have different levels needed for using that material. So for instance, if I hand somebody crayons, they can just go to it and start playing with the crayons. But if I hand them pen and ink, they're going to have to slow down, be more careful with it, because it can get very messy. It's usually permanent. So they kind of need to have some techniques and learn how to use it. So access to that material is more difficult than access to crayons. So we need to think about, is there a learning process? Is there a technique that they need to have access to this material? Also, access refers to something like if the person has physical disabilities. Are they going to be able to use this material? Is it broad enough for their hand if they have limited grip? So we need to think about access. If they have vision impairments, can they see the material? A lot of times with macular degeneration, which you get with older clients, they really need the edges of what you're working on to be very clear so that they can figure out where the surface is they're working and where the table is. So one of the things I do when I'm working with older clients is I take the paper and I lay it down on top of a black piece of paper that's slightly bigger so that I create a frame for the edge of the paper. And then sometimes I'll even put it inside a cafeteria tray so that there's a raised edge so that they know what surface they are working on. So material access can have a learning curve to them. It can be based on their prior knowledge. What do they already know how to use? And then also their physical access to that material. Can they actually use it? The next thing you need to think about is one step versus multi-step. And what I mean by that is every material you have has different steps. With crayons, it's a one step. You just hand them the crayon and they work with it. Okay, it's one step. But even something as simple as watercolor painting has multiple steps. With watercolor painting, you first have to put your brush in the water, and then you put the brush in the color, and then you put your brush on the paper, and then you put your brush back in the water, wipe it on a paper towel, maybe put it back in the water, and then pick your next color. So that's like a 5 or 6 step process. People that are very young, have intellectual disabilities, or have cognitive, like a TBI or Alzheimer's, they need fewer steps. So with those types of clients, I'm going to think about, do I want to use watercolor, or do I want to use like a tempera paint where I just keep the paintbrush in the paint so they don't have to keep putting it back and forth in the water, and they don't have to clean it. So I cut down the number of steps. So you want to think, how many steps does it take to use this particular material? The next thing you want to think about is the sensory and physical quality of the material. Every material has physical properties and has sensory properties. So you want to analyze, how does it smell? How does it feel? What is it like as it moves across the page? Is it smooth? Does it have resistance? How much pressure do you need to be able to use this material? Do you use the material with just using your hand, or is it a whole arm? How are you using this material? Also, some materials like 3D materials can have aspects where it actually comes around you, like with body casting, and they can enclose you. So you need to think about the sensory and physical qualities of that material and think about, what can your client tolerate? A client, like I said, with autism earlier, might not like things that are messy, might not like things that have a lot of texture. And so you want to introduce those things very slowly to that type of a client. Other clients, like I have a class of 4 or 5-year-old children who are deaf, they want a lot of sensory input. So we do a lot of sand play. I do a lot of projects that have a great deal of texture, that have smell, that have bright colors. things like that, because they need the sensory input because their brains are learning very rapidly and using that sensory input as part of that process. Another area that you want to think about is client access and interest. What I mean by that is, as I said earlier, it could be physical access, but it also could be, do they have these supplies to work with? So for instance, when I do a lot of volunteer work internationally, and when I go and work with the children, I try to use the supplies that are local to that area because I want them to be able to continue to make art after they work with me. So if I'm bringing in Western art supplies to an area that has very little access to art supplies, what I'm doing is setting them up for failure because I'm saying, hey, we're going to use these cool watercolor paints. I'm going to teach you how to paint. And then after I leave, they have no access to paint. So I've set them up for something that they can't do. So I need to think about what kind of access do the clients have? Are you supplying the art supplies? Do they come to you? With COVID and a lot of telehealth, we've had to go online. And as a result, I'm very dependent on what the client already has at home. So what supplies are available? How are they going to get supplies? Also, what is the client's interest? Do they prefer certain types of art projects over others? And if they do, then those are good ones, like I said before, to start with, because it helps to build that rapport and gives them a safe space to work within. And it's a material they're likely to continue to use when they're not with you. And then the last thing you want to think about is the personal relationship that they have. So with that, we need to know the client's story. What associations do they have with this material based on past relationships, past projects they've done? Did they ever use them before? Do they symbolize or some part of their life? Do they have certain memories that go with it? Do people in generally culturally see that material as being something only children use, or is it professional? What are their perceptions of that material? Okay, so with these 6 categories, we're going to start our exploration of materials. Next time, I'm going to teach you about the expressive therapy continuum and the media dimension variable. And so we'll be taking these 6 categories and expanding them a little bit to help us with our material exploration.
Hi, I'm Dr. Penny Orr, and what I want to do now is a demo on how to explore the art materials that we are going to be using in this course. So the first thing I want to show you is that in my notebook here, in my sketchbook, what I've done is I've outlined the 6 things that I talked about in this unit that we use to understand and explore materials. What you're going to do is take each material each week and you're going to explore it to get a better understanding of its qualities. What's therapeutic about it? How does it work? What are the qualities that it has that might support or hinder the client? So today what I'm going to do is demonstrate how to explore a particular material. And I'm going to start with a very simple material of pencils. So if you say that you want to work with pencils with your clients, you need to define what does that mean, because there are actually many different kinds of pencil and the pencils work in different ways. So this is a number 2 pencil, which is the standard one that we use for school, and it's the one that most people think of when we say we're going to work in pencil. But this has very different qualities than other types of drawing pencils. So what we're going to do is work through each of these steps, looking at the different types of pencils and exploring them. So first we're going to look at structure. So the first one, structure, is organized on a continuum. So it goes from very fluid to very organized. So let's look at each material just on that continuum. So we have our number 2 pencil. A number 2 pencil is your standard writing pencil. It's right in between. It's a kind of medium pencil. It, it has a nice line. It draws pretty well. You can smudge it somewhat. So it's kind of a middle range pencil. The difference with a number 2 pencil is it's fairly light in its color. than other types of pencil. So this is a medium range pencil. What I have here now is an HB pencil. Now the HB is harder than a number 2. And what I mean by harder is that the lead itself is harder. So it resists more. So it's a little more of an organized type of pencil. You can get a finer line. It's a little bit harder. It still smudges, but not as much as other types of pencils. This is a 6B pencil. 6B, so the higher the number is going towards B, the softer the pencil. Okay, so this is an HB. The softer the pencil, lead, the darker it is when you're coloring with it, and the easier it smudges, the darker you have for a smudge. So that means that it falls a little bit more towards the fluid side than, say, your standard number 2. So if I was going to mark on this continuum where these two pencils fell, I would say that then this one is pretty soft and this one is pretty hard. So they would fall at 2 separate points on the continuum. Why is that important? Well, if I was going to ask a client to work with pencil to create an image where they want to be able to do shading or use other tools like a blending tool like this, little white things, a blending tool, it's just paper, then you want a softer pencil. When you use a harder pencil, it'll still smudge, but not as good, and you don't get as good a quality to it. So that's why you want to know the difference in your pencils. And what I'm going to do is explore each different type that we have. So I've talked about these 3 pencils, an HB, a number 2, and a 6B. I also want to introduce you to the mechanical pencil. Now, the mechanical pencil is a type of pencil that's exactly like it sounds. It was used for mechanical drawings. That means that it is very precise type of pencil. So when you draw with a mechanical pencil, you can have different leads in the pencil that create a softness or a hardness, but your line quality is much more precise than if you use a pencil that you sharpen. So the point of the pencil is much more refined. See how it's smaller? So you can do more detail work. So a mechanical pencil is a good pencil to choose when you know that your client wants control and detail. And then you pick your lead depending on how much smudgeability or how much fluidity you want. So this is a 0.9 lead, which means that it's pretty soft. This is on the soft end. The lower you go, the harder it gets on your mechanical pencils, and the less it smudges. Another thing that I want to introduce you to that kind of falls in this category are the charcoals. So these are charcoals, and there's different hardnesses. I'm going to go over this again later, but I have a soft charcoal and a hard charcoal. So a soft charcoal, you can see it goes down pretty dark, and it's pretty hard. The difference between the two, and you can already sort of see it in the line quality, is the softer is darker and it smudges easier, just like with the pencils. The harder one doesn't smudge as much. The difference between a charcoal and a pencil is that a pencil erases. So this is just an eraser. So a pencil erases very nicely. And you can actually, I will have a client go and fill the whole page with a soft pencil and just really get out that physical structure, and then come back in and draw in the pencil with the eraser, which provides them with some control. So the hardness of the pencil makes a difference as far as how easy it is to erase and the quality of the eraser. So you can see with the harder mechanical pencil, it doesn't erase as well. You still have a line that's remaining, whereas with the softer pencils, you can erase more completely. Now, with charcoal, you can't erase very well at all. It does not erase well. It just kind of continues to smudge. So why does that matter? If I'm working with a client that gets very much into the details, like an adolescent who's very much into the details of what they're drawing, and they keep drawing and drawing and drawing and erasing and erasing and erasing, and the reason they do that as an adolescent is because they're trying to get control of the material and they're trying to make their image perfect. As a therapist, one of the things I'm trying to help them do is to gain more flexibility. So I'm not going to give them a mechanical pencil. I might give them charcoal to work with because you can't erase it and they have less control over it. So they have to accept more the changes that happen along the way. So I might use charcoal with that. So that's why you have to think about, is it fluid or is it organized? Because the more fluid, or in the terms of pencil, fluid means the more it smudges, the more expressive it is. The more organized it is, the more controlled and cognitive it is. So that's the first step. That's the first thing you look at, is the structure of the material. The second thing you look at is use and access. So use of a material means, how are you going to use it? Is it easy for them to use? Do they have access to it? So a number 2 pencil, most people have access to that. So if you want something that's highly accessible, then using a number 2 pencil works. Charcoal is something people have less access to. The other aspect of access that you want to think about is, not only do they have access to this material at home so they can work outside of sessions, but also do they have the physical capabilities to use this material. So for instance, if I had a motor control problem where, say, I don't have a complete grip, a pencil's not going to work very well. If I don't have fine motor skills, a pencil's not going to work so well, right? So I'm going to have to adapt my tools to make them more accessible to somebody with disabilities. And in the later units, I'll talk a little bit more about that. But the way to adapt a tool like this is to wrap it with something to make it thicker so that they can grip it better. Sometimes I'll actually have a glove that I put Velcro on, and then I'll wrap Velcro around the material and put it on there so that it's easier to hold for the client. But something like a charcoal might be easier to hold than something that is small and round. So as far as access goes, you have to think both, do they have this at home? Do they have access? Can they get the material? But also, is it adaptable for somebody with disabilities? So first thing you look at is the structure. Is it organized or fluid? And then you want to look at use and access. If I'm going to have them do a drawing of, of buildings and use, 3-point perspective or 2-point perspective, then I'm going to want them to be able to use details, right? And not do something that's really soft. So I'm going to want to use mechanical pencils depending on the type of drawing that I am doing. Okay, and then you also have steps. So the third thing that you want to look at is, how many steps does it take to use this material? So with a straightforward pencil, that's a one-step thing. You can make a mark with a pencil. That's a one-step process. But I can make it much more complicated. So like I said, sometimes with clients, I'll have them do something where they cover the whole page so that they're getting out that kinesthetic experience, using up that physical energy. And then I'll have them come in with an eraser and draw in the material. So that's what you would call as a 2-step process, okay, depending on your technique and how you use it. If you are using, if you're doing something like this where you have perspective and you're teaching them a technique on how to draw in perspective, that's much more complicated. And with that, you're probably going to use rulers, and you're going to have vanishing points, and you're going to teach them about how to draw using perspective. So that's going to be a very complicated process. So just straight drawing is very simple. Drawing with erasure is a 2-step process, so still simple and accessible, but a little more complicated. 3-point perspective drawing is going to be much more complicated. So you want to think, how many steps is it going to take for the client to be able to use the material and do the technique that I want them to use? General rule of thumb is, the younger they are, the fewer steps that you want. The more cognitive, the better ability they have to process things, then the larger number of steps you can use. If you want a client to move towards the cognitive area of the expressive therapies continuum, you want to introduce a material and a technique that is a little more complicated. If you want them to move towards the kinesthetic and expressive, then you want to use something that has fewer steps and that's simpler and that uses more of the body. So again, you can see the difference the material itself can make in how you work with your client. The next thing we want to look at is sensory and physical reaction to the material. So when we're talking sensory, we're talking about our 5 senses. So hearing, tasting, smelling, touching, all of those things are our senses. So with a number 2 pencil, we feel the wood, we might have pressure or resistance from the page, we have the sound of the pencil on the page. We're not going to taste it, of course, and there's no smell to pencil. So really the qualities that you're getting with pencil are sound, touch, and then the visual, what you see. So you have those 3 senses involved. If you're smudging, like with the charcoal, you get a touch sense that's much more intimate and much more directly sensory oriented, because there's no mediator between you and the material. The pencil itself is the mediator. The material that you're using is the lead, which is inside the pencil. So the material is encased in the mediator, which is the wood of the pencil. Whereas with charcoal, there's no mediator. You're working with it directly from your hand to the paper. So there's no mediator. When you smudge it, there's no mediator. And so as you notice, the lack of mediator makes it more fluid and messier. Okay, the more mediator you have, the more control you have over the material. So with a mechanical pencil, the lead inside is the material and the mediator is the pencil itself. So again, you have much more control and it's a lot less messy. So why do we care about that sensory input? There are some clients who need more sensory input. So that means you would want to gravitate towards something that is not mediated, something that has more mess to it, is more fluid, more expressive. So clients who need more sensory input, like very young children need more sensory input, people who have been isolated or deprived need more sensory input. But then you have the opposite end of the spectrum, which are people that don't want that sensory input, that sensory input is very irritating. So there are some clients that even the sound of the pencil on the page can cause a sensory reaction. So you need to learn that about your client. What is it that they can tolerate? There are some people that can't stand getting their hands messy, so they would have a really tough time using charcoal and getting it all over their fingers. So with somebody that can't use this, that can't get messy, that it stresses them out and causes them to act out, I would start with a mechanical pencil because that's the most controlled, and then I would slowly move them towards a regular pencil, and then drawing pencils, and then eventually the charcoal. Because what I'm trying to do is increase flexibility. So if they're very sensory sensitive, I would start them with their comfort zone and then slowly move them towards areas that are more sensory input. If I have somebody who's very sensory input, like say a preschooler, I'm going to start with the messy materials and slowly move them the other direction so that I can move them more cognitively. So sensory and physical is that step. What is their physical interaction with the material? How do they use the material? And then your 5th thing that you always want to consider is client interest. Does the client want to work with this material? Sometimes I have clients who come in and they're like, I only do pencil drawings. That's all I do. And then you get, the standard cartoons and the little animation kind of things that they know how to draw. And that's fine. That's a good place to start. But you want to move them out of their comfort zone sometimes so that they can gain that flexibility. So I usually let them start where they're comfortable and then try to move them into other areas. And one way to do that is through the materials themselves, and another is through the techniques that you use, or even the content that you're using. But right now in this class, we're talking more about the materials. So if I have somebody who is like, I only do pencil, then I'll start them with the pencil that they're comfortable with, but I will try to move them towards the more fluid and expressive types of media and eventually adding color and more expression there. So client interest, always start with client interest and then move them into other areas. Now, clients might not know about some materials. You're going to probably come across materials in this course that you don't know about or haven't used before. So you can always introduce a material that's new to a client and then see if they're interested in it. And then the sixth thing we always want to think about is personal reaction. What is the personal relationship that the client has had to their pencils, to their media? So this is a number 2 pencil. And back in the day when I went through school, this is all we used. We used number 2 pencils. We weren't allowed to use pens. And when mechanical pencils came out, we weren't allowed to use those either in school. So I very much have a school association with pencils. Now, if I had a good schooling experience, then I'm going to have a positive feeling towards using this type of pencil. But for instance, I had a friend who was left-handed, and when he would use his pencils and use it with his left hand, he went to a school that was a Catholic school with nuns, and they would actually slap his hand with a ruler because they wanted him to work with his right hand and not his left hand, because they thought that that was a sign of the devil or sin. So he probably has a bad experience with a number 2 pencil, or a bad feeling associated with it. So one of the things you want to explore with clients is, what do you remember about this material? Have you ever used it before? What was that like for you to use? Did you enjoy it? And kind of look at what is their personal connection to that material. So for me, because I'm very familiar with the number 2 pencil and I'm very comfortable, I might start me with this pencil. For my friend who had that bad experience, I might start them with a mechanical pencil, or even just jump right to the charcoal, so that it's not pencil-like at all, so that I can reduce that negative feeling that they have towards that media. So this was just to kind of give you a beginning idea about how to explore a material. And we could go even further with this materials exploration, and you're going to do it later when you look at pens and pencils. We can add color. These are Conte crayons, which are a lot like charcoal, but not exactly like charcoal. They smudge a little bit and they come in a color. You also have colored pencils, but colored pencils don't smudge at all because they have wax in them. So you could go on in how you explore your material. So what you're going to do in this class is work through these steps for each material and explore what is the nature of this material. Now you can do it really messy like I've done here, or you can do it where you're actually creating a picture and trying out the different materials in different parts of the image. That is totally up to you and what you're comfortable with. Okay, so I'm hoping that you enjoyed this course, that you enjoy the exploration of the materials in this course, and that you have a good time with materials. So I will see you next time.
Hi, I'm Dr. Penny Orr, and this is Lesson 3 in Unit 1 of Techniques and Practices in Arts and Healing. So in this session, I'm going to be focusing on looking at the ETC, which is the Expressive Therapies Continuum, and how we use that in art therapy, and assessing material needs of the client, and looking at also the MDV, the Media Dimension Variable, and how we use that within making decisions about media choices. So first, I'm going to talk about Expressive Therapies Continuum and Media Dimensions Variables. When we're looking at using the ETC and the MDV, the first thing we have to do is figure out where does that fit within our thinking about a session. So usually when I plan to do a session, I first write my session plan that I went over last time, where I review past sessions, I look at the goals and objectives and the needs that the client has, and then I think about the material choices that I could use within the session,
that would help the client to meet those goals and needs or support the client the best. But I have to think a little bit beyond that when I'm planning a session. I need to think materials are very important in what we're going to focus on in this class, but I also need to think about the things that are outside of that, because all of that does affect the session and it affects how we use the materials. So we also have to think about the environment. Where is it that we are working? Are they in their home and we're in ours? Are they in the studio? Are you at a facility or a program? Do you have access to water? Can you make a mess? Do you have to keep it clean? What is the environment like in which you're going to be using these materials? So some things that we want to try to accomplish with any environment that we're in is that we want our environment to be warm, something that the client feels comfortable, creative environment, and a consistent environment. So if you can have them come to your studio, that's usually your best bet, because you can control that environment. You can label the drawers and help the person know their way around the environment, and it stays the same. You can also make it creative based on what you put on the walls. When you're putting things on the walls, you want it to be stimulating to help with creativity, but also not too stimulating, because you will have clients that get overstimulated pretty easily. So you want to think about that as well. And then when I'm working in my own studio, like I said, I like to have the cabinets labeled so that the clients can work at their highest functioning level, which means I want them to be able to go get the supplies that they want or need when they're working, so that they gain autonomy, that they feel self-efficacy, that they increase their self-esteem by understanding the situation they're in and knowing how to get things. Consistency is really important in any session. Consistency in how they access the materials. Can they just go get them, or are you going to put them out on the table? Consistency in the rituals and how the structure of the session goes with that. Like I said, I like to do a warm-up activity and then the main intervention and then a processing and closure. Consistency in how you meet them at the door or how you say goodbye. When you make the environment consistent, then the client can take more risk within the session and try new things within the session because they feel safe within the environment. So your environment can determine what materials you can use or not use, and it can also determine how comfortable the client is in exploring new things. And then after the session, when it's all done, I always write up a note about session, about how it went, what did the client interact with, what was their experience with that material or with the intervention I chose, and what is my plan for the next session. And I always want to write those notes right after session so that it's all fresh in my head. If I get a pile of notes and then I've got to do them all at once at the end of the week, I can't individualize them. I can't make them unique to each client that I'm seeing. So I won't be able to write a note that's very helpful for me for planning the next session. And like I said, where I always start is going to my past note to read that and read what I wrote last time about what I was thinking would be good for this time, and going from there. And then the other thing I always do after sessions is I always seek personal supervision with another art therapist, probably about once a month at this point, so that any cases or clients I'm working with that I'm not sure about, that I'm doing the right thing or I'm making good choices, I can talk with them, and also they can give you ideas for things that you weren't even considering or help you to move in a direction that you hadn't thought about. So it's good to have somebody that you can go to for supervision. Okay, the expressive therapies continuum. So we're going to talk about this, and we're going to get pretty deep into some neurobiology, because the expressive therapies continuum is based on our understanding of neurology. So Lucebrink came up with the expressive therapies continuum, or ETC, as we call it for short, in the late 70s. And so she really built it based on how she thought we interacted with materials and how she thought that we worked within art therapy. The thing that's interesting about what she did is that the more we learn through brain imaging and neurology, the more we understand that what she was saying was actually correct. And she came up with these ideas based on just having worked with clients and materials without ever knowing anything too complicated about the neurology side of things. So within the expressive therapies continuum, there are several different levels. And these levels don't mean that they're placed high to low, but it doesn't mean that one is better than the other. That's not a hierarchy, it's just a placement. So on the bottom level, you have kinesthetic sensory, and then you have perceptual and affective in the middle, and then cognitive and symbolic at the top. And then right down the middle of the diagram is what's called the creative line. And that creative line is the healthy line. That's what we're shooting for, is to get clients as close to that line as we can. Now I'm going to go through this chart in detail and talk to you about what each of these levels means and how we think about them. So one of the things that's really important to consider is that people look at what we do in arts and healing as just being, artsy, crafty, and kind of fun. But it's actually based in science. And one of the most well-known areas at this point in art therapy is how it affects the neural networks. So creativity, which is that center line in the ETC, when somebody is being creative, what they are doing is they're integrating the neural networks associated with physical, emotional, and intellectual information. They're processing for optimizing performance and success. So that through being creative and doing creative things, we can optimize their neurological functioning, which is going to make them more successful at home, at school, at work, and in life. Okay, so how do we know that and how do we get there? Okay, so the conceptual foundation for expressive therapies continuum lies in the concepts of resilience and integration. So the theory is that resilience stems from the ability to connect and integrate information related to your physical, emotional, and intellectual experiences. So if we're able to connect those things within our brains, within our thinking, then we are more likely to be a resilient person, which means if we have trauma, if we have problems, we bounce back better if we are integrated. So connecting and integrating these three types of information is crucial for developing resources needed for tackling new challenges and to demonstrate resilience. So with the expressive therapies continuum, what we're trying to do is move people towards that creative center. If they can move towards that creative center, then they're integrating their neural networks and they're building resilience and the ability to tackle new challenges. So integration. In order to have resilience, you have to have integration. Anytime that we have broken or disintegrated connections in our ability to process physical, emotional, or intellectual information, this results in functional difficulties. So integration can be damaged by trauma, a history of neglect, developmental issues. There's genetic predispositions. There are many things that can cause a lack of integration neurologically. And what we have found is that we can use materials and processes and techniques in art and healing to help reintegrate the brain. When I was going through school back in the 80s, we were taught that your brain develops quite quickly when you're a baby, and that once you get to become an adult, it stops changing, it's fully finished cooking, and then when you become an older adult, then it starts breaking down again. Well, what we have learned since then is that the brain never stops growing. Our brains are in constant flux of change. So we're constantly building new networks and we're constantly pruning old networks that we're not using. So if something becomes broken within the brain, like from a head trauma or something like that, our bodies work to try to find new pathways to be able to do those same things that we used to do. So if somebody has poor brain development because of neglect in childhood and they're not integrated, we can actually use art and healing to help them reintegrate so that they have a better shot at being functional and being successful in their lives. And we can do that integration through our choice of materials, through our choice of interventions and techniques, and trying to lead the person towards more creativity. So that's kind of the underlying principle. Now what I'm going to do is talk a little bit about neurology. And if this is your area of interest, I encourage you to go out and do some reading because it's fascinating stuff. It's way too complicated for me to cover in a section of one lesson. This could be a whole nother course. So the neural basis for the expressive therapy continuum is that what you're trying to do is work with the client using the whole brain. Okay, so the whole brain is a combination of the head brain and the body brain. So in our nervous system, we have the brain and the backbone and all the nerves that go out from there that connect with our muscles and our organs and our functioning. So we want to work with the whole brain. And the beautiful thing about the brain is that, or the whole brain, is that we can work top down or bottom up. And what I mean by that is we can work with ideas and thoughts and ways of thinking, or we can work with our hands and our bodies, and both affect the other. So we can heal through doing as well as through talking and thinking. When a client experiences trauma, and the more that we know about mental health, the more we recognize that most mental health problems are caused by a history of trauma and genetics coming together. And like I said, we can take a top-down approach or a bottom-up approach. So the top-down approach is we help clients to think differently about things. The bottom-up approach is we help clients to cope with their raw emotions and their defense reactions through doing things. So top-down might be something, if you've taken the theories class, cognitive behavioral theory is a top-down approach. Whereas yoga or mindfulness, those types of things are a bottom up. We're working more with sensory motor, and art therapy, of course, is sensory motor, and we're working from the hands to the head or the head to the hands, depending on which direction we're going. So if somebody wants to tell you that art and healing is not based in science, they're wrong. It's very much based in science when it comes to how we understand what we're doing in the arts and healing. So I'm just going to talk briefly about each of these people. Joaquin Fuster talked about the cortices. So we have different cortex in our brain. And what he was saying is that we have, in our sensory processing, there are 3 levels. So we have primary sensory cortex, the unimodal association cortex, and the multimodal association cortex. And all that means is that we go from very simple understanding to a more complex understanding in our sensory information neurologically. Bruce Perry came up with the neurosequential model of therapeutics. And this is a concept, not a technique or an intervention, but it's a concept. And the concept is that people with abuse and neglect histories have anomalies in brain development. So it actually changes how your brain develops. So our treatment goals when we're working with people that have a history of abuse or neglect is to integrate areas of the brain that were disrupted by the trauma, to try to integrate again. And he suggests that using the bottom-up approach, the lowest area of the brain, treat those first, and then we can get to the point where we get to the higher order. So what that means is he's saying we need to use our senses, we need to use our hands to help start with that integration. And then as we do that, we move up until we can talk about it and organize it and think about it. So you can see that's a perfect fit for the expressive therapies area. Stephen Porges talked about the polyvagal theory. The vagus nerve it's like the largest nerve in your body, and it goes from your brainstem all the way down your backbone, and it connects to all the organs in your trunk. And what happens is it's a two-way signal system. So, when you feel anxious, your stomach feels upset sometimes. That's because of the polyvagal nerve. So your brain is saying you're anxious and it's affecting your stomach. if you smile or you have happy expressions on your face, you can literally change how you feel because it's stimulating this vagus nerve with the facial muscles. And by smiling, your body is reading that as being happy or being in a good mood. So you can change your mood just by physically making yourself smile. So the polyvagal theory is about this in the directionality where you can go both directions. So it goes bottom up, top down. There's when people have physical and psychological safety, they're integrated, and overall their nervous system is functioning well. When they have poor vagal functioning or they're not integrated, then this is also related to poor limbic regulation. Now, your limbic system, I'll talk about that a little bit later, but your limbic system is part of your brain that helps you deal with trauma and stress. Alan Shore talked about neurobiology of attachment. So this goes back to attachment theory and how children attach with their parents. In order to have self-regulation, in order to regulate your own emotions, you need to have both biological and psychological wholeness, or feeling like they're grounded. And in order to get that grounded feeling, you need a secure attachment. So insecure attachment often is equal to children who have to adapt to their environment. So for instance, if I have a parent who is not being responsive to the child cries, the parent ignores them. What the child learns is that in order to take care of themselves, they should not attach to this person. And that's where insecure attachment comes from. So actually, an insecure attachment is an adaptive response. It's a way for us to protect ourselves from a non-consistent or cold parent. And so one of the things we have to do with an insecure attachment is it creates disintegration or not integration within the neural system. So what we have to do is we have to reintegrate. The cortical and subcortical areas and functions of the vertical integration are important for optimal functioning. So we need to gain insight and awareness, but we also have to have change that in what is in the unconscious as well as the conscious. So we'll have to work on several different levels with the attachment theory. And we're going to talk a little bit more later about how you use the attachment theory to go from the bottom up, just like Bruce Perry's, where you start with the art and the hands and the body, and you move to the emotions and the thinking, and reintegrate and go back and repair some of those early attachment issues. And then Dan Siegel talked about mindsight and interpersonal neurobiology. So what he talked about here was when we are interacting with others. So this is about interpersonal. So this is about our relationship within ourselves and our relationship with others. In a person that has a brain that is not well integrated, you often see chaos versus rigidity. So they might be very chaotic or they might be very rigid, and they tend to struggle between polarities. Everything that they see is in black and white, or one extreme to the other. And that's because of integration that's been damaged or was not built well to begin with. What our brains naturally try to do is to connect these areas. So cortical and subcortical areas or functions seek to connect and to repair, but we need to help in that process. So our brains naturally want to be healthy, but we have to help and support in that process. When we respond to the self and others in appropriate ways, then this is a byproduct of brain integration. So what Dan Siegel was saying is that if you are well connected with others, with other people, kind of like what Erickson said, if you're well connected with others, then that probably means that you have good integration in your brain. Okay. And then probably the most significant theorist that's had an impact on mental health and art therapy is Bessel van der Kolk. And what Bessel van der Kolk did is wrote a book about trauma specifically. And in this book, the book is called The Body Keeps the Score. It's a very good book if you have access to it. He talks about trauma disruption. So when somebody experiences trauma, it disrupts the nervous system and the limbic system and other areas. So it causes a disruption and a disconnection. So if you ever had trauma, you know that the way you remember it is through flashes of things that you saw or heard or smelled, movements, and it's not connected into a story. It's very disrupted. And because the brain becomes disrupted, it breaks down the integration, and then we get uncoordinated responses as a result. So byproduct of disintegrated brains is an uncoordinated to response to stimuli. So we might be have too much of an extreme reaction to something, you know, like we might hit the floor if we hear a car backfire, or we might not react at all. We might freeze. So body-based interventions, such as art therapy, help to connect sensory motor functioning and thoughts and feelings. So van der Kolk really talked about the neurobiology of trauma, but really made a good argument for why the expressive therapies help with trauma so much. Okay, back to the expressive therapies continuum. So the expressive therapies continuum is based on what we know now. It is based on what we know in neurobiology. When it was first developed, like I said, we didn't actually know a lot about neurobiology at that time. We just knew what worked. And so this was developed on what worked. And what we've been doing over time is filling in the pieces on why it works. When we are doing something creative, and that's our goal, is to help them get to that creative, which is a whole brain approach. So we're integrating the brain. When we're doing something creative, we're using physical, emotional, and intellectual information. So we're integrating all these things together to fortify openness and explore multiple ideas, to further the ability to tolerate uncertainty and ambiguity, to initiate the discovery of new approaches, and to strengthen and acceptance of closures and conclusions. Now, if you look at those 4 statements on the slide, what you'll notice is off to the side I have in parens what each stage is. And these are actually the stages of change. So whenever we are going to make a change in our life, we go through the stages of preparing ourselves for that change. We're thinking about or incubating our idea about that change. We gain illumination about that change, and we verify that change. We draw conclusions from that change. So those are the ways that we help clients, is that we're using creativity as a way to integrate neurobiologically and to help the client move forward in change. Okay, now what I want to do is go over each of the levels. Like I said before, each level in the expressive therapy continuum is just a different area. It's not one is not better than the other. What's better is getting to that center of each one. So kinesthetic. So on the continuum, on the bottom level, you have kinesthetic on one end and sensory on the other. So kinesthetic is about action and effort, communication and energy and arousal. So kinesthetic is what it sounds like. It's about the body moving. So by creating art, we're moving the body. And by moving the body, we're bolstering awareness of movement, coordination, we're gaining information about how we're moving and integrating, and we're portraying information to others through moving, and we're regulating energy and arousal through this movement process. So if you've ever watched a baby that's first learning, when they first learn to draw or color, it's really all about the movement. It's just secondary that they actually make a mark on the page. So art can be very kinesthetic, and I've got examples to kind of help show you what I'm talking about in just a minute. The other end of the continuum is sensory. Sensory is about somatic stimulation, internal and external, which makes us feel good. So that's what mindfulness is about, is that soothing behavior, that sensory input. So mindfulness and memories nurtures. When we make art that deals with memories that's in the sensory side, it's about creating focus and attention. It's also about alertness to information that is processed through somatic means. So when you're on the continuum, kinesthetic, if you're on the kinesthetic side, then you're doing a lot of very physical stuff, right? And if you're on the sensory side, then you're being very mindful, you're taking in the senses, you're very focused. And what we want is to get people in the center, where they're being mindful and focused, but also using their bodies physically. So we want that integration in the center. So on this slide, slide 15, I gave examples of imagery that shows what art looks like when it's one or the other or both. So on the left is kinesthetic, which is just a scribble. On the right is feeling, a textural, looks like a fabric piece. So it's very sensory oriented. And in the middle is this play of paint that's been poured and drawn on and things like that. So it's creative, it's sensory, but it's also movement. And so it brings you into the center. The next level is the perceptual affective. So perceptual means how you perceive the world, right? So it's about, when we're looking at perceptual, it's about containment, it's about structure, and externalizing interactions. So perceptual, when we do work that is perceptual, it helps us to maintain impulse control and hold space for inner material. So it's pretty technique oriented a lot of times, perceptual work is. It helps us to increase our awareness of our own boundaries and limits and what we can do, and it enhances our interaction with the external environment and structures. And I'll give you an example of what perceptual work looks like. Affective is really the emotional side. So perceptual is using techniques and perceiving the world. Affective is feeling the world. So with affective expression, what you're trying to do there is you're creating art that allows for safe expression and experience of maybe threatening emotions or feelings. It helps us to explore motivational drives and moods. It keeps us attentive to internal processes and regulations when we're doing things. It can drive us to complete tasks or goals. And it helps us with attunement with not only ourselves, but with other people as well. So let me show you how that looks. So in the middle of the ETC, we have the perceptual affective. So on the left, I did a 3-point perspective drawing. That's perceptual. They're trying to capture what reality really looks like. It's sort of an intellectual endeavor. It's using the senses, it's using the brain, it's using all those things together. The affective side is really about a feeling. It's about expressing that emotion. In the center with creativity, what you'll see is it's still an image that's based on reality and their perception of the world, but it's done in an expressive way. So that's showing emotion, but it's also showing what the perception is. So they're using both when they integrate and are creative. And on the top level, you have the cognitive symbolic. So the cognitive side is just what it sounds like. It's your logic and analysis, it's planning and execution, and abstract thinking. So it helps us to understand cause and effect. It helps us when we create art using this cognitive side. It helps us with planning and execution of multi-step tasks, problem solving, and it supports organization of abstract ideas. And the symbolic side, that's where we make meaning. So when we're creating art that's symbolic, we're putting personal significance or awareness into the art. It helps us with more intuition. It expands our intuition and intuitive processes when we're working symbolically. And it helps us with knowledge about ourselves better, or our self-awareness, where we can identify inner strengths and resources. We can do more autobiographical work through symbols. So there's a lot of ways that you can work with that. So on this level, cognitive symbolic, on the cognitive side, I put a drawing that's one of those reverse drawings, where you look at it one way and it's a rabbit, and you look at it the other way, it's a duck. So it's a brain teaser. And then on the symbolic side, I put a a traditional symbol that we see. And then in the center, you can see that you've got this tree, which is a symbol, but it's also done with thought and organization and very cognitive understanding of what a tree is. Okay, so like I said, what we're trying to do is move towards the center, towards the creative. So the integrated creative line runs down the center on all 3 levels. We want to move people towards the creative. So the reason we do is because generation of resilient responses to stressors and situational demands is something that the creative level can give us. It can fortify openness to the exploration of multiple ideas. It can further our ability to tolerate uncertainty and ambiguity. It can initiate discovery of new approaches and strengthen an acceptance of closure and conclusions. Okay, so here I've put it all together for you, so you can start to see what these things look like. Now, when you work with a client, they could be anywhere on this chart when you first start working with them. And it isn't that you want them to move up, because that's not necessarily better. What you want to do is to move them towards the center. So if I have somebody, like say I have a kid who's very impulsive and is very physical, and they come in and they're working at the kinesthetic level, and they're very kinesthetic, I want to try to move them towards the center. So I will probably first try to move them towards the center by introducing them to sensory stimuli that's very soothing, like calming music and materials that are calming, and try to move them over towards the sensory side. Because the way this works is if you're in the kinesthetic, then you're not paying attention to the sensory things. If you're in the sensory, then you're slowing down and focusing, so you're not as kinesthetic. So the way these continuums work is you can't be both at the same time. You move back and forth on each of these lines. So if you're in the perceptual, you're not going to be in the affective as much. If you're in the affective, you're going to have a harder time perceiving things. So each line has that movement. What we want to do is move each line to the center. So if I had somebody who started out as kinesthetic, I want to move them more towards the center so that they get some more sensory experience. Then I'm probably going to want to move them up. I want them to be able to have more expression of feeling. And maybe I want them to use more symbolism in their work to express what they're feeling. So I'm going to move them towards the center, and then I'm going to try to move them up. And that's based on my goals for that client. What is it that I think that client needs? So the thing that's nice about the ETC is it gives you where you can identify the starting point for a client. You can identify where your goals and objectives are. Like, do you want them to become more expressive? And that's effective. If you want them to work with changing negative thought patterns, that's going to be cognitive. So you're going to move them around this chart based on your goals and objectives. That's the thing that's really nice about this. And once you know how to use it to move a client from where they are to where you want them to be, then you can start figuring out what materials you need to use to get them there. So that's how this works. The other piece that you need in order to be able to make these decisions is something called the media dimension variables. The media dimension variables kind of encompass the 6 areas that I talked about last lesson that we would look at when we're thinking about a material. So they divided, it was Kagan who came around and put this together to go with the ETC. You're supposed to use them together. You want to think about task complexity. Remember how I talked about STEP? So they're saying low complexity or high complexity. So low complexity is 1 or 2 steps. High complexity is 3 or more. And then structure, unstructured versus structured. So unstructured means lots of different outcomes can happen. Structure means that only one possible outcome can happen. And then they have media properties. Is it fluid? Does the media itself have less organization? Is it resistive? Is it something that you push on and it pushes back? So what you do is MDV are stated in terms of the horizontal ETC level being addressed via a particular intervention. I'm going to show you what I'm talking about because this is very complicated. Okay, Example, adult coloring books. So if you give someone an adult coloring book, it has low complexity, right? It's all laid out for you. All you're going to do is color it. The task structure is very structured. You're going to color what's given. You've been given outlines. And the media properties are resistive if you give them like colored pencils. Okay? So what you want to do then, once you figure that out, is you want to look at the possible MDV combinations. And if you notice, the bottom level is the, well, actually they have them reversed here. They have the top level with the kinesthetic sensory, the second level with perceptive affective, and the top level with cognitive symbolic. So for this, we know it's an LCSR. Low complexity, structured, resistive. It's a low LCSR. So what we have to decide is what level is it on? Is it kinesthetic? Probably not, because if you're staying within the lines, you're not going to have a lot of movement. Is it sensory? No, probably not. If you're using color pencils, it's not going to be very sensory, other than the visual. Is it cognitive? Maybe a little bit cognitive, because you have to think about what you're doing, but not very hard. Is it symbolic? This one might be a little symbolic if they chose the image, because it's a mandala. But if you chose it for them, it's not symbolic. So it means we're probably on the perceptual and affective level. So perceptual means, what are you perceiving? How are you seeing it? You're noticing the lines, you're noticing the colors, you're staying within the lines, you're working with that. Affective, your color choices could give you some emotion. So you're probably closer to the perception area on that level. So LCSR on the PA level, leaning towards the perceptual. And that gives you a starting point for how to work with this client moving forward. Okay, so an example. So when you combine the two, if you have something that it has a high task complexity, so it has more than 2 steps to it, has a lot of structure, and you're using a resistive media, something that's pretty hard, like pencil, then you're probably going to be on the cognitive level or perceptual level or kinesthetic, but probably you're going to be more on the cognitive level on this one because of their more thought-based responses. So when you're working with something that's very complex, that's highly structured, that has resistive media, you're going to be more on the thought level, right? So you're going to be up more in the cognitive. If you're doing a task that has low complexity, it's pretty easy, it's very unstructured and has a fluid media, then you're going to be much more feelings based. And so it would fall more into the affective area. When your client is talking about their art, there are certain things that they will say. And these are kind of key words to help you figure out which level they're on. So if they talk about what they sense, or if they use the word feel, but they mean in terms of texture and how their hands feel. If they say I sense, then that means they're on the kinesthetic sensory level. If they say I feel, they're on the perceptual affective level. And if they say I think, then they're on the cognitive and symbolic level. Okay, so we're gonna do some art analysis. I'm gonna switch over to my other camera, and we're gonna look at what you are going to be doing in your visual journals. So today in this demo part, what I want to talk about is how to further think about materials when you're playing with them. So last time I introduced you to the idea of these 6 steps that you want to look at. How structured is the material? What kind of use and access do they have? How many steps does it take? Is it a complex or a simple process? Is it sensory or kinesthetic? What is the client's interest and what's their personal association? So one of the things you may have noticed when I was going over the expressive therapies continuum today, that a lot of these concepts fit into that continuum. So what I want to do now is look at a specific material in terms of the expressive therapies continuum. So this is the expressive therapies continuum that I'm talking about. We have kinesthetic, which means movement. We have sensory, which means any of your senses, touch, taste, smell, hear. We have affective, which is your emotional expression. We have perceptual, which is how you organize or perceive the materials or the image. We have symbolic, so what kind of symbols or metaphors are you using, and then cognitive, and that applies to learning techniques or steps or processes. And then down the center, we have the big C, which is creativity. And that's what we're really working towards. So if we have a client who starts way over here in kinesthetic, we're probably going to try to move them in that direction. If we've got somebody way up here in the symbolic, you know, we might want to move them a little more towards the center or more towards the sensory, things like that. But how does this apply to material analysis? So I'm going to do a simple material analysis for you, and I'm going to use a very common product that we use with clients, and these are just Crayola markers. So Crayola markers come in different types. Again, like with the pencils, you have to think, what am I talking about? So you have fine tip markers that can do detail work and that are much more controllable. And then you have a broader tip marker that isn't as easy to control, but fills spaces nicely. And the other thing about these markers is that they're water-based. So if I brought in water and a paintbrush, I could now come in and make this a very fluid drawing by smearing the marker. Okay, so how does that apply to expressive therapies continuum? So let's just take one. I'm going to take the 5-point marker. So it's color, right? So in color, that means it's a little bit sensory because there's color to it. So anytime you have something you can see that is stimulating visually, that's going to be sensory. Crayola markers don't really have a smell to them, so they don't have a smell. But if I was using like Sharpie markers or scented markers, those very much have a smell. So they're a little bit sensory. Markers can be kinesthetic. You can work small details, and with a 5-point marker, you're going to work smaller. So you're going to be using fine motor skills. With a broader tip marker, you can get much more broad movement. And by having more broad movement, you have a little more kinesthetic. But it's not really strongly either. It has some sensory, some kinesthetics, but it's not as kinesthetic as, say, working with clay would be, where you're using physical muscles to do it. And it's not as sensory as, say, working with, I don't know, something, well, again, clay. Clay would be much more sensory. There's a smell and a wetness and a touch and all those kinds of things. So I would place markers right about the middle on this first line. Because markers can come in colors, they can be very emotionally expressive. So you can be emotionally expressive in the type of line that you do, which is the perceptual side, or you could be emotionally expressive in the color choices that you do. So if I did more red, that might have more color meaning to me emotionally than the purple. Perceptual are any of those qualities that we learn about in formal art. So line, shape, color, unity, all of those kinds of things are more perceptual. And one of the things to know about the expressive therapies continuum is when you're more on one side, then you're less on the other. So for instance, perceptual, if I'm thinking about pattern and repetition and line and shape, I'm not thinking emotionally. So if I'm very perceptual, I'm not thinking emotionally. If I'm making a piece of art that's very emotional, if I'm doing, really strong coloring and it's emotionally expressive, I'm not thinking about pattern and repetition and what kinds of lines I'm using and things like that. So I'm very much over here. So when you're going across, you you're one or the other, or if you're both, that means you're just a little bit of both, because they kind of cancel each other out a little bit. And that's why on the kinesthetic and sensory, it's a little bit of both, but it's not really strongly either. And that's why it's in the center. With perceptual and affective, markers can be either one. You can go very perceptual and thinking about your lines, your shapes, and your colors, or you can get very emotional and in how you are expressing or using them. So it can be either direction, and it really depends on the technique you're using. On the cognitive symbolic level, markers, again, you can learn methods or processes with markers, such as, if you're coloring it in, like a coloring book, that's going to be a little more cognitive because you're thinking about staying inside the lines. You're thinking about making sure that if you have red here, that you also have a here. So you're thinking about that perceptual design. And so that makes it a little more cognitive. It can be symbolic in how you are using it. So I did a flower here in a mandala. So that can be symbolic to me. Or it could just be a flower in a circle. So that's up to the client on how symbolic they are. And that's the content of the piece, is the symbol. But materials themselves can also be symbolic. So using markers could be symbolic of my childhood. It could be symbolic of wanting more control, but also wanting to have emotional expression. So the choice of material can also be symbolic, or the content can be symbolic. So when I'm analyzing my markers, I'm thinking about all these things. And so I would say markers are right in the middle between kinesthetic and sensory. I think markers can be anywhere on this continuum, right here. And then I think markers tend to be one or the other for cognitive or symbolic. It's usually not, you're not usually both. Like I said before, if you're more one, you're less the other. It's not both. So you're either one end or the other. With the middle one, I think you can move back and forth depending on how you're working. So you want to think about the expressive therapies continuum in terms of the materials that you are using and how they work, how you're using them, and what they're like to work with. One of the things to keep in mind is, you can see like my hands are already pretty messy. I tend to be a messy artist in general. So I still have pencil for my pencil demo, but I've already got marker on me from my marker demo. So one of the things when you're looking at the sensory aspect of a material is you also want to think about its messiness, because materials that tend to be more messy or more fluid can lend themselves to more expression, but they can also cause more anxiety for people that don't like messes. Because I'm a messy artist, I tend to like messes, and so it doesn't bother me. But some people are not messy artists and they want a lot of structure and control. So you want to think about that as well when you are choosing a different media or material to use with your clients. So when you go to analyze your art materials, for me, it's easier, and you can do this any way you want, but for me, it's easier to kind of go through this 6-point checklist and explore my materials, and then think about how does that fit on the expressive therapies continuum. Okay, so hopefully you found that helpful in understanding a little bit more about how to analyze your art materials throughout this course. So from this point on, you'll be using these explorations with all the different materials that I'm going to be introducing. And my concern is more that you get a really deep understanding of each type of material, so that you're better able to choose materials that are going to help your client and not hinder that therapeutic process. The other way to think about the expressive therapies continuum is with how to analyze images. Okay, so now what I want to do is look at the expressive therapies continuum from sort of the opposite direction. How do you analyze a piece of art using the expressive therapies continuum? So as you saw when I was looking at materials, one of the things you quickly recognize is that materials fall on all parts of the expressive therapies continuum, but some materials lend themselves better to some of the areas on the expressive therapies continuum. So for instance, I said more fluid materials like paints are going to be more emotionally expressive or fall in the affective area. Things that are very need a physical thing like clay are going to fall more in the kinesthetic. But that doesn't mean that a clay piece can't also be symbolic or cognitive even. Making a clay piece can be all of these things. So when you're looking at materials, what you're going to quickly realize is that they can fall anywhere on the expressive therapies continuum. It's how you use those materials or the techniques that determines where they actually fall on the expressive therapies continuum. So what type of art you actually make is where helps to determine where it falls. But like I said, some materials do lend themselves to more one area on this continuum than another. Okay, so let's talk about some art and how from the opposite direction to kind of help you to begin to see what I'm talking about with the expressive therapies continuum. So I have two pieces here. Both are abstract, so they're both kind of the same style, but there's some differences. So if you look at these two pieces, what you can see is that this one has much more color. This one has more aggressive line movement, you know, like you think physically it took more to do it than this. And that they both have structure, but one, I think this one feels like it has a little more structure than this one does. So when I'm looking at the expressive therapies continuum, I want to think, okay, how kinesthetic is it? This one, because of the large lines and the quick lines that are on here, it's going to fall more on the kinesthetic side than on the sensory. Okay, there's not anything real, there's no visual texture, or actually there is visual texture, but there's no physical texture on these pieces. They're flat drawings. This one actually has the white marker or the white pen here actually is raised a little bit off, and you can't see that in the picture, but if you were looking at the piece, there's a little bit more of that raised quality. So for this one, you might actually fall more on the sensory side because there is that sensory with the texture. This one has more sensory with color, but it's more kinesthetic as well. So for this one, I would probably put it somewhere as far as the sensory and kinesthetic, I'd probably put it a little bit more over here. For, and I'll mark this one in red so that we're consistent. And this one I'm going to mark in black. So this one I think is more sensory and less kinesthetic. So I'm going to put this one over here because it's just more controlled and more looking at how things are juxtaposed against each other. And if you go up, you're looking at perceptual and affective. When you look at these two pieces, they both have the same kind of line and feel, but this one is more expressive, and that's because of the color. Anytime you use color, you're gonna, and when I say expressive, I'm talking emotionally. So this one has a little bit more emotional expression to it. So for this one, I was thinking about these are both pieces that I made. I was thinking about lines and shapes and colors, but not really that much. I was more getting out the movement and playing with the color. So for this one, I would say it's more affective or more emotional. This one, I worked more slowly. I was more careful with my lines. You can see that with the repetition of the little black lines and then the dots that go over them. I was more careful about how I placed things in the image and the balance. So I was definitely more perceptual in this piece than I was in that. The other thing that makes this more perceptual is that it's in very neutral tones. So there's black and white, but also some greens and browns. So very neutral colors, which are not as emotionally expressive. Now, symbolically, what you want to look at for symbolism is, are they using actual imagery? So in this one, there's no actual imagery. It's all abstract. So this one is not symbolic. This one is much more cognitive because I was thinking about the placement of the dots and the balance of the line and the color. So it was much more cognitive, perceptual. This one, I wasn't really thinking about anything except the coloring and enjoying. I did notice as I was working that this shape kind of emerged that I think is kind of like a vase. So that very much could have a symbolic meaning. I also put in here some foliage. And for me, trees are very symbolic. I've always put in natural elements in things that I want to feel comforted by or things that make me feel safe or that I enjoy. So this one has actual imagery in it. Some of the image was intentional, like with the foliage, and some sort of emerged on its own, like this sort of flower thing here and the kind of vase thing here. So symbolism can either be conscious symbolism or unconscious symbolism coming from the unconscious. So this one is much more symbolic. I was not thinking about technique. I was not thinking about how it was laid out or anything like that. I was very intuitive in how I worked and how it flowed. So if you look at the expressive therapies continuum, oops, I did the wrong color. That should be red. So what you'll notice is this piece is kinesthetic and very much at this side of the emotional and symbolic. This piece, the darker piece, is sensory and then very cognitive. So if I was working with this client, they're here, but they're also over here. So one of the things I would want to do is try to move them, because remember the C in the center is the creativity area. So I would want to try to move them this direction because they're over here a little bit, but they're way over here. And for this person, I would want to move them that direction. And what I mean by that is that if I was working with this person, I would want to provide them with more structured art materials and structured activities, things with more steps to them to slow them down, help them be more thoughtful about what they're doing, and to bring in more cognitive and perceptual functioning. Not to say that this is bad. This is wonderful, and we want our clients to be expressive. But if your goal is to help them to have more control over that expression, then you definitely want to move them this direction on the expressive therapies continuum. And the way you do that is by the choice of materials and the techniques that you employ. If I had a person that only did this kind of work, then I would want to get them more expressive. So I'd want to introduce more color. I would want to introduce more fluid material that's going to be a little bit harder for them to control and will force them to be more expressive. So I'd want to move them in that direction. So it's not that either of these is bad. It's just these tell you where the client are in that moment and where they might want to go next. Now, the fact that I did both of these pieces and what that tells you, if I was working with myself, if I was the client, what that tells me is that I'm very flexible, that I can go back and forth working both cognitively, intuitively, emotionally, symbolically. So this client really falls on that center line, is in the creative realm, because they go back and forth. So when you analyze a piece of art, it's good to analyze it, but you also want to think about it in context of what else you know about the client. So if I have a client that is also doing this, then it's not quite as critical that I move them in a certain direction or another. I might let them go more where they feel like they need to go. But if I have a client who only works like this, then I'm definitely going to want to move them over. If I have a client who only works like this, then I might want to move them over to help them get more structure and organization. So you have to think about the context of the art piece itself. So what you're going to be doing in your group work at the end of this unit is you are going to be looking at pieces of art, analyzing them using the expressive therapies continuum like I just did, and talking about if this was what your client was making, where would you want to move them and how would you do that? What kind of materials might you choose, or what might you try to do to help move them into being a little more flexible or being more cognitive, or whatever it is you feel like they need based on what they are currently making. Okay, so hopefully this was helpful for you to understand from the other side by looking at the finished pieces and helping to figure out where to go and how the materials themselves relate to the image and how it's made. And how you can use them to move people on the expressive therapies continuum. Thank you. And I look forward to seeing what you come up with in your groups. In your study session that's coming up, you will be choosing your own piece of art and doing this same analysis with your own piece of art. And you'll be doing it in groups. So you'll choose a piece of art by an artist and you'll look at it, analyze it on the expressive therapies continuum, analyze it using the 6 steps of the MDV for the parts that you can fill out. And then think about if I knew this artist and based on where they started on the expressive therapies continuum, where would I want them to move? And start brainstorming what materials might help them to move there. So that's going to be your first study session that you're doing with other members of this class. I hope that's a fun experience, and I look forward to seeing what you guys put together. Hi, I'm Dr. Penny Orr, and we're starting our second unit today. In this unit, we're going to be exploring different art materials in particular. And the first art material that we're going to be looking at are black and white drawing materials. So in today's lesson, we're going to start by looking at art material choices versus technique choices, because each art material can be used in many different ways. So how we choose to use material is equally as important as what material we choose to use. So we're going to look at that. Then we will explore our black and white drawing materials and examine them through the lens of the expressive therapies continuum and the MDV. And finally, I'm going to show you a Zentangle project that I like to do with clients. So first I want you to look at slide 3 in the PowerPoint. On this slide, there are 2 pictures. They're both Zentangles. One is in black and white and one is in color. The reason that I have broken down drawing materials into 2 different lessons, one just on black and white and one on color, is because when you add color, you add a whole new dimension to the piece that you're making. So if you look at this slide of the 2 Zentangles, I tried to choose 2 that had very similar line work and amount of busyness, but one was done with color and one was done in black and white. And you can see the difference, I think, the impact that the color has on an image. In art therapy, we tend to think that color helps us to be more emotionally expressive, and black and white helps us to be more cognitive or more symbolic and thought processed. That's not always true because it really depends on the client as well. But in general, clients who like to work in black and white a lot of times are more cognitive in their thinking about what they're doing, more symbolic. And then the clients that really enjoy a lot of color tend to be more emotionally expressive. So the first decision you have to make is color versus not color. And sometimes I will choose to start clients with just black and white if I am unsure about their emotional stability. If they seem fairly emotionally fragile, I'll start them with just black and white because the black and white helps to provide them structure that they might need. If you start with something too messy and colorful, then that's just going to open them up even further. And you might not be able to get any work done as a result. Okay, so there are a lot of different drawing materials. And part of this class, what I'm hoping you will gain in this class, is an expansion of your understanding of what is potentially an art material. There are many different kinds. So we have charcoal, graphite, drafting leads, and Conte crayons. Those are just a few. of the different types of drawing materials out there. Now, all of those are carbon-based materials. So carbon-based materials have certain qualities to them. And one of the qualities is that they are more resistive, so you can control them better. More resistive for the harder ones. As they get softer, they become a little more fluid and with a little more expressive quality. They're pretty simple to work with. So you don't have to have a lot of steps to figure out how to work with carbon-based drawing materials. They're fairly unstructured. You don't have very many steps that you need to take to be able to use them. And they're slightly mediated. So for instance, let me show you my graphite materials. Okay, so they're slightly mediated. And what I mean by that is that the art materials come in different hardnesses. So you have here from your pencil, which I've got in HB, you can't see that, pencil. And then it slowly gets harder. So that's the HB. I mean, it slowly gets softer in my, and then this one is a 2B. This one is a 4B. And this one is a 6B. And so you can see that the mark gets darker and as the lead gets softer. And then you move to the charcoals, and with the charcoals, I have two different ones here. I have a medium and a soft. So for the medium, when you're working with a medium charcoal, you can make more defined lines, more like a pencil. And then with the softer one, you can see it's a little darker. Again, you can make sharp lines, but it's a little softer. The difference between the two is more in the smudginess. So with the softer charcoal, you can smudge it better. And that's why I consider it to be a little more fluid than a harder charcoal. So this is a blending crayon. It's just paper, but it helps you to blend and spread the any shading that you're doing. So if you use this with the media with the charcoal, then you can spread it better and get it more even, which is nice. I also have here Conte crayons, which aren't black and white. You can get black and white ones, but usually they're in natural tones. And so this is more of a red. It has a feel of charcoal. It smudges like charcoal, but it's a little harder feeling than charcoal. So that's another one that you can use. And then with the pencils, you also have the ability to use erasers, which is one of my favorite things to do with clients. So I actually like to have an eraser pen. I mean, it's just a huge eraser in a pen form. And that way they can use it to draw with, and it's kind of like a pencil. But you can also use erasers that are in block form for the same kinds of things. Erasers, there are different types of erasers. So this is why it gets so complicated in art therapy to think about what materials to use. So there are different types of erasers. With these erasers, this is a white eraser, and I like these for drawing. I like white erasers for drawing in pencil. Of course, erasers don't work very well with charcoal. You can use them, but they don't work as well. And then you have pink erasers and you have the kneaded erasers. All of them have different strengths and weaknesses as far as the choices you have for using them. Another thing to consider with the graphite is how do you sharpen it? So this is a pencil sharpener, and that gives you, a pretty standard point, but you can also use sandpaper. And what sandpaper will do is you just rub it on the sandpaper and turn the pencil. It'll give you an even finer point, almost like a really, really fine point, so that you can get really fine materials. So it's a way of controlling what the point is like with the material. Okay, so let's go back to me talking about the PowerPoint. Okay, so graphite pencils those are the qualities that fall on the MDB, what I was just talking about. How resistive is it? How simple is it? Is it unstructured? Is it slightly mediated or is it mediated? And then you also want to look at the expressive therapies continuum. So with graphite materials, the pencil or graphite-based materials tend to be, like I said, when you're working in black and white, tend to be a little more cognitive. So it's nice when you're using these materials, because if you're trying to move somebody more towards the cognitive and symbolic realm. That doesn't mean that a pencil can't be used in the other areas of the expressive therapies continuum. And this is where that debate between medium and technique come in. If I use a pencil and I use it in a certain way, I can make it very simple, very structured, very defined line, and I can lead the client more towards the cognitive symbolic realm. But I can also do shading. I can do gestural drawings. I can do large movement drawings. And I can have them think about the, how it's laying on the paper and how it feels when they smudge it and those kinds of things. So I can get into the perceptive by doing shading ideas or practices. I can get into the effective, both the gestural drawings and being very emotionally expressive with that gesture. I can be very kinetic with the large drawings and using the body. And then sensory, that's probably the weakest point for drawing materials, is the sensory element. But it does have sensory qualities, particularly the softer ones like the charcoals have a sensory quality. And if you smudge them, they can have that. So when you're looking at a material on the expressive therapies continuum, you want to think about not only the quality of the material, but how you use that material. What is the technique that you are using with that material? Because each technique changes how the material works a little bit. So there are some benefits to using graphite and lead. They're familiar. They a lot of times are erasable, so you can make mistakes and clean them up. They're less messy than charcoal or raw graphite. There's a variety of hardnesses and widths, which I talked about. You have mechanical pencils versus manual pencils, so you can shade. But there are also challenges. And with every media, you're going to have benefits and challenges. And when you're trying to decide which media to use with a client, these are the things you want to think about: is how is it going to benefit my client? And then how is it going to challenge, or is it going to be a problem for my client? Some of the challenges are that graphite you can get very detailed. And sometimes clients get stuck in those details. Particularly adolescents, I find that they want things to be perfect. And so they really focus on the details and do a lot of erasing, and they can get kind of stuck in this perseverative cycle. So sometimes I go away from using pencil intentionally with that group. Pencil is also limited in its ability to cover large areas quickly. Charcoal you can, but with graphite pencils, it's harder to cover large areas. So if you're using pencil, you want to keep your paper sizes smaller and keep the projects you're working on smaller. It can increase frustration, like I said, with erasing and making mistakes. Just because you know you can erase doesn't mean you should, but it can cause that. If you have a pencil that's not higher quality, it can be a little waxy or not have a good, doesn't lay down well, maybe doesn't get nice and dark. So you want to get some decent quality pencils. Now that doesn't mean that you can't use a regular old number 2 drawing, writing pencil, and you can. But if you are strictly working with pencils, it's nice to be able to give the client some variety. With graphite and lead pencils, most of the time you work on a 2D surface. You can't work on slick surfaces, it won't stick. So usually you work on paper or a surface with a little bit of a roughness to it, or what we call tooth to it. Storage for pencils, they can last forever, long-term or short-term. Any kind of safety precautions, the only thing that I would consider is that it could be a trigger, like using charcoal or pencil where we're smudging it and we're getting it on our hands. It could be if you have somebody that's tactile resistant and doesn't like mess, that could upset them. Pencils and graphite are not toxic and they're not lethal. Although I have worked in a facility where I saw a kid take his pencil and slam it into somebody's leg. So it can be used as a weapon. So you have to be aware of that and be careful with that. In facilities like that, they often use these soft pencils they have the lead in them, but they're soft, they're bendable, and that prevents that kind of thing from happening. Alteration, it can be protected. You can do a pencil drawing and then spray it with a sealant to protect it. But once you do that, you can't edit it. And then the population, most populations do fine with pencil because of our familiarity with it. But like I cautioned, there are some populations that get too caught up in the details and the ability to erase, and it can get them stuck and not be able to move forward or accept change, that kind of thing. Okay, graphite sticks. So graphite sticks are things like charcoal and the Conte crayons that I talked about. They're a little softer, they're more fluid. Again, on the MDV, they're restrictive, but more fluid to them, like I showed you. They're simple, unstructured, and unmediated. So these are unmediated at all. So when you pick up a graphite stick, you're holding the thing that you're drawing with. There's nothing between your hands and the media itself. And that's what we mean by mediated. On the expressive therapies continuum, again, it depends on how you use it. So it can be cognitive, but it's hard to control the charcoal or graphite sticks. So it has a little bit of the control of regular graphite, but also a little bit of the looseness of a pure charcoal stick. So you can do technical skills. It's a little bit harder. Again, you can do symbolic imagery. It's easy. They're easier for shading. So they're good for shading, which is that perceptual level. You can use them nicely with gestural drawings on the affective level. They're good for large movements. So again, that could bring you to the kinetic level depending on how you're using them. And then they have a little more feel to them than graphite. So they're a little more tactile. So graphite sticks come in different hardnesses and softness, like I showed you a little bit earlier. There's, from soft to medium to hard, and they come in the black ones like I showed you, or in the Conte crayon types. The benefits of this type of media is that it's less messy than pure charcoal. Pure charcoal is very messy, so you can control it a little bit better, but it also comes in a variety of hardness. You can cover more area because of the softness and the fact that it's not wrapped in anything, so you can use the side of the stick to cover bigger areas. And it feels more artistic. People feel more like they're an artist than using a number 2 pencil. Some challenges, it can be frustrating because it's hard to do detail. It's hard to erase. You can't really erase it. It can be fragile depending on the hardness or softness. So the real soft ones can break pretty easily if you apply too much pressure. And then it's a little messy. So again, you want to think about, is your client open to getting their fingers messy in the process when you're thinking about using graphite sticks? The media considerations for graphite sticks are very similar to pencils. You're going to probably use them on paper or 2-dimensional. You can't use them on slick surfaces, but they do work on surfaces that have been coated with gesso. So paint gesso, the undercoat for painting, you can put that down on paper or surfaces, or even like a rock, and you can cover it with charcoal. Again, it lasts forever, just like with graphite. Safety precautions, the trigger dirty hands issue. Also with the softer ones, as it gets softer, it puts more dust into the air. So you want to think about that if you have a client who has breathing problems or asthma, something like that, you want to consider the particulates that you're putting into the air. Accessibility, cultural awareness. Some people have not been exposed to these types of media, and some people have, depending on the culture. Some cultures use it more than others. You don't necessarily have to have top grade types of graphite sticks, but because most of the ones, because they're only intended for artists, usually are pretty good quality. So it's hard to buy a bad quality one. And then the only populations that I would say you want to be careful with are ones who don't like things that are messy, or if you have somebody with breathing problems. Okay, now we're going to get to straight charcoal. Straight charcoal, and I didn't show you a really, really soft straight charcoal. So charcoal comes from being compressed like the graphite stick, and it's a little harder and more easy to control, all the way to a powder form. And you can use powder charcoal, which is literally a powder, and you use a brush to put it on, or you can dump some on the paper and then smooth it around with your hands. Charcoal can be more fluid, like I was just describing. It can be simple, but you can also make it complex if you attempt to use it for any kind of realism. It can be difficult to manage. So it takes practice and skill to be able to do any kind of realism using pure charcoal. It's unstructured and unmediated. On the expressive therapies continuum, there's a little more need for cognitive skills if you're trying to control it. If you're trying to use it as a just purely expressive medium and you're just doing large movements and you're, like I've seen beautiful things done where people put the charcoal down and then just did these large movements to music and stuff, and it's been absolutely gorgeous. So no skill would be needed for that. But if you want to use charcoal in a more structured way, you're going to need to have some knowledge. So it's going to tie into that cognitive. It can, of course, be used symbolically. You can use it with shading, which is that perceptual. You have the different values from very light gray to very dark black. You can use it for gestural drawings, good for large movements. And then charcoal itself has a tactile nature. So it has a feel to it. It has, like I said, it can put particulates into the air. So it's something that is more sensory than the other graphite media that we have talked about. So the benefits of charcoal is that it can be very, very expressive, but still in that black and white realm. So you can make it very expressive, but also provide a little bit of containment for emotions because you're not working in color. So it can be used for detail or more action-oriented imagery. So it's got a lot of variety. I think that's one of the benefits of charcoal is that you have a wide range of things that you can do with it. What are the challenges of charcoal? The first one is that it's messy, and it can get very messy. Sometimes when I'm working with charcoal, I walk away and I've got it all over my face, and it can be very messy. It can increase frustration for the client due to that messiness, and it can trigger clients if they don't like messy things. It can be difficult to preserve the integrity of the completed work. So you can spray it with a fixative, but it doesn't really last well long-term unless you put it behind glass and frame it because it's softer and it'll move and break down over time. Works best on charcoal paper, which is kind of expensive. So when you're looking at papers, try out different papers to see what you think works best with that material. And then, of course, safety considerations, like I said, it puts particulates into the air. So people who have asthma problems or breathing problems, you probably don't want to work with straight charcoal with them. Okay, the media considerations for charcoal are very similar to what we've said for the earlier ones that we talked about. You work on 2D paper. There is a charcoal paper made specifically for charcoal. Any kind of textured surface works nicely. It's more of a short-term media because it's hard to make it permanent. But storage-wise, it lasts forever. Safety precautions, like I said, the messiness and the aerosol quality can be issues, but there's also another one. With charcoal, you can go very dark, very deep, very fast. So clients who are struggling with depression, and trauma in their past, charcoal can take them to those darker areas in their lives pretty quickly because of its textural quality and because the blacks are so deep and you can cover a large portion of the paper with those blacks. So charcoal can really take you to that negative side of the affect pretty quickly. So you want to be careful of that. Cultural awareness. People know about charcoal, but not a lot of people have had experience working with them unless they are artists themselves. Quality and resources, it might not be necessary to look for lots of different shades because you can shade within each type of charcoal, but you might want to have a range of softness to hardness available to clients so they could play with them. Let's see. Alternatives. And so when I talk about alternatives, these are other ways of getting that material other than buying them. So an alternative is you can actually use burnt twigs. If you burn a branch, you can draw with it because it creates charcoal, which is really nice. And then there's also the powder form of charcoal, which is very pure. And then the population. There's a wide range of people that can work with it with charcoal. It really just depends on what goals you have for them and how comfortable they are with making a mess. If they don't like messes, I'd move away from that. Okay. Conte crayons. Conte crayons are very similar to the graphite. And when I talked about the graphite, I also mentioned Conte crayons because they're very, very similar in how they work. They are more restrictive, they're very simple, very unstructured, and they're unmediated. There's no wrapper or anything on them, so you're working with it. The difference is that with Conte crayons, they have like a coating on them. So, well, I guess that didn't work. So usually you don't get as messy with them as you do with the charcoal ones, but you do still get pretty messy. Again, with the ETC, it's almost identical. Some technical skill needed. There is more control. You can do symbols. You can get more technical with your shading with Conte crayons. Conte crayons also come in a variety of colors. They come in different shades of browns, whites, grays, and blacks. So, but they're always neutral tones. You can use them for gestural drawings, large movements, and they're sensory-wise, they have a similar thing to the graphite, so they're not hugely sensory, but they're a little bit sensory. Okay, the benefits of Conte crayons, they're very versatile. They're right between that charcoal and the graphite. They're kind of in that space right in between. They can be used to do detail work as well as using them for shading and more expressive work because they come in different hardnesses as well. Challenges, you can't erase them. There's a very limited color palette. It's only in natural colors. If somebody has a texture aversion, doesn't want to get their hands messy, that's a problem, and can increase frustration due to the fine tips and edges versus the flat areas. Okay, and then the media considerations, again, 2D surfaces, papers, a paper with more tooth to it, you're going to get more of a texture. A flatter paper, you're going to get more of a fine line. You can draw on some sturdy flat surfaces. With Conte crayon, they stick a little better than graphite and charcoal. They store fairly well long-term and short-term. Again, you're probably going to want to use a fixative over top of it if you're going to be storing the artwork. Their trigger is mainly in the messiness. There's not really much dust with Conte crayons, and they're not toxic. Most people have not used or even heard of Conte crayons that are not in the artist world. And then you could use some other similar materials. Like there's something called NuPastels that are very similar to Conte crayons, but come in colors. And they feel very much like Conte crayons. Okay, and now I want to talk about non-traditional carbon-based materials. So like I said before, there's different ways. I mean, carbon is a natural substance in nature. And so we don't always have to go out and buy art supplies. And in fact, I enjoy working with clients with found or made art supplies because it connects them to the earth more, and it connects them to, I think, themselves more. It grounds them, using things that come from nature to create the art. So examples of things that you can do, you can char sticks, like I said, little twigs or sticks to make charcoal. You can char pine cones. So you can use pine cones that have been charred. You can use matches that have been used in the past. You can actually use coal, straight coal. You can burn paper or cardboard and create that charcoal edge and that you can then smudge. So there's a lot of ways of making your own charcoal and creating imagery using that natural graphite. The immediate considerations for using those types of things is that, again, no slick surfaces. You want a paper with kind of a tooth. The final product doesn't last as long as normal charcoal. Even if you spray it, it's just more fragile because it's more natural. Toxicity, if you're burning things, you're gonna have smoke and things like that that are toxic. So you wanna be careful with that. And again, if you're burning things, there's potential harm. So when I use natural stuff with children, I will pre-char things and then give them those supplies. I don't have them actually burn them with me. And I caution them not to make their own supplies on their own time unless they're with an adult. But with some adults, it's fun and interesting to actually make the art supply. Cultural awareness, again, it's people are used to burning things in culture, so that part's very normal, but actually making art from the end product is not something most people consider. You need to seal it when you finish with it and to preserve it for long term. Okay, some other items to consider. So when I was showing you some of the art supplies, I showed you things like erasers. So you want to think about erasers. There are different types. You can use smudge tools, which I showed you a paper pencil that's a smudge tool. The level of mediation. So even if you're working with charcoal and you're working with someone who doesn't like being messy, you can wrap that piece of charcoal in a piece of paper and just tape it. And then their fingers don't actually have to touch the charcoal. So you can make it neater, or you can give them a glove, a medical glove to use to make it so that they don't have to get their hands messy. So there's ways to increase the mediation with the material. The other thing that's nice about graphites is it's both additive in nature and subtractive. And what I mean by that is that we add lines, but then we can also erase and take things away. So depending on your client goals, sometimes clients need to add things to their lives, but sometimes they need to take things away as well. So it's nice to be able to go both directions in the same piece and talk about the difference and how that affects you emotionally and other aspects of your life. There are, like I said, many different types of erasers. So I would explore those and get a couple different ones for when you're working with your clients. Okay, so we're going to switch gears just for a little bit, and we're going to start looking at pens. So pens come in many different forms, and there are many benefits to pens. One of the easiest benefits to identify is that everybody knows them. Everybody knows how to use them. Everybody's been exposed to them. So they're very familiar to people. Now, just like with the charcoal-based drawing materials, there are different levels of pens. There are pens that are the everyday pen that people might use for writing. And then there are technical pens and drawing pens that are more intentional in their artistic use. And then you also have things like calligraphy pens that are even more difficult to use, that use raw ink down the line. So there are different types of pens. We also have pens like gel pens and pens in neon colors. And so there's all different kinds of pens out there. So the biggest benefit to pens is that familiarity. The challenges for pens is that They are not erasable. Once you put things down, they're not erasable. Even the pens that say they're erasable still leave a pretty strong mark. And that can increase frustration. It's also difficult to get shading and things like that with pens. You have to use techniques to get shading, which requires more cognitive knowledge. So it makes it, if you're going to use them artistically, it can make it more complicated. So on the media dimensions variable, pens can be fluid and resistive depending on the type of pen you're using. If you're using a calligraphy pen, you can go from very fluid to pretty resistive. They're simple. They tend to be unstructured. They do have mediation, but it's very mild. On the expressive therapies continuum, again, it's how you use them. So if you're doing, stippling or cross-hatching, that's going to be more cognitive because it takes a technique. They have to think about it. They have to plan it out. It can be symbolic, just depending on what imagery they use. It can be perceptual in how they do the shading, how they create depth, those kinds of things within the image. You can do contour drawing with pen. I like to use a more fluid pen. I'm going to show you the different kinds of pens that I like to use. So I like a more fluid pen if I'm going to do contour drawing that's really almost a paintbrush. Pens are generally not great for large movements because you have to have pressure going a certain direction to get them to work correctly. So they're not good for large movement drawings. So they're not very kinetic. And then they're also not very sensory. So pens tend to keep us in that higher area, that cognitive symbolic area with some perceptual and maybe some affective, depending on how they use it. With pens, again, you're mostly going to be working on paper. And depending on the pen type and the type of ink, you can be using loose ink or ink that's contained within the pen. Storage, pens can store pretty long, but they do dry out. So they don't store as long as graphite materials. The other thing to be careful with is if you're using raw ink, it can rot over time. It can get moldy and mildewy. So you can open a jar and it'll be really stinky if it's gone bad. So you don't want to keep the liquid ink for long periods of time. Once the art is made, pen is pretty permanent and can last a long time. So it's pretty easy. You don't have to coat it with anything to store it. Safety, again, if you get pen, because most pen is permanent, if you get it on yourself or your clothes, it's going to stain. So you have to be careful of that with clients. Toxicity, generally it's non-toxic. You want to check with any kind of liquid ink to make sure it's non-toxic, but generally it's non-toxic. It's pretty accessible, pretty easy to use. You can get a lot of variety with different types of pens. But again, if you want to get more artistic with the pens and learn stippling and cross-hatching and doing shading, then it can get more technical and have more steps involved. Most populations are pretty familiar with pens, so they work with most people. But again, you can't erase them, so you have to be careful about that. Okay, markers. Markers kind of cross that line between the black and white area and the color area, because markers, you can get a lot of color with markers. What I want to talk about is just the black and white markers today. So with markers, the thing that's nice about them is that they are very familiar, particularly with kids that have used a lot of markers. Adults see markers as a creative tool, but not a threatening tool. So they're very accessible. And they come in black and white and color. On the media dimensions variables, again, they're a little bit resistive, but they're pretty smooth too. Very simple to use, they're unstructured, and they're slightly mediated, they're contained. But you can use them in non-contained ways, which we will also look at. On the expressive therapies continuum, it's possible to work cognitively with markers. If you're bringing in techniques and planning and things like that, again, it's possible to work symbolically. Perceptual, you start to get more perceptual qualities than you do with the other black and white materials that we talked about, because usually markers have a smell. So you're going to have that smell added. You're going to have You could have color, you have different shapes of the tips of the markers that can create different patterns or types of line. So the perceptual ability of markers goes up. So if you're trying to move somebody more into the perceptual realm, you might want to move them from working in pencil to moving them to working with marker. They can be used for gestural drawings. They're good for large movements. They can, sensory wise, they're not as engaging unless we alter them a little bit, like I said, with, ways to use them unstructured. They do sometimes have a smell, which can be interesting and good for clients. Also, it depends on the type of marker you buy. So like regular Crayola drawing markers don't really have much smell, but if you get a Mr. Sketch marker, those have fruit smells. If you get a permanent marker like a Sharpie, that has a very definitive smell. Sensory wise, it depends. Also, markers can sometimes squeak when you're drawing with them. If they're pressing hard, sometimes they can squeak depending on the kind of marker. Okay, so the media considerations is that you're going to work on most paper. You want to make sure that the paper isn't too thin or it bleeds through with markers. The markers can go through the paper to the surface below. So you want to make sure it's on a paper that's thick enough that it won't bleed through. Also, the more tooth the paper has, or the softer the paper is, the edges of the marker line can bleed. If you have more of a compressed paper with more of a smooth surface, it's less likely to have that bleeding quality around the edges. It won't get fuzzy. Some surfaces markers don't work on. So smooth, non-stick surfaces you don't want to work with unless you are working with permanent markers like Sharpies. Those will stick to some of those surfaces. Let's see what other qualities are here. It can be protected with sealer if needed. Most of the time you don't need that. There are various options depending on money for alternatives to markers. There's lots of different options out there. And most population are pretty familiar with markers. So they're usually pretty accessible and pretty easy for people to use. So the benefits of markers in general are they're familiar, they're versatile, they have a variety of colors and thicknesses, different patterns. They're even stamp markers. You can cover large areas very quickly. The challenges are that you can't erase. They're sometimes viewed as being childlike. So with older adults, sometimes they don't want to work with markers because they think they are childlike. And if you use poor or low quality markers, the color isn't going to be as rich, and that can create frustration as well. Okay, so what I want to do is switch my camera again, and I'm going to look at markers and talk about the different qualities of the markers that I have, and then I will introduce the Zentangle to you. So there are all different kinds of markers. You have your standard pen that you use when you're just writing. This one happens to be a gel pen, and I like gel pens for writing because they're smooth and you get a very clean line and they're nice and dark. So I wouldn't be able to shade with this very well. So you have to learn techniques like cross-hatching to create shaded areas, or stippling where you're doing it with dots to create shaded areas, because this obviously isn't going to shade very well. Other types of pens, and these I like a lot. I use these with clients. These are Prismacolor. And the reason I like these is they come in different softnesses and different shapes. So these are, let me see if I can, okay, so I'm gonna start with the smallest. So it comes this one's a very small one. This is a 500. So it's a very tiny one. And you can see it makes very fine lines. It's very delicate. A little closer so you can see. So it's very delicate and the lines are very fine. Again, you're not going to be able to shade, particularly with this type of drawing pen. This is more of a technical pen. you have to use it very much straight up and down to get a good line. If you're drawing from the side, you're going to get a scratchy line because of the metal tip coming down and the squared off point. So when you're working with this, most people want to have sort of a tilt. See, and it doesn't really work if you use it like a traditional pencil. So you have to help your clients understand they need to use it more upright. So that's the finest tipped one that I have. That was a 500. And then this is a 50. So you could see the tip is a little broader. Again, you're going to get real scratchy looking if you use it from the side. So you want to use it more from the top. This is better for coloring in areas of color, but again, you can't get shading so much. You have to do shading through cross hatching and stippling. And then this is a C or a chisel tip. What that means is the tip has that chiseled quality to it. And this is good for like calligraphy writing. Instead of using a calligraphy pen, getting a marker like this is nice because it's less messy, easier to handle, and you don't have to worry about the ink. So a chisel tip, again, is fatter. You can use it in different ways. So you can do it broad like that, but then you can also use the point and get a thinner line. You can use, you can kind of stamp with it to get some nice textures in the drawings if you want as well. And then of course you can cross hatch with it really easily. And then this is one of my favorite types of pens. It's a brush pen. And so it's almost like a paintbrush. So it tends to be more fluid. You can use it from the side as well as the tip. It colors in nicely. But again, it's hard to shade. Then this is even more of a brush pen. So this one has a softer tip, so you can bend it when you touch the tip of it. So it has a softer, even softer tip. And you can see that softer line. And it's much more like a paintbrush. You can also, because we're looking at black and white, so with everything I've done so far, I've used the black, and because you can't erase, you can't create the white. So the only way you can create white with using markers is to leave white space. But they do have pens that have white ink. And I love these. I use them all the time to bring white back into an image that you're doing. The other thing I like is this is a gel pen, so it's very fluid. So you can actually kind of almost paint with it. And sometimes when you're working over traditional markers, it will actually pick up the marker and blend it. The black will blend in with it. So those are the pens. There are lots of different things. And as you're playing with your materials and trying out the different qualities, go back and make sure that you're also thinking about the ETC and the media dimensions variable and how these type of materials affect the client. The more structured the material is, the more containing it is for the client. The more colorful it is, the more expressive it is. So now I want to show you one of the things that I do with clients. It's called a Zentangle. So throughout the PowerPoint, I had examples of different kinds of Zentangles. This is a particular Zentangle that I like to do with clients. And when you're doing a Zentangle, people often struggle with how do I start? And then once they get going, they're usually pretty good with it. So I have found that having the client outline their hand is a great way to get them to start because it gives them something to work with. And I also like to overlap the hand so that they start with some different sections already that they could fill in. The idea of a Zentangle is that the reason it's called a Zentangle is because it becomes sort of meditative in the sense that you're just adding patterns and you're coloring. And so you're not thinking really hard. You're more into the movement of what you're doing. and the control of what you're doing in creating your design. And so it gets you into that nice flow state, which is more meditative. It's pretty non-threatening and easy for people to do. It's kind of like doodling on steroids. It's just accelerated doodling, and you end up with a really nice product. Whereas with doodling, you don't usually always end up with something at the end that you can show other people or feel proud of. So this is a nice way to help people doodle and get out that need for being busy doing something, but at the same time using it in a controlled manner. I like to add a step to that by thinking about what is the directive or the technique I'm having them do. So just making a random Zentangle is about relaxation and getting into that zone of that's more meditative. Doing a Zentangle with these hands, I call this, you can do this many different ways. You can come up with, like this particular one, I have words like love, hope, joy, family, friends. So if I was doing this with a client, my directive would be doing a Zentangle about the good things that we hold in our hands, the things that we want to hold on to. Sometimes you can do like the left hand being things that you hold and the right hand being things that you want to give away. Like say if I'm going to do things that I want to give away, I might do something like, I might put stress. That would be something I would like to let go of. So on this hand, you could put in the fingers different things you want to let go of. So these are things to hold on to, and these are things to let go of. You can also do things you're grateful for, things that you want to hold in your hands, things that you want to keep, things you want to attain. So you can change the content of the Zentangle based on what your hands can do. And that content can change based on the client's needs. Now, the easiest way to do a Zentangle is, I like this one, I actually did an image in it. You can actually put an image in it, or it can all just be random. You can put words in it. It's up to you. So usually you just start working and you add to it, and you want to create pattern. By giving them different levels of marker or pen, you get different thicknesses, and it's just a matter of doodling until you fill up the image in a way that is pleasing to you. But again, I like to do it with the hands because I can give it meaning, and it can address the content that the client likes to do or that they need to explore or discover more. So there's a lot of different things that you can do with Zentangles. And then once a client learns to do a Zentangle, they can do them on their own and get as creative as they want. One of the things I have found is that particularly with children and adults who have ADHD, being able to do something like a Zentangle or doodling while they're listening to something helps them to focus on what they're listening to. So this is a skill that I will often teach to adolescents or young, like preteens who have ADHD, as a way to help them manage the ADHD so that they can continue to learn the things that they need to learn. Okay, so that's it. You just try different marks, different patterns, and do things that you find interesting, and you just play with it. And eventually you end up with something that is pleasing to you. Okay, so one of the things you're going to be doing this week is a Zentangle, and this is my example of a Zentangle and how to start a good Zentangle and ways that you can use it therapeutically that go beyond just finding that meditative state. So that's it for today. I hope that this will start you on your journey of exploring materials. The materials I show in the video are just the ones that I happen to have. I would encourage you to explore where you live in your world and try to come up with many different things to play with so that you can get some better ideas on how these materials work and how you can use them with clients. Next time, we're going to be looking at very similar materials, but they're going to be in color. So it's going to change how things work and how they look. Hi, I'm Dr. Penny Orr, and today we're going to look at colored drawing materials. Now, last time we looked at black and white drawing materials, and we talked about that the main difference between working in black and white and working in color is how it contains emotion. So black and white contains emotion a little bit better, except if you work with charcoals, and you can get pretty dark imagery. So it can go, the more negative emotions can be expressed pretty well with the darker materials. Colored materials tend to encourage emotional expression. So if you're working with a client who is over intellectualizing or having a hard time getting in touch with their emotions, then you do want them to work with colored materials. The question you have then is which colored materials, and just like with the black and white drawing materials, there's a spectrum of colored drawing materials that run from very controlled and tight materials to very loose materials. So the looser the material is, the more expressive it is, the more it encourages expression. So if you really want them to open up, then you want to have them work with a colored material that's very fluid. If you have somebody who's too open emotionally, then you want to bring them back more towards a structured material like a pencil. But you could keep, if you still wanted to have that emotional expression, you could keep the color and not go all the way to black and white. So today we're going to explore different colored materials. Again, we're going to first look at them through the lens of the ETC, drawbacks, benefits. What are things that we need to think about or challenges with each type of material? And then I will do an experiential and explore some of those materials and show you some different techniques that we can do with those materials, crayons in particular. So we're going to start with crayons. Crayons are ubiquitous. They're something everybody knows about or has used as a child. But the thing to recall or to know is that not all crayons are created equal. Crayola, Prang, Rose Art crayons, there's beeswax and soy crayons, there's recycled crayons, there's thin, chunky, broken, blunt crayons, there's all different kinds. The cheaper crayons tend to have more wax and less color, so it's hard to get a good, strong color from a cheap crayon. So a more expensive crayon, the more pigment you're going to have in it. So depending on what you want to do with that crayon, you want to choose whether or not you have more pigment or more wax. The benefits of working with crayons is that everybody's familiar with them. They're very versatile, and I'm going to show you lots of different things you can do with them. There's a large variety of colors, and you can cover large areas very quickly. The challenges with crayons is that you can't erase them. They're not really good for detail work. You can't do any kind of real fine detail work. It's hard to get that in there. They can be viewed as childlike. So when working with older adults, if I ever use crayons, I will do it with one of the techniques that I'm going to show you later to make it more adult-like, even though you're still using this material that's easy to access and not very expensive. So it can be viewed as childlike, which can turn some adults off. It can increase frustration if the richness of color is poor in quality. So if you're using an inexpensive crayon and the color is not good, it can increase frustration. And then there's limited blending. You can't really blend with crayons because of the wax base. In the media dimensions variable, crayons are resistive. So that means that, they're not fluid, they're resistive. They're very simple, easy to access. They're very unstructured, and they're slightly mediated unless you take the paper off of them and then use them on their sides. Then they're not mediated at all. On the expressive therapies continuum, you can generally, with crayons on the expressive therapy continuum, they're not very engaging sensory-wise other than seeing color. So they don't have a resistance, they don't have a smell or a texture that much. So they're kind of low on the sensory. They're good on the kinetic. You can use them for large movements, and that's partly why we give them to children, is they're inexpensive. They're very easy to use with large movements. You can do gestural drawings and be very expressive that way, and also with the colors that you choose and the content. On the perceptual level, they have color, form. You can do some shading, dark and light with crayons. And then, of course, you can always do symbols. As long as you can draw an image, you can do symbols. And then cognitively, it is possible. You can do, I've seen some incredibly structured drawings that have been done with crayons. So you can do the cognitive level, but people tend to associate crayons with childhood. And because we associate crayons with childhood, that association many times puts us right back into that kinesthetic mode and that expressive mode. So I tend to use crayons when I know that somebody needs that kinesthetic or that expressive aspect, because that tends to be where most people move with crayons, no matter how you use them. With crayons, you can use them on 2D surfaces. I'm going to show you some techniques of some interesting things that you can do. You can use them on canvas, on paper, anything that's a 2D surface with texture. Crayons last forever, and you can melt them down and make new crayons when your old crayons get blunted and broken. There's a lot of really fun things you can do with that. You can use like ice trays to do shapes for the crayons, and there's all kinds of fun things you can do there. Crayons are non-toxic, so there's no real safety issues. I think the most safety issues I've seen is sometimes little kids will put them up their nose or in their ears, and that's the biggest concern that you have with crayons. It's okay if they chew on them. There's not safety concerns there. Sometimes, depending on the technique, like I'm going to be doing some techniques that use heat, and that will cause safety concerns. Accessibility. Crayons, the thing that's nice, because you can make crayons from old crayons, you can make crayons of different sizes. So if you have grip issues where somebody doesn't have a small grip, you can melt the crayons and put them into like a toilet paper tube, that cardboard tube on the inside of a toilet paper. You can use that as a mold and pour the melted crayon in there, and then you have this one huge crayon that they can then use. So you can change the size and shape of crayons to adapt to the needs of the client depending on what they need. So if there's a grip issue, you can take care of that. They can be manipulated with heat, solvents, baby oil, resistant to water-soluble material. And an alternative to crayons are oil pastels, which we'll be looking at later. Most populations find crayons to be very accessible due to the fact that most people have used crayons in the past. Chalk is the next media that I want to talk about. Now, there are different kinds of chalks, of course. So the thing that's nice about chalk is that it's familiar. Again, people have used sidewalk chalk a lot or chalkboard chalk a lot. It's familiar, it's versatile, it comes with a variety of colors. You can cover large areas with chalk. Challenges with chalk is that it's not permanent. It can be viewed as childlike because we tend to use it, like I said, on chalkboards in school or on pavement or cement outside. It can increase frustration due to smearing and its non-permanent nature. But it is very tactile, but it's also dusty. So chalk has some benefits and some drawbacks, just like all the other media. On the media dimensions variable, chalk is more fluid than resistive, so it can move more smoothly than other media. You can actually get a liquid chalk, and then when it dries, it's chalk, but it comes in liquid form. Chalk is very simple, it's unstructured, and it's unmediated, unless you're using it like in a bottle if it's in liquid form. On the expressive therapies continuum, chalk can be very sensory. Like when you're working on cement, the ground is bumpy and you're running the chalk over that bumpy surface, and it's got a little bit of resistance to it. So it can be very sensory. A caution there is that, again, it's dusty. So if somebody has breathing problems or asthma, you want to be careful with that. It's good for large movements. That's why it's kind of fun to take it outside and work on pavement. It's great for gestural drawings and being expressive. It can have a lot of colors. Again, better chalks, more expensive chalks have better color saturation. And then you can use it in alternative ways that can increase the cognitive nature. And it also can be used very symbolically. I find when using chalks with adults and children, again, like with the crayons, it tends to bring us back to childhood. So it's more kinesthetic and perceptive and emotional or affective. So it kind of stays in those areas. Some things to think about for chalk: they work on most 2D surfaces. They're not good on slick surfaces, but they do work well on sidewalks, walls, other chalkboards, other things like that. Storage can be short-term. Storage of the completed work is definitely short-term. You can't save it very well. It goes away, so you're not going to keep it long-term. The chalk supplies themselves will last forever. There's usually not any triggers. Chalks are not toxic, and chalk tend not to be lethal. The biggest consideration you have is that dust factor. Mobility considerations: a lot of times with using chalk, you want to be able to do large movements. So if they have restricted mobility, that they might not be as successful with using the chalk. Some quantity issues with chalk: when you're doing sidewalk drawings, you go through the chalk very fast. And then of course there's dust. You can try sealer on paper with chalk, especially if you're applying chalk with like a brush or a water dilution. Like I say, you can do liquid chalks, but again, it's not going to last very well, very long. An alternative to regular chalk that I'm talking about are chalk pastels, which are softer and intended for more art making. With chalk, you can use it wet or dry. Like I said, you can add liquid to it, or you can even dip the chalk itself into water and use it once it's soaked up that water, and it gives you a much deeper color while you're drawing with it, and then as it dries, it lightens. Chalk pastels are related to chalk, but they're a little softer. Chalk pastels, the thing that's great about them is that they're very versatile, lots of colors. People tend to see them more as adult or something that an artist uses rather than the sidewalk type chalk. Because they're softer, they blend better with each other. And you also get a variety of colors and richness that you don't get with regular chalk. They do come in a variety of hardnesses, but overall they tend to be softer than a regular chalk or sidewalk chalk. You can cover large areas with them, which is nice. But the challenges with chalk pastels is that they can increase your frustration because they can smear very easily. You can't do details, you can't erase, and they create a lot of dust. And so you have to have a system for removing the dust from the page before you smear it. Again, you have to watch with the asthma or breathing issues. Chalk pastels can be intimidating a little bit if you're not familiar with them. So there's a little bit of a learning curve to use them that you don't have with something like crayons or markers. They're good to introduce to people who want to go a little bit more in that cognitive realm and learn some techniques. Also, they're good to use with adults who you think are going to interpret crayons or markers as being too childish. They also have an adhesion problem. They don't adhere well to the paper. And thus they're more fragile. So you can spray them to fix them, but long term it's hard to keep a good chalk drawing in good shape. Chalk pastels on the media dimensions variable, they're a little more fluid, they're simple, unstructured, and they're unmediated. They can be very messy. So also people that don't like a mess won't enjoy working with pastels. On the expressive therapy continuum, chalks tend to be much more in the affective area and the perceptual area, as well as the kinesthetic and sensory. So they can be very engaging emotionally and on the sensory level and the kinesthetic level because they're so easy to use. You can move somebody into the cognitive level if you teach them techniques for using chalk, but I tend to find that chalks bring people to that mid-level and the lower level of the expressive therapies continuum. Media considerations for chalk pastels: they do work on 2D surfaces. They can be stored for a very long time. The finished product can be, it's usually a little more short term, but if you fix it right, you can keep them long term, or if you frame them. Safety considerations, not a lot, except that the dustiness with asthma. There are some chalk pastel holders that are made from metal that you have to be careful about, because if you're working with clients that are potentially suicidal or potentially going to do self-harm, those metal pieces can be used for that. So you have to be careful of that. Most people have not been exposed to chalks or artist chalks. So it takes a little bit of lead time or learning curve to use them. Breathing precautions, and then again, top end chalks can get very expensive, but have really lovely colors. So there's a whole range of costs to chalks. And when I'll be honest, when I'm making my own art, I buy the expensive ones, and when I'm working with clients, I buy the next level down. But I don't buy the cheapest ones because the colors aren't strong enough. Okay, and then an alternative to chalk pastel are oil pastels, which we will talk about in a little bit. They're good for most populations. Now there's something else that's a pastel that's called a pan pastel. Pan pastels are just like what they sound. They come in little pans, and you tend to use things like little wands and sponges and things like that to apply them. You can wet them and apply them kind of like a paint, and then as they dry, they lighten a little bit. So you treat them a little more like paints, but they're actually still chalks. The benefits are they're versatile, variety of colors, they're artist grade. You can cover large areas with them very quickly. The challenges are that they're a little intimidating since people are not familiar with them. They can increase frustration due to smearing. There's some dust potential, a little less with these because you're using them a lot with water, but they can be very expensive. So chalk pastels and pan pastels are more of an artist grade media of pastel. With the media dimensions variable, these, because you're using them wet, can be very fluid. They're simple, but they can also be very complex of learning techniques and how to use them. These slightly have a structure to them, and they're somewhat mediated because you're using a brush rather than the medium itself directly on the paper. Pan pastels, if you want to be able to keep that really lovely expressive quality, but move them into more of the cognitive realm, then that's where you would want to bring in pan pastels. The kinesthetic, you have to use much more fine motor skills with pan pastels. So you're not going to be doing as big a large movements, things like that. They're engaging visually and tactilely, so they do have sensory things, and they can, of course, convey emotion and are very perceptual. Some media considerations for pan pastels. Storage of the final product, just like with chalk pastels, tends to be a little bit shorter because it's hard to fix them into a permanent result. You can, and again, you can frame them and keep them, but they're not as fresh, and they tend to smear even if they're framed a little bit. Toxicity with the pan pastels, there are certain colors that are more toxic. So you're going to want to look at that if you consider using these with clients or for your own work. You want to read the labels carefully, and some of them do have more toxicity. Some of the tools that you use with the chalk pastels, because you're using them wet and you're using little wands with sponges on them and stuff to work with them, those could be used for self-harm if you're working with somebody that has that potential. The main drawback for accessibility is the cost of these. These are very costly, so the average person isn't probably going to be able to use them. But if you're working with a client that is serious about wanting to get more into art and really enjoys chalk, and they're considering doing stuff beyond the time that they're spending with you, then this might be an alternative to suggest for them to look into or to start working with. I would tend to use these with individuals and not groups because of the cost, so more in private practice or individual sessions. So those are kind of the ranges of chalks. Now we're going to move into color pencils. Color pencils, again, are very familiar. People probably use colored pencils at some point in their life. They're versatile, lots of colors. They're good at blending and shading. They can be used for realistic images. The challenges for color pencils is that they're not erasable. They're limited in their ability to cover large areas, so they retain that pencil quality where you want to work smaller with them. So I literally give clients a smaller sheet of paper when I'm working with color pencils so that they aren't intimidated by trying to fill up that larger sheet. It can increase frustration if the richness of color is poor due to, again, just like with crayons, color pencils that are lower quality are going to have more of the binder and less of the pigment. So more expensive color pencils are going to have better pigmentation, better color. If they're low quality, they can also be too hard and not soft enough, and they can get scratchy when you're working with them. Color pencils work on most papers, but they're not so good on slick papers, so you want to have something with a little more grain to it. The final product of color pencils lasts for a long time. Sometimes you get some fading if it's not a good colored pencil, good quality. Final image does last a long time, and again, you can keep color pencils forever. There's usually no trigger with color pencils. They're not toxic. They're not lethal, except that they could be used, like I said, with a regular pencil, where they could use them as a stabbing tool, or if they have metal parts on them, like on the end that you don't draw with, sometimes they have a metal cap. Those caps can be taken off, and kids who self-harm can flatten them and use them to cut with. You can use woodless colored pencils, regular colored pencils. There's watercolor color pencils. There's lots of different types of color pencils that you can look into and use. Most populations enjoy color pencils. I would say as far as accessibility, if you have people with grip problems, you're going to have an adaptive tool to add to any kind of pencil because they're usually not fat enough for a good grip. Okay, oil pastels. Oil pastels are something that we use quite a bit in art therapy. You'll see that people, if you look at art therapy exercises online, you'll see that people use oil pastels quite a bit. And there's a reason for this. First, oil pastels may not be the most familiar media, but they're close enough to a crayon that people feel pretty comfortable with them. They're more versatile than a crayon. They have more of like a painterly quality to them. You can blend the colors better. You can layer the colors. They go down onto the paper either very light, or if you use more pressure, they become more paint-like and thicker. So they're very versatile. You can layer them and blend them. There's lots of colors. You can cover large areas very quickly with oil pastels. The challenges are similar to the chalk pastels in that they're not erasable. Some clients don't like the texture. When you press hard, little bits can come off and stay on the surface. And some people don't like those. They want to pick those off. With the layering process, you can do some layering, but you can also get really messy and do too much layering. So clients can, just like with paints, they can go too far with this media. Blending can be a little bit challenging, and it can increase frustration due to inability to get any kind of fine details. You can't do fine details with oil pastels. They last a long time. They adhere well to the paper, so they hold to the paper better than chalk pastels. And of course, the main difference between oil pastel and a chalk pastel is the binder. And in oil pastels, you use oil. On the media dimensions variable, oil pastels are a little more resistive. They're very simple, unstructured. They're slightly mediated. They have paper on them, but you can unwrap them. But they can be very messy. Whenever I use oil pastels, I get them all over my hands and everything. So if you're working with clients who don't like a mess, oil pastels might not be the best direction to go. On the expressive therapies continuum, I find that these are there, and this is why we tend to use them a lot in art therapy, is they are very expressive. They have that painterly fluid quality, but at the same time controlled and non-messy, as in terms of you don't have brushes to clean or water. So they're really good at using in situations where you don't have access to water, so you can't use paint, but you want something that's very expressive. So this is kind of a good alternative to that. So due to the color and the fluidity of the oil with the pastels, the ability to blend, they're very tactile, so they fit on the sensory level. They can be very good with kinesthetic level. They're also very emotionally expressive, so they're good on the affective level and the perceptual level. They, of course, depending on what your content is, they can always be symbolic. With cognitive level, usually not as much, unless you're doing a multi-step process, bringing in like other oils and making them more painterly and trying different techniques. But usually when you're working with oil pastels, you're working with them because they're very expressive. They tap into that emotional side and the perceptual. And then they're also sensory and kinesthetic. So they really encourage that creativity and expression. You use oil pastels on most two-dimensional surfaces. Again, non-slick is good. Storage of oil pastels is kind of short term. You generally don't do finished products that you're going to frame with an oil pastel because you can work so quickly in them and you can't do detail. They tend to be more expressive rather than something that you're going to want to frame going down the road. They're non-toxic and they're non-lethal. There's no metal parts or anything that you have to worry about. They're easy for people to get into using once you do a short demonstration. People tend to pick them up pretty quickly. I think it's because they're similar to crayons, just more expressive. You can work with them in alternative ways, like on waxed paper. You can use rags to blend them, especially if you dip the rags in like vegetable oil to help blend the materials. So there's alternative ways of working with oil pastels. So they're easy to use and they're pretty soft. So they are pretty expressive in their nature. Another media that is a good solution for when you really want something expressive, but you don't have the ability to paint or you don't want to create the mess and cleanup that you need with paint, is something called tempera paint sticks or stick gels. They come in sticks, and personally, I love them. The problem with them is you can use them up pretty fast, so you have to watch the cost. But the benefits is they're pretty controlled. They're thick, so you're not going to get detail, which is a negative, but you can control them. They're not as fluid as paint, but they produce something that looks a lot like paint. They're very rich and vibrant. They're versatile, washable, blendable. They're less messy than true paint. They dry quickly. So when you put them down, they're kind of moist and you can still blend them, and then they'll dry pretty quickly. Some challenges right now, because they are a newer material, they're still fairly expensive and you can go through them very quickly. But they're very smooth. It's like drawing with butter. You know, it just goes down really nice. They're not erasable. They can be viewed as childlike by some adults. But I find that if I demonstrate them and talk enthusiastically about them, that I can get adults to use them as well. You can't do fine details. Blending takes practice. And then you get that same thing you get with the oil pastels, where there's those little sticky bits that get left behind that people want to take off of the surface. On the media dimensions variable, it's very fluid. You can add water to increase the fluidity of this media. It's more complex than just an oil pastel or a simple crayon, but not as complex and not as many steps as if you were using a paintbrush and paints. It's slightly structured, so it has a little bit more of that structure, and it's mediated in the sense that it's got usually a tube that it's in, and if you want to do any blending, you can do a little bit with your hands, but you also can use a brush and water. On the expressive therapies continuum, this is another one that sits right in the middle to the lower half of the expressive therapies continuum. It's very colorful, very expressive, So you're going to see a lot of sensory and kinesthetic qualities, perceptual and affective qualities. Again, you can always be symbolic anytime you can create an image. And cognitively, you can increase the cognitive by introducing more steps or complexity to the technique that you are doing. But most people tend to stay in the lower half of the expressive therapies continuum when using these paint sticks. Media considerations for paint sticks: 2D paper, no slick surfaces, they don't stick well. They are good for short-term and long-term type projects. They do store fairly well. I haven't had mine long enough to know if eventually they mildew or mold, but they do store fairly well. You want to be careful if you're using water with them because they become extremely fluid and out of control. And so that could trigger people if they're highly emotional and don't like that feeling of not being able to control the substance. They're not toxic. Lethality, there are plastic parts, in the tubing for them. And again, those could be used as sharps. Some of these are water soluble. Not all of them are water soluble. So you need to read the directions if you want ones that you can add water to make them more fluid. Markers. Okay, markers are something we're all very familiar with. And again, I sort of covered markers last time, so I'm not going to talk a lot about them. The difference is these markers have colors. Again, markers that are a little more expensive tend to have better depth of color to them. I put in the slideshow the media dimension variables and the expressive therapy continuum for markers, but I've already gone over that in the last lecture, so I won't go over it again. So the last thing I wanted to introduce as a potential drawing color material are digital apps, touchpads, drawing pads, working digitally using apps that have drawing tools. And in those apps, a lot of times you can choose colored pencils or crayons or chalks, and they tend to mimic the textures and the way it lays down on the paper and the color. But usually they're not, they have the visual look of it, but of course they're not going to have the textural look because you're looking at them digitally. Also, they're not going to have the mess quality because you're looking at them digitally. They could have the fluid quality, like the lacquer control that sometimes, like if you do a watercolor in a digital program, it can spread, and blend in with other colors and be less controllable. So you can still get that range from being very controlled to not having control, but you're not going to get the sensory stuff with using digital media as a coloring tool. The thing that's really nice about it is that it's very accessible. Most everybody has a phone or some kind of app that can do art materials, so it's something that people can have. It also is really nice in environments where you have to worry about germs, particularly in COVID time, because the iPad, if you take an iPad and have kids work with it, the iPad and the iPad pencil that go with it can be sanitized very easily before you go to the next room. If you're using traditional art materials, it's much harder to sanitize. And what I've seen people doing in hospitals is they create art kits that they leave with each person in their room and don't try to transfer materials from room to room. So if you're working in an art therapy studio and you've got people coming in and you're worried about COVID or another germ-based issue, you have to sanitize everything, and that can get very difficult. So doing digital media makes sanitation much easier. So those are some of the benefits. The challenges is that you're more removed from the object that you're making. You've got the screen between you and the product. For some people, it's like second nature. Some people are all over this kind of stuff. But for other people, they might be intimidated by the technology. If you're using an app that doesn't have a lot of functionality, that can be very frustrating. If you're using an app that is too complex, like the Adobe suite, then unless they are really good with technology, the learning curve is very steep, and that can create a lot of frustration. So there's lots of different apps and tools out there. My recommendation, if you're going to use apps with kids or adults and you're going to use digital tools, we're going to do a whole thing just on those. But you should definitely try them out first before you get involved in any of them. So on the media dimensions variable, touchpads or using apps are, they're complex, they're very structured, and they're mediated. On the expressive therapies continuum, they put you into the cognitive realm because you have to really think about what you're doing, but you can also be symbolic and you can be very expressive. If you approach it in a free-form method where you're just playing with the app, then that can be very expressive emotionally. Again, the kinesthetic, it's going to be pretty contained and small, but good for fine motor skills. And there can be some visual tactile experience and color experience with the media. Considerations, media considerations for the touchpad, it is its own tool. So one of the things you need to think about is the size of the tool. So, if you're on a phone, that's a very small screen. If you're on a small iPad, that's okay, but still fairly small. And then you can also get really big screens that are meant for doing artwork on, but those are more expensive. Again, they're not lethal, they're not toxic. I mean, they are toxic if you ate them, but hopefully nobody's going to be eating your digital tools. There can be misuse or abuse with the technology if you leave it with like teenagers or somebody without monitoring or putting restrictions on how it's used. Also, creating art and uploading it to the internet or the cloud can expose your clients to others. And again, I'm going to do a whole lesson on just working with digital media, and we'll talk about the safety issues. Okay, so that's the end of me talking about materials. So in the next video, I'm going to show you different materials and how to work with them. So thank you. Hi, in this section, I'm going to be talking about the different materials and how they relate to the expressive therapies continuum and different ways of using them. So the first material I'm going to look at are chalk. And I don't have every material that I talked about in the presentation because I just didn't have access to everything. So I will talk about the types of materials that I do have access to. So the first type of chalk is just the standard chalk that you use with a chalkboard, or that you can use outside with a sidewalk. So sidewalk chalk is usually pretty thick, and the chalk that you use for the chalkboard, it tends to be thinner. The issue with the chalkboard chalk, and that's what this stuff is here, is that it doesn't blend very well. It doesn't smudge very well, but you can get a variety of colors, and it's great for working outdoors. Softer chalks, like this is a soft chalk, even though it's big, this is an artist chalk. Softer chalks, like artist chalk, are softer, as you can see here. They blend much more nicely. So you can get gradations of color. They can be very expressive, but they're very messy. And so clients who don't enjoy mess, that's going to be something you want to be careful about. If you want a client to be more expressive and just more gestural, I find chalks are really nice for gestural things, then you can use chalks. With any of the materials that I'm using, you can use tools as mediators to help control things or to give structure to things. So for instance, this is a stencil of a moon that I used with chalk. And by giving the client a stencil, what I've done is I provided structure with a material that is less structured. So I changed how structured the material is. You can also use things like Q-tips to help with blending if the client doesn't want to get their hands dirty. So you can use tools with any medium to help counteract some of the media's natural qualities. So the natural quality of chalk is that it's messy. So you can use this to help decrease the mess. The natural quality of chalk is that it's hard to be precise with or control, and you can use a stencil to kind of help give it that more precise edge. But of course, if you touch it, you're going to lose that precision pretty quickly. Okay, so those are chalk-based chalks. Another kind of chalk are the oil pastel. So they're actually pastels. Another kind of pastel is an oil pastel. These are oil pastels. We use them a lot in art therapy because oil pastels are very versatile. They go on, they have an oil base to them, so they go on very smooth. And they're not as messy as chalks, but they kind of can do a lot of the same things that chalk can do. The things that they can do better than chalk is that they blend much easier. You can use them with a lot of pressure, like with crayons, or you can use them very light, just like with crayons. And you get different colors and techniques. The darker the oil pastel is, it's going to dominate other colors, but you can come back in over top of a dark oil pastel with a light one, like this is a light gray, and you can blend it some to lighten it up a little to give some gradation and change. So oil pastels are nice because they blend a little bit more like paints, so you get more of a painterly quality to them in how the final product looks. They're not as messy as chalks. They're much more controlled, but you still get these little bits that come off that build up on the surface that many clients don't like. And then when they try to brush them off, they end up creating more, messes on their work. And so that can be frustrating for clients. The thing that's nice about oil pastels is that people pick them up pretty quickly. You can use them quickly. You can cover a whole page very quickly. They're really good for that expressive side that you want to come out on the ETC. Not as good for the cognitive side because they're harder to control. You can't do details as much. So people can get frustrated with that lack of detail or ability to control what they're doing. Okay, let's talk about color pencils. So color pencils come, like I said, in a variety of qualities. The better quality of the color pencil, the richer the color. You can also get color pencils in different hardnesses, but usually color pencils are pretty hard. And you can use color pencils like crayons and use them light to color in areas. You can also press down hard and get a different type of color from the same color pencil. They're good for detail work. You can move a client more into the cognitive realm using color pencils while at the same time offering them the opportunity for emotional expression because of the color. So they can still stay pretty technical and symbolic and cognitive, but at the same time still have some more expression. The problem with color pencils is it takes a long time to fill up a space with color pencils. If you use them on their side, they can go faster like I'm doing right now, but it can take a long time to fill up a space. So I will generally give clients a smaller sheet of paper to work on when we're working with color pencils because of that, because I don't want them intimidated with trying to cover the whole thing. So if you do a body outline and you want the person to color it in, do not hand them color pencils. That's going to take way too long. You want to hand them something much bigger that they can color in much more quickly. And that could be markers. There are lots of different types of markers as well. I always like to make sure that I have a marker set that has skin tone colors, because in the regular marker set, they have black, white, and maybe yellow. So they don't really have any skin tones. So it makes them hard to do people. And so marker colors are strong. They don't blend very well. So that's why you need to have the colors that you want to use. And I always make sure I have multicultural ones. Another type of marker that's different than the traditional markers that we're all used to is Mr. Sketch. I really like Mr. Sketch markers. Sometimes they're hard to find, actually. But the reason I like Mr. Sketch is because they have wonderful smells. So like this one smells like grape, because it's purple. So they have really nice smells. The drawback to the smell is that it can be distracting for some kids and they can't get past the smell. They just want to sniff it and don't get on to doing the work. But for kids that need the sensory stimulation, like particularly if they have like low vision or they need that to help them focus, like ADHD, having the smell adds an extra element to that sensory level and helps them to stay in that sensory level. These Mr. Sketch markers tend to be very bright and they don't mix at all. So they're a little restricted. The color palette, if you only have one set of colors for Mr. Sketch, you can't get lots of different colors. So you only have these colors to work with, which is limiting as well. But it is nice to have ones that have that smell. I had a child who I worked with low vision, and I gave him those to work with. And so because the colors are really bright, they're easier for him to see. And then he also was able to tell what color it was by the smell. So he could smell it and say, this one's purple because it smells like grape. Whereas the black one, which looks similar to him, smells different. I think it's licorice. So he was able to differentiate the colors. Okay, so now, oh wait, I have one more marker, and that's the brush markers that I talked about last time. Brush markers are nice when you want to have something that goes on and has that kind of nice tip to it. When you color solid with a brush marker, it looks just like a regular marker. You know, when you color it in, it just looks like a regular marker. But if you use the tip intentionally, you get more of a paintbrush, sort of where it goes thin to thick and back type line. These aren't a good quality, so the marker point is stiffer. If you get a good quality paint marker, the brush can actually be very much like a brush, like a regular paintbrush, and work like that. And that's nice if you are in a situation where you don't have access to water or you can't paint. So that's a nice alternative. Okay, now I want to talk about crayons. Crayons are a standard, right? Crayons are something that we've used since childhood. Everybody's familiar with them. The drawback to crayons is that people can see them as being childish. With crayons, we all start out using crayons and we're usually coloring pretty hard with crayons. We tend to break them a lot when we're little kids. And then as we get older, we learn to lighten up and use the dark and light intentionally to create our image. But there's a lot more we can do with crayons than just this. And that's something that I want to show you. Okay, with crayons, because they are wax-based, they can be manipulated by heat. And there's lots of different ways that we can manipulate crayons with heat. So one way is using an iron, okay? And so when we use an iron, we're adding heat to the surface that we are working on from above, which means you have to lay down what you're gonna do first. So you can do this, and then you can also break off or use chunks of crayon. You can do scrapings of crayons. You can use old, and that's why, you know, you always end up with a million old crayons, right? So you can use them for this type of a technique. And so it's kind of a fun thing to do. What I do is with this is lay some wax paper over the crayons, and then I will lay a cloth over it, because you can ruin your iron very quickly if you don't put the cloth down. I have an iron that's only for art making because it inevitably gets stuff on it. You iron it. And those little crayon bits will melt and create patterns. So it's a nice way to use melted crayon in an abstract way. You can also do the melted crayon right on the wax paper itself. And the thing that's nice about doing that is that you can then hang it up in a window and light will show through it. So it looks, so if I came in and did my wax paper, I could do a design in my permanent marker and then put in my wax crayon over top. And then what will happen is it ends up looking kind of like a stained glass window. This is just the beginning of the technique. I would do I'd put a lot more crayon in there to get more of that stained glass look to fill it up. But so because crayons melt, you can use this where you use scrapings and small bits and then iron it. But that's bringing in heat from above, which makes it much less controlled and you don't know what outcome you're going to get. So it's more abstract with unknown outcomes. Another thing you can do with crayons is, this is actually a canvas. And one of the things that you can do is you can color on the canvas. Okay, just like with the crayons. And then you can come in with your hairdryer. And you can turn your crayon into a painting. And that's a really nice technique. It's clean, but you're working with heat. But if you're working with a hairdryer, it's usually pretty safe. It's interesting for people to work with because they have never done anything like that before. You definitely want to use a Q-tip or something like that as your tool for blending and for drawing because it's hot underneath here, so you don't want to use your fingers. The crayon will be hot itself. So you can do that. You've also probably seen on the internet people taping crayons onto the sides of a canvas and then turning on a hairdryer and blowing them until it melts and drips. My variation of that is you can use the crayon directly as a drawing tool and control the melted crayon itself as you're drawing. And then that way, you get, by doing it this way, you get a thicker coating of the wax crayon on there, so it's more lush looking. By doing it with coloring first and then coming in with a Q-tip, you get not quite as lush, but a different kind of texture, depending on what kind of texture you want to use. Another thing that you can do, and you ruin your glue gun, but you can get a cheap glue gun and put crayons in it. And what you can do with that is you're heating it into a liquid form. And you can do more abstract kind of stuff. It's kind of fun to play with. And then because it's still pretty liquidy, you can leave it like that, but you can also come in with tools or the crayons themselves and play with it. Just depends on what kind of technique you're looking for. And then if you wanted to smooth it all out, you could come back in with the wax paper and the iron and put it on top and iron it again, and that'll smooth everything out. So you don't have the little bits sticking up like this. Okay, so I showed you lots of different things that we were doing this week. And one of the projects I want you to focus on is doing what I call an in-depth or a deep dive into one material. So like with crayons, I did more of a deep dive where I really looked at what are non-traditional ways that I could use this material. What can I change? What can I add? What can I take away? What can I expose that material to see how it works? So one of the things I'm going to ask you to do this week is a deep dive. And so I want you to pick a material that is a standard material that you might use and try things with it. Try it on different surfaces, see how that works. Try adding water or oil or alcohol to it, and or dipping it into those things and seeing how that changes. There's a lot of really cool things that you can do with markers if you do a deep dive with those, and the same thing with the chalk pastels. You can do a lot of really interesting things there. So this week, my technique is more about doing that deep dive and exploration with the art materials themselves. Many times within art therapy, our goal isn't necessarily to have a product that has a finished image. It's about the process. It's about the play. It's about exploration and playing around with those materials and seeing what you can do with them, learning something new, exploring. So this week, it's not about creating a finished image. It's about the process. It's about that exploration. And I want you to focus on that deep dive using the colored drawing materials. And I look forward to working with you again.
Hello, I'm Dr. Penny Orr, and today we're going to be talking about painting materials and the therapeutic qualities of the different types of painting materials. So in this lesson, what we're going to do is explore the concept of fluidity and opaqueness, and how these impact the therapeutic qualities of the art making that we're doing with our clients. So we'll be looking at a bunch of different types of media within painting and comparing what those things look like. So first I want to start out by saying that paint is one of the oldest recorded media that we have historically that people have used. It's been used cross-culturally, and overall it's one of the most versatile media that we use in art therapy. Traditionally, we view painting as a very fluid medium, but within the fluidity of paint, there is a medium. Medium is what mixes the color, and that medium has distinct qualities to it. So some have a thicker, like a wax-based paint, where it's thicker and less fluid, and then others are very fluid, like a watercolor. So expression within the painting comes from not only that medium, but also the level of the color that's within the paint. So some paints have very bright colors, and some paints have very translucent colors or not opaque colors, and that can affect the level of expression that your clients are able to do with it. The means of application, how do you apply the paint, also impacts the therapeutic qualities of the paint. So for instance, with finger paints, you literally use your hand to put them on there. But in other types of painting, like a wax-based paint, you may use a hard tool to be able to put it down in the layers and to create the thickness. And then of course your paint brushes and different types. So the means of application is also an important thing to consider. So first I want to talk about oil paints. I won't be covering oil paint in my demo because oil paint is, even though it's one of the oldest recorded means of painting, it's not always real healthy. There's particularly the cleaners can be toxic. And with oil painting, there's a certain level of knowledge that you have to gain to be able to use it. So it can be difficult for clients to learn to manage it. So I tend not to use oil paint with my clients. But oil painting is one of the earliest known types of painting. For instance, Buddhist murals found in Afghanistan caves were painted with oil painting, and that was about 7th century. Basic oil paint is a mixture of ground up pigment, the color, which is usually from stone or natural products, a binder, and with oil paints, a lot of times the binder is linseed oil, and then a thinner so that you can thin it and clean your brushes. And traditionally, thinner is turpentine. They make some non-toxic similar products that can also be used in place of turpentine because turpentine is very toxic. So paint becomes more luminescent due to the oil surrounding the pigment particles. So that's why you capture a little bit more light within an oil painting than you would within acrylic paint because the oil reflects the light. Oil paint is very slow drying. Oil paintings never actually 100% dry. What it is an oxidation process that happens over time. And that's why you see with some very old paintings that you'll get cracking and things like that because it's still changing over time. You can use additives to change how oil paints dry and how they work and how the paint itself behaves, how it lays down on the page. There's a large possible range of colors within oil paints. There are various drying times with oil painting depending on what the mixture is and whether or not you're using a medium. The thing that oil paintings have shown is that they really do last. The 7th century ones are an example that they span the test of time. You can cover up water-based paints, but not oil-based paints. So many times I'll give clients a canvas that already has a background color on it to help create a color that pops through the painting that comes from the back. And you can do that with acrylics when you're using oil paints, but you can't do the opposite. You can't paint the background with oil paints and then try to do acrylics over top. It doesn't work. On the MDV with oil paint, it's basically fluid overall, but it's a very complex process. It can be very structured because there's certain steps you have to take with it, and it's mediated. You have to use tools. I find that on the ETC, sensory-wise, it has a certain smell, which is actually quite pleasant, the linseed oil. But if it gets on your hands and things like that, it creates this coating that many people don't like. It can be, if you're painting large scale, it can be movement driven, or it can be, you can get very precise with oil paints as well. But like I said, I tend not to use oil paints with clients because I just find that it's too toxic and too difficult for most clients. The clients that I do use oil paints with are the ones that have already used it. So sometimes we work with clients who are artists themselves, and if they already know how to use oil paints, then sure, I'm fine working with them using oil paints. But it's not something I would introduce to a client that has not worked with oil paints before. So that leads us to acrylic paints. Acrylic paints is, again, made up of different parts. So you have a polymer, which is basically a plastic. A polymer is the binder, and you add the pigment to the binder, which is the plastic. The type of polymer determines the type of paint or medium. So you have acrylic polymers, which make up acrylic paints. So that tells you the type of polymer that's been used. With acrylic paint, you don't quite have the same range of color that you do with oil paints. And that's because alkaline sensitive pigments can't be used in the manufacture of acrylic paints because the acrylic emulsion are alkaline themselves. So in polymer emulsions, there are subtle differences between similarly colored pigments, and you often can't see that difference. And therefore, it's pointless to manufacture those range of colors. So there's not as many colors within the acrylic palette. Acrylic paint is water-based when it is still wet. So with acrylic paint, you can clean it up, soap and water, non-toxic, but you have to do it while it's wet. Once the paint dries, it becomes a plastic, and the polymers connect and become solid. So if you get it on clothing or something like that, it will bind within the fibers of the cloth, and therefore you won't be able to get it out. So with acrylic painting, I always make sure my clients are wearing a smock or they don't care about their clothes, because you can ruin their clothes pretty easily. But it does clean up with water and soap if you can get to it before it hardens. Okay, so with acrylic paint, one of the things that's nice about acrylic paint is that there's a number of amending products that are available for use. So you can use different products that are made to go with acrylics for preparing the surface for your painting, to slow the drying time so that they work a little bit more like an oil paint, to enable the artist to create a texture on the surface. So there's a lot of things that you can add to acrylic paints to create different qualities in that paint. On the medium dimensions variable, acrylic paint is fluid overall. The more water you add to it, the more fluid it gets. The less water you add, the more you can build out that thickness in the surface. It can be complex in how you use it, but it can also be pretty simple. So it just depends on how you're using it. It's structured and it is mediated because you're using a paintbrush and you have those steps that are involved in doing it. On the expressive therapies continuum, acrylics are fairly sensory because they provide a little resistance and they have that fluidity to them, and then they also have the bright colors, but there isn't really a smell so much that goes with them like you have with the oil paints. You can use acrylic paints on a large scale. So acrylic paints go everywhere, and the range is everywhere from the artistic acrylic paint that you get in smaller tubes to house paint that you can literally cover huge swaths with. So it can be very kinesthetic. If you're working large scale, it can be very gestural. There's lots of color, you can do shading, and then of course you can use symbolic imagery if you choose. Using acrylics is a multi-step process, so it does bring in that cognitive step as well. Okay, so another type of paint that kind of crosses boundaries, we talked about drawing materials last week. Well, ink, Asian ink in particular, is one of those things that crosses boundaries. So you can define an Asian ink as a drawing material, but you can also define it as a painting material. So Chinese brush painting, of course, dates back to 4000 BC. It's a very old craft. What began as craft related expanded over time, in society to including high art. The ink cakes are ground and mixed with water, producing various thicknesses, allowing for depth in your field when you're painting, and variation in color. So typically, Asian inks are used with a soft bristle brush with a fine tip, allowing for variation in line. On the media dimensions variables, Asian inks are very fluid and they're complex. They're actually really hard to use and to become good at using them. There's structured process and steps that you take when you're using them, and it's mediated through the brush and the grinding of the stone and all of those things. On the expressive therapy continuum, it's a multi-step process, so it actually uses a lot of cognitive skills. It can be, of course, very symbolic. You can create shading, so perceptually it's not so much color but shading. There's a little bit of color to it, but it's mostly shading. It's very gestural. When you're painting with the brush, you're usually holding the end and using the whole arm rather than just the fine points of the fingers and the small fine motor skills. It can be used large scale, and sensory wise it's possible with the different shades to find some pretty intricate things. And then there's something called Asian watercolors. Research on inks and watercolors leads back time and time again to China and Japan. So China and Japan are sort of the leader in research in our understanding of inks and watercolors, and some of the original ones were developed in those areas. So natural inkstones are made from slate, and imitation inkstones are ceramic. The inkstone with water is used to grind the sticks into tiny particles to form liquid. Ink sticks are like wines. Their quality is determined as much by the aging process as by the method of preparation. So there's a real art form to getting good quality color from these Asian watercolor sticks. The major difference between Western watercolors and Oriental watercolors is that the Oriental system, some of the colors are by tradition opaque, and others are transparent. So opaque means light doesn't pass through it. Transparent means light does pass through it. The higher quality ones can get very, very expensive. Dry cakes that need to be ground and mixed was the original type, and those are actually the best quality if you're getting them. A tube or ready to use is considered inferior, but it's more something that we can afford more as art therapists, and we often use them because of that. So with Asian watercolors, again, it's very fluid. It can be extremely complex. It's structured and mediated. Because it's complex, it has that strong cognitive aspect to it. It can be used symbolically. There's perceptually, there's color, form, shading, all of those things that you're using. It's, again, gestural because it's done with this paintbrush and you're using the whole arm when you're doing it. It can be kinesthetic because of the use of the whole arm. Also, you can work fairly large. And then you have the shading and the color to make it more sensory. The other thing I've noticed about working with Asian watercolors and inks, sensory-wise, is that the grinding of the stone or the stick is a really lovely process, and it's almost like meditation, moving you from the outside world to the art space and making that transition to that more meditative space by sitting there and doing that grinding and hearing that sound as well as feeling the friction is very sensory oriented. Okay, and then westernized watercolor paints are heavily dominated by the principles of the English watercolor school. So watercolor paints, as we know them in Western culture today, came out of the English background. Term watercolor means transparent watercolor, so it makes sense. Today there is an opaque watercolor that's known as gouache. You also might see something called poster paint, and tempera are sometimes the different words that are used to describe an opaque or a type of watercolor that light does not transfer through. So the term tempera, poster paint are used for lesser quality ones, so those are usually not as good. And they're fairly common in the art therapy room. So the reason that tempera and poster paint are pretty common in the art therapy room is because of cost, because clients can go through paints very fast. So we tend to provide those types of paints to people that are more about expressing ideas and less about creating an end product that's high quality. But you still want to think about, is this the best paint for them? Is this going to get to that expressive qualities that they're trying to explore? So it shouldn't always be about cost. It also needs to be about, is this paint supporting what they are trying to do in art therapy? There are masking materials that you can use with watercolor paint to prevent the water from absorbing into the paper. There's lesser high art tape, so you can use tape. You can use different kinds of glue, you put the glue down, let it dry, and then you peel it up, or you put the tape down, paint, and then peel that up. Quality matters with watercolor paints. If you buy cheap watercolor paints, the really cheap ones, they're just not very good quality. The colors aren't very good, which when you don't have those good qualities, you're sending two messages to your clients. One, you're reducing their ability to be expressive because you're limiting the level of the pigment, the choice in the colors, those kinds of things. But also you're saying that, you're not a real artist, and you're devaluing the art that they're producing. So in art therapy, we have to kind of get that balance depending on where the client is in their thinking about who they are in that art making process, between the quality and the cost. On the media dimensions variable, watercolor paint is fluid again. It can be very, very fluid if you do like wet on wet painting. It can be complex. There are lots of techniques that you can use. You can't cover up mistakes with watercolor paint because of the translucence, so that can also make it difficult to learn. It can be very structured, and it's mediated. On the expressive therapies continuum, because it's a multi-step process, again, you've got that cognitive element. It can be symbolic. You have color and that flow feeling for perception. It can be gestural. You can use it on large scale or small scale. What I have found is that when you're using watercolor paint, if you don't teach, like if you give it to a child and you don't teach them how to use it, they'll use it like it's an acrylic or a tempera paint. They'll use very little water and a lot of pigment. And so sometimes you have to show them how they can spread the color and create shading and all that through an addition of water. Okay, Cason paint. I don't know if you've heard about Cason paint, but Cason paint is a 9,000-year-old type of paint. It was used in cave paintings, and it's been discovered it was discovered in Asia. The medium was used by ancient Egyptians for brightly colored murals or frescoes. The binder is a milk-based protein. Cason paint has a milk foundation, and it dries with a kind of a film to it because of that milk protein. It's thicker, water resistant, but not waterproof. So it is permanent, but you have to be careful with it. So it's water soluble, less chemicals for use than oil paints. So it's it's a natural product. But if you have somebody with milk allergies, you definitely don't want to use it. It needs to be on a rigid surface. So you tend to work on a board or a hard, thick piece of cardboard if you're going to use Cason paint, because it needs that rigid surface. It can become brittle when it's dry, especially if it's applied very thick, so it'll flake off if you bend the background of it. Newer Cason has a small amount of oil in it, which allows the curing process to be delayed a little bit more. Milk-based paints are fairly popular actually with redoing furniture, like doing furniture design and repainting furniture. We don't tend to use it that much within the art therapy world because of the potential for allergies, but also because it's just harder to get, and it's not something that is well known, so people don't tend to ask for it. With the media dimensions variable, again, it's fluid, it's complex, it's structured, and it's mediated. It's a multi-step process, so it's cognitive. You have color and shading. It can be gestural. You can do a little bit kinesthetic, but milk-based paint is more difficult to use on a larger scale, so it tends to work better on a smaller scale when you're painting an actual painting. It doesn't lend itself very much to the sensory aspect other than the color. Okay, gouache. Now I mentioned gouache earlier. Gouache paints are opaque watercolor, so that again means they're watercolor based, but light doesn't travel through the pigment, so you can't see things that are underneath. So you have pigment and the binder. The binder is called gum arabic, or dextrin is the newer thing that's used. It's been in use for about 600 or so years, so it's a newer paint because it's only about 600 years old. It tends to be popular for illustration work because it photographs really well. The technique of use is very similar to acrylics in how you apply it. You can layer it, you can cover up mistakes. The colors are really bright and can be re-wetted, so if you're working on it, you let it dry and put it aside. You can bring it back out, add a little bit of water to your brush, and you can rework areas. It has a matte finish once it's dry, again, which makes it really nice to photograph for illustration. So on the media dimension variables, it is a fluid paint, but it also has a little bit more structure to it than like a traditional watercolor. It's complex, structured, and mediated. It's a multi-step process, so it's very cognitive, and you can get, sensory and all of that kind of thing with this. Gouache tends to be used for smaller works, not so much for the larger, expansive works. Okay, egg tempera. So this is another one that if you use true egg tempera, you have to be careful because there's allergies and there's potential for bacteria and things like that. So I tend not to use true egg tempera with my clients just because of that. But egg tempera, you can get incredibly fine detail with. So it's one of the oldest types of paints. It was used before casein paint came along. It's more versatile, and it's one of the most durable painting methods. So it holds up the best over time. It's said to date back to prehistoric times. It's generally unaffected by humidity, not humility, humidity and tempera. Temperature changes don't seem to bother it. So it's an old type of paint. It's very durable over time, and works well when you're trying to get very detailed type work. Tempera emulsions form their own protective surface or film, and they don't darken or yellow with age. So unlike oil paints, usually with oil paints, it's the varnish coat that they put on it that cracks and yellows with time. But oil paints do change over time. Temperas don't. They create their own finished surface through a chemical process, so they don't darken or yellow with time. Basically, what you do to make an egg tempera is you use a fresh egg yolk and distilled water to bind the pigment. So historically, in ancient times, they would do that as they'd mix their own paints as they needed them, because they don't last when they're like that. So you have to just use make the quantity that you want to use, because it will harden. But like I said, there's concerns of salmonella and other things like that, so I tend not to use egg tempera with clients. But egg tempera can do astonishing detail work. Egg tempera is fluid, complex, structured, and mediated. It's a multi-step process. It can be very complex, so it's highly cognitive. It doesn't lend itself so much for the sensory other than color. Kinesthetically, not so much. You tend to work very small and fine details, so it's not large movements or gestural. I love egg tempera paintings myself. I love looking at them, but I don't usually have clients who create them. Okay, other inks. Modern inks are very versatile. Thick ink is very deep and glossy, while a thinner ink appears very lively and translucent. The main consideration when choosing an ink is what you're going to use it to apply them. Whether or not you need a finish that is a permanent type finish, or if it's something that doesn't matter if it's permanent. Inks are fluid overall, complex, structured. There's a multi-step process there. There's color and shading. It can be gestural. It can be very movement driven if it's used large scale, and it can be multi-sensory with the smell and the way it looks on the page. The one caution I have about liquid inks is they do go bad over time. I've had a few that I have opened up and they smell awful when they have gone bad. So if you open one up and it smells really bad, you just need to get rid of it and replace it. There's a newer type of ink that is really fun to experiment, and it's called an alcohol ink. So it's ink, but it also has alcohol as part of its base, and it creates these lovely translucent images. So it's really fun to play with, but it has some drawbacks. You can't control it. You can't really do a lot of detail with it. It's very fluid, and it has that alcohol smell. So you want to be careful if you're working with clients who have any kind of substance abuse issues. You don't want to trigger them by opening something that smells like alcohol. But it's a really lovely thing to play with. So if you have access to alcohol inks, you should try them out. They're really interesting. Very fluid, complex, structured, mediated. There's some potential for sensory and some perceptual, but it can be an intuitive process if you're just doing abstract, but then it can also be a very detailed process if you're trying for realism. So it depends on what level of work you're trying to do. There's another kind of paint that is only one atom different from acrylic paint, and that is called vinyl paint. Vinyl paint is usually found in interior house paints. It's virtually the same as acrylic paint, but with a little bit different properties. Vinyl is said to break down more than acrylic when it's exposed to ultraviolet light, and it's therefore not recommended for murals where there may be exposure to direct sunlight. So vinyl tends to be more smooth and matte than acrylic, but it can come in matte satin, silk versus gloss, high gloss, those types of things. On the media dimensions variable, it can be fluid. You can actually buy it in spray paint form or in a liquid form with a brush. It's complex, structured, and mediated, and it's a multi-step process with a lot of sensory experience. If you buy the spray paint, you need to be careful and wear masks and goggles and make sure that the client is safe. The next type of paint I wanted to talk about was chalk-based paint. Chalk paint adheres to almost any surface, so that's one of the things that's really nice about it. Kind of like acrylic, it adheres to most surfaces, but like a metal surface it might peel off of. Chalk paint adheres to every surface, so you rarely need to sand or prime before you use chalk-based paint. A little bit of chalk-based paint goes a long way. It's not a miracle paint, but it works well if whatever you are painting is exposed to sun, and chalk paint is able to dry really hard. Moisture has to be controlled even after the paint is cured though, so you don't want it to be in a really humid environment. You can use a sealer on it, which is a sealer paint or a poly type clear coat to seal it. Chalk paint, again, is something that you see used like milk paint with interior design and furniture. So chalk paint, you can do lots of really fun things with chalk paint. Chalk paint is typically a latex based, mixed with a calcium carbonate or a chalk, and thinned with water. You get a matte finish, but you can add a gloss or a wax on top of the final image to create a protectant or to give it a gloss if that's what you wish. On the media dimensions variable, it's fluid, complex, structured, mediated. Again, it can be very movement driven if you're working large. It can be multi-sensory. It has a certain smell to it as well as the colors. And it's an interesting type of paint to work with. If you're looking for something that's a little bit different for clients to work with, if they're getting bored with acrylics and watercolors, chalk-based paint is fairly interesting to work with. And then, of course, there are lots of other types of painting materials. I'm just covering some of the basic categories. One that I didn't cover here that is used a lot in graffiti is, like an airbrush type paint. Sometimes that's an enamel, but you can also get water-based. So if you're doing airbrush, just make sure you're careful about the paints that you buy because some of them are more toxic than others. So you want to make sure that you're buying ones that are specifically non-toxic. Doing airbrush, particularly like with teenagers, is something that they enjoy doing. It's a little more difficult to learn to do it well, but it's an interesting paint to use. And then there are all kinds of natural paints. You can go outside and pick up different kinds of dirt and mix it with an oil or a water and create a color palette. So paint is not something you have to buy. It's also something that you can make if you have access to certain natural materials. If you do make your own paint, you just have to recognize that if it's made from natural materials, that it will fade or break down over time because it's not a lot of the stuff you buy with has been tested over time and made sure that it's durable. So some general items to consider with any paint that you're using is you always want to think about toxicity. And then you also want to think about cleanup. How hard is this to clean? Do I need to protect the client's clothes? Is there an irritant, a potential irritant if somebody has allergies? How do you get rid of them? Is it going to hurt the environment to be putting it down the drain? How are you going to be handling the paint itself? So you want to think about the toxicity of the paint. And then you want to use a surface, you want to pick a surface that's intentionally used for painting. So the type and size needs to correlate with the paint, the type and size of the brush, and the desired outcome. And there's all different combinations that you can use. The type and size of brush, does it always have to be a brush? You could also use other things to paint with, sponges and your hands, and there's lots of different things that you can use to apply paint. Preparation of the painting surface. Do you need to gesso it first, like for acrylic paint? Or does it have to be sized? Or is it okay to be left fluid? Drying time of the painting itself. Is there any way you can change that drying time, like with a medium or a hairdryer or something like that? The storage for the paint. What happens with leftover paint? If you put it out on the palette, can you save it? Can you not save it? What do you have to do about the leftover paint? What about the paint itself in the cabinets, you know, when you're keeping paint? Do you need to lock that cabinet to make sure that people are only using what you want to give them access to? How do you keep the client safe? And then you also need to consider the age of the paint, because paint does go bad, just like the inks I was talking about. And then, of course, you always have to think about price and access. Do you have access to those things? Okay. So that is what I wanted to go over for about paint, and there's a lot more out there. So I highly encourage you to do your own explorations on different types of paints that are out there, and doing your own research on the internet about the different qualities of those kinds of paints. In the next video on my demonstrations, what I'm going to be doing is going through and showing you some different techniques with the different kinds of paints that I most typically use with clients. Okay, well, thank you for joining today, and I look forward to seeing you next time.
Hi, I'm Dr. Penny Orr, and today I'm going to be talking about different painting materials. In the PowerPoint, I start with talking about oil paints, and I'm not going to be demonstrating oil paints because oil paints are more toxic than other paints, and the cleanup process is more toxic. They're also much more difficult to use. You need to have a steeper learning curve and know more techniques to be able to use oil paints well. So I don't usually use those with clients. So I'm going to start with acrylic paints. There's a couple things with acrylic paints you need to think about. First, you need to think about the type of acrylic paint you're using. So this is a craft acrylic paint, which is the cheaper end of acrylics. So there's craft level, and then there's artist level. The artist level is more expensive. The difference between a less expensive and a more expensive acrylic is that the less expensive ones, and this was painted on here, are not as opaque, which means the white of the canvas is showing through. The more expensive ones are more solid and more opaque, and which means the things underneath don't show through as much. The issue is that one of the really nice qualities about acrylic paints is that when you are painting and you make mistakes, you can cover it up. But if you're using a cheaper acrylic, it's not going to cover up that mistake as well. Another thing that you have to consider with painting, with any painting, is the type of brush that you're using. There are many, many, many types of brushes out there. For acrylic paints, because the canvas has gesso on it, that's the white, and the gesso primes the canvas to accept the paint. It does not absorb water. So you want a brush that doesn't hold a lot of water so you can control the amount of water, and that's what this is. This is a synthetic brush. Sometimes these brushes are also made from like horsehair or the mane or tail, where it's a stiffer bristle and it doesn't hold water as much. This type of brush is a natural hair brush. It's much softer and it holds water really well. So this type of brush would be used for watercolor paints. When you're choosing your brushes, I like to give my clients a variety of sizes and shapes. The brushes themselves they can be flat, they can be chiseled, they can be round. There's all different kinds. So I like to give a variety of choices. Oftentimes the canvas itself can be pretty intimidating. So there's a couple of things to think about when you're considering what canvas to use. So this is a canvas board, and that means that it's thin, but it's still covered with canvas and it has cardboard in the back, so it's hard. I like canvas board because it's a middle ground. It's stiff so that it works well when you're painting on it. It holds its shape. It doesn't bend if it gets wet. But it's not as expensive as a stretched canvas. A stretched canvas looks a lot like this. They're usually primed with gesso like this, and they're framed with wood underneath. They tend to be a little more expensive, so these are cheaper, and that's why I like to use them with clients, but they still have the integrity that they feel like a real painting. They also make a canvas paper
that you can paint on. And that's very nice as well, but often I find that clients think that the canvas itself is not, doesn't feel as professional. Okay, and then the other option you have is to work with unprimed canvas. So this here, this is a canvas is the background, and it was not primed, which means it doesn't have that white gesso layer. So the background was not primed. I painted it with acrylic paints, and what happens when you're painting on unprimed canvas is that it soaks through. So it just creates this nice blended effect, and it soaks in, you can't get any detail, it expands. But I like to do that because, as you can see in my own art, I later come back and embroider on top of the canvas. If it was gessoed, I wouldn't be able to embroider on it because the surface would be too hard. Okay, so let's talk about working with acrylic paints. So when I give a client a canvas, sometimes they find it very intimidating. So I might give them a pencil to start with to draw out their design and then do their image. One of the things that you want to be careful about is the minute you hand them a pencil, they're going to get very tight and restrictive and worried about how it's going to look. So if I have a client that I know is going to be very anxious, I will not give them a pencil. I will just give them the canvas to start. If they're intimidated by a blank white canvas, one of the things I have on hand is I pre-paint a bunch of canvases with just a solid color. Because sometimes if you start with a solid color, then it's easier to get going on the canvas itself. Acrylic paints have some different qualities. So acrylic paints can be used with less water. And when you use it with less water, it tends to be thicker. The thing that's nice about acrylic paints is that it can, you can build surfaces with it. So you can get it very thick if you want to, kind of like an oil paint, but it's more controlled and less toxic. The other thing about acrylic paints is if you use more water, you can thin it out and use it more like a watercolor, and that makes it more fluid. Now, because like I said, we're working on gesso, when you're working on gesso, the background does not absorb very well. So it's so it doesn't have that saturated look. So when you add water, more of the white is going to show through. But you can certainly do lots of layers. One of the things I keep in my studio is a hair dryer. So if I had a client who say they were working on this and they wanted to add another layer of color and they wanted to do it right over top, I give them the hair dryer and they can dry it really fast and then they can go over top. So acrylic dries pretty quickly, which is nice. Acrylic paint is plastic in nature. That's its base, its foundation is a plastic. So that means that when you're working with acrylics, it is still malleable while it's wet. So you could wipe it off while it's still wet. You can blend it and change it. You can come in with a hard card or a surface and scrape it and change how it's working. But once it's dry, it's dry. This is an example of a card that's been scraped. So a couple layers of paint were put on and then it was scraped using an old credit card or, you know, a card you get from a store that you're not using anymore. And so you can scrape it and create lots of really nice sort of textures and patterns. And so I'll just have a bunch of these handy and then anybody could pick them up. But you could see, like, you look at this one, this was just random. You look at this one and a client you could see easily could pick it up and make this into a really nice landscape. So they're not starting totally from scratch, but it sometimes helps those who need a little boost or are intimidated by the white page to get started. The thing that's nice about having a pre-colored background is that it shows through. So it can tie your whole piece together. So you can paint over this whole thing and have no pink showing, except for little lines around the edges of the things that you're actually painting. Another thing that, and this is the technique that I want to show you today that I do with acrylic paints. So with acrylic paints,
like I said, one of the qualities that's really nice about it is that it's opaque, which means it covers itself up really nicely. With this project, you can do a lot of things. So let me show you what it looks like, and then I'll tell you how I use it with art therapy. So what I did with this is I painted a layer of paint, like my pink one. I painted a layer of paint, and then I use masking tape or painter's tape, and I put tape down. It can be done abstractly or randomly, or you can try to make it look like something. They can use the full width of the tape, or they can tear it up into smaller bits to put down. And you just put it down on the canvas on the layer of paint that you've got. And then you paint another layer. Let that dry, or use the hairdryer, and then put down more tape. And then paint another layer, and let that dry, and then put down more paint. And then once it's all dry and done, then what the client does is come back in and starts pulling the tape strips off. So this is a form of resist painting. Resist means that you use something that doesn't hold the paint, and that allows you to create imagery within the paint itself through that resist process. You might be most familiar with resist in terms of batik types painting, but this is using it with acrylics. So you can see I did kind of like a tree or a branch surface. And I've got a big piece here. And the thing that's fun about this for clients is you don't always know what you're going to get in the end. You don't know what it's going to look like. You can try to plan it some, but you don't know what it's going to look like in the end. So it's kind of like that surprise sort of thing, or present feeling to it, because you're finding out together what this is going to look like, rather than the client planning all of it. It's also got a randomness to it, which is really good for clients that struggle with ambiguity, or struggle with being comfortable with change, things like that they can't control. Because of the randomness of this, and that they can't control it, that helps them to work through situations that they can't control while they have you for support. Okay, so I think I got most of the tape off. There might be a little bit more. So you can see I had several layers of paint. I didn't have really good selection of paint for this particular one, but there's lots of layers here. Started with a green, and then I added blue, and I had some pink, and then I added blue again. And you can keep building up the surface that way. Therapeutically, the way that I use this resist tape method is I will plan to use this with, like I said, people that need to understand that some things don't go away. So I worked with some children that had behavioral and trauma problems. They had a trauma history and had behavioral problems. So I gave them a project, and we worked on it. And then when it was finished, we talked about how some things don't go away. Some scars last forever. And those scars make us who we are, and that we are layered, that we have lots of layers, and we have layers that we put on top of other layers to repair, but some of those scars last forever and they change us. And so working with these children who have trauma background, it helps them to come to terms with and accept their scars, and accept that they're always there and hidden underneath, and that we need to work with them and expose them, but also that they make them who they are. And who they are can be beautiful even with the scars. So that's kind of a metaphor that I use with this particular type of process in acrylics. Next in the PowerPoint, I talked about inks. I'm not going to be going over inks because, again, that's something that I tend to use more with more advanced clients, depending on the cultural background and experience with ink. It depends, you know, on their preference and all of that, if I'll decide to do it. So what I want to talk a little more in depth on now are watercolor paints. Watercolor paints have a binder in them that is soluble to water. That's why they're called watercolor paints. So they are affected by water. The watercolor paints come in many forms. Again, different quality levels and different grades. So you can get watercolor paints that come in a tube like this, and you can get a watercolor paint that comes in a palette or a container like that. Generally, when I'm working with children, I like to use this with the hard pieces of watercolor, because children make a mess and they use a lot of paint. And if you squeeze paint from a tube, they're going to go through it very quickly. So this helps to give them structure and to manage them in how they use the watercolor paint. When I'm working with adults, I tend to give them these paints. I tend to give them the watercolor paints that come in the tubes because it's seen as more adult, it's more artistic, and also I can show them, you know, you just put a little dab on your palette and then use water from there, and they can follow those directions. Sometimes they see this type of paint as being childish, and so they might not be as willing to use the watercolor paints to create an image. Again, like I said before, you also want to think about the brush that you're using. It's important to use a natural hair brush with watercolors so that it absorbs the water really well, so that you can then wet your paint well and use the paint to paint with. One of the things to keep in mind with any kind of paint is that in order to learn to paint, you have to use many steps. And we tend to think of something like watercolor painting as pretty simple and straightforward. But if you think about it, it's actually fairly complex. If you've ever tried to paint with a child, like a 3-year-old or a 4-year-old, you'll realize that pretty quickly that it's more complicated than you were thinking. So in order to work with watercolor paints, you first have to wet the brush. So that's step 1. And then you have to come in and get your paint. So that's step 2. And then you have to paint it onto your page. So that's step 3. And then when you're ready to get a new color, you have to wash your brush. Step 4, dry it on some paper, make sure all the paint's off, get a little more water on it. Step 5, and then pick your new color and you start over again. So it's actually a little more complicated than it would appear. There's 4 or 5 steps. And when you work with little children, what you find is that they just start mushing all the colors together and your palette gets ruined. And that's okay with little kids. So that's why I use these kind of paints with little kids, because I can clean them up easily afterwards if they've messed up all the colors with each other. I can also buy the little palettes of the little things that paint separately, and then replace them when they run out, which is really nice with children. Okay, so there's lots of different ways to work with watercolor paints. I'm going to show you a couple. So this is just standard watercolor painting that we all think of. Is you just work on a piece of watercolor paper. There are many different grades of watercolor paper. The thicker the paper is, the more tooth it will have, and the better it is at absorbing water. You want it to have the ability to absorb, but watercolor paper can get really, really expensive. So I try to buy a quality of watercolor paper that isn't horribly expensive so that people don't feel like they're wasting it, but at the same time has enough absorption to it that they can actually use them as watercolors are intended. What little kids try to do with watercolor paint is, let's see if I can mimic this, is they keep the paint very dark and use very little water. And you have to work with them on helping them to understand that watercolor paints are supposed to have more water and they are a lighter kind of paint that you use. So this is watercolor painting on just straight watercolor paper. Well, I've got this one out. One of the things that I can show you is that you can use all kinds of surfaces, all kinds of things to change how the watercolor paint looks. So this is just a piece of tissue, and I can come in and dab and it creates a texture. I don't know if you can see that on the page or not. Let me do it darker and see if you can see it. And you just dab and it creates a texture in the paint. So you get some really nice textures. You can also use things like saran wrap or aluminum foil. You can use bubble wrap that you get in packaging to create patterns in the paint itself. Another thing that you can do in the paint that's quite pretty is using what I call kosher salt. It's the bigger grained salt. You don't want fine grained salt. You want the crystal salt. And you put that on there, and then as it dries, it creates kind of this sparkly pattern, kind of like what you're seeing in here, right here on this piece. It's kind of like the salt goes there, and then you get a white sparkle absorption around the salt. Another way that you can work on watercolor paper is called wet on wet. So what you do with wet on wet technique is you just take a big brush and you wet the paper. And my water has a little bit of blue in it because I was just using blue. But you want to soak the paper. And then while it is wet, then you come in with your other colors and paint on it. And what you'll see is that it bleeds. So because the paper is already wet, the color bleeds and gets more, and when I say bleed, I mean it gets more fuzzy. So it's a nice kind of way to work if you have a client that you don't want them to have a lot of control over what's happening, so that they can kind of play with it and see what it does. You can get really abstract. You can, again, come in with other tools and create patterns. So you can do some really creative, sort of abstract work with watercolor paints. The difficulty with watercolor paints is getting precision. So with acrylics, you can get nice hard lines. You can get nice hard lines, and you can be very precise with acrylics. You can go down to very small if you have a small paintbrush, and you can do lots of detail with acrylics. Watercolors, you can't do that with. Watercolors are not good for details. So if you have a client that wants to do a painting with details, do not use watercolor paint. There are some ways to increase the ability to do details. So the first, most obvious that we often see in watercolor is drawing with pencil first. And by drawing with pencil first, what we can do is gain the ability to have the watercolor paint, but at the same time have some precision with the image. And the thing that's good about this combination is the pencil will show through the watercolor paint. So they can do an initial pencil drawing and then come in with watercolor on top and be able to fill in what they've drawn. In here, what I did is I used marker here. I showed you that before, that you can add water to marker. And so what I did is I just colored it in with marker, and then I'm just using straight water to come in and blend that so that it ends up being painted. But I actually used marker first. This technique is nice with children, because then you're not giving them lots of different colors. You give them the watercolor paper, and you could have a design already drawn on it, or they can draw a design with markers, and then you just give them a paintbrush with water and no paint. And then that way they can still make a painting without messing up the different colors. This one just kind of shows a couple different things. This here was marker that I just added water to. The purple was marker that I added water to. If you want, you can, like I said, start with pencil so it shows up. But if you want that design to show up even more, you can paint the whole thing and then come back in with permanent marker. And by using permanent marker, what you do, the permanent marker itself won't run. So it will maintain the image that you want. So if you want precision, you have to come in with different kinds of pens and things like that. So this piece here is an example of lots of different techniques. So you have You have regular watercolor painting. You have the wet on wet technique where they just did dots of color and let it spread. That's what you're seeing here. You have the whiter patches, which is from the salt. And then they also came in with pen and ink and did an image over it with ink. And you can see it comes out, you come up with a pretty nice complex type of an image. One of the reasons that I like watercolor is because you can do so many different techniques with it. So you don't have to be a good painter to end up with a good design in the end. With clients, one of the parts that's nice is that you can work in layers. So you give them one tool at a time. When I have children that have like impulse control or behavior problems, what I'll do is first, give them the pencil and only the pencil and the paper and have them work on the drawing. So that's step one. And then I'll remove the pencil and maybe give them the markers, the Crayola markers, and have them color it in. And then I'll remove the markers and I'll give them the paintbrush. And so what you're doing is you're using the materials to control the behavior. So the structure, the inherent structure in the material helps to, and being able to do different steps helps to control that impulse behavior so that they can end up doing something that is meaningful for them and that they get a good result from. The other thing that's lovely about watercolors is they can do the exact opposite. You can have somebody work on something like this, where you're doing wet on wet, you're doing more textural and techniques, where they don't have control over what's happening. So you can help clients that are too controlled, clients that are too anxious or worried, to loosen up a little bit and learn to accept that sometimes that randomness can be a really beautiful thing. So it can help them to loosen up as well. As we talked about on the expressive therapies continuum, color can add quite a bit of mood or emotion. And you can see that with these different paintings that I did. So with this one, I've got very compatible colors, yellow and green. And so it's very calm. This one, I used opposites. I used red and green, which are opposite on the color wheel. And you can see that they create more contrast, and it's not, quote unquote, as pretty. And what I mean by that is that it's not as calm. It feels more, because of the color choices, it feels like there's more energy there. And it could be interpreted as good energy or bad energy. And then when you use the full color spectrum like this one, they've got blues, warm, cool, warm, cool. You can get a sense of balance. I think this piece here feels very balanced with that cool, warm, cool, and then the trees organized across. So it has energy, but it's also calm. So this one's, I think, is pretty balanced. That one's calm, and this one has more energy. And it's because of two things. It's because of the color choices that you're using, and it's because of the type of line that you're using, or the type of texture that you're using can change that. Okay, the last type of paint that I want to talk about in my demonstration is tempera paint. And then tempera paint is very inexpensive. I like these because they're really nice and big tempera paints. And then what that allows is for children or people with disabilities to have an easier time accessing the different colors. Tempera paint is pretty inexpensive. Tempera paint can work very well as a paint, as a type of paint. You can see it looks a lot like watercolor when it's wet. So it's not as opaque as acrylics. You can't cover up as much with tempera paints as you can with acrylics. The difference is with tempera paint, when it dries, it becomes more chalky. So tempera paintings don't last well if they're on a surface that bends. So for instance, this kind of paper is very bendable. So I wouldn't give this child tempera paints to paint on this, because the minute they bend it, the paint's going to flake off because of the chalkiness that's natural to tempera paints.
Tempera paints are non-toxic, so they're really good at working with kids. They're inexpensive, so you can cover big areas of color, but the storage of the final art piece doesn't last as well. So with tempera paints, I usually don't use tempera paints with adults. I usually only use them with children because of that fact. They're not something, because most kids, you know, they do the picture and then they're done and they don't remember what they did or they don't care about it. But with adults, if they want to keep the piece, you need to use paint that's going to hold up long term. Okay, so those are just several of the paints that I went over today. There are many, many more things you can do with paint. In the PowerPoint, you'll see there are lots of different paint, and every day there's new things coming out. Like there's a paint that is an alcohol-based watercolor paint, and it's really just stunning in how beautiful it is. Again, because it's alcohol, there's a little bit of toxicity there, so I'd probably only work with adults. All the time they come out with really fun stuff. So this is an acrylic paint with sparkles in it. This is an acrylic, a varnish or a glaze that can go over top of a painting that also has sparkles in it. I don't know if you can see the sparkles. So there are many different things that you can do with paints. There are gold paint and silver paint. There's lots of different things out there. So this week, what I want you to do with your painting is you're going to explore paints in your journal, and then you are going to choose a painting that's done by an artist, and you're going to do it in a different way, in a different manner. So for instance, this is an oil painting. It was done by one of my students that I have in my office. And if this was the painting that I was choosing to recreate, because it was done in oil, I don't want to use oil paints in the exercise I'm asking you to do this week. What I want you to do is pick a different kind of paint. So I could try to recreate this image in watercolor or acrylic or pen or like an ink type, black and white. I want you to recreate a painting using a different type of paint so that you can explore how it looks different than the type of paint, between the two types of paint you use. So I find that oil paints tend to have a warmth to them. Because of that oil, it creates a little bit of a shine and a warmth to them, whereas acrylics can end up looking pretty harsh or hard. They're more of a hard type of paint. So you can sort of see that here. But I could still recreate this painting using acrylic. So that's what you're going to be doing this week in your exercise. Have fun with that, and I will look forward to seeing what you guys come up with.
Hi, I'm Dr. Penny Orr, and today we're going to talk about printmaking. We're going to talk about the characteristics of printmaking that make it unique from other materials, such as the benefits of repetition and multiple versions. We will explore the therapeutic qualities of repetition and alteration and being able to have those multiple products. We'll work with simple printmaking techniques such as stamp making, natural object printing, and artist cards or postcard making. Printmaking is unique from other art products because it has that aspect of being able to make multiple copies. So people tend to be less intimidated by printmaking, maybe because they see it more as a craft rather than a fine art. So it's not as intimidating, but also I think the reason it's not as intimidating for clients is that you can make multiple copies and they all come out a little bit different, and then you can pick your favorite ones from what you've produced. So it's okay if they don't come out perfect because you'll find the one that you do like. Also, if it's not perfect, you can go back in and edit the original plate that you were working on and change it, or you can take the final products and make enough copies that you can alter the final products and make changes until you find things that you want. I think it's a really great metaphor for life, that with printmaking that you have multiple shots at things that you can edit and change as you go. And you can use creative problem solving to be able to do that. So printmaking has some built-in aspects that almost guarantee success for the client, and that is that ability to make multiple copies, to have multiple tries at getting things the way you want them. And then, of course, being able to alter it with the finished product, adding paint or coloring them or cutting them, however you want to alter them. There's also a built-in reflective distance to printmaking that we have it in a lot of art processes, but it's a little bit stronger in printmaking. And that is because you have to, with printmaking, you have to do your print on a plate, and then you print from the plate onto paper. So instead of your thoughts going directly from your head to the paper, you're doing this other step. So it goes from your head to the plate, and then the plate to the paper. And a lot of times you have to think in reverse, because with printmaking it prints in reverse. So there's a really strong cognitive element to that provides for that reflective distancing that clients need sometimes when they're working through issues. Printmaking materials are pretty easy to get and fairly cost effective. Most printmaking techniques and tools could provide a hindrance for some. So there are safety concerns with some of the tools about them being sharp, and then also some of the chemicals that they use. So more higher or fine art types of printmaking, such as lithography or other types of intaglio, things like that, we won't be doing with our clients because the process is too complex and a lot of times has emulsions and things like that that are actually pretty toxic. So we don't do those forms, but I'll show you the types of forms that you can do with printmaking that are easily accessible. Okay, history of printmaking. So engraving is one of the oldest forms seen through carving and etching into different materials, like in Lascaux Cave in France. The Sumerians also used ceramic or clay cylinders that they would press marks into, or sometimes even carve into stone. And then these slabs could be printed from, or they even put them on rollers, and then you could roll the design out. Several other cultures began utilizing print, making various forms during the 2nd century. The rise of printmaking really expanded pretty consistently in the 15th century because of the printing press. Production historically has been on different types of surfaces, many times paper, but occasionally, particularly some of the older forms, like you'll see in China, is on fabric. So you have fabric printing, you have paper printing, parchment, other supports, and various techniques are possible. We have the increased ability to make multiple copies of an image, and this also allows for alterations, as I said before. Techniques in printmaking are divided into 3 major processes: the relief, the intaglio, and the surface. The surface processes are divided into 2 categories: the planograph, or lithograph, and a stencil method. And then methods of printmaking are often combined. One of the things you want to familiarize yourself with first are some of the art making tools with printmaking. So with printmaking, you need to have brayers and the ink, and I'll be showing you all these things in my demo. You need to have your tools. If you're going to be doing carving, that means some carving tools which can be sharp. You need to have your printing ink. You might need a press or some other way of flattening the paper. I'll show you some different techniques without a press because we don't always have those. Okay, so the first type of print I want to talk about is a relief print. So the negative or non-printing part of the block or plate is either cut or etched away, leaving the design standing in relief or standing up. So what is printed is what is standing up. The surface can also be additive in nature. So you can cut away at a surface, like with woodcut, where you cut away and then what's left is what's printed, or linoleum cut. Or you can add. So you could take glue and use the glue to draw a design, let the glue dry and harden, and now that glue is standing up from the surface and you can print it. You can do cardboard cutouts and add those to a surface. You can put a leaf on a surface and print that. So relief print is basically just printing anything that stands in relief or that stands up off the surface so that you can capture that form. Probably one of the easiest print making in relief to do is called a rubbing, or a crayon rubbing, or a chalk or charcoal rubbing, where you put something under the paper and then you just use the side of the chalk or the crayon and rub over it to capture the texture. But there are more complex forms too, and we'll talk about those. And then we have intaglio prints. Printing done from ink that is below the surface of the plate. So this is the exact opposite of what we were just talking about. With relief printing, you're printing what's above the surface. With intaglio printing, you're printing what has been cut away. So it involves a process of embossing the paper into the incise lines. So that means you have to have enormous pressure and you need to have a printing roller. It produces a very rich printed surface that has a three-dimensional quality. There are a couple different methods. There's engraving, where your design is cut into the metal with a graver or a burin. Dry point, where you're scratching lines into metal plates with steel or a diamond point needle. Mezzotint, where the entire plate is distressed and then details are added. Stipple engraving, stippling is dot making, is used to create the design. And etching, where lines or textures are bitten or etched into the metal plate with a variety of acids. All of these processes are pretty complicated, and many of them have dangerous qualities to them. So I tend to shy away from doing any type of intaglio printmaking. And then you have surface printing. Surface printing means basically that your images are printed from a flat surface of the metal or stone to another material. So your first one, your relief, is you're printing the part that stands up. Your intaglio, you're printing the part that is lower on the plate. And with surface printing, you're just printing the whole surface. It's just a flat surface. So there are different kinds of surface printing. There's lithography. And with lithography, you draw on a stone or paint on a stone with a greasy litho crayon substance. And then the undrawn areas, the areas you don't draw, actually pick up the resist ink, and then you print that. Again, it's really difficult to do lithography because you're working with pretty complex materials, and you have to have these really big stones that you work with and a printing press. Another type of printing that is very accessible for us is called screen printing or silk screen printing. With silk screen printing, you're using a frame with a piece of silk in it, and you're using a stencil, or you're using a resist or a blockout ink that prevents the ink from going through the surface. So once you have your stencil, you put it onto the screen print, and then you pull the ink across it, and the ink goes through any place that's not been made resist, and you get your image underneath. So we tend to think of screen printing as something that's used for like making t-shirts, and you certainly can do that with clients, and I find that clients really enjoy doing that. But you can also make really cool posters using screen printing, and then other things like cards and things like that you want multiple copies of. A really simple form of surface printing is using just a regular old stencil. Doing a cutout design of a stencil, or with any kind of thin, strong material, so like a plastic or something that's going to resist the paint, and then you cut out the image, and then when you roll the ink over it, it just fills in the stencil part. You can also use it with like spray paint and other things like that. So for linoleum lino cuts, there are considerations. On the MDB and the ETC, there's different surfaces. You need to be thinking about the storage and all those kinds of things. It's very complex. All of these printing processes that are more of the fine arts that I just talked about are very complex. So of course they're going to be very cognitive, and they're highly mediated, and they have lots of steps to them. Some of the simpler processes like surface printing don't have as many steps, are more accessible to the clients, and while still have a cognitive aspect, also can be very expressive. So what are some of those methods that we do tend to use a lot with clients? So the first is monoprinting, where the images are painted onto a surface and then transferred onto a paper through rubbing or pressing. So a monoprint is exactly what it sounds like. You only get one print from it. So you take a piece of plexiglass or some kind of surface like that, you paint an image on it, and then you press the paper on it and pull it off, and you have an image. You can sometimes get two prints from that. The other thing that's kind of nice about monoprinting is you can slowly build up the surface and add things to it, and then you still get a little bit of the old piece showing through underneath. So monoprinting, the images are painted onto a surface and then transferred to the paper through rubbing or pressing the paper onto it. Something called gelatin prints, which I'm going to show you. It's made from a thick gelatin, and then you ink the surface of the gelatin. Textured items are pressed into the surface and then removed, and then the images are transferred to the paper through a gentle rubbing on the back. And then there are, of course, stamps, which we're all pretty familiar with. You can buy stamps, but you can also have clients make their own stamps. And stamps are inked and then pressed onto the paper. So instead of putting the paper onto the surface, like with the gelatin, you're going to put the stamp onto the paper. You can do really nice things like layering with monoprints. You can, or any kind of prints, you can layer them, doing one print on top of another. You can use very simple things like with monoprinting, you can use old paint that you're going to maybe throw out or not use or you don't like anymore. And you can use things like trash bags as your surface that you put the paint on, because it will create a really nice texture. And it's a resistive surface, so the paint will come off onto the paper. There's lots of really creative things that you can do with monoprinting or with painting and different print products as well. You can do monoprinting with Elmer's glue, so you can mix the paint with the glue, and then what that does is it creates these kind of patterns in the paint. You can use everyday materials when you're doing painting, just things that you collect around the house or things that you find in nature to use as part of your, to create your textures, whether it's a rubbing or a monoprint or a different kind of print. You can use all kinds of found materials. There's a lot of really fun types of printing for little kids. So like one is called shaving cream printing, which I will show you, and then where you put shaving cream down and then drizzle color over it and then you print from it. Also bubble printing, where you put some dish detergent and a tiny bit of water in a container and add paint to it, and then you give them a straw and they blow through the straw and make bubbles. And as the bubbles stand up over top of the container, then you can roll the paper over top and the bubbles pop and leave the paint on the paper. So there's lots of really fun things you can do with printmaking. The thing that's really nice about printmaking is that you get a lot of pieces of paper that you don't want to necessarily use for that particular project. So I work on a print series, and I can get 100 pieces, but I might only use one or two for the actual finished product that I'm trying to make. Now I've got all these wonderful, like, marbleized and textured painted papers that I'm not using for this project. If you keep all those papers, they're great for doing things like cutting them down and using them for other projects, or using them as collage material, or using them as backgrounds for future paintings. So don't get rid of all the excess printmaking things that you make, because you can do a lot of really fun things with them. You can do marbleized paper using a traditional marbling technique, which has some chemicals, but it's actually can be quite fun. I've done that with older adults because they see it as being a more legitimate process. It's not quite so kid-like, but a simpler version of doing marbleized prints is using the shaving cream, and that'll give you a similar effect. You can use gelatin prints, like I said before, where you put the paint down on the gelatin and then you put objects onto it, and then you pull the objects off. It leaves the texture, and then you print from that as well. A lot of printmaking materials can be pretty easy to find, and you just have to look around. So like bubble wrap, the bubble stuff that you get in packages makes for great printmaking textures. You can use regular old styrofoam, like from your egg cartons, to draw into and create designs and print from. You can use just you can make your own stamps from erasers and things like that that you have. So there's lots of things that you can do with printmaking if you get creative. So the main project I'm going to have you guys working on is something called artist trading cards. I don't know if you've actually seen these before. They're usually about 2.5 by 3 inches, and it goes back to like 1990, where a Swiss artist, Vancy Sternemann, was inspired to produce a catalog of his work. He wanted to put his work out there in a format, but he found out that the printing costs were going to be too expensive. So he didn't do anything with it. And then in 1996, he decided to make the cards by hand, and thus the first artist trading cards were created. And so the idea is that you make these and then you can trade them with your friends. And I'm hoping that you will make these and trade them with other people in your class, and also send me some, because they're quite fun to collect. Okay, so that's all I wanted to talk about really with printmaking. And in the demo, I'll be showing you several techniques, several different ones that you can use and explore in your process of working through what is therapeutic about this particular media. Thank you.
Okay, today I want to do some work around printmaking. And first, in printmaking, what I want to do is introduce you to the variety of tools that are possible. So with printmaking, like I stated in the other lecture on printmaking, you can work in many different ways. Some basic tools that you're going to probably see or need are a brayer, which is you use to roll ink out onto your ink pads. You need something to hold your ink, which I use just egg carton tray tops, and they work nicely to hold the ink, and then you can throw it out when you're done, so you don't have to worry about it. So you need your ink. I have different kinds of ink. We've got a litho ink and then a fabric ink. So you have different types of ink that you can use, and there are more types than just this. That just happens to be what I have. You can also use regular old paint rather than specific inks for printing. So particularly with monoprints and things like that, you can use regular paint. Another way to use ink, like if you're doing stamping, is you can have stamp pads or ink pads that you can use with your stamping. So you need a brayer, you need something for your ink, you need a plate, something that you print on, and there's all different kinds. This is a monoprint plate, which is just plastic that you do your image on and then you press and pull off. This is a gel pad. As you can see, it's literally made from a gel. The thing that's nice about the gel pad rather than this pad is that the gel is soft. So when you press textured items into it to remove the ink and to make textures, it holds the details better. This will smudge more and won't provide as much detail. So these are two plates that are potential that you can use. You can also make your own plate. Like this is just one that I carved. It's a soft substance that I used carving tools to carve. So it's kind of like, you can use a wood block, or you can use foam, or you can use something like this as more like an eraser material. And then you can carve it out to create a plate there. You can also buy lots of fun things that you can print. So there's a type of printing where you print fish. And so this is an example of a fish mold that somebody made, but you can ink it up and print it as well. And then you want to have a collection of things that you use, like this is just bubble wrap that you can push into your ink to create textures or patterns. So there are lots of tools that you can use to embellish your surface once you put the ink on or the paint. And then you need a way to smooth the print itself. So
one that I use that's really easy is just a wooden spoon that's got a nice smooth back surface. So you just place the paper over top of whatever it is you want to print, and then you run the spoon over it, and that helps to press it down. You can also use your hand. You can use a brayer that doesn't have ink on it to get a nice smooth surface. Or if you have a printing press, you can certainly use that as well. Okay, the first type of printing I want to demonstrate for you is relief prints. Like I said, relief prints, you're printing what is left on the surface. So there are different types of relief printing. The easiest, what I'm going to be showing you are ways that I have done printing with clients. So the first one are the linoleum cuts. Now the linoleum cuts, you have to have a client that you feel is pretty trustworthy, and you need to teach them how to do it. So for instance, with this is a linoleum like rubber. Linoleum used to be like literally linoleum, like you put on the floor in your house, and it was very hard and very difficult to cut. But they now come out with products that are much softer and easier to use, and that you can cut a lot easier. So in order to do these, you need a linoleum cutting tool. I like this type of tool because it has a back that opens up and you store all your different cutting edges in here. So there are different widths and points and roundness that you can use to get different textures within your linoleum plate. So in the linoleum plate, the way you start is you draw your design in pen on the linoleum plate, and then you cut out all the areas that you don't want to see. And those will remain white. Anything that you leave will be colored. So once you have your plate finished, then you need to pull out your ink and your brayer. And with your brayer, what's important is that you get a good consistent layer of ink on it. So you kind of do this up and down motion where you're tapping it to make sure that it's moving around and that you're getting all of the sides. And then once you have it sufficiently to a level, where the ink is smooth on your brayer, then you want to ink your plate. You might want to wear gloves for this, but of course I didn't manage to remember my gloves. But you just roll it out very smoothly across the plate, and you want to go both directions so you get all of the plate. Now, if you look at this probably has too much ink on it because you can't see a lot. But the thing that's really nice about printmaking is that it doesn't matter. You can do a print with just a scrap piece of paper for the first one if you think there's too much ink on it, and then you can do another print with with the nicer paper. So I'm just using some scrap, and all I'm doing is holding it down and then gently rubbing the back and making sure that I get all the edges. And then you pull it up and it looks like that. So you can see this turned out fairly nice. There's a little too much ink in here, but other than that, it turned out really quite nicely. So I have a choice now where I can ink it again, or I can try pulling a print with it just as it is and see. And that's the beautiful thing about printmaking, is you can keep trying different options until you get what you like. So I'm going to pull a second one on scrap paper just so that I can see what that looks like. And then I can decide, do I want to take on my nice cards, do I want to print onto them with my first ink, or do I want to pull one and then print with my second? So that's my second one. So you can see that you can see the detail a lot better in the second one, but the first one has really nice color to it. So I have to decide which I like personally better, the one with a lot of color on it or the one with less color, but really good detail that it shows. So I'm going to ink it again. And again, you want to get your roller so you have a nice consistent layer of ink on it.
And then I'm gonna take one of my nicer cards and use that to pull a final. Now, this is the hard part, is getting it to line up exactly the way you want it. So one of the things you can do, if it's small enough, is you can place it yourself. So that way I can center it better. And then again, you want to press down. You can even flip it over once you have it on there and then rub it. And then you pull it. And again, this one has a lot of ink on it, so I might want to do a second one. Do it this way again. Now, by nature, I am a pretty messy artist, so you can already see I'm getting blue on my paper where I don't want it, stuff like that, and that's pretty normal for me. Hopefully you're not as messy an artist as I am. And then we've got another one that we can use. Now you can come back into these and you can color, once they're dry, you can come in and I could color this. I could cut pieces out if I wanted to. I can cut these out as a whole and then glue it down onto another piece of paper if I want to do that. So the thing that's lovely about printmaking is there are so many different ways of working. Now with a linoleum cut like this, you are going to want to wash it and get the ink off as much as you can. So because once you have a cut like this, you can keep it forever and keep reprinting it. So that's one of the things that's nice about doing a linoleum plate. Another simpler, cost-effective way of creating this type of a print without the sharp tools, like if you're concerned that people are going to cut themselves. Oh, I wanted to show you one more thing. When you're cutting, you always want to make sure the client is cutting away from their hand. Don't ever let them cut towards their hand because it can slip and then go right into their hand and cut them. So you don't ever want to have them working towards their hand. So another way that you can work is just using a regular pen. Now this I'll do with little kids because you don't get a fantastic result, but it's fun for them. So what you do is just use a regular pen and create a drawing. And this is the top of an egg carton. So I just used foam, like from an egg carton. The foam trays that you get with meat also work, but you need to make sure that you put them through the dishwasher and totally sanitize them because they might have bacteria on them. So as you can see with this type of a print, because I'm working on a surface that already has something printed on it, it's a little bit hard to see. So one of the nice things about this type of printing or with a linoleum block is you can work on it and then ink it and print your image. And if you don't like it, you can go and add more. But see, you can get a pretty nice print. It's harder to get as much detail as you can with a linoleum block, but it's much safer and easier to use with children. So if I felt like there wasn't enough detail in my drawing and I wanted to say add a house, I could now come in and add that to my plate. Now you can always add, you just can't take away when you're working on a plate. So then you can add that, ink it, and take a print.
Like I said, you can use the back of your hand when you're doing this. You can also use the back of a spoon, which would probably be a good idea with me since I end up with ink all over my fingers. And that way I would keep my paper clean. So you can see I added the house onto this one. So that's one of the things that's nice about printmaking is that you can change things as you go along and you're not stuck with any certain end result. Another type of relief print that you can make is called stamping. And so you can buy stamps that are pre-done and use an ink pad. This ink pad's dry, I think. There's a little bit on there. And you can get your ink pad in all different colors. So you can do inking, you can combine methods. So like if I have this one and I want to add to it, I can add to that. So you can do different types of you can combine different types of printmaking together. You can also make your own stamps. So these, this is a pack that I bought. They're pre-cut round. It's the same linoleum cut material as this. It's a little thinner, but it's the same softness. And then the nice thing is it comes with a sticky back so that you can stick this to a block of wood or a piece of plastic or something like that to create a handle so that you can print it easily. So I'm going to stick it to the back of this one. So I just stuck it to the back of a different stamp. And you have two methods that you can use with this. You can use the brayer and cover it just like you do the other ones. And I'm going to do that because my ink pads appear to be a little dry. And then you can print it. Let's see what side's up. Okay. And you can see as you keep going, you get different levels. So you can make your own stamps, and you can make them out of, like I said, this stuff that's just like linoleum. I bought like a 10 pack, and then you can cut different ones. You could also use common pink erasers, but they're a little bit, they look a lot like this, but they're a little bit harder substance, and so you don't get as clean of a cut. So it's really, and these are very inexpensive to buy, so it's really better to buy some of these and cut them to smaller sizes if that's what you want, but they're much easier to work with. So stamping is another option with a relief print. Another type of relief print can be made with found objects. So what I've done here is I just took a piece of cardboard, and you can glue things down, but then you have to let them dry overnight. And what I used is some double-sided tape. Now, if you use the double-sided tape, that will stick everything, but you're also going to be printing the tape as well. So you just put found objects down to get some more of my printing ink. To be a little more careful when you do it because you're gonna knock things as well. And so this just comes up with sort of a more abstract sort of piece. And you end up with more of an abstract type print. Again, these are really nice because then you can take a bunch of these, you can come back in and paint on them and color on them. You can cut them out and put them onto different colors of paper. It's just a starting point, which is really nice. And you can take, 50 of these and make 50 of them and do something different with each one. So it's a nice process, and it's cheap and inexpensive and easy to do with found objects. And you can also print things that you just find. And this is almost a monoprint type process. But you can make several prints from it. It's just you're going to get different kind of textures each time. So I just took some plastic paper that I had, some plastic wrap stuff. And the reason that this is called more of a monoprint is because every time you pull a picture from it, or pull a print, it's going to look a little bit different. So again, you get this really nice abstract sort of image that you can then cut from and add to or change. You can come back in and draw on top of it. And then you have your original plastic that you printed from, and you can keep pulling prints or you can throw it out. It's up to you. Next, I want to talk about jelly prints and monoprints. So monoprints are just on plexiglass, and plexiglass is, sometimes I'll take the plexiglass out of old frames, old picture frames, and use that. So I'm recycling it. Pretty much any resistive surface will work. You could even put down plastic wrap or trash bags and tape them down so that they're good and straight, and you can work on those. And then the jelly print is a gel substance that you buy. And the thing that's nice is you get a lot of detail with the jelly print. You can use acrylic paints, you can use watercolor paints, anything that has the ability to stay wet for a little length of time. So this is actually a stamper for bingo, and they come in all different colors. But I like them because you can get some really nice circular patterns. So what I'm going to do is mark each page so that you can kind of see the difference. Now with a monoprint, you can keep working over your old surface. Sometimes it makes it hard to tell what you're doing, but you can keep working on it, and then you wash your surface when you're all done. And then you take your print. So as you can see, with the jelly print surface, you get really nice detail. You get all different levels of how the ink is on there, and you get really nice detail, which is why jelly prints are becoming such a fad right now, because you get lovely design. With the monoprint, you get interesting things as well, but it's just a different quality. It's not quite as good as the jelly print. The other way to work on monoprint and jelly print, there's actually several ways, but another way to work is to ink the whole plate. I'm going to do it for both. The difference. Now you can get a device that it's a piece of wood with two lips on it, and it hooks to the edge of your table, and then the other edge goes on the edge of your print plate. And that prevents your print plate from moving around while you're trying to ink it.
So one of the methods that you can do is you can lay the paper over the wet ink plate, and then you can draw on the plate, but you're just drawing on the paper. And you can use your fingers. And wherever you put pressure, it's going to pick up the ink. Actually, just picked up the ink in a lot of places. But you can see the line there that I was drawing. Let me do one more on this plate since it seems to have a lot. So you can kind of play around with different ways to get texture. There we go, that one's better. That one looks the way it's supposed to. So you can see that it picked up the ink where I was drawing and making marks. So that's one way of doing a monoprint as well. And you can just keep taking more and more prints and adding more layers of paint or ink, whatever you feel like. Another way is with the jelly print. And with this one, any texture you put onto it, you can pull it off. So I'm going to start with this texture. And let's see, what other do I want to try? This. And you smooth it. You can also use stencils with these plates. You just put the stencil down before you ink it, and then the ink sticks to the plate. And look how lovely that is. You can really do lots of really cool things with jelly plates. And then, of course, you can use this by cutting it up and using it as part of collage, or you could have them come in and add images to it. It could be a background. It could be all kinds of fun things. So it's only limited by the amount of creativity you use in thinking about how to use these particular tools. Okay, and then as my last bit, what I want to remind you is to make one of your assignments is going to be to make artist trading cards. So to make the card, you want to make lots of prints, and then what I will probably do is come in and add some hand coloring or painting on top of this, add in some words, and I will sign it. So if you send me one of your artist trading cards, I will send you one of mine. It's just a really nice way to remember people and get to know people. With clients, I like to use it to help them reach out to people important in their lives. Like if somebody, like a child who has a parent who's in jail, or like with COVID where we can't actually see each other very often, it's nice to send something like this to someone you care about that's at a distance. So enjoy making your cards, and I look forward to seeing what people produce. Thank you.
Welcome, I'm Dr. Penny Orr, and today we are going to be talking about collage. So in today's lesson, what we're going to be thinking about are looking at the differences between working two-dimensionally and three-dimensionally. We'll also be looking at the concept of making special, making meaning out of for something and making it special, and then bringing together and adding. All of these are really great metaphors within the therapeutic process to help people dealing with challenges. But we will also explore techniques such as doing origami or paper collage, personal shrine making, things like that. Okay, so a couple of concepts I want to talk about first. Two-dimensional versus three-dimensional. So with three-dimensional, one of the aspects that's nice about working three-dimensionally with clients is that it doesn't require the ability to be able to draw. And a lot of clients come in saying, I can't draw. And so they feel intimidated by having to draw. Well, if you hand them a 3D material and they know they don't have to draw, sometimes that makes it a lot easier for them to trust you and to get into that art making mode. Three-dimensional materials can sometimes be novel for people if people haven't studied in the arts or completed arts for a long time. It might be novel to be able to work with clay or work with something that is more three-dimensional. 3D is also more structural. So you have to be thinking about, like if you're working with clay, is it going to stand up? Is it going to hold its own weight? So you have to be thinking about different kinds of concepts to make it work. Two-dimensional art has all the qualities that we've talked about before. And with collage, the thing that's nice about collage is that it is a two-dimensional art form, but because you're using things that are already pre-made and putting them together, it has that kind of structural quality to it that you get with 3D art making. So collage is really nice because it's right in between that 2D, 3D sort of benefits, and you get the benefits of both. They don't have to be able to draw to do it. They have that structural quality where they're putting things together. And depending on what you have them work with, it can be fairly novel. Okay, another concept I wanted to talk about was making special. So whenever we take an object, say I'm walking on the beach and I find a really beautiful piece of driftwood on the beach. If I take it home and I put it on my mantle, I didn't make that a piece of art. I just appreciated its beauty. But by putting it on the pedestal, by putting it on the mantle, I've made it special. I've pulled it out and made it something that you're supposed to look at and appreciate. So I've made it special by how I chose to use it or how I chose to frame it. And we can do that with found objects. So, you know, there might be something like I saw these bottle washers that you hang bottles on to dry them after you've washed them that were really fascinating to look at. You might see some other kind of found objects in your environment, you know, just something random like the lid to something that just has some kind of unique quality about it, a texture or a color or something that is really fascinating. So by using everyday objects, we can find a new purpose for old things, and we can increase our creative problem solving and our creative thinking process by trying to look at old objects in new ways. And then the third concept I want to talk about today is collage. So collage can be used in a couple different ways. It can be used, and it actually was designed, there is a collage assessment tool. So it is a type of assessment that you can use with collage. Again, you'll probably learn about that in the assessment course that you take. Collage tends to be less threatening. Like I said, you don't have to be able to draw to be able to use collage, so it's easier to access for clients. It can help trigger ideas and connections. So if I'm looking through, for instance, if I'm working with older adults, I might give them a whole magazine to look through to find images and I might try to find like a 1960s magazine or something like that, because what it does is it triggers memories. By looking through all those different images, it triggers memories as they go. If I'm working with teenagers, I might want to provide pre-cut images for them to choose from so that I can intentionally focus them where I want them to go instead of getting distracted by the other things that they might have access to. So looking at images and creating a collage can trigger ideas and connections that you might not normally have seen. By taking two images and juxtaposing them, you might make connections that you wouldn't have if you were just thinking about it. Collage making is also a way of organizing chaos. So it's a great metaphor for life, that we can take things and move them around and try them in different ways until we find a pattern that is pleasing or that we like. So collage is also good for that, for organizing chaos. And then finally, collage is also good for fine motor skills, practicing cutting and gluing and pasting and those kinds of things. So let's talk a little bit about the history of collage. So paper collage emerged as an art form in Japan in the early 12th century to provide a dynamic background for their calligraphy. Collage is used often to embellish other images throughout the medieval time period. So they would add collage to things that they were creating. They added fabrics to coat of arms during the Renaissance to create more texture and pattern. There were stamp collectors in the early 19th century who used the stamps and made collages with those. Posters and illustrations or photomontage was a typical thing that you saw in the 19th century. And then in the 20th century, collage really emerged as a fine art form with modernist painters like Picasso and Braque, Dubuffet and Rauschenberg as well. And then with Rauschenberg, it was not only collage, but became assemblage, and I'll talk about the differences in there to increase texture and interest within their art. So there's different methods for collage. There's gluing together, and that means things like photo collage, montages, and other 2D images, flat images, words, lettering, etc., that you glue together. Assemblage is 3D. So you're still gluing and putting things together, but you might be nailing, you might be tying with wire, you could solder, depending on what it is that you know how to do. But assemblage is taking 3D objects and putting them together in a structure. And then you have decoupage, which is probably from late 19th century. The purpose of decoupage was to decorate a surface. And it can be very complex. You use little tiny scissors to cut out things perfectly, and then you put it on the surface and you make sure that it's nice and smooth. So decoupage was about more decorating the surface of something rather than collage, which is more of bringing ideas together. So let's talk about collage as a therapeutic tool. So collage, it can provide structure while promoting freedom of expression. So if you think about the expressive therapies continuum and the MDV, it can be very structured, but at the same time you can play with it. So you can cut out a bunch of different things and move them around and play with what you've got. So it provides that structure, but also freedom for expression. So be on the affective level, but as well as on the cognitive and the perceptual as well. It doesn't demand that perceived idea that you need to be able to draw. So you collage, you just put things together. It could limit your client's opportunity for regression or due to overstimulation. So with some art media that are like very fluid, like painting, you can have clients regress because the medium itself doesn't provide enough structure. So collage is a way to allow for expression, but it provides that structure that's needed for clients that you might have that might regress or become overstimulated easily. You can use pre-cut images. Like I said before, I might choose to use pre-cut images with clients that I want to keep them focused on a certain topic, or I want to reduce the distractions if they have ADHD or something like that. But then I might want to leave the whole magazine or leave a whole box of images for somebody that I do want to stimulate memory. So I can be intentional in what I choose to provide for them to use for the collage. Collage can be very fine cut. You can get in there with tiny scissors and X-Acto knives and be very fine with it. Or you can just tear. And tearing things and putting them together is collage. So collage can work with those fine motor skills, but also the larger skills, that kinesthetic skills as well. You can focus on intentional subjects such as substance abuse or memorializing a loss of somebody or something, or you can leave it random and see what evolves for the person. It can be mindful if you focus on an abstract image or a color, so you can do collage in a very mindful way if you wish. And then you can also, collage is also a great way of increasing visual communication for dementia. I've worked with older clients, and one of the things I've noticed is that when I've worked with collage, because it's stimulating memory, and it's stimulating the visual cortex, that they sometimes create images that they can't even name what it is, but it's an actual image of something. Like I had an older gentleman that created what he called the dancing woman, and it was beautiful. And it was just a woman in a dress and flowy hair, and he did it through collage. He didn't, as he was making it, he didn't realize what he was making, but once he was finished and we were able to give it a name, he was able to understand what it was. So it can have like that opposite effect. It comes from this stored area that he doesn't normally have access to the front through the visual. Okay. Collage was also, in 1993, Longgarden created an assessment that uses collage to do the assessment. She called it the Multicultural Projective Assessment, or the magazine photo collage. And the reason she created it was because she felt like most assessments prior to that were not multicultural enough. That they were very westernized, very standardized, and not very multicultural. So she wanted to provide an assessment process that was structured and that you could control, but at the same time that allowed more freedom of expression. So basically, to do this assessment, you find images and you sort them into two labeled boxes, one for people and the other for miscellaneous items. And then you make sure, as the clinician, that when you're picking out your images, that you include diverse cultures, varied ages, gender, mostly realistic, don't do a lot of cartoon images, diverse environments, and various facial expressions and body placements. And then you can include black and white as well as color imagery. You have them look through the box of miscellaneous items and pick out pictures that catch your attention. So these are your directions for them. Paste them onto the paper, write directly onto the page, or tell me, the therapist, anything that comes to mind about each picture. Select approximately a half dozen pictures of people, paste them down, and then comment on what the people are thinking and saying. Select another half dozen image of the miscellaneous items in the box. What do they stand for, something good or something bad? And paste them down and tell the meaning of the images. And then you select and paste down one image of a person and tell what is happening to that person. Then consider whether the situation will change. And if so, then the client is directed to select an image depicting what will make that change. So you can see it's still a very structured process, just like any assessment, but it really taps into that visual imagination where you're using the images to stimulate projectively what you think is like what the people are thinking or saying, or are the objects good objects or bad objects. So it's a projective assessment, but it's a nice structured assessment as well. If you've noticed, I'm moving a little bit away from constantly talking about the ETC and the MDV, because I think you've got that by now and you should be able to do a lot of that work on your own. And I'm talking more about the media itself and how I use it and how it fits with the work that I do. And that's kind of the progression of this course. I wanted to really make sure you had a good solid understanding of the ETC and the MDV, how you analyze materials, and now I'm moving more towards how do you use that analysis with your clients. In the last part of this course, the third section, we're going to be looking at case studies and look at exactly what it was that we were doing. So in this part of the course, with these next couple sections, I'm going to be making that slow transition to talking about the ETC and the MDV a little bit less and talking more about how I use these things with clients. Okay, so there's a few other types of collage that are worth mentioning. There's something called digital collage, and you probably are familiar with this. You use apps on your phone or your iPad And you can create photo montages of pretty much anything you can find on the internet or of your own personal photographs. It's a really nice, easy process access. You don't have to have sharps, you don't have to have scissors or anything like that, or glue. You have an unlimited array of digital information, and you can sanitize what it is you're working with. So doing digital collage is a nice alternative for if you're working like in a prison, or if you're working within a hospital where you have to sanitize or you're not allowed to have sharps. A digital collage is also really nice for, I have found, for preteens, people that enjoy working on digitally and on the internet as well. So you can do digital collage, and there's a lot of programs or apps out there to help you do that. Another type of collage is called soul collage, and this is actually a trademarked process. You can take a course in how to do soul collage. There's some books out there on soul collage. I do use this with clients, soul collage, but I don't use it in the way soul collage teaches you to use it necessarily. Basically, what you're trying to do with soul collage is you're trying to create a deck of images, like a deck of cards, that have represent different parts. So one of the 4 suits, it represents the inner parts or aspects of our personality. Another suit represents persons who have influenced our life. Another part are archetypes of interest to the creator, and 4 is an animal totem or physical energies. And then, unlike other types of collage that may combine many concepts into one piece, each soul collage is limited to a specific aspect. Each card that you make is limited to a different aspect that you want to focus on, such as an angry inner child, or the artist self, or the great mother archetype. And then you can play with the cards and juxtapose them and interact with them. I tend to have clients make collages about their inner selves, like with family systems therapy. So I will have them identify the different aspects of self and then have them make a card representing that self. So for instance, the goddess, or the mother, or the child. And not in general terms like an archetype, like Jung, but in terms of how that child is represented in them, how that mother is represented in them. And then we can have discussions about which card is more dominant and which card is in the background, which cards are most influential for them, and that kind of thing. And it's just a nice way to explore that system within the self. Another type of collage are altered books, which is kind of what the visual journal is about with you. With an altered book, you can combine scrapbooking and journaling together. You can use the concept of containment while also providing creativity. So the nice thing about an altered book is that it's small, you can take it with you, and you can add to it at any time. Like I said, it creates this containment or a place to hold all this stuff, but also improves creativity. And then the last one I want to talk about was decoupage. Decoupage is Victorian, like I said. It's from the Victorian time period, late 19th century. And in that time period, what they would do is they would cover objects or make presents, sometimes ornaments that they'd hang or little badges that they would give. Very detailed work. And they'd put them together and then use like a Mod Podge or whatever to coat them. Very beautiful things, but can be very intricate and difficult to work with. Okay, so assemblage. I want to talk a little bit about assemblage. So assemblage is an art that's made by assembling, that's where the word comes from, assembling different elements together. So often with artists who worked in assemblage, you would take everyday objects that you scavenge, that you buy, that you find, and you put them together. So artists to think about, if you want some examples, are Pablo Picasso, Kurt Schweitzer. There was a couple time periods in there, the Futurists, the Surrealists, the Cubists, they all used different aspects of assemblage and collage as part of their art making process. And in the course, I've put some links to the different artists that use these techniques so that you can see what they look like. when they use them. When we use assemblage in art therapy, we're looking at specific things. So for instance, the therapeutic qualities of assemblage in art therapy is that it's similar to collage in the sense that you don't have to be able to draw. You're using things that you've already got and you're putting them together. So it's not really threatening. It's easy to access. You are making special, so you are finding, you know, objects that you're putting together to make something stand out, to make it special. It's very non-threatening. One of the nice qualities is you can reuse any objects. So it's a great way to pre-cycle. It's also a nice way to memorialize. It's just because you're using found objects, and it's not expensive because you can use found objects. So it also helps you to think about viewing things differently. So it's a nice metaphor for life that, you know, something that was old and used up that people consider trash, I can reuse and make special and think of it as being beautiful. And that's a huge metaphor for life. So it's got that nice quality to it. It's constructive in nature, which means that you are building it. You are constructing it. So you're building and adding and improving and changing. So all great metaphors for things that we need to do in our lives. And then of course it's three-dimensional rather than two-dimensional collage. Some examples of assemblages are pocket shrines. Pocket shrines are little tiny containers that hold specific energy or thought or intention, whether playful or deeply meaningful, and they can be fun and interesting. This is one that a student of mine made about Friedel Dicker-Brandes, who worked at the Terezin camp in Prague during World War II, and she was an artist. But I loved it, so I bought it off my student. I was like, I want to keep that one. Another type are shadow boxes, which are similar to the little pocket shrines, but on a larger scale. Joseph Cornell is an artist and Louise Nevelson are both artists that did things that are kind of like shadow boxes, a larger level, larger imagery of putting things together. Joseph Cornell used two-dimensional stuff as well as 3D within his boxes, and Louise Nevelson was pretty much strictly 3D in her work. And then there's sculpture of found objects, so putting things together in unlikely combinations, like Marcel Duchamp put together, you know, he's the one that put the urinal in a museum, and so there's some humor there, but there's also that making special, you know, taking it out of context and looking at it in a different context gives it new meaning. Salvador Dali, he explored his dreams and surrealistic ideas through collage or through sculpture of found objects. And then you can call attention to natural beauty or nature of found objects in like an environmental art. Okay, so I'm just going to mention briefly the ETC. So collage in general uses logic and in memory, so it can be cognitive, can be very symbolic, particularly with what images you choose and how you juxtapose things. Perceptual with color, shape, and pattern, affective with content, but you contain that affect because of the structured materials. Kinesthetic with cutting and pasting, and then sensory is pretty much visual, very little texture unless you're using objects that are textured. Like I have made specifically texture collages intentionally for people with low vision. So they cut out different materials that have different textures and put those together as a collage so that it's interesting to touch as well as to view. Assemblage is cognitive, using logic, memory, having to figure out how things structurally work together, having, you know, how do I make this stick to that, and how do I bind this? It can be symbolic, again, with the juxtaposition and the imagery. You'll have color, shape, pattern, and texture. It can be very effective, both in the process of putting it together, you know, with hammering and soldering and working very kinesthetically, as well as the finished product and what it looks like. It can be very kinesthetic, like I said, with building and putting together. And then it's also sensory with visual and texture and sounds and depending on the materials. So assemblage and collage are some of the areas that I particularly enjoy working with clients because It is non-threatening. It can be very interesting, the things that come up that you weren't expecting because of putting things together that don't normally go together or seeing images next to each other. In the demonstration, I'm going to be showing you some more about pocket shrines, looking a little bit more at altered books, soul collage cards, shadow boxes, and decoupage. Okay, thank you for joining me.